ನಮಸ್ಕಾರ. ವೇದಿಕೆ ಮೇಲೆ ಹಸಿನರಾಗಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ಗಣ್ಯರು, respected dignitaries on the dais, today's chief guest, Professor Ramaya Sridharji, keynote speaker Dr. Jaiprabhakar, Deputy Director of this institution and also coordinator of this program, Srimati H.S. Girijamba, Madam, Research Officer Dr. Krishnamurthy, organizers Dr. Dinesh and Dr. Ramkrishnaya of the dais, all the invitees, participants, scholars from outside state, media friends, ladies and gentlemen. At the outset, let me congratulate the Deputy Director and all the organizers for organizing an very important and theme of the seminar, the impact of globalization, cultural belief on tribal health and healthcare practices. The theme of the seminar is both deeply human and globally significant. The impact of globalization, the cultural belief and tribal healthcare practices. Health means it is not only hospitals or medicines. It is about the belief, tradition, identity, access, dignity, and survival. When we talk about the tribal communities, we are talking about some of the world oldest cultures, because which are rich in knowledge and unique healthcare traditions. But during the globalizing world, the tribal communities are experiencing major transformation, some including some beneficial, some are the harmful for the communities. Both advantage and disadvantage we can find. But undertaking the tribal communities and tribal healthcare communities here, when we referred to the indigenous population, if we see the global perspective, they are living very close to nature. In countries like Brazil, Australia, Canada, Africa, all tribal populations are here, maintain their cultural identity for centuries. And health in tribal society is not viewed only as a physical well-being, because each tribal community is unique and they have their own belief and practices. So it is a balance between body, mind, spirit, and nature. They are closely connected to land and environmental and deeply influenced by community tradition. For many tribes, illness may be seen as a spiritual imbalance. Spiritual imbalance, violation of social norms, disturbance in the harmony with the nature. So therefore, healthcare practices here include the herbal medicines, ritual healings, spiritual ceremonies, and community-based care. So here we find this as a holistic is very different from the modern biomedicine medical system. But cultural belief and their influence on healthcare practices here shows how people understand the disease seeking as well as the treatment acceptance. It varies from community to community, and even we find here childbirth, nutrition, and even hygiene also. Even today, many tribal communities, we find childbirth happens at home with a traditional birth attendant and herbal medicines. And only in very rare case they use the modern medicine, especially their elders as well as the healers. They take very care of the pregnant woman as well as the newborn child, and their tradition and belief has been rooted for many centuries. In fact, in modern medicine, we find even today the tribal medicines as well as indigenous method they are doing. In the new development in pharmacology is integration of indigenous medicine, and especially this tribal medicine as well as what we call Ayurveda, which is one of the oldest method in the world. So integration of this is a big challenge, and now pharmaceutical companies they have come forward and accepted, and this Ayurveda and this traditional medicine is getting now some good recognition. When we talk about this globalization, normally we think in a negative way. Both there is a positive as well as the negative impact of this globalization. So we should be very careful when we adopt any new this globalization. So this globalization, whether it is good for the tribal community or it is harmful, we find both. So while accepting or when we introduce certain things, we should be very careful that it should not harm any tribal indigenous knowledge system. So globalization normally refers here. Positive thing is it connects countries between through trade, technology, media, migration, education, healthcare system. But it brings the world very closer. But here we should bring everyone forward equally. There should not be any dominance of the other culture on these indigenous communities. One. So not always positive here. And positive impact of globalization is here health, which brought several important movements also. Better access to healthcare and government schemes will reach to the remote area because of this globalization. Now we are seeing the telemedicines and mobile clinic vaccinations for certain diseases to eradicate certain diseases. So, and again, these hygiene and sanitations are also very important. This technology and telemedicine, which is a digital services, and even through online consultation is also helpful for certain uh, diseases where we can find the reduced mortality rate and also better maternal health care is also one of the important aspects. But the negative impact is here because of this globalization, we really see certain loss of traditional knowledge, especially among the younger generation. And this will may stop the learning the herbal medicine and lose respect for the traditional healers. It is a very dangerous impact, this one, especially on this indigenous medical system. Coming to the lifestyle style changes, this one. Now we have carried out certain studies in collaboration with ICMR on certain PVTGs. This we find that younger generation are more prone to diabetes mellitus, hypertension, as well as some chronic diseases. Because of this urbanization, they are addicted to alcohol and also the processed food. And lifestyle here, processed food will have a negative impact on this indigenous community where they are stop taking their traditional food. And because of this urbanization, industrial development, here environmental displacement is another very dangerous thing where most of the tribal areas surrounding mining works are taking place. Because of that, here we can see tribal lands have been destroyed, forest is shrinking, and this will have a very serious impact on the air pollution, water pollution, and even noise pollution. All this will have a negative impact on this, where they don't get a nutrition, clear food access, even mental health, livelihood, all this will last because of shrinking of this forest. And another thing is coming from the cultural mistrust historically, even today, many tribal communities have faced here discrimination, exploitation, neglected. This creates mistrust towards the even the government healthcare system. When if the community is not trust on it, definitely they will not accept the new this modern medicines as well as so because of this there will be lot of clash between the traditional as well as the modern medicine. So this is one of the most important challenge and also in the, especially modern science is scientific standard technology driven here But the traditional medicine is very important because it is experience based. For many generations, this knowledge has been transmitted from generation to generation. Even today, Japan, China, and many other countries, they are following this indigenous medical system. With that system, they are very much comfort, and they are not easily accepted the modern medicines also. So there is a correlation between this mental health and cultural identity. Mental health is deeply connected to the cultural belonging. If there is a negative impact on any culture, again, it will create a mental stress for the indigenous community. And because of that, there's many times they go depression because of this, there will be a lot of healthcare issues. For this, uh, the way forward, what we should do is, one is, I would like to mention on 4 points where the cultural sensitivity healthcare doctors must, because they should understand the tribal belief practices which communicates respectfully and avoiding dismissing the traditional practices. Second one is we have to protect the indigenous knowledge by documenting the herbal medicine and encouraging integration of this and giving re-recognize to this tribal healers, because for many centuries these tribal healers have served the communities and they have lived very comfortably. And third point is improve infrastructure without destroying the culture, and providing them a clean water, sanitation, and nutrition program, especially for the school children's one. The fourth important point is community participation especially in healthcare policies, which they should include the tribal voices, and no decision about them should be made without them. Many times in many meetings, I have suggested you involve the tribal communities when you are preparing any policies, because each tribal community is very unique. Suppose if government make a policy of common program, it will not be successful. It will not be successful. So while making any policy decision, it should be a tribe specific program, and each tribal community have their own traditional occupation that should be protected, and technology may be introduced there for their production as well as the marketing issues. This one. And let me conclude. Globalization is very powerful, which connects us, modernizes us, and also offers progress. But it must not erase the identity of those who have lived sustainably for centuries. Tribal community, they lived like a very comfortably inside the forest or surrounding the forest. But when we don't respect their cultural belief, it will have a different impact. And globalization space access to healthcare, but the challenge is balanced here, and we must respect culture, promote scientific, but it should not erase any. And we are indigenous knowledge, and we should protect the dignity between the true healthcare, and it is not only for curing the disease, and it is about the respecting the people, because normally there are more than 1,000 healthcare healers in Karnataka itself. 1,000 healthcare healers. But after this introduction of this modern medicine span, they have been disrespected and created a problem. And even many of them, they are at the verge of what we call this knowledge has been disseminated. So let us aim for a world when tribal communities are not only left behind, where tradition and knowledge should talk together. Otherwise, globalization should will not get respect, and globalization should be a bridge between these two and not a bulldozer, because now we are seeing, and we should respect this indigenous community and help them to get and respect in the society as well as their livelihood. So now government schemes have been introduced, even that should be utilized with a positive way. And I think this seminar will give some good information and conclusion for the policymakers. One. And I wish the program will be successful, and all the participants should be participate actively for the discussion. And very senior professor is here, and you should make use of it because he is from bioscience, and bioscience is also an important area, especially it is very connected with healthcare. I hope everybody will listen and participate actively. And once again, I congratulate the deputy director and all the organizers for organizing this very important uh, seminar theme. And thank you for inviting me and giving me an opportunity to share few words with this. Thank you, one and all. ನಮಸ್ಕಾರ. Nonetheless, Professor Computer Shivasa, Pablo Professor, Department of Overseas University, and Deputy Director Institute, Senior PHS Gijamba, Dr. Krishnamurthy KV, Research Officer, Modern University Study Center, Dr. Dinesh, Dr. Amit, and participants from different parts of country, and in Karnataka. So I've been asked to speak in Tamil. In fact, I prepared my keynote at the same time. Is it okay? We will switch over to English also. Okay. So, ತುಂಬಾ ಮುಖ್ಯವಾದಂತ ವಿಷಯ ಈಗಾಗಲೇ ರಿಜಿಸ್ಟರ್ ಭಾಷಣವಾದಂತ ಮಾನ್ಯ ಚಾಮರಾಜನಗರ ವಿಶ್ವವಿದ್ಯಾಲಯದ ಮುಖ್ಯರು ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ಗ್ಲೋಬಲೈಸೇಷನ್ ಮತ್ತೆ ಜಾಗತೀಕರಣ ಮತ್ತೆ ಪ್ರಮಾಣ ಹಾಗೂ ಹಾಗೂ ಇದೆಲ್ಲ ನಾವು ಸಂಬಂಧಪಟ್ಟಂತ ವಿಷಯ ಜಾಗತಿಕ ವಿಚಾರಗಳನ್ನು ಜಾಗತಿಕ ಮಾಡುವುದಾಗ್ತದೆ ಸಾಂಸ್ಕೃತಿಕ ನಂಬಿಕೆಗಳನ್ನು ಕಂಡುಬಿಡುತ್ತೆ ಯಾಕೆಂದ್ರೆ ಭಾರತ ಬಿಟ್ಟ ದೇಶ ಕೆಲಸವನ್ನು ಮಂಜೂರಾಗಿ ಇರ್ತಕ್ಕಂಥದ್ದು ಮತ್ತೆ ಆಚಾರ ವಿಚಾರಗಳು ಬರುವುದು ಬೇರೆ ದೇಶಗಳಲ್ಲಿ ಬಹಳಷ್ಟು ಇರ್ತಕ್ಕಂಥದ್ದು ಸಮುದಾಯಗಳಲ್ಲಿ ಬಹಳಷ್ಟು ಇರ್ತಕ್ಕಂಥದ್ದು ಶಿಸ್ತು ವಿಷಯ ನಾವು ಬಳಸ್ತಿದ್ದೀವಿ ಅಂತಂದ್ರೆ ಯಶಸ್ವಿಯಾಗಲಿಕ್ಕೆ ಸಾಧ್ಯ ಮುಖ್ಯ ಸಾಂಸ್ಕೃತಿಕ ಮಾತ್ರ ಅಂತಕ್ಕಂಥದ್ದು ನಮ್ಗೆ ಹಾಗೆ ಆರೋಗ್ಯ ಪಾಲನೆ ವಿಚಾರಗಳು ತುಂಬಾ ಮುಖ್ಯವಾದಂತ ವಿಚಾರ ಆರೋಗ್ಯ ನಾವು ಎಷ್ಟೋ ಆದಿವಾಸಿಗಳ ಆರೋಗ್ಯ ಚಿಂತೆ ಮಾಡಲಿಲ್ಲ ಆದಿವಾಸಿಗಳ ಆರೋಗ್ಯ ಬಹಳಷ್ಟು ಸಂಶೋಧನೆ ಆಗ್ತದೆ ಯಾಕಂದ್ರೆ ಇಷ್ಟು ಕಾಲಘಟ್ಟಗಳು ಆದಿವಾಸಿಗಳು ಸಿವಿಲೈಸೇಷನ್ ಅಂತಕ್ಕಂಥದ್ದು ಅನ್ಕೊಂಡಿದ್ವಿ ವಿಷಯ ಮಾಡಿರ್ತಕ್ಕಂಥ ವಿಷಯ ನಾವು ನಾವು ಸಂಶೋಧನೆ ಮಾಡಬೇಕು, ಡಿಸ್ಕಸ್ ಮಾಡಬೇಕು, ವಿಚಾರಗಳನ್ನು ಮಾಡಬೇಕು. ಹಾಗೆ ಅಷ್ಟೇ ಅಲ್ಲ, ಮಾನಸಿಕ, ಸಾಮಾಜಿಕ ಮತ್ತು ಆಧ್ಯಾತ್ಮಿಕ ಕ್ಷೇಮದ ಸಮಗ್ರವಾದಂತಹ ಸ್ಥಿತಿ ಅಂತ ನಾವು ಕರೀತೀವಿ. ಅವೆಲ್ಲ ಕೂಡ ಎಲ್ಲವೂ ಮಾತ್ರ ಒಂದು ಆರೋಗ್ಯ, ನಿಸರ್ಗದಲ್ಲಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜವನ್ನು ಕಟ್ಟಲಿಕ್ಕೆ, ಆರೋಗ್ಯವಂತ ಸಮುದಾಯಕ್ಕೆ ಆಗ್ತದೆ. ನಾವು ಇದು ಆದಿವಾಸಿ ಸಮುದಾಯಗಳಿಗೆ ಕಾನ್ಸೆಪ್ಟ್ ಸಿಗಡ ಕಾನ್ಸೆಪ್ಟ್ ಅಂತ ಅಷ್ಟು ಶತಮಾನ ಕೂಡ ಆದಿವಾಸಿಗಳು ಆರೋಗ್ಯ ಅಂತ ದೈಹಿಕ, ಮಾನಸಿಕ, ಸಾಮಾಜಿಕ, ಆಧ್ಯಾತ್ಮಿಕ ಶಿಕ್ಷಣ ಹಾಗೆಯೇ ಆರೋಗ್ಯ ಸಂಬಂಧಪಟ್ಟಂತೆ ಪ್ರಕೃತಿ ಇರ್ತಕ್ಕಂಥದ್ದು, ಮತ್ತೆ ಸಮುದಾಯ ಜ್ಞಾನಕ್ಕೆ ಆಧಾರವಾಗಿದ್ದಂಥದ್ದು ಆರೋಗ್ಯ ಪಾಲನೆಗಳಾಗಿತ್ತು ಅಂತಕ್ಕಂಥದ್ದು ನಾನು ಹಾಗೆ ಪ್ರಕೃತಿ ಸಮತೋಲನ ಅಂತಂದಾಗ ಮನುಷ್ಯ ಮತ್ತು ನಮ್ಮ ಪ್ರಕೃತಿ ಒಟ್ಟಾಗಿ ಸೇರಿದಾಗ ಮಾತ್ರ ಆರೋಗ್ಯ ಸಮಾಜ, ಆರೋಗ್ಯ ಮತ್ತೆ ಆರೋಗ್ಯವಂತ ಸಮುದಾಯವನ್ನ ವಿಸ್ತರಿಸ್ತದೆ. ಸಂಬಂಧವನ್ನು ಪ್ರಕೃತಿ ಸಮುದಾಯದ ಇದು ಸಂಪದನ್ನು ಇದರಲ್ಲಿಟ್ಟು ಅದನ್ನು ಸ್ಪಿರಿಚುವಾಲಿಟಿ, ಆಧ್ಯಾತ್ಮಿಕ ಶಾಂತಿ ಅಂತ ನೋಡ್ತೀವಿ. ಆಧ್ಯಾತ್ಮಿಕ ಸ್ಪಿರಿಚುವಾಲಿಟಿ ಅಂತಂದ್ರೆ ಸ್ಪಿರಿಚುವಾಲಿಟಿ ಸ್ಪಿರಿಚುವಾಲಿಟಿ ಆ ಸ್ಥಿತಿಯನ್ನು ಕಲ್ಪಿಸಿದಂಥದ್ದು ಶಸ್ತ್ರ ಸಮಾಜವನ್ನ ಜೀವನ ಶೈಲಿ ಸಾಕಷ್ಟು ಇವತ್ತು ಡಿಸ್ಕಷನ್ ಆಗ್ತಾವೆ. ಎಲ್ಲರೂ ಕೂಡ ಸಮನ್ವಯ ಸ್ಥಿತಿ ಆರೋಗ್ಯ ಅಂತಕ್ಕಂಥ ಮಾತನಾಡಿದ್ರು. ಹಾಗೆ ಇದು ನನ್ನ ಕನ್ನಡದ ಶೋಧಿದ್ರು ಅವರ ಸಂಪೂರ್ಣ ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಿದೆ. ಅಂದ್ರೆ ಕಾಯಿಲೆ ಸಂಬಂಧವಾಗಿ ಸಂಪೂರ್ಣ ಆರೋಗ್ಯ ಕೂಡ ಸುಭಿಕ್ಷವಾಗಿರ್ತದೆ ಅಂತಕ್ಕಂಥದ್ದು ಈಗ ಸಾಕಷ್ಟು ನಮ್ಮ ಆದಿವಾಸಿಗಳು ಗುರುಜನರು. ಹಾಗೂ ಜಾಗತೀಕರಣ ಗ್ರಾಮ ಕಷ್ಟ ಇಲ್ಲ, ಇಷ್ಟು ಕಲ್ಪಿಸಿ ಸಿಗೋದು ಅದ್ರ ಪ್ರಶ್ನೆ ಏನಂತಂದ್ರೆ ಹೃದಯವಾಸಿ ಆರೋಗ್ಯಕ್ಕೆ ಹಿತ ತರುವುದು ಅಥವಾ ಮಾಡ್ಬೋದು ಅಂತಕ್ಕಂಥದ್ದು ಪ್ರಶ್ನೆ. ಆ ಜಾಗೃತ ಆಗ್ತದೆ ಅಧಿಕರಣ ಜಾಗೃತಿಕರಣ ಅಂತಕ್ಕಂಥದ್ದು ನಾವು ಮಾತಾಡಿದ್ದೀವಿ. ಸಕಾರಾತ್ಮಕ ಜಾಗತಿಕರಣ ಹೆಚ್ಚಾಗಿದೆ. ಮತ್ತೆ ಲಸಿಕೆ ಕಾರ್ಯಕ್ರಮಗಳು ಪ್ರದೇಶಗಳನ್ನು ಕೂಡ ತಲುಪಿದೆ. ಅದ್ರ ಕಾರಣ ಜಾಗತೀಕರಣ. ಸೊ ಜಾಗತೀಕರಣ ಅಂದ್ರೆ ಅಷ್ಟೇ ಒಂದು ಜಾಗತೀಕರಣ ಆದ ಸೊ ನಮ್ಗೆ ಸಾಕಷ್ಟು 98% ಏನು 98% ರುಚಿಗಳಿಗೆ ಕಾರಣ ರೆವಲ್ಯೂಷನ್ ಆಗಲಿ ಅಂತ ಹೇಳ್ಬೋದು. ಹಾಗೆ ಭಾರತ ಯೋಚಿಸಿ ತಾಯಿ ಹೆಚ್ಚು ಪೌಷ್ಟಿಕಾಂಶಗಳನ್ನು ಸಾಕಷ್ಟು ಪರಿಣಾಮಗಳಿದೆ. ಸೊ ಇಂಥ ಮೆಂಟಾಲಿಟಿ ರೇಟು ಕಡಿಮೆ ಸಾವಿರ ಆದಿವಾಸಿ ಪರ್ಸೆಂಟ್ ಅಂತಕ್ಕಂಥದ್ದು ಕೆಲವೊಂದು ಸಂಶೋಧನೆಗಳಲ್ಲಿ ಉಲ್ಲೇಖ ಆಗಿದೆ. ಸೊ ಹಾಗೆ ರೀಸೆಂಟಷ್ಟು ರೈಲ್ವೆ ಚಿಂತನೆಗೆ ಲಸಿಕೆಗಳನ್ನ ಹಾಕಿದ್ದು ಆಗಕ್ಕಾಗಿಲ್ಲ. ಸೊ ಅದು ಆ ಚಾರ್ಜಿನ ಸಿಹಿ ಇದೆ ಅಂತ ಹಾಗೆ ಸಂಕ್ರಾಂತ ಚಾಲೆಂಜಸ್ ಆಗುವುದು ಶಾರ್ಟೇಜ್ ಆಫ್ ಡಾಕ್ಟರ್ಸ್ ನಮ್ಮ ಜನ ಹಾಡುಗಳು ಕೆಲಸ ಮಾಡಲಿಕ್ಕೆ ಇವತ್ತು ಡಾಕ್ಟರ್ಸ್ ಶಾರ್ಟೇಜ್ ಚಾಲೆಂಜಸ್ ಇದೆ. ಸೊ ಸಾರ್ವಜನಿಕ ಸಂಖ್ಯೆ ಶಿಕ್ಷಣದಲ್ಲಿ ಇರುತ್ತೆ ಮತ್ತೆ ಸ್ವಚ್ಛತೆ ಕುಟುಂಬ ನಿಯಂತ್ರಣ ವೃತ್ತೀಕರಣದಿಂದಾದಂತ ಒಂದು ರೀತಿಯ ಅಂತಕ್ಕಂಥ ಅರವತ್ತು ವರ್ಷದಿಂದ 40 ವರ್ಷಗಳು ಎಕ್ಸ್ಪೆಕ್ಟೆನ್ಸಿ ಜೀವಿತಾವಧಿ ಆದಿವಾಸಿಗಳು ಅಂತಕ್ಕಂಥ ಹಾಗೆ ಆ, ಆ, ರಾಷ್ಟ್ರಪತಿ ಆದಿವಾಸಿಗಳು ಜಗತ್ತಿನ ವಿಷಯಗಳನ್ನು ಬಗ್ಗೆ ವಿಶ್ವವಿದ್ಯಾಲಯದ ಒಂದು ಸಾಂಪ್ರದಾಯಿಕವಾದಂತಹ ಆಹಾರ ಸಾರ್ವಜನಿಕ ಸಿಸ್ಟಮ್ ಅಕ್ಕಿ ಆಧಾರಿತ ಇದಕ್ಕೆ ಅವ್ರಿಗೆ ತಲುಪಿಸ್ಬೇಕು ಅಥವಾ ಲಂಚ ಸರಿಯಾಗಿ ಅಂತಕ್ಕಂಥ ಸಾಧ್ಯ. ಸಮಸ್ಯೆಗಳು ನಕಾರಾತ್ಮಕ ಪ್ರಭಾವಗಳು ಅಂತ ಹೇಳ್ಬೋದು. ಅದು ಚೌಳಿ ಸಾಕಷ್ಟು ಕಾಯಿಲೆಗಳು ಹುಟ್ಟಾಗ್ತಕ್ಕಂಥದ್ದು ರೋಜಗಾರಗಳು ಮತ್ತೆ ಸಾಕಷ್ಟು ಸಂಶೋಧನೆ. ಸೊ ಅದು ನಾಶ ಆಗುವಂತ ಹಂತದಲ್ಲಿದೆ. ಸಂವಿಧಾನ ಸಾಕಷ್ಟು ನಾವು ಸಾಕಷ್ಟು ಔಷಧಿಗಳನ್ನ ಸಾಕಷ್ಟು ವರಕ್ಷಣೆ ಆಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಎಲ್ಲ ಕಾಲದಲ್ಲಿ ಸಿದ್ಧ ಮೇಜರ್ ಇಸ್ಕೊಳ್ಬೇಕಂತ ಕಂಪನಿ ಕೂಡ ಸರ ನಾಶ ಸಾಕಷ್ಟು ಕಾರಣವಾಗಿದ್ದು ಸರಿಸುಮಾರು 40,000 ಕ್ಲಿನಿಕ್ ಅರಣ್ಯ ಕರ್ನಾಟಕದಲ್ಲಿ ಸಾಕಷ್ಟು ಕಾರಣ ಮಾಡಲಿಕ್ಕೆ ಸರ್ಕಾರಗಳು ಸಾಕಷ್ಟು ಅದು ಸಾಧ್ಯವಾಗ್ತಾವು. ಹಾಗಾಗಿ ವರ್ಷ ಆಗ್ತಾ ಇರೋದ್ರಿಂದ ಇರ್ತಕ್ಕಂಥ ಸಾಕಷ್ಟು ಉತ್ಪನ್ನಗಳಿವೆ. ಅದಕ್ಕೆ ಮತ್ತೆ ಪ್ರಾಣಿ ಸಸ್ಯಗಳಿಗೆ ಅಷ್ಟೇ ಅಲ್ಲ ರೈತರ ಬಗ್ಗೆ ಸಾಕಷ್ಟು ಔಷಧ ಸಸ್ಯಗಳು ಕೊಟ್ಟು ಎಲ್ಲ ಕೂಡ ಆಗ್ತಾ ಇದೆ ಎಂದು ನಾವು ಆದಷ್ಟು ನಾವು ಅವರ ಸಾಂಸ್ಕೃತಿಕ ನಂಬಿಕೆ ಮಾಡಬೇಕು ಆರೋಗ್ಯ ಕೊರತೆಗಳನ್ನು ಸ್ಪಿರಿಚುವಲ್ ಮತ್ತೆ ancestral relation ಅಂತ ನಂಬಿಕೆಗಳು ಸೊ ಬಹಳಷ್ಟು ಯಾಕೆಂದ್ರೆ ಸೈಕೋ ಸೋಷಿಯಲ್ ಹೆಲ್ತ್ ಅನ್ನೋ ಇದರಲ್ಲಿ ಮಹತ್ವದ ಪಾತ್ರವನ್ನು ವಹಿಸ್ತಾ ಇದೆ ಅಂತಕ್ಕಂಥ ಔಷಧಿಗಳ ಸಂಶೋಧಿಸಿದಂತ ಔಷಧಿಗಳ ಸಸ್ಯ ಔಷಧಿಗಳನ್ನ ಪ್ರಸಾದ ಪದ್ಧತಿಗಳು ಸೊ ಸಾಕಷ್ಟು ಇಶ್ಯೂಸ್ ಡೆವಲಪ್ಸ್ ಆಗ್ತಾ ಇದೆ ಆಲ್ಮೋಸ್ಟ್ ನಾವು ಒಂದು 20% ಅಷ್ಟು ಇಶ್ಯೂಸ್ ಆಗಿಲ್ಲ ಆದ್ರೂ ಸಿಸ್ಟಮ್ ಕೂಡ ಕೂಡ ಸಾಕಷ್ಟು ಮತ್ತೆ ಸಿಸ್ಟಮ್ ಕೂಡ ಸರಿ ಅಂತಕ್ಕಂಥ ಕಾನ್ಸೆಪ್ಟ್ ಮಾಡ್ತಾರೆ ಕಂಟಿನ್ಯೂ ಬಹಳಷ್ಟು ಸ್ವಲ್ಪ ಇದಾಗ್ತದೆ ಚಿಕಿತ್ಸೆ ಕಮ್ಯುನಿಟಿ ಮೆಡಿಕಲ್ ಸರ್ವಿಸ್ ಸ್ವಲ್ಪ ಕೂಡ ಸೊ ಆಗ್ತಾ ಇದ್ದಂತೆ ಕಂಟಿನ್ಯೂ ಆರೋಗ್ಯ ಸಮಸ್ಯೆಗಳು ಆಗ್ತವೆ ಅಂದ್ರೆ ಕೆಲವೊಂದು ಹಾಗೆ ಚಿತ್ರ ಕಾರ್ಯಕ್ರಮಗಳು ರೀಚ್ ಆಗತಕ್ಕಂಥದ್ದಾಗಿ ಹಾಗೆ ಶಿಕ್ಷಣ ಕೂಡ ಆಗ್ತದೆ ಕಾರ್ಯಕ್ರಮಗಳು ಸರ್ಕಾರದ ಕಾರ್ಯಕ್ರಮಗಳು ಸೊ ಅದಕ್ಕೆ ರೀಚ್ ಆಗ್ಲಿಕ್ಕೆ ಇನ್ನೂ ಅದನ್ನ ತಲುಪಲಿಕ್ಕೆ ಸಾಧ್ಯ ಅಂತಕ್ಕಂಥದ್ದನ್ನ ಅದ್ರ ಜೊತೆನಲ್ಲಿ ಸೌಲಭ್ಯಗಳ ಮಾನಸಿಕ ಒತ್ತಡ ಜೀವನದ ಇರ್ತಕ್ಕಂಥ ಒಂದು ಅದನ್ನು ಕೂಡ See these are the reasons. So, ಸುಮಾರು ಇಷ್ಟಷ್ಟು ಕನಸುಗಳಲ್ಲಿ ಸಿಗುವಂತದ್ದು ಮಾಡ್ತಾರೆ. ಮತ್ತೆ 25% ಅಷ್ಟು ಜನಗಳು ಇದು ಸೂಪರ್ ಅಂತಕ್ಕಂಥದ್ದು ಆತಂಕ ವಿಚಾರ ಅಂತ ಹೇಳಿದಾಗ ಅಂತಕ್ಕಂಥ ಈ ಸಂದರ್ಭದಲ್ಲಿ ರಾಷ್ಟ್ರಪತಿ ಸಮಿತಿ ಸರ್ವಸಿದ್ಧಿ ಸಾಕಷ್ಟು ದುರುಸ್ ತಕ್ಕಂಥ ಕೆಲಸ ಮಾಡ್ತಾರೆ. ಚಂದ್ರಸಿದ್ದು ಇಲಾಂಟಿಗಳನ್ನು ಎಷ್ಟೋ ರಸ್ತೆ ಇರಬೇಕು ಚಾನಲ್ಸ್ ಎಷ್ಟು ಸಕ್ಸಸ್ಫುಲ್ ಕಾರ್ಯಕ್ರಮ ಸರ್ಕಾರದ್ದು ಅಂತ ಹೇಳ್ಬೋದು. ನಾವು ಸಾಕಷ್ಟು ಕಾರ್ಯಕ್ರಮ ಸರ್ಕಾರದಿಂದ ಆರೋಗ್ಯ ಕಾರ್ಯಕ್ರಮ ಸಾಕಷ್ಟು cultural sensitives, cultural sensitive ಪ್ರತಿಯೊಂದು ಮಾಡಿದ್ರೆ ಸಾಕಷ್ಟು ಮಹಿಳೆಯರು ಖರ್ಚು ಮಾಡ್ತಿಲ್ಲ ತುಂಬ ಲೆವೆಲ್ ಯಾಕೆ ಸರ್ಕಾರ ಕೊಡ್ತೇವೆ ಸರ್ಕಾರ ಕೊಟ್ಟಂತ ಗಣೇಶ ಆಗುದು ಅಂತಿಲ್ಲ ಶಿಕ್ಷಣ ಖರ್ಚು ಮಾಡ್ತಿಲ್ಲ ವರ್ಷಕ್ಕೆ ಆಗ್ತದೆ ಅಂತ ಹೇಳಿದ್ರೆ ತಾವು ಮತ್ತೆ ಸರ್ಕಾರದ ಕಾರ್ಯಕ್ರಮಗಳು ಅದರ ಕಾರ್ಯದಲ್ಲಿ ಉಳಿತಾ ಇಷ್ಟಪಡ್ತೀನಿ ಹಾಗೆ ಮಾತೃಭಾಷೆಗಳನ್ನ ಆರೋಗ್ಯ ಜನರಿಗೆ ಆಗ್ತಾ ಸ್ಪೆಸಿಫಿಕ್ ಅವ್ರ ಭಾಷೆಗಳಲ್ಲಿ ಟ್ರೈಬಲ್ ಭಾಷೆಗಳಲ್ಲಿ ಲಿಂಗ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮಗಳು ಮಾಡಿಸಿದ್ದೆ ಆಗ್ತದ ಅಂತಕ್ಕಂಥ ನೋಡ್ಬೇಕು ಹಾಗೆ ಮಾಡಿಸಿದಂತಹ ಸಂಘಟನೆ ಪ್ರತಿಯೊಂದು ಕನ್ನಡದಲ್ಲಿ ಕೆಲಸವನ್ನ ಮಾಡಬೇಕು ಪ್ರತಿಯೊಂದು ಕಟ್ಟಡದಲ್ಲೂ ಕೂಡ ಆರೋಗ್ಯ ಶುಗರ್ ಯಾವ ಮಾನಸಿಕ ಎಷ್ಟು ಶಕ್ತಿಗೆ ಸಂದರ್ಭಗಳಲ್ಲಿ ಕೆಲಸವನ್ನ ಸಂಸ್ಥೆಗಳು ಸರ್ಕಾರ ಮಾಡಬೇಕಾಗ್ತದೆ ಅಂತಕ್ಕಂಥದ್ದನ್ನ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಪೌಷ್ಟಿಕ ಆಹಾರ ಭದ್ರತೆ ಅರಣ್ಯ ಹಕ್ಕುಗಳ ರಕ್ಷಣೆ ಸಮುದಾಯ ಪಾಲ್ಗೊಳ್ಳುವಿಕೆ ಇವೆಲ್ಲವೂ ಕೂಡ ಮುಖ್ಯ ಹಾಗಾಗಿ ಈಗ ನಮ್ಮ ಈ ಒಂದು ಸೆಮಿನಾರ್ಗೆ ಸಂಬಂಧಪಟ್ಟಿಗೆ ಸಂಶೋಧಕರ ಪಾತ್ರ ಏನು ಅಂತಕ್ಕಂಥ ತುಂಬಾ ಮುಖ್ಯ ಆಗ್ತದೆ ನಾವೆಲ್ಲರೂ ಕೂಡ ಪಾರಂಪರಿಕವಾದಂತ ಜ್ಞಾನವನ್ನ ನಮ್ಮ ಗಿರಿಜನರಲ್ಲಿ
ಮತ್ತೆ ಅರಣ್ಯವಾಸಿಗಳಲ್ಲಿ ಏನಿತ್ತು ಅವನ್ನ ದಾಖಲೀಕರಣ ಮಾಡ್ತಕ್ಕಂಥ ಜವಾಬ್ದಾರಿ ನಮ್ಮೆಲ್ಲ ಸಂಶೋಧಕರ ಮೇಲಿದೆ. ಹಾಗೆ ಸಮುದಾಯದ ಧ್ವನಿಯನ್ನ ಅಧಿಕಾರಿಗಳ ಮಟ್ಟಕ್ಕೆ ಮತ್ತೆ ನೀತಿಯಾಗುವ ಮಟ್ಟಕ್ಕೆ ತಲುಪಿಸ್ತಕ್ಕಂಥ ಜವಾಬ್ದಾರಿ, ಅದನ್ನ ಪೇಪರ್ ಆಗಿ ಪಬ್ಲಿಷ್ ಮಾಡ್ತಕ್ಕಂಥದ್ದು, ಅದನ್ನ ಒಂದು ರಿಸರ್ಚ್ ಬೇಸ್ಡ್ ಆಗಿ ಮಾಡ್ತಕ್ಕಂಥದ್ದು ಇವೆಲ್ಲವೂ ಕೂಡ ನಮ್ಮ ಜವಾಬ್ದಾರಿ ಇದೆ. ಹಾಗೆ ಸಂಶೋಧನಾ ವಿಧಾನಗಳನ್ನ ನಾವು ಬದಲಾವಣೆ ಮಾಡ್ಕೋಬೇಕಾಗಿದೆ. ಎಲ್ಲಾ ಸಂಶೋಧನಾ ವಿಧಾನಗಳು ಎಲ್ಲ ಸಮುದಾಯಗಳನ್ನ ಅಧ್ಯಯನ ಮಾಡ್ಲಿಕ್ಕೆ ಎಲ್ಲವೂ ಕೂಡ ಒಗ್ಗೋದಿಲ್ಲ. ಬೇಕಾದಂತ ಆ ಸಮುದಾಯಕ್ಕೆ ಆ ಸಮುದಾಯದ ಸಂಸ್ಕೃತಿ ಮತ್ತೆ ಆ ಸಮುದಾಯದಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ನಂಬಿಕೆಗಳ ತಕ್ಕ ಹಾಗೆ ನಮ್ಮ ಸಂಶೋಧನಾ ವಿಧಾನಗಳನ್ನು ಒಗ್ಗಿಸ್ಕೊಳ್ಬೇಕಾದಂತ ಇವತ್ತಿನ ಒಂದು ಚಾಲೆಂಜಸ್ ಇದೆ ನಮ್ಮಲ್ಲಿ ಸಂಶೋಧಕರಿಗೆ ಅಂತ ಹೇಳ್ತೀನಿ. ಹಾಗೆ ಆರೋಗ್ಯ ಅಸಮಾನತೆ ಮತ್ತೆ ನೀತಿ ಶಿಫಾರಸುಗಳ ಮೇಲೆ ನಾವು ಸಂಶೋಧನೆಗಳನ್ನ ಮಾಡಿ ಯಾವುದು ಒಳಿತು ಯಾವುದು ಕೆಡುಕು ಯಾವುದು ತಲುಪಬೇಕು ಅದನ್ನ ಸರ್ಕಾರಗಳಿಗೆ ನಾವು ಅದನ್ನ ಮಂದಟ್ಟು ಮಾಡ್ತಕ್ಕಂಥ ಜವಾಬ್ದಾರಿ ನಮ್ಮ ಸಂಶೋಧಕರ ಮೇಲೆ ಇದೆ ಅಂತಕ್ಕಂಥದ್ದನ್ನ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಹೇಳ್ತೀನಿ. ಕೊನೆಗೆ ಇವೆಲ್ಲವೂ ಕೂಡ ಜಾಗತೀಕರಣ, ಕೊನೆಯದಾಗಿ ನಾನು ಹೇಳೋದೇನಂದ್ರೆ ಜಾಗತೀಕರಣನ ತಡೆಯಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ. ಅದು ಜಾಗತೀಕರಣ ಆಗ್ತಾ ಇದೆ, ಮುಂದುವರ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದೆ. ಸೊ ಆದ್ರೆ ಅದನ್ನ ಮಾನವ ಕೇಂದ್ರಿತ ಮತ್ತೆ ಸಾಂಸ್ಕೃತಿಕವಾಗಿ ಸಂವೇದನಶೀಲ ಮತ್ತು ಆದಿವಾಸಿ ಹಕ್ಕುಗಳನ್ನ ಗೌರವಿಸುವ ರೀತಿಯಲ್ಲಿ ರೂಪಿಸ್ಲಿಕ್ಕೆ ಸಾಧ್ಯವಾಗ್ತದಾ ಅಂತಕ್ಕಂಥದ್ದೇ ನಮ್ಮ ಮುಂದೆ ಇರತಕ್ಕಂತ ದೊಡ್ಡ ಚಾಲೆಂಜು ಅಂತ ಹೇಳ್ಬೋದು. ಸೊ ಹಾಗಾಗಿ ಅರಣ್ಯವಾಸಿಗಳು ಮತ್ತು ಆದಿವಾಸಿಗಳನ್ನ ಆರೋಗ್ಯವನ್ನ ಸುಧಾರಿಸಬೇಕಾದ್ರೆ ನಾವು ಅವರ ಭೂಮಿ ಉಳಿಬೇಕು, ಅವರ ಅರಣ್ಯ ಉಳಿಬೇಕು, ಅವರ ಸಂಸ್ಕೃತಿ ಉಳಿಬೇಕು, ಅವರ ಜ್ಞಾನ ಉಳಿಬೇಕು ಅಂತಕ್ಕಂಥದ್ನ ಈ ಸಂದರ್ಭದಲ್ಲಿ ನೆನಪು ಮಾಡ್ಕೊಳ್ತಾ, ಆದಿವಾಸಿಯ ಆರೋಗ್ಯದ ಭವಿಷ್ಯ ಅವರ ಸಂಸ್ಕೃತಿಯ ಭವಿಷ್ಯಕ್ಕೆ ಅವಿಭಾಜ್ಯವಾಗಿ ಸಂಬಂಧಿಸಿದೆ ಅನ್ನೋ ಮಾತನ್ನ ನಾನು ಹೇಳ್ತಾ ಈ ದಿಕ್ಸೂಚಿ ಭಾಷಣ ಮಾಡ್ಲಿಕ್ಕೆ ನನಗೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಂತ ಈ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರು ಮತ್ತೆ ಈ ಕೋಆರ್ಡಿನೇಟರ್ ದಿನೇಶ್ ಅವರು ಮತ್ತೆ ಇಲ್ಲಿ ನೆರೆದಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ಸಂಶೋಧಕರಿಗೆ ನನ್ನ ನಮಸ್ಕಾರಗಳನ್ನ ತಿಳಿಸ್ತು ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ನಮಸ್ಕಾರ.
ಆದಿವಾಸಿಗಳಲ್ಲಿ ಪಾರಂಪರಿಕ ಜ್ಞಾನ, ಸಮುದಾಯದ ಐಕ್ಯತೆ ಹಾಗೆ ಆಧುನಿಕ ಸಂದರ್ಭದಲ್ಲಿ ಇವುಗಳ ಮೇಲೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಪರಿಣಾಮ ಬೀರ್ತಿದೆ, ಅವನ್ನ ಯಾವ ರೀತಿ ಉಳಿಸ್ಕೋಬೇಕು ಅಂತ ಸುದೀರ್ಘವಾಗಿ ತಮ್ಮ ದಿಕ್ಸೂಚಿ ಭಾಷಣದಲ್ಲಿ ಆಶಾ ನುಡಿಗಳಾದ ಪ್ರೊಫೆಸರ್ ಜಯಪ್ರಭಾಕರ್ ಸರ್ ಇವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಈಗ ಈ ಕಾರ್ಯಕ್ರಮದ ಮುಖ್ಯ ಅತಿಥಿಗಳಾಗಿರ್ತಕ್ಕಂಥ ಪ್ರೊಫೆಸರ್ ಖಂಡಿಕೆ ರಾಮಯ್ಯ ಸರ್ ಅವರು ತಮ್ಮ ಮುಖ್ಯ ಅತಿಥಿ ಭಾಷಣವನ್ನು ಆಡ್ಬೇಕಂತ ಕೇಳಕತ್ತೀನಿ.
Dignitaries on the dais, delegates, invitees, and participants of this seminar. I feel that I am an odd person in this group because I am a biologist, Jiva Vignani, and I have not extensively worked on tribal studies. Me and my students have carried out some studies pertaining to tribes of the Western Ghats and also west coast of Karnataka. So there are several tribes use plants and also microbes and different types of animals for their nutrition, livelihood, and medicinal purposes and other requirements. We are all aware that the importance of tribal knowledge. The tribal knowledge has been inherited over a period of time, and they have excellent ideas about how to protect the environment and how to use them for their nutrition and how to use those materials or the biological materials for their health and other required necessities. So we are all witnessing, as Professor Gangadhar has mentioned and also Prabhakar has mentioned, several aspects pertain to human development and also urbanization. What type of urbanization is going on today? So we are all witnessing a sort of catastrophic development with regard to urbanization. As Prabhakar has mentioned, we cannot stop it, but the development the development is taking place in a human-centric development. human-centric development, and it should be switched over to nature-centric developments. So unless we protect the nature, we will not survive. And if we want to survive, we have to protect the nature. In that context, we have to honor whatever nature we have, whatever nature we have inherited, it has to be protected in a very uh, tangible manner. So in this context, this institution has taken a very important step to uh, convene this meeting or the seminar pertain to the tribes and their importance and their exposing their knowledge and also documentation of such knowledge, and all those particulars have been given, and that is very, very important. So therefore, we should switch over to the nature-centric developments it should be a sort of positive thinking. I congratulate the institution and also all the organizers and all those who have helped to convene this meeting to carry out research on tribals and also their importance pertaining to nutrition and health and other lifestyle features like and you I'm sure you are all aware that so one health is one of the important aspects nowadays people are believing. One health means it should be the health of human being, health of animals, and health of environment. So all of them has to be taken into consideration equally, and nothing is inferior. So human health is important, animal health is important, and also environmental health is important. In that context, One Health concept has come into existence, and that has to be promoted. So I congratulate the institution and also the organizers and those who have involved directly and indirectly to convene this meeting and conference. And I hope these deliberations will bring out very important issues pertaining to One Health, including tribes, everyone like that. Let us hope for the best. Thank you very much.
ಒನ್ ಹೆಲ್ತ್ ಅನ್ನೋದು ಹೇಗಿರಬೇಕು ಅನ್ನೋದನ್ನ ತಿಳಿಸ್ಕೊಟ್ಟಂತ ಪ್ರೊಫೆಸರ್ ಕಂಡಿಕೆರೆ ರಾಮಯ್ಯ ಶ್ರೀಧರ್ ಸರ್, ವಿಶ್ರಾಂತ ಪ್ರಾಧ್ಯಾಪಕರು, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಬಯೋಸೈನ್ಸ್, ಬೆಂಗಳೂರು ವಿಶ್ವವಿದ್ಯಾಲಯ, ಇವರಿಗೆ ತುಂಬ ಹೃದಯ ಧನ್ಯವಾದಗಳು. ಈಗ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಉಪಸ್ಥಿತರಿರುವಂತಕ್ಕಂಥ ಶ್ರೀ ಶಿವಕುಮಾರ್ ಸಿ, KGS, ಸಂಶೋಧನಾಧಿಕಾರಿಗಳು, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಮೈಸೂರು, ಇವರು ಈ ಕಾರ್ಯಕ್ರಮದ ಕುರಿತು ಭಾಷಣ ಮಾಡಬೇಕು ಅಂತ ಕೇಳ್ಕೊಳ್ತೀನಿ.
ವೇದಿಕೆ ಮೇಲಿರುವ ಎಲ್ಲ ಗಣ್ಯರೇ ಹಾಗೂ ಇಲ್ಲಿ ಈ ದಿನ ವಿವಿಧ ಪತ್ರಿಕೆಗಳನ್ನು ಮಂಡಿಸಲು ಆಗಮಿಸಿರುವ ಮಂಡನಕಾರರೇ ಹಾಗೂ ಟ್ರೈಬಲ್ ಮುಖಂಡರುಗಳೇ ಹಾಗೂ ವಿವಿಧ ವಿಶ್ವವಿದ್ಯಾಲಯದಿಂದ ಆಗಮಿಸಿರುವ ವಿದ್ಯಾರ್ಥಿ ಮಿತ್ರರೇ, ಈಗಾಗಲೇ ಪ್ರೊಫೆಸರ್ ಗಂಗಾಧರ್ ಸರ್ ಅವರು ಮತ್ತೆ ಈಗ ತಾನೇ ಮಾತನಾಡಿದಂತಹ ಎಲ್ಲ ಭಾಷಣಕಾರರು ಏನು ಗ್ಲೋಬಲೈಸೇಷನ್, ಅದರ ಇಂಪ್ಯಾಕ್ಟ್ ಆನ್ ಟ್ರೈಬಲ್ ಅದರ ಬಗ್ಗೆ ಸೂಕ್ಷ್ಮವಾಗಿ ವಿಚಾರ ಮಾಡಿದ್ದಾರೆ. ನಾನಾದರೂ ನನ್ನ ಟ್ರೈಬಲ್ ಇಲಾಖೆಯ ಅನುಭವದ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ನಾವು ಈ ದಿನ ಈ ಒಂದು ವಿಷಯನ ಒಂದು ರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದ ಸಂಕೀರ್ಣವಾಗಿ ಒಂದು ಸೆಮಿನಾರ್ ನಾವು ಏರ್ಪಾಡು ಮಾಡಿದ್ದೀವಿ. ಕಾರಣ ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ, ಟೈಟಲ್ ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಲ್ಲಿ ದೇರ್ ಈಸ್ ಇಂಪ್ಯಾಕ್ಟ್ ಆನ್ ಟ್ರೈಬಲ್ ಪೀಪಲ್. ನಾವು ಸೂಕ್ಷ್ಮವಾಗಿ ಗಮನಿಸಬೇಕು. ವಾಟ್ ಈಸ್ ಗ್ಲೋಬಲೈಸೇಷನ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಾವು ಯೋಚನೆ ಮಾಡಿದಾಗ ಇವತ್ತು ಬಂತ ಗ್ಲೋಬಲೈಸೇಷನ್, ಯಾವಾಗ ಸ್ಟಾರ್ಟ್ ಆಯ್ತು ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂತ ನಾವು ಒಂದು ಅವಲೋಕನ ಮಾಡಿದಾಗ ಇಟ್ ಹ್ಯಾಸ್ ಬಿನ್ ಸ್ಟಾರ್ಟೆಡ್ 1492. ದಟ್ ಮೀನ್ಸ್ ಕೊಲಂಬಸ್ ಅನ್ನೋರು ಯಾವಾಗ ಇದನ್ನ ಎಕ್ಸ್ಪ್ಲೋರ್ ಮಾಡಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರಲ್ಲ, ಆಗ್ಲೇ ಗ್ಲೋಬಲೈಸೇಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. ಅಲ್ಲ, ಏನ್ ತಪ್ಪು ಹೇಳ್ತಾ ಇದೀನ ಅಂತ ಅನ್ಕೊಂಡ್ಬೋದು. ನಮ್ಗೆಲ್ಲ ಗೊತ್ತಿದ್ದಾರೆ, ನಾವೆಲ್ಲ ಓದಿದ್ದೀವಿ. 1990ನಲ್ಲಿ ಗ್ಲೋಬಲೈಸೇಷನ್ ಲಿಬರಲೈಸೇಷನ್ ಆಗಿದೆ ಅಂತ. ಎಸ್, ಅದು ಕಾಂಟೆಂಪ್ರರಿ ಗ್ಲೋಬಲೈಸೇಷನ್. ನಾವೇನ್ ನೋಡ್ತಾ ಇದೀವಿ ದಟ್ ಈಸ್ ಕಾಂಟೆಂಪ್ರರಿ ಗ್ಲೋಬಲೈಸೇಷನ್. ಆದ್ರೆ ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂದ್ರೆ ಏನು ಅಂದ್ರೆ ನಾವು ಕನೆಕ್ಟಿವಿಟಿ ಬಿಟ್ವೀನ್ ದ ಕಂಟ್ರೀಸ್, ಕನೆಕ್ಟಿವಿಟಿ ಬಿಟ್ವೀನ್ ದ ಪೀಪಲ್, ಕನೆಕ್ಟಿವಿಟಿ ಬಿಟ್ವೀನ್ ದ ಕಲ್ಚರ್, ದಟ್ ಈಸ್ ಗ್ಲೋಬಲೈಸೇಷನ್. ಸೊ ಅದರಲ್ಲಿ ಪಾಸಿಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಇರುತ್ತೆ, ನೆಗೆಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಇರುತ್ತೆ. ಸೊ ಪಾಸಿಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಏನಾಗಿದೆ ನಮ್ಮ ಟ್ರೈಬಲ್ ಪೀಪಲ್ಗೆ ಮತ್ತು ನೆಗೆಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಏನಾಗಿದೆ, ಎರಡೂ ನಾವು ಇವತ್ತು ಚಿಂತನ ಮಂಥನ ಮಾಡಿ ಒಂದು ಎಷ್ಟು ಹೆಚ್ಚು ಇಂಪಾರ್ಟೆಂಟ್ ಟ್ರೈಬಲ್ಗೆ ಇನ್ಫ್ಲುಯೆನ್ಸ್ ಅನ್ನು ಗವರ್ಮೆಂಟ್ ಇಂದ ಏನ್ ಮಾಡಬಹುದು ಮತ್ತೆ ನಾವು ರೆಕಗ್ನೈಸ್ ಮಾಡ್ಬೇಕತ್ತೆ. ಎಸ್ ಎ ಎಜುಕೇಟರ್, ಎಸ್ ಎ ಪ್ರೊಫೆಷನಲ್ಸ್, ಎಸ್ ಎ ಪ್ರೊಫೆಸರ್ಸ್, ಯೂನಿವರ್ಸಿಟಿ ನಾವು ಯೋಚನೆ ಮಾಡ್ಬೇಕಾಗತ್ತೆ. ಇವಾಗ ನೀವು ಕಾಣ್ಬೋದು ಕೆಲವೊಂದ್ಸತಿ ಒಂದು ಟೆಕ್ನಾಲಜಿ ಬಂದಾಗ ಒಂದು ಪ್ರಾಣಿ ಮೇಲೆ ಅದರ ಒಂದು ಪರಿಣಾಮ ಬೀರುತ್ತೆ, ಒಂದು ಪಕ್ಷಿ ಮೇಲೆ ನೀವು ಪರಿಣಾಮ ಬೀರುತ್ತೆ ಅಂತ ಈಗಾಗಲೇ ಗೊತ್ತಾಗಿದೆ. ಏನ್ ಟೆಲಿಫೋನ್ ಟೆಕ್ನಾಲಜಿ ಬಂದ ನಂತರ ಗುಬ್ಬಚ್ಚಿಗಳ ಸಂಖ್ಯೆನೆ ಕಡಿಮೆ ಆಗಿದೆ ಅಂತ ಹೇಳ್ತಾ ಇದೀವಿ, ನಾವು ಕಾಣ್ತಾ ಇದ್ದೀವಿ. ಹೌದು, ಯಾಕೆ? ಅದು ಅಧ್ಯಯನ ಮಾಡಿದಾಗ ಗೊತ್ತಾಗತ್ತೆ. ಅಧ್ಯಯನ ಮಾಡದೆ ಹೋದ್ರೆ ಸುಮ್ನೆ ಹೇಳ್ಬೋದಷ್ಟೇ. ನಾವು ಇವಾಗ ಸೆನ್ಸ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಸೊ ಗ್ಲೋಬಲೈಸೇಷನ್ ನಿಂದ ಇಂಪ್ಯಾಕ್ಟ್ ಏನು ಟ್ರೈಬಲ್ ಮೇಲೆ ಆಗಿದೆ ಅನ್ನೋದು ಸೆನ್ಸ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಆ ಸೆನ್ಸ್ ನ ನಾವು ಸಿಸ್ಟಮ್ಯಾಟಿಕ್ ಆಗಿ ಒಂದು ಅಧ್ಯಯನಕ್ಕೊಳಪಡಿಸಬೇಕು. ಮತ್ತೆ ವಿಚಾರಗಳು ಬೇರೆ ಬೇರೆ ಅದೇ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ವರ್ಕ್ ಮಾಡಿದವರು ವಿಚಾರ ಚಿಂತನ ಮಂಥನ ಮಾಡಿದಾಗ ಅವ್ರ ಕ್ವಶನ್ ರೀಸ್ ಮುಖಾಂತರ ಏನ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಅಂತ ಈಗಾಗಲೇ ಸರ್ ಹೇಳ್ದಂಗೆ ನಮ್ಗೆ ಸಣ್ಣ ಸಣ್ಣ ವಿಚಾರಗಳು ತುಂಬಾ ಬಹಳ ಎಫೆಕ್ಟಿವ್ ಇದಿರುತ್ತೆ. ಎಫೆಕ್ಟಿವ್ ಅದರ ಪರಿಣಾಮ ತುಂಬಾ ಎಫೆಕ್ಟ್ ಇರುತ್ತೆ. ಇವಾಗ ನೋಡಿ, ನಾವೆಲ್ಲ ಚಿಕ್ಕವರಿದ್ವಿ. ಚಿಕ್ಕವರಿದ್ದಾಗ ನಮ್ಮ ತಂದೆ ತಾಯಿಗಳು ಏನ್ ಹೇಳ್ತಾ ಇದ್ರು ಅಂದ್ರೆ, ಇರುವೆಗೆ ಶನಿವಾರ ಬಂದಾಗ ನೀವು ಇರುವೆ ಗೂಡಿಗೆ ಸಕ್ಕರೆ ಹಾಕ್ಬೇಕು ಅಂತ ಹೇಳ್ತಿದ್ರು. ಸೊ ಆಗ ನಮ್ಗನ್ಸ್ತಿದ್ವಿ ಇದು ಏನು ಒಂಥರ ಏನೋ ಹೇಳ್ತಾರೆ ಇವ್ರು ಮೂಢನಂಬಿಕೆ ಅಂತ. ಸೊ ನಾನು ಮೂಢನಂಬಿಕೆ ಅನ್ನೋದನ್ನ ನಾವು ಓದಿ ನಂತರ ಅನಲೈಸ್ ಮಾಡಿದಾಗ ಮತ್ತೆ ಜ್ಞಾನವನ್ನ ಬೆಳೆಸ್ಕೊಂಡಾಗ ಗೊತ್ತಾಯ್ತು, ಇರುವೆ ಇಸ್ ದ ಮೈನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಎಲಿಮೆಂಟ್ ಇನ್ ಎಲ್ಲ ಈ ಪ್ರಾಣಿ ಸಂಕುಲದಲ್ಲಿ ಇರುವೆ ಬಹಳ ಅತ್ಯಂತ ಇಂಪಾರ್ಟೆಂಟ್ ಒಂದು ಜೀವಿ ಅಂತ. ನಾವು ಅದನ್ನ ಸುಮ್ಮನೆ ಒಂದು ಕಾಲ್ ಗಂಟೆ ಅರ್ಧ ಗಂಟೆ ಅದನ್ನೇ ಸ್ಟಡಿ ಮಾಡೋಣ ಅಂತ ನೋಡಿದಾಗ ಗೊತ್ತಾಗ್ತಾ ಇದೆ, ಇರುವೆ ಬಹಳ ಕೆಲಸ ಮಾಡುತ್ತೆ. ಅದು ಈ ಭೂಮಿಯ ಸಂರಕ್ಷಣೆಗೆ, ಈ ಭೂಮಿಯ ಫಲವತ್ತತೆಗೆ ಕೆಲಸ ಮಾಡುತ್ತೆ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಅದರಿಂದ ಹಿಂದಿನವರು ಯಾವ ರೀತಿ ಹೇಳ್ತಾ ಇದ್ರು ಅಂದ್ರೆ, ಅವ್ರಿಗೆ ನೇರವಾಗಿ ಜನರಿಗೆ ನಾಲೆಡ್ಜ್ ಯಾವ್ದಾರ ಒಂದು ವಿಚಾರ ಹೇಳಿದಾಗ ಫಾಲೋ ಮಾಡೋದಕ್ಕೆ ಬೇಕಲ್ಲ. ಸೊ ಆಗ ಫಾಲೋ ಮಾಡೋದಕ್ಕೆ ಎಲ್ಲರಿಗೂ ಈ ತರ ಸಿಸ್ಟಮ್ಯಾಟಿಕ್ ಯೂನಿವರ್ಸಿಟಿ ಆಗುವುದು, ಕಾಲೇಜ್ಗಳು ಇರ್ಬೋದು, ಆ ತರ ಒಂದೇ ಒಂದು ಯೂನಿಫಾರ್ಮ್ ಎಜುಕೇಶನ್ ಇರಲೇ ಇಲ್ಲ. ಆದ್ರೆ ಹ್ಯಾಶ್ಟ್ಯಾಗ್ ಟು ದಿ ಗಾಡ್ಸ್, ಹ್ಯಾಶ್ಟ್ಯಾಗ್ ಟು ದಿ ಗಾಡೆಸಸ್ ಅಂತ ನಾವು ಹೇಳಿದಾಗ ಎಲ್ಲರೂ ಫಾಲೋ ಮಾಡ್ತಾ ಇದ್ರು. ಆಗ ಅದರಿಂದ ಅದನ್ನ ಒಂದು ಫಾಲೋ ಮಾಡ್ಕೊಂಡು ಬಂದಿರ್ತಾರೆ. ನಮ್ಗೆ ಮೊದ್ಲು ಇವಾಗ ನಾನು ಇಲ್ಲೊಂದು ದಾರ ಕಟ್ಟಿದ್ದೀನಿ, ಈ ದಾರ ಕಟ್ಟಿದ್ದು ಗೊತ್ತಿರ್ಲಿಲ್ಲ. ಬಟ್ ನಾವು ಮತ್ತೆ ದಿನೇಶ್ ಅವರು ಒಂದು ಆ ಏನು ಟ್ರೈಬಲ್ ಹೀಲರ್ಸ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಒಂದು ರಿಸರ್ಚ್ ಮಾಡಿದ್ವಿ, ನಮ್ಮಲ್ಲೇ ಆಗಿದೆ ಪೇಪರ್ಸ್. ಅದು ಮಾಡಿದಾಗ ಗೊತ್ತಾಯ್ತು ಏನೆಲ್ಲ ಟ್ರೈಬಲ್ ಹೀಲರ್ಸ್ ಏನೆಲ್ಲ ಈ ಮೆಡಿಸಿನ್ಸ್ ಆಗಿ ಬಳಸ್ತಾರೆ. ಮತ್ತೆ ಅದು ನಮ್ಮ ಮಧ್ಯೆನೇ ಇದೆ. ಮತ್ತೆ ನಮ್ಮ ಮಧ್ಯೆ ಇದ್ದಾಗ ಯಾಕೆ ನನಗೂ ಕುತೂಹಲ ಬಂತು, ಯಾಕೆ ಇದನ್ನ ನಾವು ಒಂದೊಂದು ವಿಚಾರನ ಸೂಕ್ಷ್ಮವಾಗಿ ಅಬ್ಸರ್ವ್ ಮಾಡಬಾರ್ದು? ಸೂಕ್ಷ್ಮವಾಗಿ ಅಬ್ಸರ್ವ್ ಮಾಡಿದ್ರೆ ಅದ್ರಲ್ಲಿ ಏನಾದ್ರೂ ಒಂದು ಹಿನ್ನೆಲೆ ಇದೆ. ಸೊ ನಮಗೆ ಕ್ಲಿಯರ್ ಕಟ್ ಆಗಿ ಗೊತ್ತಾಗಬೇಕು, ದೇರ್ ಇಸ್ ಎ ಕ್ಲಿಯರ್ ಕಟ್ ಡಿಫರೆನ್ಸ್ ಬಿಟ್ವೀನ್ ಬಿಲೀಫ್ ಸಿಸ್ಟಮ್ ಅಂಡ್ ಮೂಢನಂಬಿಕೆ ಅಥವಾ ಏನೋ ಒಂದು ಆಚಾರ ವಿಚಾರ. ಟ್ರೈಬಲ್ ಅಲ್ಲಿ ಇರೋದು ಬಿಲೀಫ್ ಸಿಸ್ಟಮ್ ಇದೆ. ಆ ಬಿಲೀಫ್ ಸಿಸ್ಟಮ್ ಎಲ್ಲ ಮೂಢನಂಬಿಕೆ ಅಲ್ಲ. ಅಂದ್ರೆ ಅವರು ತಲಾಂತರದಿಂದ ಬಂದಂತ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋ ಅವ್ರ ಪೂರ್ವಜರಿಂದ ಬಂದಂತ ಜ್ಞಾನ ಯಾವ ರೀತಿ ಇರುತ್ತೆ ಅಂತಂದ್ರೆ, ಈಗಾಗಲೇ ಸುಮಾರು ವಿಚಾರಗಳಲ್ಲಿ ಪೂರ್ವಜರಿಂದ ಹೆಂಗ್ ಟ್ರಾನ್ಸ್ಫರ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ನೀವು ಒಂದು ಅಧ್ಯಯನ ಮಾಡಿದರೆ, ಚೈನಾದಲ್ಲಿ ಒಂದು ಅಧ್ಯಯನ ಮಾಡಿದರೆ ಯಾವ ತರ ಅಂದ್ರೆ, ಆನೆಗಳು ಎಲಿಫೆಂಟ್ ಕಾರಿಡಾರ್ ಅಂತ ಇದೆಯಲ್ಲ, ಎಲಿಫೆಂಟ್ ಕಾರಿಡಾರ್ ಅಂದ್ರೆ ಏನು ಅಂದ್ರೆ, ಆನೆಗಳು ತಮ್ಮ ಆಹಾರವನ್ನ ಹುಡುಕೊಂಡು ಒಂದು ಹೋಗುವಂತಹ ಜಾಗಗಳು. ಅದು ಒಂದು ಮಾರ್ಗ, ಆ ಕಾಡಿನಲ್ಲಿ ಒಂದು ಮಾರ್ಗ ಇದು ಮಾಡಿರುತ್ತೆ. ಕಾಡಿನಲ್ಲಿ ಒಂದು ಹಿರಿಯ ಆನೆ ಇನ್ನು ಮಿಕ್ಕಿದ ಆನೆಗಳಿಗೆ ದಾರಿ ತೋರಿಸ್ತಾ ಹೋಗುತ್ತೆ. ಯಾವಾಗ ಇವ್ರೇನ್ ಮಾಡಿದ್ರು, ಆ ಹಿರಿಯ ಆನೆನೆ ಡಿಸ್ಪ್ಲೇಸ್ ಮಾಡ್ತಾರೆ. ಆಗ ಉಳಿದ ಆನೆಗಳಿಗೆ ಕಷ್ಟ ಆಗುತ್ತೆ, ಸರ್ವೈವಕ್ಕೆ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ಅದನ್ನ ಈಗ ಆಲ್ರೆಡಿ ಡಾಕ್ಯುಮೆಂಟೇಶನ್ ಮಾಡಿದ್ದಾರೆ, ನೀವು ನೋಡ್ಬೋದು. ಸೊ ಅದೇ ರೀತಿ ನಮ್ಮ ಟ್ರೈಬಲ್ ಜನರು ಸಹ ಅವರ ಸರ್ವೈವ್ ಸುಮಾರು ವರ್ಷದಿಂದ ಸರ್ವೈವ್ ಆಗಿದ್ದಾರೆ, ಮತ್ತೆ ಕಾಯಿಲೆಗಳಿಂದ ಅವರು ವಾಸಿ ಮಾಡ್ಕೊಳ್ಳುವ ಟೆಕ್ನಿಕ್ಗಳನ್ನ ಕಲ್ತಿದ್ದಾರೆ. ಬಟ್ ಈಗ ಏನಾಯ್ತು, ಎಲ್ಲಿ ನಮ್ಮ ದಾರಿ ತಪ್ಪಿತ್ತು, ನಾವು ಅದೇನು ಏನ್ ಮಾಡ್ಬೇಕು? ಗ್ಲೋಬಲೈಸೇಷನ್ ಓಕೆ, ಕರೆಕ್ಟ್, ಅದನ್ನ ಯಾರು ತಡೆಯಕ್ಕಾಗಲ್ಲ. ಯಾಕೆ ಅಂದ್ರೆ ಇವತ್ತು ಕನೆಕ್ಟಿವಿಟಿ ಬೇಕು, ನೆಟ್ವರ್ಕ್ ಬೇಕು. ನೆಟ್ವರ್ಕ್, ವಾಟ್ ಈಸ್ ನಾಲೆಡ್ಜ್ ಅಂದಾಗ ನೆಟ್ವರ್ಕೇ ನಾಲೆಡ್ಜ್ ಆಗಿದೆ, ಕನೆಕ್ಟಿವಿಟಿನೇ ನಾಲೆಡ್ಜ್ ಇದೆ. ಸೊ ನೆಟ್ವರ್ಕ್ ಮತ್ತೆ ಕನೆಕ್ಟಿವಿಟಿನ ಬೇರ್ಪಡಿಸದ ಒಂದು ಸಂಬಂಧ. ಸೊ ಈಗ ನಮ್ಗೆ ಎಲ್ಲಿ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಾ ಇದೆ, ಏನು ಕಲನೈಸೇಷನ್ ಇಲ್ಲಿ ಬಂದಾಗ, ಇಂಡಸ್ಟ್ರಿಯಲೈಸೇಷನ್ ಆದಾಗ, ಇಂಡಸ್ಟ್ರಿಯಲೈಸೇಷನ್ ಯಾವಾಗ ನಮ್ಮಲ್ಲಿ ಪ್ರಾರಂಭ ಆಯ್ತು, ಆಗ ಒಂದು ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಪ್ರಾರಂಭ ಆಗ್ತಾ ಹೋಗುತ್ತೆ ಇಂಡಿಯಾದಲ್ಲಿ. ಈ ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಲ್ಲಿ ತುಂಬಾ ಎಫೆಕ್ಟ್ ಆಗಿರೋ ಕಂಟ್ರೀಸ್ ಅಂದ್ರೆ ಒಂದು ಇಂಡಿಯಾ, ಬ್ರೆಜಿಲ್ ಮತ್ತೆ ಆಸ್ಟ್ರೇಲಿಯಾ ಮತ್ತೆ ಆಫ್ರಿಕನ್ ಕಂಟ್ರೀಸ್ ಅಷ್ಟು ಎಫೆಕ್ಟ್ ಆಗಲಿದೆ. ಇನ್ನು ಇಂಡಸ್ಟ್ರಿಯಲೈಸೇಷನ್ ಅಷ್ಟು ನಮ್ಮ ಇಲ್ಲಿ ಈ ಕಂಟ್ರೀಸ್ ಆಗಿರೋಷ್ಟು ಇಂಡಸ್ಟ್ರಿಯಲೈಸೇಷನ್ ಆಗಿಲ್ಲ. ಸೊ ಈ ಇಂಡಸ್ಟ್ರಿಯಲೈಸೇಷನ್ ಆದಾಗ ನಮ್ಮ ಟ್ರೈಬಲ್ದು ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಆಗಿದೆ, ಸುಮಾರು ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಆಗಿದೆ. ಏನು, ಅವರ ಇದ್ದಂತ ಸ್ಥಳಗಳನ್ನ ಕಾರ್ಖಾನೆ ಕಟ್ಟೋದಕ್ಕಾಗ್ಬೋದು, ಅಥವಾ ಒಂದು ಕಾರ್ಖಾನೆ ಬಂದಾಗ ಬೇರೆ ಪ್ರದೇಶದ ಜನರು ಅಲ್ಲಿ ಬರೋದಾಗ್ಬೋದು. ಏನೇನು ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಆಯ್ತು ಅಂದ್ರೆ, ಅವರ ಒಂದು ಅಗ್ರಿಕಲ್ಚರ್ಸ್, ಅವರ ಇದ್ದ ರೀತಿ ನೀತಿ ಮತ್ತೆ ಅವರ ಜಾಗಗಳು, ಇವು ಸ್ವಲ್ಪ ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಆಗಿದೆ. ಈಗ ನಮಗ್ ಗೊತ್ತಿದೆ, ಈಗ ಇರೋದೆಲ್ಲ 1972 ಇಂದ ಏನು ವೈಲ್ಡ್ ಲೈಫ್ ಆಕ್ಟ್ ಬಂದ ಮೇಲೆ ಇರುವಂತಹ ಉಳಿದಿರಂತ ಕೆಲವು ಕಾಡಿನ ಪ್ರದೇಶ. ಸೊ ಹಾಗಾದ್ರೆ ಟ್ರೈಬಲ್ಸ್ ಎಷ್ಟಿದ್ರು, ಎಲ್ಲ ಇದ್ದಾರೆ, ಕಾಡಲ್ಲಿರೋರು ಇದ್ದಾರೆ, ಯಾರು ಫಾರೆಸ್ಟ್ ಬೇಸ್ಡ್ ಟ್ರೈಬ್ಸ್ ಇದ್ದಾರೆ, ಅದ್ಬಿಟ್ಟು ಊರಲ್ಲೂ ಸಹ ಟ್ರೈಬ್ಸ್ ಇದ್ದಾರೆ. ಟೋಟಲಿ ನಮ್ಮ ಕರ್ನಾಟಕದಲ್ಲಿ 42 lakhs ಟ್ರೈಬ್ಸ್ ಇದ್ದಾರೆ. ಸೊ ಈ ಎಲ್ಲಾ ಟ್ರೈಬಲ್ ಅಲ್ಲಿ ನಾವು ಗ್ಲೋಬಲೈಸೇಷನ್ ಏನ್ ಆಗಿದೆ, ಮುಖ್ಯವಾಗಿ ಫಾರೆಸ್ಟ್ ಬೇಸ್ಡ್ ಟ್ರೈಬಲ್ಸ್ಗೆ ಏನ್ ಇಂಪ್ಯಾಕ್ಟ್ ಆಗಿದೆ ಅಂದ್ರೆ, ನಾವು ಹೋದಾಗ ಅಲ್ಲಿ ನೋಡ್ತೀವಿ, ಅವ್ರ ಹತ್ರ ಮೊದಲು ವೆಹಿಕಲ್ ಇರ್ಲಿಲ್ಲ, ವೆಹಿಕಲ್ ಇದೆ. ಸೊ ಅವರು ಮೊದಲು ಅವ್ರು ಯಾವ ರೀತಿ ಅವರ ಒಂದು ಬದುಕನ್ನ ಕಟ್ಕೊಂಡಿದ್ರು ಗೊತ್ತಿಲ್ಲ. ಈಗ ಎಲ್ಲ ಆಡಿಗಳಿಗೆ ಹೋಗಿ ನೋಡಿದಾಗ ಬಾಟಲ್ ಸಿಗುತ್ತೆ ನಿಮ್ಗೆ, ಎಲ್ಲ ಏನು ನಿಮ್ಗೆ ಒಂದು ಆಡಿ ಇದೆ, ಇವಾಗ್ಲೂ ಹೋಗಿ ನೋಡ್ಬೋದು, ಎಷ್ಟು ಅನ್ಸ್ ಪ್ಯಾಕೆಟ್ ಇದೆ, ಎಷ್ಟು ಇವೆಲ್ಲ ಇದೆ ಅಂತಂದ್ರೆ ಗ್ಲೋಬಲೈಸೇಷನ್ ಇಂದ ಆಗಿರಂತಹ ಇಂಪ್ಯಾಕ್ಟ್. ಇದನ್ನ ನಾವು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. ಸೊ ಮೊದಲು ಕಮ್ಯುನಿಕೇಶನ್ ಕಡಿಮೆ ಇತ್ತು, ವ್ಯಾಪಾರ ಜಾಸ್ತಿ ಇರ್ಲಿಲ್ಲ, ಟ್ರೈಬಲ್ಸ್ ಅಲ್ಲೇ ಇದ್ರು, ಇವರು ಇಲ್ಲಿಂದ ಅಲ್ಲಿ ಹೋಗಿ ಇವರ ಒಂದು ಏನಿದೆಯಲ್ಲ ಸಂಪರ್ಕ, ಇವಾಗ ಎಲ್ಲ ಊರಿಗೂ ಒಂದು ಕನೆಕ್ಟಿವಿಟಿ ಮಾಡ್ಬೇಕಂತ ಬಸ್ ಇದೆ, ಬಸ್ಸಲ್ಲಿಂದನೇ ಎಲ್ಲ ತಗೊಂಡೋಗಿ ಮಾಡ್ಬೋದು. ಸೊ ಈಗ ಏನಾಗಿದೆ, ಅವರ ಬದುಕು ಹಂಗೆ ಇದೆ, ಆದ್ರೆ ಬದಲಾವಣೆ ಏನಾಗಿದೆ ಅಂದ್ರೆ ಗ್ಲೋಬಲೈಸೇಷನ್ ಇಂಪ್ಯಾಕ್ಟ್ ಇಂದ ಅವ್ರಿಗೆ ಈ ಒಂದು ಆಲ್ಕೋಹಾಲಿಸಂ ಮೇಜರ್ ಇಂಪ್ಯಾಕ್ಟ್. ಅಂದ್ರೆ ನಾವು ನೋಡಿರೋದು ಟ್ರೈಬಲ್ ಪೀಪಲ್ ಅಲ್ಲಿ ಆಲ್ಕೋಹಾಲಿಸಂ ಜಾಸ್ತಿ ಆಗಿದೆ. ಈ ಆಲ್ಕೋಹಾಲಿಸಂ ಮತ್ತೆ ಈ ಬೇರೆ ಇದೇನಿದೆಯಲ್ಲ ಅದ್ರ ಬಗ್ಗೆ ನಾವು ಅಧ್ಯಯನ ಮಾಡ್ಬೇಕಾಗಿದೆ. ಸೊ ಕಲ್ಚರಲ್ ಡಿಸ್ಪ್ಲೇಸ್ಮೆಂಟ್ ಆಗಿದೆ, ಆಲ್ಕೋಹಾಲಿಸಂ ಬಂದ್ಮೇಲೆ ಕಲ್ಚರಲ್ ಡಿಸ್ಟರ್ಬ್ ಆಗಿದ್ದಾರೆ. ಕಲ್ಚರಲ್ ಡಿಸ್ಟರ್ಬ್ ಅಂದ್ರೆ ಮೊದಲು ಹಿಂದೆ ಇದ್ದಾಗ ಎಲ್ಲರೂ ಆಡಿಯಲ್ಲೇ ಕುಳಿತುಕೊಂಡು ಸಂಜೆ ಆದ್ಮೇಲೆ ಬೇಟೆಗೆ ಹೋಗ್ತಿದ್ರು, ಕತ್ಲೆ ಆದ್ರೆ ಅವ್ರ ಮನೆಗೆ ಬರ್ತಾ ಇದ್ರು, ಎಲ್ಲ ಕೂತ್ಕೊಂಡು ಮಾತಾಡ್ತಾ ಇದ್ರು, ಎಲ್ಲ ಕೂತ್ಕೊಂಡು ಒಂದು ಹಾಡುಗಳು ಇರ್ಬೋದು, ಮತ್ತೊಂದು ಡ್ಯಾನ್ಸ್ ಇರ್ಬೋದು, ಬೆಂಕಿ ಹಾಕೊಂಡು ಡ್ಯಾನ್ಸ್ ಮಾಡೋದೆಲ್ಲ ಮಾಡ್ತಾ ಇದ್ರು. ಈಗ ನಿಮ್ಗೆ ಗೊತ್ತಿಲ್ಲ, ನಾವು ಒಂದು ಪ್ರಪ್ರಥಮವಾಗಿ ಒಂದು ಎಲ್ಲರನ್ನು ಕೂರಿಸಿ ಮಾತಾಡೋಣ ಅಂತ ಹೋದಾಗ ನಮ್ಮ ಜೀಪ್ ಮೇಲೆ ಆವಾಗ ಕಲ್ಲು ಎಸ್ತರು, ಮತ್ತೆ ಯಾಕೆ ಹೆಸರು? ಎಲ್ಲರೂ ಕೆಟ್ಟವರಲ್ಲ, ಒಳ್ಳೆಯವರು ಇದ್ದಾರೆ. ಅಲ್ಲಿ ಅವನು ಆ ದಿನ ಡ್ರಿಂಕ್ಸ್ ಜಾಸ್ತಿ ಮಾಡಿದ, ಮತ್ತೆ ಜೊತೆಗೆ ಬಂಗಿ ಸೊಪ್ಪನ್ನು ಸಹ ಸೇದಿದ್ದ. ಆ ಹುಡುಗ ಅವನು ಕಂಟ್ರೋಲ್ಗೆ ಬರ್ತಾ ಇರ್ಲಿಲ್ಲ, ಯಾರು ಹೇಳಿದ ಮಾತು ಕೇಳ್ತಾ ಇರ್ಲಿಲ್ಲ. ಸೊ ಈ ತರ ವಿಚಾರಗಳನ್ನ ನಾವು ಸ್ಟಡಿ ಮಾಡ್ಬೇಕು, ಮತ್ತೆ ಅದಕ್ಕೆ ಇಂಟರ್ವೆನ್ಷನ್ ಮಾಡ್ಬೇಕು. ಯಾವ ತರ ನಾವು ಅವ್ರಿಗೆ ತಿಳಿ ಹೇಳಿದ್ರೆ ಏನೆಲ್ಲ ಸಾಧ್ಯತೆಗಳಿದೆ, ಎಜುಕೇಶನ್ ಮುಖಾಂತರ ಈ ನಾವು ಅವ್ರನ್ನ ತಲುಪಬಹುದು, ಕೆಲವು ಸಕ್ಸಸ್ ಸ್ಟೋರೀಸ್ ಮುಖಾಂತರ ಅವ್ರನ್ನ ತಲುಪಬಹುದು. ಈಗ ನಮ್ಗೆ ನಮ್ಮ ಭಾರತದ ಅತ್ಯುನ್ನತ ಪರಮೋಚ್ಚ ರಾಷ್ಟ್ರಪತಿಗಳು ಸಹ ನಮ್ಮ ಟ್ರೈಬಲ್ ಮಹಿಳೆ ಅನ್ನೋದು ಒಂದು ಹೆಮ್ಮೆಯ ವಿಷಯ. ಹಾಗಾಗಿ ನಾವು ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಈ ಒಂದು ಏನು ವಿಚಾರಗಳನ್ನು ಮಂಡನೆ ಆಗ್ತವೆ, ನಾವು ಜಸ್ಟ್ ಹೇಳಿದ್ದೀವಿ, ಈಗೆಲ್ಲ ಹೇಳಿದ್ದಾರೆ, ವಿಚಾರ ಮಂಡನೆ ಆದ ನಂತರ ಕೊನೆಗೆ ಇದನ್ನೆಲ್ಲ ಸಮ್ ಅಪ್ ಮಾಡುವಾಗ ಹೌದು ಏನೆಲ್ಲ ಇಂಪ್ಯಾಕ್ಟ್ ಆಗಿದೆ. ಸೊ ಇದು ತುಂಬಾ ಒಳ್ಳೆಯ ಒಂದು ಇದಿದೆ ಕಾನ್ಸೆಪ್ಟ್ ಮತ್ತೆ ನಮ್ಮ ಸಬ್ಜೆಕ್ಟ್. ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂದ್ರೆ ಕೆಟ್ಟದಂತೂ ಅಲ್ಲ, ಎರಡೂ ಇದೆ, ಪಾಸಿಟಿವಿಟಿ ಇದೆ, ನೆಗೆಟಿವಿಟಿ ಇದೆ. ಇವತ್ತು ಗ್ಲೋಬಲೈಸೇಷನ್ ಇಲ್ಲ ಅಂದಿದ್ರೆ ಇಷ್ಟು ಬೇಗ ನಾಲೆಡ್ಜ್ ರೀಚ್ ಆಗ್ತಾ ಇರಲಿಲ್ಲ, ಇಷ್ಟು ಬೇಗ ನಾವು ಕಮ್ಯುನಿಕೇಟ್ ಆಗ್ತಾ ಇರಲಿಲ್ಲ, ಇಷ್ಟು ಬೇಗ ಕನೆಕ್ಟಿವಿಟಿ ಇರಲಿಲ್ಲ. ಎಸ್, ವಿ ಹ್ಯಾವ್ ಟು ಅಗ್ರಿ ದಟ್. ಸೊ ಪಾಸಿಟಿವ್ನ ಹೆಚ್ಚಿಗೆ ನಾವು ಆಹ್ವಾನಿಸೋಣ, ವೆಲ್ಕಮ್ ಮಾಡೋಣ. ನೆಗೆಟಿವ್ನ ಹೌದು, ಇದರಿಂದ ನೆಗೆಟಿವ್ ಇಂದ ಯಾರು ನಾಲೆಡ್ಜ್ ಗೊತ್ತಿಲ್ಲದೆ ಎಜುಕೇಶನ್ ಇಂದ ಸ್ವಲ್ಪ ಹಿಂದುಳಿದಿದವರು, ಅವರು ಯಾವ್ದನ್ನ ಹೊಸ ತನದಲ್ಲಿ ನೆಗೆಟಿವ್ನೇ ಅವರು ಅಪ್ಕೊಂಡಿರ್ಬೋದು. ಟ್ರೈಬಲ್ ಪೀಪಲ್ ಪಾಸಿಟಿವ್ನ ಇದ್ ಮಾಡೋದ್ ಬದಲು ನೆಗೆಟಿವ್ ಅವ್ರಿಗೆ ಬೇಗ ಅಟ್ರಾಕ್ಟ್ ಆಗಿರ್ಬೋದು. ಸೊ ಅದನ್ನ ನಾವು ಇವಾಗ ಋಣಾತ್ಮಕವಾಗಿ ಯೋಚನೆ ಮಾಡೋಣ. ನೀವೆಲ್ಲ ಏನ್ ಬಂದಿದ್ದೀರಿ, ನಿಮ್ಮ ಇನ್ಪುಟ್ಸ್ನು ಕೊಡಿ. ಇಲ್ಲಿ ಏನು ಮಾಸ್ಟರ್ ಡಿಗ್ರಿ ಓದ್ತಾ ಇದ್ದೀರಾ, ಮತ್ತೆ ಬೇರೆ ಬೇರೆ ಯೂನಿವರ್ಸಿಟಿಲಿ ಓದ್ತಾ ಇದ್ದೀರಾ ಅಂದ್ರೆ ಯು ಶುಡ್ ಬಿ ಒಂದು ನಾಲೆಡ್ಜ್ ಅಲ್ಲಿ ಯಾವ್ದಕ್ಕೂ ಹಿಂಜರಿಬಾರ್ದು, ಒಂದು ಸ್ಪಷ್ಟ ಒಂದು ಇದಿರ್ಬೇಕು. ನಿಮ್ಮನ್ನು ನೀವು ಕೇಳಿದಾಗ ಕ್ವಶನ್ಗಳು ಕೇಳ್ಬೇಕು. ಈಗ ಅವ್ರಿಗೆ ಗೊತ್ತಿರುತ್ತೆ, ಕೆಲವೊಂದು ಕೀ ಪಾಯಿಂಟ್ಸ್ ಬರ್ಕೊಂಡ್ ಬಂದಿದ್ರೆ ಮಾತಾಡ್ತಾ ಇರ್ತಾರೆ. ಕೆಲವೊಂದ್ಸತಿ ನೀವು ಪ್ರಶ್ನೆ ಮುಖಾಂತರ ಕೇಳಿದಾಗ ಅವ್ರು ಇರೋ ನಾಲೆಡ್ಜ್ ನ ನಿಮಗೆ ಶೇರ್ ಮಾಡ್ತಾರೆ. ನಿಮ್ಮಲ್ಲಿರೋ ನಾಲೆಡ್ಜ್ ನ ಶೇರ್ ಮಾಡಿ. ಕೆಲವು ಅದ್ಭುತವಾದ ಈಲರ್ಸ್ ಗಳು ಬಂದಿದ್ದಾರೆ, ಅವರು ಸಹ ಪೇಪರ್ ಪ್ರೆಸೆಂಟ್ ಮಾಡೋರಿದ್ದೀರಿ, ಅವ್ರನ್ನು ಸಹ ನೀವು ಆಹ್ವಾನ ಮಾಡಿದ್ದೀವಿ, ಅವರು ಮಾಡ್ತಾರೆ. ಅದನ್ನ ಯಾವ ತರ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೋದು, ಏನೇನಿಲ್ಲ, ತುಂಬಾ ಅದ್ಭುತವಾದ ವಿಚಾರಗಳಿದೆ. ಅದ್ಭುತವಾದ ವಿಚಾರ ಅಂದ್ರೆ ಹೌದಾ, ಅದೇನಾಗಿದೆ, ಟ್ರೈಬಲ್ ಮೆಡಿಸನ್ ಇವತ್ತು ಮಾರ್ಕೆಟಿಂಗ್ ಆಗಿ ಬೇರೆಯವರು ಅದನ್ನ ಕಲೆಕ್ಟ್ ಮಾಡಿ ಅದನ್ನ ನಿಮಗೆ ಮಾಡ್ತಾ ಇದಾರೆ. ಇವತ್ ಬರೀ ಏನಿಲ್ಲ, ಈ ಫೇಸ್ ಪ್ಯಾಕ್ ಮತ್ತೊಂದು ಎಲ್ಲ ಟ್ರೈಬಲ್ಸ್ ಇದೆ. ಇವತ್ತು ನಿಮ್ಗೆ ಗೊತ್ತಿಲ್ಲ, ರಾಮ್ ಪತ್ರೆ ಅಂತ ಒಂದು ಇದಿದೆ, ಇದು ಕಾಯಿ ತರ ಇದೆ. ನನಗೆ ಗೊತ್ತಿಲ್ಲ, ನಾನು ಹೋದಾಗ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ಇದು ರಾಮ್ ಪತ್ರೆ ಸರ್ ಅಂತ. ನನಗೇನು ಅದು ಹಣ್ಣು ತರ ಇತ್ತಲ್ಲ, ಹಚ್ಬೇಕಂತ ಟ್ರೈಬಲ್ ಸಾರ್ ಕಚ್ಚಿಬಿಡಿ ಅಂದ. ನಾನು ಏನಾಗತ್ತೆ ಅಂತ ಕಚ್ಚಿದ್ರೆ ಈ ಅಲ್ಲಿದೆಯಲ್ಲ, ಇದು ಒಂದು ವಾರ ಆಯ್ತು, 1 ವೀಕ್ ಆಯ್ತು, ಅದು ಹೋಗ್ತಾನೆ ಇಲ್ಲ. ಅಷ್ಟು ಗಟ್ಟಿಯಾಗಿ ಅದು ಕಲರ್ ಚೇಂಜ್ ಆಗ್ಬಿಟ್ಟಿತ್ತು. ಅದು ಈ ಅಷ್ಟು ಕೆಲವು ವಿಚಾರಗಳು ಯಾವ ತರ ಇದೆ ಅಂತಾರೆ, ಅದನ್ನ ಮಾರ್ಕೆಟ್ ಮಾಡಿದೆ. ಇವ್ರಿಗೆ ಆಲ್ಕೋಹಾಲ್ ಕೊಡೋದು, ಅವರಿಂದ ರಾಮಪತ್ರೆ ತಗೊಳ್ಳೋದು, ಇವರು ಅದನ್ನ ಮಾರ್ಕೆಟ್ ಮಾಡೋದು, ಈ ತರ ಆಗಿದೆ ಅಷ್ಟೇ. ನಿಮ್ಗೆ ಅದು ನಾಲೆಡ್ಜ್ ಗೊತ್ತಾಗಿ ನೀವೇ ಗ್ಲೋಬಲ್ ಮಾರ್ಕೆಟ್ ಅಲ್ಲಿ ನೀವು ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿದ್ರೆ ಆವಾಗ ಅದ್ರ ಪ್ರತಿಫಲನ ನೀವೇ ಅನುಭವಿಸ್ಬೋದು. ಸೊ ಆದ್ರಿಂದ ನಿಮ್ಗೆ ಬೇಕಾಗಿರೋದೇನು, ನಿಮಗೆ ಒಂದು ಕನೆಕ್ಟಿವಿಟಿ ಬೇಕಾಗಿದೆ. ಕನೆಕ್ಟಿವಿಟಿ ಅಂದ್ರೆ ಏನು? ಎಜುಕೇಶನ್ ಇಸ್ ದ ಕನೆಕ್ಟಿವಿಟಿ. ಮತ್ತೆ ಈ ತರ ಒಂದು ಆರ್ಗನೈಸೇಷನ್ ಇಸ್ ದ ಕನೆಕ್ಟಿವಿಟಿ. ಯು ಕನೆಕ್ಟ್ ವಿತ್ ದ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್, ಯು ಕನೆಕ್ಟ್ ವಿತ್ ದ ಪೀಪಲ್, ಯು ಕನೆಕ್ಟ್ ವಿತ್ ದ ಯೂನಿವರ್ಸಿಟೀಸ್ ಅಂತ ಅಂದಾಗ ಶೇರ್ ದ ನಾಲೆಡ್ಜ್, ಒಬ್ರಿಗೊಬ್ರು ನಾಲೆಡ್ಜ್ ಮಾಡಿದಾಗ ನಿಮ್ಗೂ ಸಹ ಅದ್ಭುತವಾದ ಸಕ್ಸಸ್ ಸಿಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾ, ಎಲ್ಲರಿಗೂ ಈ ದಿನ ಆಗಮಿಸಿದ್ರಿ, ಎಲ್ಲ ಫ್ರೆಶ್ ಆಗಿ ಕಾಣ್ತಿದ್ರಿ. ಲಾಸ್ಟ್ ಟೈಮ್ ಬಂದಾಗ ಎಲ್ಲ ಸೆಮಿನಾರ್ ಕೇಳಿ ಸುಸ್ತಾದಂಗ್ ಕಾಣ್ತಾ ಇದ್ರಿ. ಇವಾಗಂತೂ ವೆರಿ ಬ್ರೈಟ್ ಅಂಡ್ ವೆರಿ ಸ್ಮೈಲ್ ಫೇಸಸ್ ಇದೆ. ಇದೇ ತರ ಇರ್ಲಿ ಅಂತ ಹೇಳ್ತಾ ನನಗೂ ಮಾತಾಡಕ್ ಅವಕಾಶ ಕೊಟ್ಟ ಎಲ್ಲರಿಗೂ ಒಂದ್ಸಿ ನನ್ನ ಮಾತು ಮುಗಿಸ್ತೇನೆ.
ಗ್ಲೋಬಲೈಸೇಷನ್ ಪಾಸಿಟಿವ್ ಮತ್ತು ನೆಗೆಟಿವ್ ಇಂಪ್ಯಾಕ್ಟ್ ಬುಡಕಟ್ಟುಗಳ ಮೇಲೆ ಹೇಗಾಗುತ್ತೆ, ಹಾಗೆ ಒಂದು ಇರುವೆನ ಉದಾಹರಣೆ ಕೊಟ್ಟು ಪಾರಂಪರಿಕವಾಗಿ ನಾವು ಅನುಸರಿಸ್ಕೊಂಡ್ ಬಂದಿರ್ತಕ್ಕಂಥ ಅದರ ಹಿಂದಿನ ವೈಜ್ಞಾನಿಕತೆ, ಹಾಗೆ ಸಾವಿರಾರು ವರ್ಷಗಳಿಂದ ಆರೋಗ್ಯದ ಕಾಯ್ದೆಗಳಲ್ಲಿ ಹೇಗೆ ಬುಡಕಟ್ಟುಗಳು ಗುಣಪಡಿಸ್ಕೊಂಡು ಬರ್ತಾ ಇದ್ರು, ಮತ್ತೆ ಗ್ಲೋಬಲೈಸೇಷನ್ ಇಂದ ಬುಡಕಟ್ಟುಗಳ ಕಲ್ಚರ್ ಹೇಗೆ ಡಿಸ್ಟರ್ಬ್ ಆಗ್ತಿದೆ, ಮತ್ತೆ ಅವರ ಏನು ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತ ಮೆಡಿಸಿನ್ ಮಾರ್ಕೆಟಿಂಗ್ ಇದೆಯಲ್ಲ, ಅದರ ಪ್ರತಿಫಲ ಬುಡಕಟ್ಟುಗಳಿಗೆ ಸಿಗ್ಬೇಕು ಅಂತ ಸಾಕಷ್ಟು ವಿಚಾರಗಳನ್ನ ಈ ಭಾಷಣದ ಮೂಲಕ ಮಂಡಿಸಿದಂತ ಶ್ರೀ ಶಿವಕುಮಾರ್ ಸರ್ ಇವರಿಗೆ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳು. ಹಾಗೆ ಮತ್ತೋರ್ವರಾದ ಉಪಸ್ಥಿತಿಯಲ್ಲಿರತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಕೃಷ್ಣಮೂರ್ತಿ ಕೇವಿ, ಮೂಲ ಆದಿವಾಸಿಗಳ ಅಧ್ಯಯನ ಕೇಂದ್ರ, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಪ್ರಕೃತಿ ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಇವರು ಕೂಡ ನಿಮ್ಮ ಭಾಷಣವನ್ನ ಮಾಡಬೇಕಂತ ಕೇಳ್ಕೊತೀನಿ.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈ ಕಾರ್ಯಕ್ರಮ ಹಾಗೂ ಮಾಡಿದ ಮಾನ್ಯ ನಿರ್ದೇಶಕರು ಹಾಗೂ ಉಪನಿರ್ದೇಶಕರು ಮತ್ತು ತಾವೆಲ್ಲ ಏನ್ ಬಂದಿದ್ದೀರಿ ತಮ್ಮೆಲ್ರಿಗೂ ಕೂಡ ಮತ್ತೊಮ್ಮೆ ನಾನು ಸ್ವಾಗತವನ್ನ ಕೋರ್ತೀನಿ. ಹಾಗೂ ವೇದಿಕೆ ಮೇಲೆ ಹಾಸನಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ಗಣ್ಯರಿಗೂ ಕೂಡ ನಾನು ವಂದನೆ ತಿಳಿಸ್ತೀನಿ. ಬಹಳ ಪ್ರಮುಖವಾಗಿ ಇವತ್ತು ಎಲ್ಲ ವೇದಿಕೆ ಮೇಲೆ ಇದ್ದಂತ ಗಣ್ಯರು ಕೂಡ ಜ್ಞಾನದ ಬಗ್ಗೆ ಹೆಚ್ಚು ಚರ್ಚೆ ಮಾಡ್ತಿದ್ದಾರೆ. ಇವತ್ತು ಜ್ಞಾನ ಪ್ರಪಂಚವನ್ನ ಆಳ್ತಾ ಇದೆ. ಆದ್ರೆ ಯಾವ ಜ್ಞಾನ, ಯಾರ ಜ್ಞಾನ, ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿ ನಾವು ಚರ್ಚೆ ಮಾಡತಕ್ಕಂತ ಸಂದರ್ಭ ಇದಾಗಿದೆ. ಇವತ್ತು ಭಾರತ ಅಂತಕ್ಕಂಥದ್ದೇ ಒಂದು ಹಲವಾರು ಜನಾಂಗಿಕವಾಗಿ, ಪ್ರಾದೇಶಿಕವಾಗಿ, ಸಾಮಾಜಿಕವಾಗಿ, ಆರ್ಥಿಕವಾಗಿ ವಿಭಿನ್ನ ಇರತಕ್ಕಂಥ ದೇಶ. ಈ ದೇಶದಲ್ಲಿ ತನ್ನದೇ ಆದಂತ ಒಂದು ವೈಶಿಷ್ಟ್ಯ ಹಿನ್ನೆಲೆಯ ಬೌದ್ಧಿಕತೆ ಇವತ್ತಿಗೂ ಜಾರಿ ಇದೆ. ಇಡೀ ಪ್ರಪಂಚಕ್ಕೆ ಭಾರತ ಕೆಲವೊಂದು ಬೌದ್ಧಿಕ ವಿಚಾರಗಳಲ್ಲಿ ತನ್ನದೇ ಆದಂತ ಒಂದು ಅಸ್ಮಿತೆಯನ್ನ ಉಳಿಸ್ಕೊಂಡು ಬರ್ತಾ ಇದೆ. ಇವತ್ತು ಜ್ಞಾನದ ಬಗ್ಗೆ ಯಾಕೆ ಇಷ್ಟೊಂದು ಚರ್ಚೆಗಳಾಗ್ತಿದೆ ಅಂತಕ್ಕಂಥದ್ದು ಬಹಳ ಚರ್ಚಿತ ವಿಚಾರ. ಭಾರತದಲ್ಲಿ ಜ್ಞಾನ ಪರಂಪರೆಯಿಂದಲೂ ಕೂಡ ಒಂದು ಸೀಮಿತ ವರ್ಗದ ಸೊತ್ತು ಅಂತಲೇ ಭಾವಿಸಲಾಗಿತ್ತು. ಭಾರತದಲ್ಲಿ ಜ್ಞಾನ ಅಂತಕ್ಕಂಥದ್ದು ಕೆಲವು ವರ್ಗದ ಆಸ್ತಿ ಅಂತಕ್ಕಂಥದ್ದು ನಮ್ಮೆಲ್ಲ ಭಾರತದ ಚರಿತ್ರೆಯ ಸಂದರ್ಭದಲ್ಲಿ ನಾವು ಕಾಣ್ತೀವಿ. ಜ್ಞಾನ ಅಂದ್ರೆ ಏನಂದ್ರೆ ವೇದ, ಉಪನಿಷತ್ಗಳು, ಕರ್ಮ ಸಿದ್ಧಾಂತಗಳು, ಇದೇ ಜ್ಞಾನ. ಆ ಕರ್ಮ ಸಿದ್ಧಾಂತ ಮತ್ತು ವೇದ ಉಪನಿಷತ್ಗಳ ಮಾರ್ಗದರ್ಶನದಲ್ಲಿ ಏನ್ ಬಂದಿದೆ ಅದಷ್ಟೇ ಜ್ಞಾನ ಅಂತಕ್ಕಂಥ ಒಂದು ಚರಿತ್ರಾ ಬರವಣಿಗೆ ಕ್ರಮಗಳನ್ನ ನಾವು ಇವತ್ತು ಇತಿಹಾಸ ಮತ್ತು ಬೇರೆ ಬೇರೆ ಜ್ಞಾನ ಶಿಸ್ತುಗಳಲ್ಲಿ ಕೂಡ ನಾವು ಗಮನಿಸಿದ್ದೇವೆ. ಹಾಗಾದ್ರೆ ಜ್ಞಾನ ಅಂದ್ರೆ ಏನು? ಇವತ್ತು ಅದೇ ಅಲ್ವ ಚರ್ಚೆ ಆಗ್ತಾ ಇರೋದು. ಇವತ್ತು ಯಾಕೆ ಆದಿವಾಸಿಗಳಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಜ್ಞಾನ ಪರಂಪರೆ ಅದನ್ನ ನಾನು ಜ್ಞಾನ ಅನ್ನೋಕ್ಕಿಂತ ಹೆಚ್ಚಾಗಿ ಒಂದು ವಿಜ್ಞಾನ ಅಂತಾನೆ. ಯಾವ ಜ್ಞಾನ ಮಾನವೀಯ ಮೌಲ್ಯಗಳಿರ್ತದೋ, ಸಮಾಜ ನಿರ್ಮಾಣ ಮಾಡಲು ಪೂರಕವಾಗಿರ್ತದೋ ಅದೊಂದು ವಿಜ್ಞಾನ. ಶಿವಕುಮಾರ್ ಸರ್ ಬಹಳ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು ಒಂದು ಮಾತನ್ನ. ಇವತ್ತು ಆದಿವಾಸಿಗಳಿರ್ತಕ್ಕಂಥ ವಿಜ್ಞಾನವನ್ನ ಕದ್ದು, ನಿಮ್ಮದೇ ಜ್ಞಾನವನ್ನ ಕದ್ದು ಬೇರೆ ಲೇಪನ ಮಾಡಿ ನಿಮ್ಗೆ ಪರಿಚಯಿಸಲಾಗ್ತಿದೆ ಅಂತಕ್ಕಂಥ ಒಂದು ಮಾತನ್ನು ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಬಹಳ ಪ್ರಮುಖವಾಗಿ ಭಾರತದ ವಿದ್ವಾಂಸರು, ಚಿಂತಕರು, ಜ್ಞಾನಿಗಳು, ಎಲ್ಲಾ ರೀತಿಯ ವಿದ್ಯಾವಂತರಿಗೆ ಒಂದು ವ್ಯಾಮೋಹವಿದೆ. ಏನಂದ್ರೆ ಭಾರತದಲ್ಲಿ ಜ್ಞಾನ ಅಂತ ಅಂದ್ರೆ ಅದು ಕೆಲವೇ ವರ್ಗ ಹೇಳ್ಬೇಕು, ಇಲ್ಲ ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಇರ್ಬೇಕು, ಇಲ್ಲ ಪಾಶ್ಚಿಮಾತ್ಯದಿಂದ ಬಂದಿರಬೇಕು, ಇದಿಷ್ಟೇ ಜ್ಞಾನ. ನಮ್ಮದು ಪ್ರಭಾಕರ್ ಸರ್ ಅದನ್ನ ದೇಸಿ ಚಿಂತನೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಂದ್ರೆ ನಮ್ಮದಲ್ಲ, ನಮ್ದು ಜ್ಞಾನ ಅಲ್ಲ, ನಮಗದು ಬೇಕಾಗಿಲ್ಲ. ನಮ್ಮ ಹಿರಿಯರು ಹೇಳ್ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಜೀವನದ ಅನುಭವಗಳು ನಮಗೆ ಜ್ಞಾನವಾಗಿ ಕಾಣಿಸಲ್ಲ. ಈ ಯಾವ ವರ್ಗದಿಂದ ಮೇಲ್ವರ್ಗದಿಂದ ಬಂದಿರಬೇಕು, ಅಥವಾ ಹೇಳಿದ ಇಂಗ್ಲಿಷ್ ಜ್ಞಾನ, ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಮಾತ್ರ ಪ್ರೆಸೆಂಟೇಷನ್, ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಮಾತ್ರ ಬಂದಿರಬೇಕು, ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಪ್ರೆಸೆಂಟೇಷನ್ ಒಳಪಡ್ತಕ್ಕಂಥದ್ದು ಜ್ಞಾನ. ಜ್ಞಾನ ಅಂದ್ರೆ ಕೇವಲ ಶಿಕ್ಷಣ, ನಾವು ಓದ್ತಿದೀವಲ್ಲ ಅದೇ ಜ್ಞಾನ. ಆಗಿದೆಯಾ ಪ್ರಪಂಚ ಅಥವಾ ಜೀವನ ಆಗಿದೆಯಾ? ಶಿಕ್ಷಣವೇ ಜ್ಞಾನವ? ಇವತ್ತು ಹಾಗೆ ಆಗೋಗಿರೋದು. ಇವತ್ತು ಜ್ಞಾನಕ್ಕೆ ಅಧಿಕಾರ ಬೇಕಾಗಿದೆ, ಜ್ಞಾನಕ್ಕೆ ಒಂದು ಮಾನದಂಡ ಬೇಕಾಗಿದೆ. ಶಿಕ್ಷಣದ ಮೂಲಕ ಹೇಳ್ತಕ್ಕಂಥದ್ದು ಅಷ್ಟೇ ಜ್ಞಾನ ಅಂತ ನಾವು ನಂಬಿಕೊಂಡ್ಬಿಟ್ಟಿದೀವಿ. ಇವತ್ತು ಅದೇ ಅನಿವಾರ್ಯವಾಗಿ ಜಾರಿಯಲ್ಲೂ ಕೂಡ ಇದೆ. ಉದಾಹರಣೆಗೆ IAS ಮಾಡಿದಂತ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಇವತ್ತು ಇಡೀ ಅಧಿಕಾರವನ್ನ ತನ್ನಲ್ಲೇ ಇಟ್ಕೊಂಡು ಆತ ಏನ್ ಹೇಳ್ತಾನೋ ಅದು ಜ್ಞಾನದ ಸಂಕೇತವಾಗಿ ಹೊರಹೊಮ್ಮುತ್ತದೆ. ಅಧಿಕಾರ ಯಾರ ಹತ್ರ ಇರುತ್ತೋ ಅವ್ರು ಏನ್ ಹೇಳಿದ್ರು ಜ್ಞಾನವೇ. ಯಾಕೆ ಈ ಮಾತು ನಾನು ಹೇಳ್ತಿದ್ದೀನಿ ಅಂದ್ರೆ, ಭಾರತದ ಸಂದರ್ಭಗಳಲ್ಲಿ ಇವತ್ತಿಗೂ ಕೂಡ ದೇಶೀಯತೆ ಅಂದ್ರೆ ನಮ್ಮ ಸ್ಥಳೀಯಲ್ಲಿರ್ತಕ್ಕಂಥ ಇಂಡಿಜಿನಿಯಸ್ ನಾಲೆಡ್ಜ್ ಅಂತ ಏನ್ ಕರಿತೀವಲ್ಲ ಅದೊಂದು, ಆದಿವಾಸಿಗಳಿರ್ತಕ್ಕಂಥ ಜ್ಞಾನ ಪರಂಪರೆಗಳು ಇವತ್ತಿಗೂ ಕೂಡ ಜ್ಞಾನ ಅಂತ ಅನಿಸೇ ಇಲ್ಲ. ಯಾಕೆ? ಹಾಗಾದ್ರೆ ಈ ಜ್ಞಾನವನ್ನ ಯಾರು ಆಳ್ತಿದ್ದಾರೆ? ಯಾವುದನ್ನ ಜ್ಞಾನ ಅಂತ ನಮಗೆ ಹೇಳಲಾಗ್ತಾ ಇದೆ, ಯಾವುದನ್ನ ಜ್ಞಾನ ಅಂತ ಬರವಣಿಗೆಯಲ್ಲಿ ಬರೆದಲಾಗಿದೆ, ಯಾವುದನ್ನ ಜ್ಞಾನ ಅಂತ ದಿನನಿತ್ಯ ಟಿವಿ ಚಾನೆಲ್ ಪ್ರಸಾರ ಮಾಡ್ತಾ ಇದೆ? ಜ್ಞಾನ ಅಂದ್ರೆ ಏನು? ಇವತ್ತು ಒಬ್ಬ ಜ್ಯೋತಿಷಿ ಟಿವಿ ಮುಂದೆ ಕುತ್ಕೊಂಡು ಅವನು ಏನ್ ಹೇಳ್ತಾನಲ್ಲ ಅದನ್ನ ನಾವು ಸುಮ್ಮನೆ ಅನುಕರಣೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದೇ ದೊಡ್ಡ ಜ್ಞಾನ. ಹಿಂದೆ ಎಲ್ಲ ಗ್ರಹಣಗಳು ಹೇಳಿದ್ರೆ ನಮ್ಗೆ ಅದರ ಅರ್ಥನೇ ಗೊತ್ತಾಗ್ತಿರ್ಲಿಲ್ಲ. ಇವತ್ತೊಬ್ಬ ಜ್ಯೋತಿಷಿ ಗ್ರಹಣದಲ್ಲಿ ಏನಾದ್ರು ಬಂದ್ ಕೂತ್ಕೊಂಡು ಇವತ್ತು ಯಾರು ಹೊರಗಡೆ ಬರಬೇಡಿ ಅಂದ್ರೆ ಒಬ್ಬರು ಬರೋದಿಲ್ಲ ಹೊರಗಡೆ. ನನ್ನ ಅನುಭವದಲ್ಲಿ ಬೆಂಗಳೂರು ಸ್ತಬ್ಧ ಆಗ್ಬಿಟ್ಟಿತ್ತು ಒಂದ್ಸಾರಿ ಗ್ರಹಣ ಹಿಡಿದಾಗ. ನೀರ್ ಕುಡಿಬೇಡಿ ಅಂತಾರೆ, ನೀರ್ ಮುಟ್ಬೇಡಿ ಅಂತಾರೆ. ಅವ್ರು ಏನ್ ಹೇಳಿದ್ರೆ ಅದನ್ನ ಒಪ್ಕೋತೀವಿ. ಅಂದ್ರೆ ಜ್ಞಾನ ಅಂತಕ್ಕಂಥದ್ದು ಒಬ್ರಿಗೆ ಗೊತ್ತಿದೆ, ಅವ್ರು ಏನ್ ಹೇಳ್ತಾರೆ ಅದೇ ಸತ್ಯ ಅಂತ. ಶತಶತಮಾನಗಳಿಂದ ಈ ಕಾಡಿನ ಜೊತೆ ಒಡನಾಟವನ್ನು ಇಟ್ಕೊಂಡು ಒಂದು ಪ್ರಾಣಿಯ ಹೆಜ್ಜೆಗಳು, ಆ ವಾಸನೆಗಳು, ಅವ್ರ ಮುಖಾಂತರ ಇದೇ ಪ್ರಾಣಿ ಹೋಗಿದೆ, ಇದೇ ಪ್ರಾಣಿ ಹೆಜ್ಜೆ ಅಂತಕ್ಕಂಥ ಗುರುತಿಸ್ತಕ್ಕಂಥ ಜ್ಞಾನವನ್ನ ನಾವು ಗಮನಿಸ್ತಾನೆ ಇಲ್ಲ. ಅದು ಜ್ಞಾನನೇ ಅಲ್ಲ. ಇವತ್ತೇನಾಗಿದೆ ಅಂದ್ರೆ ಜ್ಞಾನದ ವಿವಿಧ ಪ್ರಕಾರಗಳಿದೆ. ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಜ್ಞಾನ, ಆಡಳಿತಾತ್ಮಕ ಜ್ಞಾನ ಒಂದು, ಐಟಿ ಜ್ಞಾನ, ಕೃಷಿಕ ಜ್ಞಾನ, ಆದಿವಾಸಿ ಜ್ಞಾನ, ಅರಣ್ಯ ಜ್ಞಾನ. ಆಯಾ ಜ್ಞಾನಕ್ಕೆ ಅವಕಾಶಗಳು ಸಿಕ್ಕಾಗ ಮಾತ್ರ ಅದು ಮುನ್ನೆಲೆ ಬರಕ್ ಸಾಧ್ಯ ಆಗ್ತದೆ. ಯಾಕೆಂದ್ರೆ ಈಗ ನಾವು ಇಲ್ಲಿ ಓದ್ಕೊಂಡು ಇಲ್ಲಿ ಬಂದು ಕೂತ್ಕೊಂಡು ಡಿಗ್ರಿ ತಗೊಂಡಿರೋದಕ್ಕೆ ನಮ್ಗೆ ಇಲ್ಲೊಂದು ವೇದಿಕೆ ಮೇಲೆ ಸಿಕ್ಕಿದ ಅವಕಾಶಗಳು. ಒಂದು ಜ್ಞಾನ ಪ್ರಕಾರದಲ್ಲಿ ನಾವು ಸಾಧನೆ ಮಾಡೋದಕ್ಕೆ ಮಾತ್ರ ಬಂದು ಇಲ್ಲಿ ಕೂತಿದ್ದೀವಿ. ಇಲ್ಲಿ ಕೂತಿರ್ತಕ್ಕಂಥ ಎಷ್ಟೋ ನಮ್ಮ ಮೂಲ ಆದಿವಾಸಿಗಳಿರ್ತಕ್ಕಂಥ ಹೀಲರ್ಸ್ ಗಳೇನಿದಾರಲ್ಲ, ಅವ್ರಿಗೂ ನಮಗೂ ಕಾಂಪಿಟೇಷನ್ ಬಿಟ್ಟು ಒಂದು ಕಾಡಕ್ ಬಿಡಿ. ನಮಗ್ ಚಪ್ಪಲಿಲ್ದೆ ನಾವು ಹೆಜ್ಜೆನೇ ಆಡಲ್ಲ. ಅವರ ಜ್ಞಾನ ಪ್ರಕಾರಗಳು ಉಪಯೋಗ ಬರ್ತಕ್ಕಂಥದ್ದು ಎಲ್ಲಿ? ಕಾಡಲ್ಲಿ. ಅದೇ ಆ ಹೀಲರ್ಸ್ ಗಳೇನಿದಾರಲ್ಲ, ನಮ್ಮ ಕಮ್ಯುನಿಟಿ ನಾಲೆಡ್ಜರ್ ಏನಿದೆ ಕರಿತೀವಲ್ಲ ನಾವು, ಅವ್ರನ್ನ ಬೆಂಗಳೂರು ಅಂತ ಒಂದು ಐಟಿ ಕಂಪನಿ ಒಳಗಡೆ ಬಿಟ್ರೆ ಅವ್ರು ಏನ್ ಮಾಡ್ತಾರೆ? ದಿಕ್ ತೋಚಂಗ್ ಕೂತ್ಕೊಬಿಡ್ತಾರೆ. ಇದು ತಾರತಮ್ಯಗಳು ಇವತ್ತು ಜಗತ್ತಿನಲ್ಲಿ ನಡೀತಿರ್ತಕ್ಕಂಥದ್ದು. ಅಂದ್ರೆ ಜ್ಞಾನ ಪ್ರಕಾರಗಳು ಅಧಿಕಾರ ಕೇಂದ್ರಿತವಾಗಿ ರೂಪುಗೊಳ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದು, ಪ್ರಸಾರ ಆಗ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದು. ಇದನ್ನ ಗುರುತಿಸ್ಬೇಕು. ಆದ್ರೆ ಬಟ್ ಏನಾಗ್ತಿದೆ ಇವತ್ತು, ಅಧಿಕಾರದಲ್ಲಿರ್ತಕ್ಕಂಥ ಜ್ಞಾನ ಆದಿವಾಸಿಗಳು, ಬುಡಕಟ್ಟು ಜನರು ಮತ್ತು ಸ್ಥಳೀಯರಲ್ಲಿರ್ತಕ್ಕಂಥ ಜ್ಞಾನ ಪ್ರಕಾರದ ಮೇಲೆ ಪ್ರಭಾವ ಬೀರ್ತಾ ಇರ್ತಕ್ಕಂಥ ಬಹಳ ಅಂಶ. ಯಾಕೆಂದ್ರೆ ಸಿಕ್ಕಲ್ ಸೆಲ್ ಅನಿಮಿಯಾ ಮತ್ತೆ ಮಂಕಿ ಫಾಕ್ಸ್ ಅಂತ ಕರಿತಿರಲ್ಲ, ಮಂಗನ ಕಾಯಿಲೆ ಅಂತ ಚಿಕ್ಕಮಗಳೂರು ಭಾಗದಲ್ಲಿ ಏನ್ ಕರಿತೀವಲ್ಲ, ಇವತ್ತು ಅದು ಒಂದು ವಿಶ್ವ ಮಟ್ಟದಲ್ಲಿ ಚರ್ಚೆ ಆಗ್ತಕ್ಕಂಥ ವಸ್ತು ವಿಷಯ. ಈ ಎರಡೂ ಕೂಡ ಆದಿವಾಸಿಗಳ ಮೇಲೆ ವೈದ್ಯಕೀಯ ಹಿನ್ನೆಲೆಯ ಟ್ರೀಟ್ಮೆಂಟ್ ನಡೀತದೆ. ಒಂದು ಸಿಕ್ಕಲ್ ಸೆಲ್ ಎನಿಮಿಯಾ ಕಾಯಿಲೆಗಳನ್ನ ಗುರುತು ಮಾಡ್ತಕ್ಕಂಥ ಸಂದರ್ಭಗಳು ನಾವು ಗಮನಿಸಿದಾಗ ಈ ವೈದ್ಯಕೀಯ ಜ್ಞಾನ ಏನ್ ಪಡ್ಕೊಂಡಿರ್ತಾರಲ್ಲ, ಅಲೋಪತಿನೋ ಅಥವಾ ಏನ್ ಮೆಡಿಸಿನ್ ಅಂತ ಏನ್ ಕರಿತಿರಲ್ಲ, ಅವ್ರು ಏನ್ ಹೇಳ್ತಾರೋ ಅವ್ರು ಕೊಡ್ತಕ್ಕಂಥ ಟ್ರೀಟ್ಮೆಂಟೇ ಜ್ಞಾನ. ಅದೇ ಅವ್ರಿಗೆ ಆದಿವಾಸಿ, ಯಾಕೆಂದ್ರೆ ಸ್ಥಳೀಯಲ್ಲಿರ್ತಕ್ಕಂಥ ಕಾಡಿನ ಬಗ್ಗೆ ಜ್ಞಾನ ಇರ್ತಕ್ಕಂಥದ್ದು, ಪ್ರತಿಯೊಂದು ಕಾಯಿಲೆ ಬಗ್ಗೆ ಅನುಭವ ಇರತಕ್ಕಂಥದ್ದು, ಅದಕ್ಕೊಂದು ಮೆಡಿಸಿನ್ ಕಂಡುಹಿಡಿದಿರ್ತಕ್ಕಂಥದ್ದು, ಅದನ್ನ ಅನುಕರಣೆ ಮಾಡಿ ಪರಿಹರಿಸ್ಕೊಳ್ತಿರ್ತಕ್ಕಂಥ ಗುಣ ಇದ್ರೂ ಕೂಡ ವೈದ್ಯಕೀಯ ಪ್ರಪಂಚ ಏನ್ ಬರ್ಕೊಡುತ್ತಲ್ಲ ಅದೇ ಅಷ್ಟೇ ನಾವು ಮೆಡಿಸಿನ್ ಆಗಿ ತಗೋಬೇಕಾಗಿದೆ. ಇಲ್ಲಿ ನಾವು ಯಾವ ಜ್ಞಾನಕ್ಕೆ ಆದ್ಯತೆ ಕೊಟ್ಟಿದ್ದೀವಿ? ಇವತ್ತು ಎರಡು ಬಹಳ ಚರ್ಚಿತ ವಿಚಾರ ಏನಂದ್ರೆ, ಆ ತರದ ಎರಡು ಹಿನ್ನೆಲೆ ದಿನೇಶ್ ಸರ್ ನಾನು ಮತ್ತೆ ನಮ್ಮ ಮೇಡಮ್ ಅವ್ರಿಗೆ ಈ ವಿಚಾರದಲ್ಲಿ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತೀನಿ. ಯಾಕೆಂದ್ರೆ ಇದು ಎರಡೂ ಕೂಡ ಒಂದು ಕಡೆ ಪಾರಂಪರಿಕ ವಿಜ್ಞಾನ, ಆದಿವಾಸಿಗಳ ಅಥವಾ ಬುಡಕಟ್ಟು ಜನರ ಪಾರಂಪರಿಕ ವಿಜ್ಞಾನ, ಮತ್ತು ನಾವು ನೀವೆಲ್ಲ ನಂಬ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ವೈದ್ಯಕೀಯ ಪ್ರಪಂಚ, ಎರಡೂ ಕೂಡ ಒಂದ್ ಕಡೆ ತರೋದು ಬಹಳ ಕಷ್ಟ ಇದೆ. ಬಟ್ ಎರಡೂ ಕೂಡ ಉತ್ತರ ರಿಸಲ್ಟ್ ಒಂದೇ, ಆರೋಗ್ಯವನ್ನ ಸರಿಪಡಿಸ್ತಕ್ಕಂಥದ್ದೇ ಬಹಳ ಪ್ರಮುಖವಾಗಿರ್ತಕ್ಕಂಥದ್ದು. ಹಾಗಾಗಿ ಈ ದಿನ ತುಂಬಾ ಸಮಯ ಕಡಿಮೆ ಇದೆ. ಬಹಳ ಪ್ರಮುಖವಾಗಿ ನಾನು ಈ ದಿನ ಹೇಳ್ತಕ್ಕಂಥದ್ದು ಆದಿವಾಸಿಗಳ ಪಾರಂಪರಿಕ ಜ್ಞಾನ ಅಂತಕ್ಕಂಥದ್ದು ನಿಮಗೆ ಏನಿವತ್ತು ವಿಜ್ಞಾನದ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ನಿಮಗೆ ಒಂದು ಮಾನದಂಡಗಳಾಗಿರ್ಬೋದು, ಒಂದು ಸಂಕೇತದ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ಇರಲ್ಲ. ಇವತ್ತು ಆದಿವಾಸಿಗಳಲ್ಲಿರ್ತಕ್ಕಂಥ ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳು, ಬಗೆಹರಿಸ್ತಕ್ಕಂಥ ರೀತಿಗಳು, ಈ ಬಗ್ಗೆ ಎಲ್ಲ ನಾನು ಬೆಂಗಳೂರಲ್ಲಿ ಮೊನ್ನೆ ನನಗೆ ಒಂದು ಮೀಟಿಂಗ್ ಕರೆದಿದ್ರು. IPH ಅಂತ ಕೇಳಿದಿರಾ? ಅದರಲ್ಲಿ ದೇಶದ ಬಹುತೇಕ ಮಾನವಶಾಸ್ತ್ರಜ್ಞರು ಬಂದಿದ್ರು. ಒಂದ್ ಕಡೆ ನಾವು ಟ್ರೈಬಲ್ ಇಂದ ಹೋಗಿದ್ವಿ, ನಾವೊಂದ್ 3 ಜನ. ಅವರ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆಯಲ್ಲ, ಮಾನಸಿಕ ಕಾಯಿಲೆಗೆ ಸಂಬಂಧಪಟ್ಟ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆಯಲ್ಲ, ಅವ್ರು ಸುಮಾರು ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಖರ್ಚು ಮಾಡಿ 6 ತಿಂಗಳು 1 ವರ್ಷದವರೆಗೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾರೆ ಮಾನಸಿಕ ಕಾಯಿಲೆ ಸಂಬಂಧಪಟ್ಟಂಗೆ. ನಮ್ಮಲ್ಲಿರ್ತಕ್ಕಂಥ ಏನ್ ಕಣಿಕಾರ ಅಂತ ನಾವೇನ್ ಕರಿತೀವಲ್ಲ, ಕೋಲ್ಕಾರ ಅಂತ ಏನ್ ಕರಿತೀವಲ್ಲ, ನಮ್ಮಲ್ಲಿರ್ತಕ್ಕಂಥ ರಳೆಕಾಯಿ ಪಂಡಿತ ಅಂತ ಬ್ರಾಂಡ್ ಆಗ್ಬಿಟ್ಟಿದಿರಲ್ಲ, ಅವ್ರು ಮಾಡಿದ ಕೆಲಸ ಬರೀ 2 ರಿಂದ 3 ದಿನದಲ್ಲಿ ಬಗೆಹರಿಸ್ತಕ್ಕಂಥದ್ದು. ಅದೇ ಕೆಲಸನೇ ಅವರು ಮಾಡ್ತಕ್ಕಂಥದ್ದು. ನಾವು ಕೂಡ ಮಾನಸಿಕ ಕಾಯಿಲೆಗೆ ಹಾಡ್ ಮರಿ ಗೊತ್ತಲ್ಲ ನಿಮ್ಗೆ, ಹಾಡ್ ಮರಿ ಕುರಿ ಮರಿಗಳ ಜೊತೆ ಕಾಲ ಕಳೀರಿ ಅಂತ ಹೇಳ್ತಕ್ಕಂಥದ್ದು, ಒಂದು ಎತ್ತರ ಪ್ರದೇಶದಲ್ಲಿ ದೇವಸ್ಥಾನಗಳನ್ನ ಕಟ್ತಕ್ಕಂಥದ್ದು, ಅಲ್ಲಿಗೆ ನಡ್ಕೊಂಡೋಗ್ರಿ ಅಂತ ಹೇಳ್ತಕ್ಕಂಥದ್ದು, ಹರಿಯೋ ನದಿಯ ಪಕ್ಕದಲ್ಲಿ ಕೂತ್ಕೊಳ್ಳಿ ಅಂತ ಹೇಳ್ತಕ್ಕಂಥದ್ದು, ಒಂದು ತಣ್ಣನೆ ಗಾಳಿ ಬರ್ತಕ್ಕಂಥ ಪ್ರದೇಶವನ್ನು ಆಯ್ಕೆ ಮಾಡ್ಕೊಳ್ಳಿ ಅಂತಕ್ಕಂಥ ಹೇಳ್ತಕ್ಕಂಥದ್ದು, ಇದನ್ನೇ ಅವರು ಕೂಡ ಹೇಳ್ತಕ್ಕಂಥದ್ದು. ನಾವು ತುಂಬಾ ಮುಖಾಮುಖಿ ಚರ್ಚೆ ಮಾಡಿದಾಗ ಈ ತರ ಅಂಶಗಳೆಲ್ಲವಿದೆ. ಹಾಗಾಗಿ ನಮ್ಮ ಪಾರಂಪರಿಕ ಆದಿವಾಸಿಗಳಿರ್ತಕ್ಕಂಥ ಜ್ಞಾನ ಪರಂಪರೆನ ಇವತ್ತು ಗೌರವಿಸಬೇಕಾದಂತ ಸಂದರ್ಭ ಇದೆ, ಸಂರಕ್ಷಣೆ ಮಾಡಬೇಕಾದಂತ ಸಂದರ್ಭಗಳಿದೆ. ಮತ್ತು ಅವು ಮುಂದಿನ ತಲೆಮಾರಿಗೆ ಯಾವ ಜ್ಞಾನ ಪರಂಪರೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳು, ನಾನು ಮೊದಲೇ ಹೇಳಿದಾಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಸಮಾಜ ನಿರ್ಮಾಣಕ್ಕೆ ಅಗತ್ಯ ಇದೆ, ಆ ತರ ಜ್ಞಾನ ಪರಂಪರೆ ಅಗತ್ಯ ಇದೆ. ಅದನ್ನು ಉಳಿಸುವಂತ ಕೆಲಸಗಳು ಇಂತಹ ಸೆಮಿನಾರ್ ಮುಖಾಂತರ ನಾವೆಲ್ಲರೂ ಕೂಡ ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಸ್ವಲ್ಪ ಚರ್ಚೆಗಳು ಮಾಡಿ, ಅವೆಲ್ಲವೂ ಕೂಡ ನಮ್ಮ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ ದಾಖಲೀಕರಣ ಮಾಡಿಕೊಳ್ಳುತ್ತೆ. ನಿಮ್ಮ ಹೊಸ ವಿಚಾರಗಳೇನಿದ್ರು ನಮ್ಮ ಅಧ್ಯಯನಕ್ಕೆ ಪೂರಕವಾಗಿ ಬಳಸ್ಕೊಳ್ಳಲಾಗುತ್ತದೆ. ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ಕೂಡ ಶಿವಕುಮಾರ್ ಸರ್ ಹೇಳ್ದಂಗೆ ಚರ್ಚಾತ್ಮಕವಾಗಿ ತಮ್ಮ ಅಸ್ಮಿತೆನ ಮತ್ತೆ ಇರುವಿಕೆಯನ್ನು ವ್ಯಕ್ತಪಡಿಸಿ ಸುಮ್ಮನೆ ಕೂತಿದ್ದು ಎದ್ದೋಗ್ಬೇಡಿ. ಯಾಕೆಂದ್ರೆ ಆದಿವಾಸಿಗಳನ್ನ ನಾವ್ ಯಾರೋ ಒಂದ್ ಇಬ್ರು ಹೀಲರ್ಸ್ ನಾವು ಮುಂದೆ ತಂದು ಕೂರಿಸ್ತೀವಿ ಅಂದ್ರೆ ನೀವೇನಾದ್ರೂ ಪ್ರಶ್ನೆ ಕೇಳಿದ್ರೆ ಮಾತ್ರ ಉತ್ತರ ಕೊಡ್ತಾರ ಅವರು. ಇಲ್ಲಾಂದ್ರೆ ನೀವು ಸುಮ್ಮನೆ ಕೂತಿದ್ರೆ ಅವರು ಕೂತಿ ಎದ್ದೋಗ್ತಾರೆ. ನಿಮ್ಗೆ ಏನ್ ಡೌಟ್ಸ್ ಗಳಿದೆಯಲ್ಲ, ಅದರ ಅಗತ್ಯತೆಗಳೇನಿದೆಯಲ್ಲ ಅದನ್ನ ಅವ್ರ ಮುಖಾಂತರ ಚರ್ಚೆ ಮಾಡಿ. ಈ ಸೆಮಿನಾರ್ ಆಗು ಮಾಡಿಕೊಟ್ಟಿರತಕ್ಕಂತ ಮತ್ತೊಮ್ಮೆ ನಮ್ಮ ನಿರ್ದೇಶಕರಿಗೆ ಮತ್ತೆ ಗಿರಿಜಾಂಬ ಮೇಡಮ್ ತುಂಬಾ ಇಂಟ್ರೆಸ್ಟ್ ತಗೊಂಡು ಈ ತರದ ವಿಚಾರಗಳನ್ನ ಪರ್ಟಿಕ್ಯುಲರ್ ಹುಡುಕಿ ಈ ತರ ವಿಷಯಗಳನ್ನ ತಮ್ಮ ಮುಂದೆ ಇಟ್ಟಿದ್ದಾರೆ. ಹಾಗಾಗಿ ನೀವೆಲ್ಲ ಇಲ್ಲಿ ಕೂರಕ್ ಸಾಧ್ಯ ಆಗಿದೆ. ಮತ್ತೊಮ್ಮೆ ನಾನು ಡಾಕ್ಟರ್ ದಿನೇಶ್ಗೆ ಮತ್ತೆ ಡಾಕ್ಟರ್ ರಾಮಕೃಷ್ಣಯ್ಯ ಅವರಿಗೆ ಮತ್ತು ವೇದಿಕೆ ಮೇಲೆ ಇರ್ತಕ್ಕಂಥ ಎಲ್ಲ ಗಣ್ಯರಿಗೆ ವಂದಿಸಿ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೀನಿ. ನಮಸ್ಕಾರ.
ಭಾರತದಲ್ಲಿ ಜ್ಞಾನ ಎಂಬುದು ಇತ್ತೀಚಿನ ದಶಕಗಳವರೆಗೂ ಕೇವಲ ಸೀಮಿತ ವರ್ಗಗಳ ಸುತ್ತಾಗಿತ್ತು. ಸಮಾಜದ ನಿರ್ಮಾಣ ಮಾಡುವಲ್ಲಿ ಜ್ಞಾನ ಹೇಗೆ ಕೆಲಸ ಮಾಡ್ತದೆ, ಹಾಗೆ ಜ್ಞಾನದ ವ್ಯತ್ಯಾಸಗಳು ಮತ್ತೆ ಬುಡಕಟ್ಟುಗಳ ಜ್ಞಾನವನ್ನು ಹೇಗೆ ಮುನ್ನೆಲೆಗೆ ತರಬೇಕು, ಇತ್ತೀಚಿನ ಸಂದರ್ಭದಲ್ಲಿ ಯಾವ ರೀತಿಯ ಜ್ಞಾನ ಪ್ರಪಂಚವನ್ನು ಆಳ್ತಿದೆ ಮತ್ತೆ ಯಾವೆಲ್ಲ ಜ್ಞಾನಗಳನ್ನ ಕಡೆಗಣನೆ ಮಾಡಲಾಗಿದೆ, ಹಾಗೆ ಆದಿವಾಸಿಗಳ ಆರೋಗ್ಯದ ಪದ್ಧತಿಗಳ ಬಗ್ಗೆ ಸಾಕಷ್ಟು ವಿಚಾರಗಳನ್ನ ತಮ್ಮ ಭಾಷಣದ ಮೂಲಕ ತಿಳಿಸಿಕೊಟ್ಟಂತ ಡಾಕ್ಟರ್ ಕೃಷ್ಣಮೂರ್ತಿ ಕೆವಿ ಇವರಿಗೆ ಪ್ರೀತಿಯ ಧನ್ಯವಾದಗಳು. ಹಾಗೆ ಈ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆ ವಹಿಸಿಕೊಂಡಿರ್ತಕ್ಕಂಥ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರು ಶ್ರೀಮತಿ ಗಿರಿಜಾಂಬ ಮೇಡಮ್ ಅವರು ತಮ್ಮ ಅಧ್ಯಕ್ಷೀಯ ಭಾಷಣ ಮಾಡಬೇಕು ಅಂತ ಕೇಳಕತ್ತೀನಿ.
ವೇದಿಕೆಯ ಮೇಲೆ ಉಪಸ್ಥಿತರಿರುವ ಎಲ್ಲ ಗಣ್ಯರೇ, ಆಹ್ವಾನಿತರೆ ಹಾಗೂ ಸಂಶೋಧನಾ ವಿದ್ಯಾರ್ಥಿಗಳೇ ಹಾಗೂ ಬುಡಕಟ್ಟು ಮುಖಂಡರೇ ಹಾಗೂ ನನ್ನ ಕಚೇರಿಯ ಸಿಬ್ಬಂದಿ ವರ್ಗದವರೇ ಹಾಗೂ ಮಾಧ್ಯಮ ಮಿತ್ರದವರೇ, ಈಗ ಇಂದಿನ ಸೆಮಿನಾರ್ ಅಲ್ಲಿ ಈಗ ಎಲ್ರೂ ವೇದಿಕೆ ಮೇಲೆ ಇರೋರು ತಮ್ಮ ತಮ್ಮ ಅಭಿಪ್ರಾಯವನ್ನ ವ್ಯಕ್ತಪಡಿಸಿದ್ದಾರೆ. ಆಸ್ ಎ ಕಾಮನ್ ಪೀಪಲ್ ನಾನು ಏನು ಯೋಚನೆ ಮಾಡ್ತೀನಿ, ಈಗ ನಮ್ಗೊಂದು ತಲೆನೋವು ಬಂತು ಅಥವಾ ಹೊಟ್ಟೆ ನೋವು ಬಂತು ಅಂದ್ರೆ ಇಮಿಡಿಯೇಟ್ ನಾವೇನ್ ಮಾಡ್ತೀವಿ, ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ಹೋಗ್ತೀವಿ. ಆದ್ರೆ ನಮ್ಮ ಬುಡಕಟ್ಟು ಸಮುದಾಯದವ್ರು ಏನ್ ಮಾಡ್ತಾರೆ, ತಮ್ಮದೇ ಪರಿಸರದಲ್ಲಿರುವ ಔಷಧಿಯನ್ನ ಬಳಸ್ಕೊಂಡು ಯಾವ ವೈದ್ಯರ ಹತ್ರ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಹೋಗೋದಿಲ್ಲ. ಅದೇ ನಮಗೂ ಅವ್ರಿಗೂ ಇರೋ ವ್ಯತ್ಯಾಸ. ಹಾಗಿದ್ರೆ ನಾವು ಮೆಡಿಸಿನ್ ತಗೊಂಡು ಕ್ಯೂರ್ ಆಗೋ ರೋಗ, ಅವರು ಪರಿಸರದ ವಸ್ತುಗಳನ್ನ ಬಳಸ್ಕೊಂಡು ಮೂಲಿಕೆಗಳನ್ನ ಬಳಸ್ಕೊಂಡು ಏನೋ ಔಷಧಿಯನ್ನ ಪಡ್ಕೋತಾರೆ. ಆ ನಾಲೆಡ್ಜ್ ನಮ್ಗಿಲ್ಲ. ಇಂದಿನ ಸೆಮಿನಾರ್ನ ಉದ್ದೇಶ, ನೀವು ಏನೇನು ಪ್ರಸ್ತುತಪಡಿಸ್ತೀರಿ ಆಧುನಿಕ ವೈದ್ಯ ಪದ್ಧತಿಯ ಜೊತೆಗೆ ನೀವು ನಿಮ್ಮ ಸಾಂಪ್ರದಾಯಿಕ ಪದ್ಧತಿಯನ್ನ ಎರಡನ್ನೂ ಮಿಕ್ಸ್ ಮಾಡಿದಾಗ ಹೇಗೆ ರಿಸಲ್ಟ್ ಬರುತ್ತೆ, ಅಥವಾ ನಿಮ್ಮ ನಾಲೆಡ್ಜ್ ಏನಿದೆ ಅದು ನಮ್ಮ ಸಾಮಾನ್ಯ ಜನರ ಕೈಗೆ ಎಟುಕ್ತಾ ಇಲ್ಲ, ಅದನ್ನ ಹೇಗೆ ನಾವು ಎಲ್ಲರನ್ನೂ ರೀಚ್ ಆಗ್ಬಹುದು ಅನ್ನೋದನ್ನ ಮೇಲೆ ದಯವಿಟ್ಟು ಬೆಳಕು ಚೆಲ್ಲಿ. ಜೊತೆಗೆ ನಿಮ್ಮಿಂದ ನಿಮ್ಮಲ್ಲಿ ಇರೋ ನಾಲೆಡ್ಜು ಯಾರಿಗೂ ಇಲ್ಲ. ಅಷ್ಟು ನಿಮಗೆ ಆಳವಾದ ಔಷಧಿಯ ಮೇಲೆ ಆಳವಾದ ಜ್ಞಾನ ಇದೆ. ಆದ್ರೆ ವೈಜ್ಞಾನಿಕವಾಗಿ ನಾವು ಅದನ್ನ ಹೊರ ಪ್ರಪಂಚಕ್ಕೆ ಪ್ರಸ್ತುತ ಪಡಿಸಕ್ ಆಗ್ತಾ ಇಲ್ಲ. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ನೀವು 2 ದಿನದ ಸೆಮಿನಾರ್ ಅಲ್ಲಿ ಈ ವಿಷಯಗಳ ಮೇಲೆ ಬೆಳಕು ಚೆಲ್ಲಿ, ಹಾಗೂ ನಾವು ಇದನ್ನ ಏನೇ ಮಾಡಿದ್ರು ಸರ್ಕಾರಕ್ಕೆ ವರದಿ ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳ್ತಾ ಇದೀವಿ. ಈಗ ಆಯುರ್ವೇದಿಕ್ ಪದ್ಧತಿ ಆಗ್ಲಿ ಅಥವಾ ನಾಟಿ ಔಷಧಿ ಪದ್ಧತಿ ಆಗ್ಲಿ, ಇದನ್ನ ಹೇಗೆ ನಾವು ಸಾಮಾನ್ಯ ಜನರಿಗೆ ಪರಿಚಯ ಮಾಡಬಹುದು, ಇದರಿಂದ ಹೇಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ, ಇದರಿಂದ ನಿಮ್ಮ ಜ್ಞಾನ ಹೊರ ಪ್ರಪಂಚಕ್ಕೆ ಹೇಗೆ ಪರಿಚಯ ಮಾಡ್ಬೋದು ಅನ್ನೋ ವಿಷಯಗಳ ಮೇಲೆ ನೀವು ಈ 2 ದಿನ ಸೆಮಿನಾರ್ ನಲ್ಲಿ ಚರ್ಚೆ ಮಾಡ್ಬೇಕು ಅಂತ ವಿನಂತಿ ಮಾಡ್ಕೊತಾ ಇದ್ದೀನಿ. ಹಾಗೂ ಈ ಸೆಮಿನಾರ್ಗೆ ನಾವೆಲ್ಲ ಬೇರೆ ಎಲ್ಲ ಸೆಮಿನಾರ್ಗಿಂತ ಹೆಚ್ಚು ಪೇಪರ್ ಪ್ರೆಸೆಂಟರ್ಸ್ ಬಂದಿದ್ದಾರೆ. ಹಾಗಾಗಿ ನಾನು ಸಂಯೋಜಕರಾದ ದಿನೇಶ್ ಅವರಿಗೆ ಅಭಿನಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಇತರೆ ಜಿಲ್ಲೆಗಳು, ಇತರ ಆ, ಆ, ರಾಜ್ಯದವರು ಕೂಡ ಇಂಟ್ರೆಸ್ಟ್ ಕೊಟ್ಟು ಇಲ್ಲಿ ಬಂದಿದ್ದೀರಿ. ಹಾಗಾಗಿ ಒಂದು ಪ್ರಾದೇಶಿಕ ಭಿನ್ನತೆ ಏನಿದೆ, ಆ ಪ್ರಾದೇಶಿಕ ನಾಟಿ ಔಷಧಿ ಪದ್ಧತಿ ಏನಿದೆ, ಪ್ರಾದೇಶಿಕ ಬುಡಕಟ್ಟು ಸಮುದಾಯದವರ ವಿವಿಧ ವೈದ್ಯ ಪದ್ಧತಿಗಳೇನಿದೆ, ಎಲ್ಲವನ್ನು ನಾವು ತಿಳ್ಕೊಳ್ಳೋದಕ್ಕೆ ಇದೊಂದು ಅವಕಾಶ ಅಂತಾನೆ ನಾನು ಭಾವಿಸ್ತೀನಿ. 2 ದಿನದ ಚರ್ಚೆ ಅರ್ಥಪೂರ್ಣವಾಗಿರ್ಲಿ, ಹೊಸ ಹೊಸ ವಿಷಯಗಳು ಮೇಲೆ ಬೆಳಕು ಚೆಲ್ಲಿ KSTRI ಇದನ್ನ ಹಮ್ಮಿಕೊಂಡಿದ್ದಕ್ಕೂ ಸಾರ್ಥಕ ಆಯ್ತು. ಈ ತರನು ನಾವು ನಮ್ಮ ಸಮುದಾಯದವರ ಜ್ಞಾನದ ಆಳ ಏನಿದೆ ಅದನ್ನ ನಾವು ತಿಳ್ಕೊಬಹುದು ಅಂತ ನೀವು ಪ್ರೂವ್ ಮಾಡ್ಬೇಕು ಅಂತ ನಾನು ಕೇಳ್ಕೊತಾ ಇದ್ದೀನಿ. ಚರ್ಚೆ ಆರೋಗ್ಯಕರವಾಗಿರ್ಲಿ, ಆರೋಗ್ಯದ ಮೇಲೆ ಇರಲಿ, ಹಾಗೂ ಆ ಆರೋಗ್ಯದ ಸಮಸ್ಯೆಗಳೇನಿದೆ ಅದನ್ನ ನಮ್ಮ ಬುಡಕಟ್ಟು ಸಮುದಾಯದವರು ಹೇಗೆ ತಮ್ಮ ಹಂತದಲ್ಲಿಯೇ ನಿವಾರಿಸ್ತಾರೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಮ್ಗೆಲ್ರಿಗೂನು ತಿಳ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅವಕಾಶ ಒದಗಿಸ್ಲಿ. ಎಲ್ರಿಗೂನು ಆಲ್ ದಿ ಬೆಸ್ಟ್. ಥ್ಯಾಂಕ್ ಯು.
ಈ ಕಾರ್ಯಕ್ರಮ ಆಯೋಜನೆ ಮಾಡಲಿಕ್ಕೆ ತುಂಬಾ ಶ್ರಮಿಸಿರೋಂಥ ಮಾನ್ಯ ಉಪನಿರ್ದೇಶಕರು. ನಾವಂತೂ ಬಹಳ ತೊಂದರೆ ಕೊಟ್ಟಿದ್ದೀವಿ ಅವ್ರಿಗೆ. ಒಂದಲ್ಲ ಒಂದು ತಗೊಂಡೋಗ್ತಾ ಇರೋದು, ಕರೆಕ್ಷನ್ ಬೇರೆ ಬೇರೆ ಸಾಕಷ್ಟು ಸರಿ ಮಧ್ಯರಾತ್ರಿ ಎಲ್ಲ ಫೋನ್ ಮಾಡೋದು, 10 ಗಂಟೆ ಬೆಳಿಗ್ಗೆ ಈ ರೀತಿಯಾಗಿ ಎಲ್ಲ ಯಾವುದಕ್ಕೂ ಕೂಡ ಅವರು ಬೇಸರ ಪಡಿಸೋದು ತುಂಬಾ ಸ್ಫೂರ್ತಿದಾಯಕವಾಗಿ ನಮ್ಗೆ ಸಹಾಯ ಮಾಡಿದ್ದಾರೆ. ಹಾಗಾಗಿ ಈ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿ ಈ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷೀಯ ನುಡಿಗಳಾದ ಶ್ರೀಮತಿ ಗಿರಿಜಾಂಬ ಮೇಡಮ್ ಅವರು, ಉಪನಿರ್ದೇಶಕರು, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಇವರಿಗೂ ಕೂಡ ಪ್ರೀತಿಯ ಧನ್ಯವಾದಗಳು. ಈಗ ಗಣ್ಯಮಾನ್ಯರನ್ನು ಸನ್ಮಾನಿಸುವ ಸಂದರ್ಭ. ಮೊದಲಿಗೆ ಪ್ರೊಫೆಸರ್ ಕಂದಿಕೆರೆ ರಾಮನಾಥ ಸಿಂಗರ್ ಸರ್ ಇವರಿಗೆ ಸನ್ಮಾನ. ಜಯಪ್ರಭಾಕರ್ ಸರ್ ಹಾಗೂ ವೇದಿಕೆ ಮೇಲಿನ ಗಣ್ಯರು. ಹಾಗೆ ಈ ಕಾರ್ಯಕ್ರಮದ ದಿಕ್ಸೂಚಿ ಭಾಷಣವನ್ನು ಆಡ್ಕೊಟ್ಟಂತ ಡಾಕ್ಟರ್ ಜಯಪ್ರಭಾಕರ್ ಸರ್ ಇವರಿಗೆ ಕೂಡ ಪ್ರೀತಿಯ ಗೌರವ ಸಮರ್ಪಣೆ. ಹಾಗೆ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರಾದ ನಾನು ಹಾಗೆ ನನ್ನ ಸಂಸ್ಥೆಯ ಸಂಶೋಧನಾಧಿಕಾರಿಗಳಾದ ಶ್ರೀ ಸೂಕ್ಷ್ಮ ಕೆಜಿ, ಹಾಗೆ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಮತ್ತೊಬ್ಬ ಸಂಶೋಧನಾಧಿಕಾರಿಗಳಾದ ಡಾಕ್ಟರ್ ಕೃಷ್ಣಮೂರ್ತಿ ಕೆವಿ ಇವರಿಗೆ ವೇದಿಕೆ ಮೇಲಿನ ಗಣ್ಯರಿಂದ ಕಿರು ಸನ್ಮಾನ. ಮಾನ್ಯ ಉಪನಿರ್ದೇಶಕರಿಂದ ಸಂಶೋಧನಾಧಿಕಾರಿ ಡಾಕ್ಟರ್ ಶ್ರೀ ಶಿವಕುಮಾರ್ ಸಿ KGS ಇವರಿಗೆ ಮಾನ್ಯ ಉಪನಿರ್ದೇಶಕರಿಂದ ಸನ್ಮಾನ. ಸನ್ಮಾನವನ್ನು ಸ್ವೀಕರಿಸಿದಂತ ಮಾನ್ಯರಿಗೆ ಧನ್ಯವಾದಗಳು. ಹಾಗೆ ಮೂಲ ಆದಿವಾಸಿಗಳ ಅಧ್ಯಯನ ಕೇಂದ್ರದ ಸಂಶೋಧನಾಧಿಕಾರಿಗಳಾದ ಕೃಷ್ಣಮೂರ್ತಿ ಕೆವಿ ಅವರಿಗೆ ಸಂಸ್ಥೆಯ ಸಂಶೋಧನಾಧಿಕಾರಿಗಳಾದ ಶ್ರೀ ಶಿವಕುಮಾರ್ ಸರ್ ಅವರಿಂದ ಸನ್ಮಾನ. ಸನ್ಮಾನವನ್ನು ಸ್ವೀಕರಿಸಿದ ಡಾಕ್ಟರ್ ಕೃಷ್ಣಮೂರ್ತಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಹಾಗೆ ನನ್ನ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರಾದ ಶ್ರೀಮತಿ ಗಿರಿಜಾಂಬ ಮೇಡಮ್ ಅವರಿಗೆ ವೇದಿಕೆ ಮೇಲಿನ ಎಲ್ಲಾ ಗಣ್ಯರಿಂದ ಸನ್ಮಾನ. ಸನ್ಮಾನವನ್ನು ಸ್ವೀಕರಿಸಿದಂತ ನನ್ನ ನಿರ್ದೇಶಕರಿಗೆ ತುಂಬುವುದಾದ ಧನ್ಯವಾದಗಳು. ಈಗ ಈ ಕಾರ್ಯಕ್ರಮದ ಕೊನೆಯ ಘಟ್ಟ ವಂದನಾರ್ಪಣೆಯನ್ನು ನಡೆಸಿಕೊಂಡಿದ್ದಾರೆ ಡಾಕ್ಟರ್ ರವಿಕುಮಾರ್, ಕ್ಷೇತ್ರ ಸಂಶೋಧಕರು, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಮೈಸೂರು. ಇವರು
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಬುಡಕಟ್ಟು ವ್ಯವಹಾರಗಳ ಮಂತ್ರಾಲಯ, ನವದೆಹಲಿ, ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆ, ಕರ್ನಾಟಕ ಸರ್ಕಾರ, ಬೆಂಗಳೂರು ಹಾಗೂ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಮೈಸೂರು ಇವರ ಸಹಯೋಗದಲ್ಲಿ ದ ಇಂಪ್ಯಾಕ್ಟ್ ಆಫ್ ಗ್ಲೋಬಲೈಸೇಷನ್, ಕಲ್ಚರಲ್ ಬಿಲೀಫ್ಸ್ ಅಂಡ್ ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ಅಂಡ್ ಹೆಲ್ತ್ ಕೇರ್ಸ್ ಪ್ರಾಕ್ಟೀಸಸ್ ಎಂಬ 2 ದಿನಗಳ ವಿಚಾರ ಸಂಕಿರಣವನ್ನು ಆಯೋಜಿಸಿದ್ದು, ಈ ಒಂದು ವಿಚಾರ ಸಂಕಿರಣಕ್ಕೆ ಉದ್ಘಾಟನೆ ಹಾಗೂ ಉದ್ಘಾಟನಾ ಭಾಷಣವನ್ನು ಮಾಡಿದಂತ ಪ್ರೊಫೆಸರ್ ಎಂ.ಆರ್. ಗಂಗಾಧರ್, ಮಾನವಶಾಸ್ತ್ರಜ್ಞರು, ಮಾನ್ಯ ಕುಲಪತಿಗಳು, ಚಾಮರಾಜನಗರ ವಿಶ್ವವಿದ್ಯಾನಿಲಯ, ಚಾಮರಾಜನಗರ ಅವರ ಅನುಪಸ್ಥಿತಿಯಲ್ಲಿ ಅವರಿಗೆ ತುಂಬು ಹೃದಯದ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಘನ ಉಪಸ್ಥಿತಿ ಇದ್ದಂತ ಶ್ರೀಮತಿ ಕನಗವಲ್ಲಿ, ಕಾರ್ಯದರ್ಶಿಗಳು, ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆ, ಕರ್ನಾಟಕ ಸರ್ಕಾರ ಹಾಗೂ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಯೋಗೇಶ್ ಟಿ, KS ನಿರ್ದೇಶಕರು, ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆ ಹಾಗೂ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಮೈಸೂರು ಅವರ ಅನುಪಸ್ಥಿತಿಯಲ್ಲಿ ಇವರಿಗೂ ಕೂಡ ತುಂಬು ಹೃದಯದ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಈ ಒಂದು ಸೆಮಿನಾರ್ನಲ್ಲಿ ದಿಕ್ಸೂಚಿ ಭಾಷಣವನ್ನ ಮಾಡಿದಂತ ಡಾಕ್ಟರ್ ಜೈ ಪ್ರಭಾಕರ್ SC, ಸಹಾಯಕ ಪ್ರಾಧ್ಯಾಪಕರು, CMRD ಧಾರವಾಡ ಇವರಿಗೆ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಈ ಒಂದು ಸೆಮಿನಾರ್ನಲ್ಲಿ ಮುಖ್ಯ ಅತಿಥಿಗಳಾಗಿ ಆಗಮಿಸಿ ತಮ್ಮ ಮುಖ್ಯ ಅತಿಥಿಗಳ ಭಾಷಣವನ್ನು ನೆರವೇರಿಸಿಕೊಟ್ಟ ಪ್ರೊಫೆಸರ್ ಕಂದಿಕೆ ರಾಮಯ್ಯ ಶ್ರೀಧರ್, ವಿಶ್ರಾಂತ ಪ್ರಾಧ್ಯಾಪಕರು, ಇವರಿಗೆ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಈ ಒಂದು ಸೆಮಿನಾರ್ನಲ್ಲಿ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರು ಶ್ರೀಮತಿ HS ಗಿರಿದಾಂಬ, ಉಪನಿರ್ದೇಶಕರು, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಇವರು ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿ ಅಧ್ಯಕ್ಷೀಯ ನುಡಿಗಳನ್ನ ಆಡಿದ್ದಾರೆ. ಇವ್ರಿಗೂ ಕೂಡ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಉಪಸ್ಥಿತರಿದ್ದಂತ ಶಿವಕುಮಾರ್ ಸಿ, ಸಂಶೋಧನಾಧಿಕಾರಿಗಳು, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಇವರಿಗೂ ಕೂಡ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಡಾಕ್ಟರ್ KV ಕೃಷ್ಣಮೂರ್ತಿ, ಸಂಶೋಧನಾಧಿಕಾರಿ, ಮೂಲ ಆದಿವಾಸಿ ಅಧ್ಯಯನ ಕೇಂದ್ರ, ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆ, ಇವರಿಗೂ ಕೂಡ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತಾ ಇದ್ದೀನಿ. ಇದುವರೆಗೆ ಮತ್ತೆ ವೇದಿಕೆಯ ಮೇಲಿರುವಂತೆ ಎಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ನನ್ನ ವಂದನಾರ್ಪಣಾ ಭಾಷಣವನ್ನು ಮುಗಿಸ್ತೀನಿ. ಥ್ಯಾಂಕ್ ಯು.
ಈ ಕಾರ್ಯಕ್ರಮದ ಕೋಆರ್ಡಿನೇಟರ್ ಆಗಿರ್ತಂತ ಡಾಕ್ಟರ್ ದಿನೇಶ್, ಇವ್ರಿಗೂ ಕೂಡ ತುಂಬು ಹೃದಯದ ವಂದನೆಗಳು. ಹಾಗೆ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಭಾಗವಹಿಸಿರತಕ್ಕಂತ ಬುಡಕಟ್ಟುಗಳ ಎಲ್ಲಾ ಮುಖಂಡರುಗಳು, ಯುವಕರು ಹಾಗೂ ಬೇರೆ ಬೇರೆ ರಾಜ್ಯಗಳಿಂದ ಬಂದಿರತಕ್ಕಂತಹ ಏನು ಪ್ರೆಸೆಂಟೇಷನ್ ಮಾಡಿ ಬಂದಿರತಕ್ಕಂತಹ ಪಾರ್ಟಿಸಿಪೆಂಟ್ಸ್, ಹಾಗೆ ಮೈಸೂರಿನ ಹಲವಾರು ವೈದ್ಯಕೀಯ ಕಾಲೇಜುಗಳಿಂದ ಬಂದಿರತಕ್ಕಂತಹ ವಿದ್ಯಾರ್ಥಿಗಳು, ಸಂಶೋಧನಾ ವಿದ್ಯಾರ್ಥಿಗಳು ಹಾಗೂ ಡಾಕ್ಟರ್ಗಳು ಇವರೆಲ್ಲರಿಗೂ ಕೂಡ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಆಶಿಸ್ತೇವೆ. ಹಾಗೆ ಈಗಾಗಲೇ ಏನು ಪಾರ್ಟಿಸಿಪೇಷನ್ಗೆ ರಿಜಿಸ್ಟ್ರೇಷನ್ ಮಾಡ್ಕೊಳ್ಳೋ ಸಂದರ್ಭದಲ್ಲಿ ಒಂದು ಫಾರ್ಮೆಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಅದರಲ್ಲಿ ಟೆಕ್ನಿಕಲ್ ಸೆಷನ್ ಮತ್ತೆ ಪ್ಯಾನಲ್ ಸೆಷನ್ ಅಂತ ಹೇಳಿದೆ. ಪ್ಯಾನಲ್ ಸೆಷನ್ ಇರೋರು ಏನು ಮೊದಲೇ ಮಾಡಿದ ಮೀಟಿಂಗ್ ಗಳಲ್ಲಿ ಪ್ಯಾನಲ್ ಸೆಷನ್ ಇರುತ್ತೆ, ಮತ್ತೆ ಟೆಕ್ನಿಕಲ್ ಸೆಷನ್ ಇಲ್ಲಿರುತ್ತೆ. ತಾವು ಅದನ್ನ ಗಮನಿಸಿಕೊಂಡು ಆ ಸೆಷನ್ಗೆ ಅಟೆಂಡ್ ಆಗ್ಬೇಕಂತ ಕೇಳ್ತೀನಿ. ಎಲ್ರಿಗೂ ಮತ್ತೊಮ್ಮೆ ಪ್ರೀತಿಯ ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸ್ತೇನೆ.
ಇವಾಗ ಟೀ ಬ್ರೇಕ್ ಇರುತ್ತೆ, ಒಂದು 5-10 ನಿಮಿಷ. ಅದನ್ನ ಮುಗಿಸಿದ ನಂತರ
to kindly grace the dais and preside over the proceedings. I also request all the paper presenters of this session, Dr. Arindran P., Assistant Professor, Dr. Carolina Teresa Kutina, Dr. Shibu P., Assistant Professor, Department of Anthropology, Kannur University, Dr. Bhagya V., Professor, Ivan Raja, Tiger Black HD Kote, belongs to Akipiki community. Now I am requesting Srimati Pallavi Madam to introduce our chairperson of this session.
A very good afternoon to all the delegates. I request all the delegates to gather inside the hall. The first technical scientific session is going to start. I request all the delegates, those who are standing outside, to gather inside the hall. So it gives me an immense pleasure to introduce, and I also feel it's my honor to introduce Dr. N.V. Krishnamurthy sir to the gathering. Sir is a principal at Maharaja Institute of Ayurveda Medical Science, Mysuru, and also is a founder and chief consultant at Pragna Kutira, Kergalli, Mysuru. Sir is a distinguished academician and clinician with vast experience in the field of Ayurveda. Sir has done his BMS from Government Ayurveda Medical College, Mysuru, and also postgraduate in Kaya Chikitsa from Government Ayurveda Medical College, Mysuru. He has done his diploma in yoga. Also, sir is a PhD holder from Esvasa University, Bangalore. So, sir has done his numerous publications in reputed journals. Also, he participated in national, international conferences. So, he has contributed a lot to the field of Ayurveda and to the field of medicine. So, he is awarded with a lot of awards for his service and for his service in the field of Ayurvedic science. So it is our honor to have you here, sir. So thank you so much.
All respected audience and also the eminent speakers. So they are given me an instruction. There are 5 speakers. Already the time is up. It was supposed to start at 11:30. You know, now it is already 12:30. There is one more session. So starting from Dr. Harindran, it is allotted just 10 minutes. I don't know, you have so many things to tell, but restrict yourself to just 10 minutes, and all the 5 you should finish within 50 minutes. Then we should go for the next session. That is my kind request. Thank you very, very much.
I invite our first presenter, Dr. Arindran P., Assistant Professor. Please come. It's okay. So how can I change it? Is there any pointer or anything else? I think it's the point for that. It's not
So I have only 10 minutes. So, respected chair and other dignitaries, first of all, I express my gratitude to the organizers for giving this opportunity, for sharing my ideas in this important seminar. I'm going to talk about a particular tribal healing practice that is called Gediga. It is very much prevalent among a particular community. It's called Raula. They also known as Adia. Raula or Adia is a scheduled tribe community in Kerala. They actually uh, inhabiting in the bordering area of Kerala and Karnataka. So I'm going to discuss about the continuity and change of this particular ritual healing practice and what is happening in these practices of the period. That is, I am going to evaluate through these presentations. Uh, so actually, I have already mentioned this particular community inhabits in Kabini River basins. Actually, this is a bordering area of Kerala and Karnataka. And Gadiga is an important ritual practices of this community that is closely connected with the health and well-being. So Gadiga has undergoing uh, significant transformation over the period. Its context, meaning, and manifestations is largely redefined in the contemporary era. In this context, this paper seeks to explore both the changes and continuity of this particular ritual healing practice. So this is a area where this particular community inhabits, and I'm actually in methodological side. I used a ethnographic approach for studying this particular topic, and I used participant observations and interview for data collection. So Giddiga is actually is a ritual healing practices that is connected with that is trying to ensure the well-being of people as well as the locality by dispelling the evil forces, and it is closely linked with both mental and physical health of the people. So there are three kinds of Geddigas. One is Nurture Geddiga, and second one is Puja Geddiga, and is Nattu Geddiga or Nadanika. And the Nurture Geddiga is actually performed when a person is sick, uh, and it is conducted in the house of affected persons or sick persons or his relatives' house, and it is mainly trying to identify the cause of illness, and they believe that after conducting this particular Gediga, they will get relief. So this is the Nircha Gediga, and the Puja Gediga is conducting after recovery of this particular sick person. It is actually a Thanksgiving ritual performance, and the performance and other kinds of things is almost similar that we can find in Nircha Gediga. And the third one is Nattu Gadiga. Nattu Gadiga is performed annually for the well-being of the village. It is performers visit each houses and dance in a divine possessions. Symbolically drives actually through these practices, it's drive away the diseases and illness of the particular places or particular village. So this is the picture of Nirchagadiga. Actually, this particular
photo or photograph has taken from an event which was taken place in 2021. It is this performed by for a this ritual performed for a woman who is suffering from depression. It's actually begin this the ritual is begins in 9:30 p.m. after the dinner and continued until the next morning. Uh, and in this ritual process we can see the invoking of deities and actually communicate with the deity, and it is also different kinds of ritual process is also taken place during this period, and they prize different kinds of deities of that particular community. So this is about Nirchagadiya, and then we move on to the Natugadiya. Natugadiya is actually it's performing not only for the community members. It's performing for the whole people in the village. So it visited everywhere in the workplaces and in the commercial centers and houses and everywhere. This particular team has visited, and they try to perform certain kinds of rituals. So that is actually it is for the village as such and the health of the village as such. So when we look into these changes of these particular practices, we can find although these ritual healing practices remain prevalent among the community, it has undergone significant transformation due to both internal dynamics and the external influence. Traditionally, confined to this particular practices confined to the domain of health, belief, and ritual. These practices have now been reinterpreted as an art form of cultural expression. So, in contemporary period, Gediga has emerged as a prominent cultural manifestation of Raula community. So, it is a feature. It's featured in art festival and frequently presented in the cultural program organized by governmental and non-governmental agencies. Further, it is widely performed as a representation of tribal heritage and showcased before tourists, students, and various public audience. So this is a photo actually the Gadiga is performing in a stage, and this is actually Gadiga is part of a school curriculum uh, in, in 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 the state of Kerala, uh, and here also it is Gadiya is a ritual dance. It is representing as a ritual dance, and also it is giving as a art form. And now we can also find the tourist guides, and we can find the pictures and the promotion of Gediga as a ritual art, an art form of tribal community. Uh, when we look into this analysis part, uh, uh, the Gadiga reflect both continuity and change. In the contemporary era, Gadiga is performed both as an art form and as a ritual practices, reflecting multi locations in the modern society. So, ritual practices Gadiga continue to serve as an important agency for curing illness, alleviating distress, and safeguarding both individual and community from uh, perceived evil forces. It also reflects how much importance is given for the personal and also collective well-being. It is also highlighted the interplay between spiritual beliefs, health, and social solidarity. The performative tradition of Gediga also reinforce the cultural memory of the people as well. uh, when we look into this, the other part, the study also reveals that Gildiga is increasingly identified as a cultural markers of this Raula community. It has now gained recognition as a prominent tribal art form of in Kerala. This ritual act represent tribal artistry while also symbolizing the political and cultural facets of indigeneity in the state. Over the past several years, it has been showcased on various state organized platform across Kerala. In contemporary time, Gediga intertwined ritual and artistry and creating a new intersections that redefine indigeneity. 1 minute. Okay, I'll going to come. So, in conclusions, uh, Guddiga is a healing ritual of Raula community that has evolved from ritual practices into a cultural performance and an art form. It continued to cure illness, strengthen social bonds, and communicate with the deities while also serving as a marker of Ravula community and heritage. Its transformation reflects resilience, showing how indigenous tradition adapt to modern context, balancing spirituality, health, and cultural expressions. Gadiga explains how ritual practices can simultaneously function as a healing traditions, spiritual communications, and cultural performance. Its transformations highlights the resilience of indigenous knowledge systems and their ability to remain relevant in negotiating tradition and modernity. Thank you. So I try to confine the time constraint. Thank you for your person listening.
Thank you, Dr. Harindran sir. You maintained your time very well. Thanks for that. Now I request Dr. Caroline Madam. She is a professor from Government Ayurveda Medical College to present it. Thank you very much.
So good morning, everyone. Myself, Dr. Caroline. So I am here to present the topic Balam Kira, a tribal remedy as a potent stone crusher. So this is a folklore medicine or a tribal community medicine. Here we have formulated the medication, standardized and evaluated both in vitro and clinically to see its effect in kidney stones. This is a local health traditional medicine used in tribal populations of both Africa as well as India. So, National Health Mission, along with the National Rural Health Mission, supports the evidence-based validation of the LHT drugs, local health traditional drugs. ಸೊ ರಾಷ್ಟ್ರೀಯ ಆರೋಗ್ಯ ನೀತಿ ರಾಷ್ಟ್ರೀಯ ಗ್ರಾಮೀಣ ಆರೋಗ್ಯ ಮಿಷನ್ ಜೊತೆ ಸೇರಿ ಸ್ಥಳೀಯ ಆರೋಗ್ಯ ಸಂಪ್ರದಾಯದ ಮೇಲೆ ವೈಜ್ಞಾನಿಕ ಆಧಾರಿತ ಮೌಲ್ಯಮಾಪನ ಮಾಡೋದಕ್ಕೆ ಹೇಳುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ಈ ಅಧ್ಯಯನವನ್ನ ಕೈಗೊಳ್ಳಲಾಗಿದೆ. ಸೊ ಇನ್ ಆಫ್ರಿಕಾ, mainly in Kenya, we can see Kikuyu, Embu, as well as Akamba tribes. They use this dried fruit for alcoholic fermentation beverage. They'll prepare a beverage and it is used mandatorily in all types of ceremonies. So its therapeutic effect is it improves the blood circulation as well as fertility. And the formulation is Muratina. The beverage name is Muratina. And in Luo as well as Luiha tribe, this is used in symbolically. It is used in funeral rites. If any person from their community is died in a far place and his body is not recovered, then they will bury this fruit as a symbol. So in Nigeria, in Shona, Maputaland tribe, Zulu, Igbo, as well as Tanzanian tribes, they use this fruit. So our study is on Balam Kira fruit. So this is used mainly for the kidney stones. They will prepare a pickle by using vinegar, and this is used for kidney stones as well as in urinary ailments, as well as its root as well as bark, as well as leaves are used in the treatment of ulcers, abscess, as well as skin disorders, and also it is used in cosmetic purpose. So in India, especially in West Bengal, in Jalpagiri district, we can see the tribes like Mek, Toto, Raba, Garo, Mag, as well as Hajang. And they also use this fruit, Balamkira fruit, for the treatment of kidney stones, as well as for wounds, rheumatism, gynecological, as well as obstetric disorders. And in northeastern India, especially in Chhattisgarh, we see Korwa tribe. They also use this for kidney stones, rheumatism. And in Karnataka, in Western Ghats, in the areas of Beltangadi, we can see Malekudi tribe, as well as all over Karnataka, we can see Hakki Pikki tribes, as well as in Chamrajnagar, Soliga tribe, and in Coorg district, we can see Erava tribe. They also use this Balamkira fruit for skin disorders, rheumatism, and also as a aphrodisiac. So in our Ayurvedic science, Ayurvedic system of medicine, we consider it as a major disorder because if it is not treated in a proper time, it may cause certain complications. And even though there are advanced modern treatments nowadays, the recurrence of kidney stones is common, and herbal remedies are considered to be quite effective in preventing the recurrence of the disease. So, as I told, in local health traditions in India, in northern India as well as in Africa, this is used in the form of decoction, kashaya as well as churna form in empty stomach. So, we have done the same clinical study here. We won't get more of clinical studies in clinical field. Only experimental studies are available, which are done on albino rats, where ethanolic as well as aqueous extract is injected on albino rats, and both studies proved that the drug has got anti-urolytic activity. So ಇಲ್ಲಿ ಇಲಿಗಳ ಮೇಲೆ ಅದರದ್ದು ಜೈವಿಕ ಸಾರವನ್ನ ತೆಗೆದು ಇಂಜೆಕ್ಟ್ ಮಾಡಿ ಕಿಡ್ನಿ ಸ್ಟೋನ್ಸ್ ಅನ್ನ ಆಗೋ ತರ ಮಾಡಿಕೊಂಡು ಡ್ರಗ್ ಅನ್ನು ಕೊಟ್ಟಾಗ ಕಿಡ್ನಿ ಸ್ಟೋನ್ಸ್ ಹೋಗಿದೆ, ಮತ್ತೆ ಯಾವುದೇ ಸೈಡ್ ಇಫೆಕ್ಟ್ಗಳು ಇಲ್ಲಿ ಆಗಿಲ್ಲ. ಯಾಕೆ ಅಲ್ಬಿನೋ ರ್ಯಾಟ್ಸ್ ಯೂಸ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ 98% ಆಫ್ ದಿ ಜೀವಶಾಸ್ತ್ರ, ಮನುಷ್ಯನ ಜೀವಶಾಸ್ತ್ರ ಅಲ್ಬಿನೋ ರ್ಯಾಟ್ಸ್ಗೆ ಹೊಂದಾಣಿಕೆ ಆಗೋದ್ರಿಂದ ಇಲ್ಲಿ ಅಲ್ಬಿನೋ ರ್ಯಾಟ್ಸ್ ಅನ್ನ ಯೂಸ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಇಲ್ಲಿ ನಾವು ಇನ್ವಿಟ್ರೋ ಮತ್ತೆ ಕ್ಲಿನಿಕಲ್ ಸ್ಟಡಿಯನ್ನ ಮಾಡಿದೀವಿ. ಇನ್ವಿಟ್ರೋ ಆಸ್ ವೆಲ್ ಆಸ್ ಕ್ಲಿನಿಕಲ್ ಸ್ಟಡಿ ವಿ ಹ್ಯಾವ್ ಡನ್. The drug is in Ayurvedic fold, it is a extra pharmacopoeial drug. We won't have any explanation of this drug. Balamkira is not explained in Ayurveda. In English, it is called it is distributed all over India, especially in West Bengal. In Mysuru also we can see this as a roadside tree which is used for shadow purpose. The fruit is very huge, around 12 kg of weight, 45 centimeter long. And our objectives of our study is preparation as well as standardization, phytochemical analysis, and in vitro as well as clinical study. So we collected the fruits, and as it is a new drug, we did the identification at FRLHT Bangalore, and drug identification is done in University of Mysore. The fruits were collected, washed, dried, and then it is powdered, and then it is labeled. Okay, so this is a process of drug authentication and preparation, and then the drug is sent for standardization. So standardization is nothing but we are checking the quality as well as safety and efficacy of the drug before giving it. So the drug has passed this test. And then phytochemical screening is done. Phytochemical screening is nothing but in Kannada it is called as ಸಸ್ಯಗಳಿನ ಜೈವಿಕ ಸಕ್ರಿಯ ರುಚಿಯನ್ನ, ಬಣ್ಣ ಮತ್ತೆ ರುಚಿಯನ್ನ ಕೊಡುತ್ತೆ, ಜೊತೆಗೆ ಸಸ್ಯಗಳನ್ನ ಬೇರೆ ರೀತಿಯ ರೋಗಗಳಿಂದ ರಕ್ಷಿಸುತ್ತೆ. ಸೊ ಅಂತ ಜೈವಿಕ ಸಂಯುಕ್ತಗಳು ನಾವು ತಗೊಂಡಾಗ ನಮಗೂ ಕೂಡ ಅನೇಕ ರೋಗಗಳಿಂದ ಅದು ಪ್ರೊಟೆಕ್ಷನ್ ನೀಡುತ್ತೆ. ಸೊ ಹಿಯರ್ ದಿಸ್ ಡ್ರಗ್ ಹ್ಯಾಡ್ ಆಲ್ ದೀಸ್ phytochemical constituents. In vitro litholytic study, which is done by using egg semi-permeable membrane. This is done in test tubes, where we took 4 samples. We took 500 mg of the stone. We transferred it in 4 test tubes inside the egg semi-permeable membrane. In one, we used negative control normal saline. In another, we used positive control sodium citrate. And in other 2 samples, we used 10 mg as well as 5 mg of the powder, Balamkira powder, aqueous solution. And for 2 months, we tested this to see the changes in the size of the stone. So ಇಲ್ಲಿ ನಾವು ಟೆಸ್ಟ್ ಟ್ಯೂಬ್ ಅಲ್ಲಿ ಮೊಟ್ಟೆಯ ಒಳಗಿನ ಪದರದಲ್ಲಿ ಮೆಡಿಸಿನ್ ಅನ್ನ ಇಟ್ಟು ಅದರಲ್ಲಿ ಕಲ್ಲನ್ನು, ಕಿಡ್ನಿ ಸ್ಟೋನ್ ಅನ್ನ ಇಟ್ಟು 2 ತಿಂಗಳ ಕಾಲ ಅಧ್ಯಯನ ಮಾಡಿದಾಗ ಕಿಡ್ನಿ ಸ್ಟೋನ್ ಸೈಜ್ಗಳು ರೆಡ್ಯೂಸ್ ಆಗಿದೆ. ಸೊ ಇದು ಫಾರ್ಮುಲಾ ಯೂಸ್ ಮಾಡಿರೋದು. ದಿಸ್ ಇಸ್ ದ ಫಾರ್ಮುಲಾ, ಅಂಡ್ ಫಾರ್ ಈಸಿ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ದಿಸ್ ಇಸ್ ದ after 2 months it was 276 grams. With 50 mg of solution it is 272 grams. So ಈ ಸ್ಟಡಿ ಕಿಡ್ನಿ ಸ್ಟೋನ್ಸ್ ಅನ್ನ ಕರಗಿಸುವ ಎಫೆಕ್ಟ್ ಇದೆ ಅಂತ ತೋರಿಸಿದೆ. So this is a picture of in vitro litholytic study. Next, based on the phytochemical analysis, ಯಾವ ಜೈವಿಕ ಸಂಯುಕ್ತಗಳಿದೆ, so most of the phytochemicals are having antioxidant, anti-inflammatory as well as antimicrobial activities. Okay, and all they are having nephroprotective, diuretic as well as muscle relaxing properties and also lithotripsy properties. So as it is a new drug, we will assess the rasa panchakas of the drug, and it has been found to be having lithotriptic diuretic action. Okay, so we did clinical study also. So before and after, like for 2 months, we have given the medicine, 6 grams of medicine for the patients. USG and other blood tests were repeated before and after. And most of the patients, there is reduction in the stones, initially 6 mm. After 1 month, there was no stone. And in another patient, 8 mm stone, it was reduced to 5 mm. And there is one more patient, female patient with multiple calculi, and after 40 days of treatment, the stones were not there. And there is one more case where a patient had 2 stones. In that, one stone was not there, and the other stone was reduced in size. Okay, so all these studies prove that the tribal information of anti-urolithic activity is true, and it can be used scientifically for the medication purpose in urolithiasis. Thank you. And I acknowledge Dr. Ganesh Babu from Foundation for Revitalization of Local Health Tradition and Dr. M.S. Sharada for drug authentication as well as identification. Thank you.
Thank you very much, Dr. Caroline, madam. You completed in time. Very wonderful paper. Nobody knows this actually. It is a good highlight. Thank you very much. Next, I would like to invite Dr. Shibu. Shibu, sir, please.
To all, and I convey my gratitude to the entire TRI team for giving this opportunity to be here. So actually, this is a paper. Actually, we have done one of the ICMR funded project conducted by Department of Anthropology and headed by Professor M.R. Gangadhar and Professor Kamala Madam. We are highlighting that key points of this project, and so I'm going to present about the title, Community Health and the Cultural Reliance, a study of Malaikudia tribe in Coorg district, Karnataka. So then we know that the health-seeking behavior among a tribal community population is strongly influenced by cultural beliefs and the traditional knowledge system. That's already we have already while inauguration speech, Professor M.R. Gangar sir also discussed about the globalization cultural aspect and impact and its defect also. So the tribal communities represent socially and the culturally distinct population whose health outcomes are shaped by environment, economic and cultural determinants. So here the present study examines the relationship between community health and the cultural relations among the Malaikudia tribe residing in Coorg district of Karnataka. So I'll give brief introduction about the community. So actually the Malaikudia, they are a rich cultural heritage with the traditional practices centered around agriculture, forest conservation and wildlife protection. So they have a deep understanding of the forest ecosystem and have developed sustainable practices to coexist with nature. This is the photograph I have taken during my field work. So then their complexion is also varies from dark brown, and so their females wear sarees in a manner similar to Coorg women. So the area of study, actually the Malaikudia name is there are representing different names are representing. Actually their Malaikudia is in Coorg and South Canara districts of Karnataka. So they are known in different nomenclature depending on the region, like Kudia, Malaikudis, Malaikudian, Malaikudis, etc. So then the present study conducted in the tribal population inhabited at Kunyila Kakabe Panchayat in Virajpeta Taluk of Karnataka state. So actually the origin of name. So different concepts are also existed about the origin of the name Malay Kudia. So here that Malay means hill or hilltop, and Kudi means family. So accordingly, the name is originated like they are the tribes with their families settled on hills. So then only they are represented as a Malay Kudia. So these are also other myth related to their origin and history. So I'll skip these slides. So then, so they are the aborigines of mountain Kurgan. Their early progenitors were gods who wandered in the mountains they habited. So earlier they claimed that they lived in the mountains. Then later it is find difficulty for inhabiting in the caves, and they started to construct the house. So then, so they are very much interacted with, their adapted to the environment. So their environmentalism is reflected in the sacred forest. They are known as Devara Kadu, or the god's forest. So the forests are not only for their livelihood but also place for spiritual significance. Then and their all their necessities were available in the forest. Accordingly, there now any other occupation is considered as a traditional occupation. So today the toddy is extracted from palm trees considered as their livelihood. Both men and women were engaged in this profession. So earlier days, it was used as a barter system for exchange of toddy with other food items like rice, oil, etc. And the trunk of the ripened palm tree is also used as a food item used for barter system. So their cultural practices are then they practice sustainable type of agriculture, and they have aptitude of agriculture and cultivate when land is available. And some families have a large holding within forest and rural areas. Rearing and trading of pigs, poultry, and cattle is also seen in common. So nowadays, cardamom is the major crop cultivated. So the earlier also they are also cultivated their crop. So ಅವ್ರದ್ದು ಮೂಲದನೇ ಬೆಳೆ ಅಂತ ಹೇಳೋದು ಕಾರ್ಡಮ್ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. Okay, so now they cultivate coffee, pepper, ginger, banana, ragi, maize, etc. So then honey is also collected from the forest, and apiculture is also seen as one of the livelihood of their community. So their settlement pattern, so they constructed a house within the material available in their surroundings. So the traditional knowledge is interesting that they are constructing house with unburned bricks. So I asked the question why. So the Coorg is a very pleasant climate and is high rainy falling area. So they are claiming that the burning woods provide good protection for the house due to its smoke and heat. So the rituals and belief, so they are believe in totemism. They reside in the forest, and it is essential to protect the forest, honor to their ancestors. That they worship natural spirit and deities, recognizing sacredness of the natural world. So they also worship the local deities like Ganesha, Ishwar, Subramanya, and regional deities such as Manjunatha of Dharmasthala and Kuke Subramanya. The goddess Kaveri is also worshipped at Bhagamandala. So anyway, the health, so health is defined by different organization, also defined about the health. But we actually we searched about their concept of what is health. So then so according to their concept, they are saying that the health is the ability to work, and so it reflects a functional and social cultural understanding of well-beings rather than purely a biomedical one. So health is measured by the individual's capacity to perform daily economic and subsistence activities. A person who can gather forest products, cultivate crops, hunt or contribute a communal work is considered as health. So anyway, illness or weakness is often defined by an inability to perform these tasks rather than clinical symptoms alone. So the methodology, actually the project is funded by ICMR. So the title is to study the prevalence of obesity among the selected tribal population inhabiting in South India. So actually the methodology is also framed, all the ICMR framed the methodology, and we followed that procedure. So for that we also describe the dietary practices, their physical activity levels also. So for dietary survey, we have taken as a specialized questionnaire we prepared. Actually, dietary take we have we gathered information regarding what are the food they are having from their birth to sorry their wake up in the morning, and during the daytime what are the foods they are having, what time they are having, is there any traditional food is there, so is there any taboo, is there any seasonal food, that also clearly we verified. Then so we also identified high calorie or processed food intakes. So actually we done a field work. So okay, we'll choose. So physical activity also, actually we also collected information on what are the works they are doing in a day. And so anthropometry measurement also we have done. So for that we used the anthropometric, and one more machine we also done. This is the body composition monitor. This is also known as Carada scan. In this Carada scan, we used it to identify the BMI and the fat level, then internal and external fat, everything. So we used the Carada scan to detect that or to kind the information for that. So then blood pressure also, we collected the blood pressure, and we also collected the blood samples, and we also set up in a laboratory in our field work. And actually the Malaikudia tribe, they are the Kurg is very famous for coffee plantation. They are inhabiting in between the coffee plantation and forested area. Actually, the transportation is very difficult for that. So then for our field work, we faced that. Okay. Okay. So this is are my findings, and one more. So during my field work, I interested noticed that that is area. It is electrified on the 4 to 5 back years only. So then actually the work we conducted, but the exact result about obesity we can find out only after 10 years only, because now they are implemented television and other all equipments also. So these are our research team. Thank you.
Thank you very much, Dr. Shibu sir. It is very interesting, and it is an ICMR project, very useful. But what to do? Time is limited. Thank you very much, Dr. Shibu sir. Now I request Dr. Bhagya V. Ma'am, Department of Pharmacology, KLE, College of Pharmacy and University. Please welcome, ma'am. Thank you.
Sure, sir. Sure, sir. Yes, of course. ಡಾಕ್ಟರ್ ಭಾಗ್ಯ ಎರಡನೇದು. ನಮಸ್ಕಾರ. ನಾನು ಕನ್ನಡದಲ್ಲಿ ಎಷ್ಟೋ ಮಾತಾಡೋಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡ್ತೀನಿ, ಆಯ್ತಾ? I know, sir. I understood. Yeah. So before I start, I dedicate my presentation to the Soliga tribal, because I come from the Chamarajnagara, because my father belongs to the Kollegala Taluku. So before I start, I really, dedicate my work to the Soliga family. ಸೊ ಇದು ತುಂಬಾ ಸೈನ್ಸ್ ಇದೆ, ನಾನು ಅಷ್ಟೊಂದು ಸೈನ್ಸ್ ಹೇಳಕ್ ಹೋಗಲ್ಲ. ನಾವೇನ್ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ, ಈಗ ನಮ್ಗೆಲ್ರಿಗೂ ಗೊತ್ತಿದೆ ಎಷ್ಟು ಒತ್ತಡದ ಜೀವನ ನಾವು ನಡೆಸ್ತಾ ಇದ್ದೀವಿ ಅಲ್ವಾ. ಓದ್ಬೇಕು, ರ್ಯಾಂಕ್ ತಗೋಬೇಕು, ಅದಾದ್ಮೇಲೆ ಒಳ್ಳೆ ಕೆಲಸ ಸಿಗ್ಬೇಕು, ಒಳ್ಳೆ ಕೆಲಸ ಸಿಕ್ಕಿದ್ಮೇಲೆ ಮದ್ವೆ ಆಗ್ಬೇಕು, ಒತ್ತಡ ಜೀವನ ದಿನ ಇದ್ದೇ ಇರುತ್ತೆ. ಅದು ತುಂಬಾ ಒತ್ತಡ ಆದಾಗ ಏನಾಗುತ್ತೆ, ನಮಗೆ ತಡ್ಕೊಳಕ್ ಆಗೋದಿಲ್ಲ. ಅದೇನಾಗ್ತಾ ಇದೆ, ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳಿಗೆ ದಾರಿ ಮಾಡ್ಕೊಡ್ತಾ ಇದೆ, ಆಯ್ತಾ. ಸೊ ಏನಂದ್ರೆ, ಜಾಬ್ಗೆ ಹೋಗೋರ್ಗೆ ತುಂಬಾ ಡಿಮ್ಯಾಂಡ್ ಇರುತ್ತೆ, ಡೆಡ್ ಲೈನ್ಸ್ ಇರುತ್ತೆ, ಅವ್ರಿಗೆ ಮಾಡಕ್ ಆಗೋದಿಲ್ಲ. ಅದೇನಾಗುತ್ತೆ, ಬೇರೆ ಬೇರೆ ರೀತಿಯಲ್ಲಿ ಅವ್ರಿಗೆ ತೊಂದರೆ ಕೊಡ್ತಾ ಇರುತ್ತೆ. ಸೊ ಆ ಕಾನ್ಸೆಪ್ಟ್ ನ ತಗೊಂಡು ನಾವಿಲ್ಲಿ ಸ್ಟಡಿ ಮಾಡಿದ್ವಿ. ಸೊ ಯಾವ ತರ ಸ್ಟಡಿ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ, ನಾವು ಹೇಗೆ ನಮ್ಮ ಪೂರ್ವಜರು ಉಪಯೋಗಿಸ್ತಾ ಇದ್ದಂತಹ ಗಿಡಮೂಲಿಕೆಗಳಿಂದ ಹಾಗೂ ಸಂಗೀತ, ಎಲ್ಲರಿಗೂ ಸಂಗೀತ ಅಂದ್ರೆ ಇಷ್ಟ, ಹೇಗೆ ಸಂಗೀತನ ಉಪಯೋಗಿಸ್ಕೊಂಡು, ಗಿಡಮೂಲಿಕೆಗಳನ್ನು ಉಪಯೋಗಿಸ್ಕೊಂಡು ಈ ಒತ್ತಡದ ಜೀವನದಿಂದ ಆಗುವಂತಹ ಅಪಾಯಕಾರಿ, ಅಂದ್ರೆ ಏನಾಗುತ್ತೆ, ಒತ್ತಡ ಆದಾಗ ಏನಾಗುತ್ತೆ, ನಮ್ಗೆ ಹಳೇದೆಲ್ಲ ಮರ್ತೋಗುತ್ತೆ, ನಮ್ಗೇನು ಹೊಸದನ್ನ ಮಾಡ್ಕೊಳಕ್ ಆಗೋದಿಲ್ಲ. ಆಮೇಲೆ ಈಗ ತಾನೇ ಸರ್ ಹೇಳಿದ್ರು, ಡಯಾಬಿಟಿಸ್ ಆಗುತ್ತೆ, ಹೈಪರ್ ಟೆನ್ಷನ್ ಆಗುತ್ತೆ. ಸೊ ಅದನ್ನೆಲ್ಲ ಹೇಗೆ ಮಾಡಬಹುದು ಅಂತ ಒಂದು ಇದನ್ನ ಇಟ್ಟುಕೊಂಡು ನಾವು ಈ ಸ್ಟಡಿನ ಮಾಡಿದ್ವಿ. ಇದ್ರಲ್ಲಿ ನಾವೇನ್ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ, ನಾವು ಒಂದು ಗಿಡಮೂಲಿಕೆನ ಸೆಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡ್ವಿ. ಅದ್ರ ಹೆಸರು ಶರಪುಂಕ. ಶರಪುಂಕ ಅನ್ನೋದು ಒಂದು ಸಂಸ್ಕೃತದ ನೇಮ್. ಕನ್ನಡದ ನೇಮ್ ಆದದ್ದು ಕೊಗ್ಗಿ ಅಥವಾ ಕೋಲಿಂಗಿ ಅಂತ. ಅದನ್ನ ತುಂಬಾ ಜನ ಆದಿವಾಸಿ ಜನಗಳು ಇದನ್ನ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಎಲ್ಲಿ ಅಂದ್ರೆ, ಒರಿಸ್ಸಾದಲ್ಲಿ, ವೆಸ್ಟ್ ಬೆಂಗಾಳಲ್ಲಿ. ಕರ್ನಾಟಕದಲ್ಲಿ ನನಗೆ ಏನು ಇನ್ಫಾರ್ಮೇಶನ್ ಸಿಕ್ಕಿಲ್ಲ. ಆಮೇಲೆ ನಾವೇನ್ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ ಇಂಡಿಯನ್ ಕ್ಲಾಸಿಕಲ್ ಮ್ಯೂಸಿಕ್. ಸೊ ನಮ್ದಲ್ಲಿ ಬೇರೆ ಬೇರೆ ವಿಧವಾದಂತಹ ಸಂಗೀತದಿದೆ. ಒಂದು ಹಿಂದೂಸ್ತಾನಿ ಸಂಗೀತ, ಇನ್ನೊಂದು ಶಾಸ್ತ್ರೀಯ ಸಂಗೀತ, ಕರ್ನಾಟಕ ಶಾಸ್ತ್ರೀಯ ಸಂಗೀತ. ಅದರಲ್ಲಿ ನಾವು ಒಂದು ರಾಗವನ್ನ ಸೆಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡ್ವಿ. ಸೊ ಕೆಲವೊಂದು ರಾಗಗಳಿರುತ್ತಲ್ಲ, ಒಂದೊಂದಕ್ಕೂ ಒಂದೊಂದು ರಾಗಗಳಿರುತ್ತೆ. ನಾವು ಈ ಸ್ಟಡಿಗೆ ಮೋಹನ ರಾಗವನ್ನ ಸೆಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡ್ವಿ. ಸೊ ನಾವು ಏನ್ ಮಾಡಿದ್ವಿ, ನಾವು ಮನುಷ್ಯರ ಮೇಲೆ ಮಾಡ್ಲಿಲ್ಲ ಸ್ಟಡಿನ, ಇಲಿಗಳ ಮೇಲೆ ಸ್ಟಡಿ ಮಾಡಿದ್ವಿ. ನಾವು ಹೇಗ್ ಮಾಡಿದ್ವಿ ಅಂದ್ರೆ, ಇಲಿಗಳನ್ನ ತಗೊಂಡ್ವಿ, ಅದಕ್ಕೆ ಸ್ಟ್ರೆಸ್ ಕೊಟ್ವಿ. ಸ್ಟ್ರೆಸ್ ಅಂದ್ರೆ ಈಗ ನಮ್ಗೆ ಆಗ್ಲಿ ಒಂದೇ ಕಡೆ ಕೂತ್ಕೊಳ್ಳಿ ಬೆಳಗ್ಗಿಂದ ರಾತ್ರಿವರೆಗೂ ಅಂದ್ರೆ ಏನಾಗುತ್ತೆ, ಆಗಲ್ಲ ಅಲ್ವಾ, ಕಷ್ಟ ಆಗತ್ತೆ. ಅದೇ ರೀತಿ ನಾವೇನ್ ಮಾಡಿದ್ವಿ, ಇಲಿಗಳನ್ನ ಒಂದು ಸ್ಟ್ರೆಸ್ ತರ ಕೊಟ್ವಿ, ಅದಕ್ಕೆ ಒಂದೇ ಕಡೆ ಇರ್ಬೇಕು ಆ ತರ ಮಾಡಿದ್ವಿ. ಸ್ಟ್ರೆಸ್ ಆದ್ಮೇಲೆ ಏನಾಯ್ತು, ಅನಿಮಲ್ಗಳಿಗೆ ಏನ್ ಮಾಡಿದ್ವಿ, ಏನು ನಾವು ಕೋಲಿಂಗಿ ಗಿಡದ್ದು ಇತ್ತಲ್ಲ ಅದು, ಅದರ ರಸವನ್ನ ಕುಡಿಸಿದ್ವಿ. ಆಮೇಲೆ ಅದಕ್ಕೆ ಮ್ಯೂಸಿಕ್ ಕೊಟ್ವಿ. ಅದಕ್ಕೆ ಅಂತ ಸ್ಪೆಷಲ್ ಆಗಿ ಏನಾಗತ್ತೆ ಅಂದ್ರೆ, ನಾವು ಕೇಳೋ ಮ್ಯೂಸಿಕ್ಗೂ ಇಲಿಗಳು ಕೇಳೋ ಮ್ಯೂಸಿಕ್ಗೂ ವ್ಯತ್ಯಾಸ ಇರುತ್ತೆ. ಈಗ ಬಾವುಲಿ ಎಲ್ಲ ಅದು ಕೇಳೋ ಶಬ್ದ ಬೇರೆ ಇರುತ್ತೆ. ಸೊ ನಾವು ಆ ಇಲಿಗಳಿಗೆ ತಕ್ಕಂತೆ ಆ ಮ್ಯೂಸಿಕ್ ನ ರೆಡಿ ಮಾಡಿ ನಾವು ಆ ಮ್ಯೂಸಿಕ್ ನ ಅನಿಮಲ್ಗೆ ಕೊಟ್ವಿ. ನಾವೇನ್ ನೋಡಿದ್ವಿ ಅಂದ್ರೆ, ಇದೊಂದು ಕೆಲವೊಂದು ಟೆಸ್ಟ್ಗಳು, ಅಂದ್ರೆ ಅದಕ್ಕೆ ಜ್ಞಾಪಕ ಶಕ್ತಿ ಇದೆಯಾ, ಅಥವಾ ಅದಕ್ಕೆ ಕೋಪ ಬರುತ್ತಾ, ಆಂಗ್ಸೈಟಿ ಬರುತ್ತಾ, ಮತ್ತೆ ಅದು ಹಳೇದನ್ನ ಮರ್ತಿಲ್ವಾ, ಆ ತರ ಇದೆಲ್ಲ ಬೇರೆ ಬೇರೆ ಟೆಸ್ಟ್ ಮಾಡೋದು ಲ್ಯಾಬ್ ಅಲ್ಲಿ. ಸೊ ನಾವು ಬರೀ ಸ್ಟ್ರೆಸ್ ಮಾಡಿದ ಅನಿಮಲ್ಗಳನ್ನ ಇದೆಲ್ಲ ನೋಡಿದಾಗ ಏನಾಯ್ತು, ಈ ಸ್ಟ್ರೆಸ್ ಆಗಿರೋ ಅನಿಮಲ್ಗಳು, ಒತ್ತಡದಿಂದ ಇದ್ದಂತಹ ಅನಿಮಲ್ಗಳೇನಾಯ್ತು, ಅದಕ್ಕೆ ಹಳೆದೆಲ್ಲ ಜ್ಞಾಪಕ ಇರ್ಲಿಲ್ಲ, ಕೋಪ ಇತ್ತು, ಡಿಪ್ರೆಷನ್ ತರ ಮಾನಸಿಕವಾಗಿ ಅದು ಎಲ್ಲ ತೋರಿಸ್ತು. ಆದ್ರೆ ನಾವು ಯಾವಾಗ ಈ ಕೋಲಿಂಗಿ ಗಿಡದ ರಸ ಮತ್ತೆ ಮ್ಯೂಸಿಕ್ ಅನ್ನ ನಾವು ಒಟ್ಟಿಗೆ ಕೊಟ್ಟಾಗ ನಾವು ನೋಡಿದ್ವಿ, ತುಂಬಾ ಚೆನ್ನಾಗಿ ಅನಿಮಲ್ಗಳು ಜ್ಞಾಪಕ ಶಕ್ತಿನೂ ಇತ್ತು, ಅದ್ರ ಕೋಪನೂ ಕಡಿಮೆ ಆಗಿತ್ತು, ಮತ್ತೆ ಅದಕ್ಕೇನ್ ಡಿಪ್ರೆಷನ್ ತರ ಏನಿತ್ತು ಅದು ಕಡಿಮೆ ಆಗಿತ್ತು. ಸೊ ಇದು ನಮ್ಮ ಸ್ಟಡಿ. ಓಕೆ, ಸೊ ಇದೆಲ್ಲ ಡೇಟಾ ನಾನೇನು ಹೇಳಕ್ ಹೋಗಲ್ಲ. ಸೊ ಏನಂದ್ರೆ, ನಮ್ಮ ದೇಶದಲ್ಲೇ ಎಷ್ಟು ಒಳ್ಳೆ ರೀತಿಯಾದಂತ ಆಯುರ್ವೇದ ಚಿಕಿತ್ಸೆ ಇರಬಹುದು, ಅಥವಾ ಆದಿವಾಸಿಗಳಿರುವಂತ ಇಂಡಿಯನ್ ನಾಲೆಡ್ಜ್ ಸಿಸ್ಟಮ್, ಭಾರತೀಯ ಜ್ಞಾನ ಪರಂಪರೆ ಇರಬಹುದು, ಅದನ್ನೆಲ್ಲ ನಾವು ಉಪಯೋಗಿಸಿ ಹೇಗೆ ನಮ್ಮ ಜನರನ್ನ ಆರೋಗ್ಯನ ಹೆಚ್ಚು ಮಾಡಬಹುದು. ಬಿಕಾಸ್ ಈಗ ನಮ್ಮ ಟಾಪಿಕ್ ಇರೋದೇ ಗ್ಲೋಬಲೈಸೇಷನ್. ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂದ್ರೆ ಏನು, ಓದಿ ಜಾಸ್ತಿ, ಒಳ್ಳೆ ಕೆಲ್ಸಕ್ಕೆ ಸೇರ್ಕೊಳ್ಳಿ, ಜಾಸ್ತಿ ಸಂಪಾದನೆ ಮಾಡಿ, ಮನೆ ಮಾಡಿ, ಬಂಗಾರ ಮಾಡಿ, ಇದೆ ಸ್ಟ್ರೆಸ್ ಅಲ್ವಾ. ಸ್ಟ್ರೆಸ್ ಬೇಕು, ಎಷ್ಟು ಬೇಕೋ ಅಷ್ಟಿದ್ರೆ ಒಳ್ಳೇದು. ಜಾಸ್ತಿ ಸ್ಟ್ರೆಸ್ ಆದ್ರೆ ನೀವೇನೇ ಸಂಪಾದನೆ ಮಾಡಿದ್ರು ಅದನ್ನ ಅನುಭವಿಸಕ್ಕೆ ನಮ್ಮ ಹತ್ರ ಟೈಮ್ ಇರೋದಿಲ್ಲ. ಸೊ ಈ ಸ್ಟಡಿಯಿಂದ ನಾವೇನ್ ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ, ಆದಷ್ಟು ಒಳ್ಳೆ ಸಂಗೀತವನ್ನ ಕೇಳಿ, ತುಂಬಾ ಒಳ್ಳೇದು. ಒಳ್ಳೆ ಸಂಗೀತನ ಬೆಳಗ್ಗೆ ಹೊತ್ತು, ನಾವೆಷ್ಟೋ ಮನೆಗಳಲ್ಲಿ ದೇವ್ರ ನಾಮಗಳು ಅದು ಇದು ಎಲ್ಲ ಹಾಕಿರ್ತಾರೆ, ಒಳ್ಳೆ ಸಂಗೀತನ ಕೇಳಿ. ಆಮೇಲೆ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಸಿಗುವಂತಹ ಗಿಡಮೂಲಿಕೆಗಳನ್ನ ಉಪಯೋಗಿಸಿ ಹೇಗೆ ನಮ್ಮ ಆರೋಗ್ಯನ ಕಾಪಾಡ್ಕೋಬೇಕು ಅನ್ನೋದೇ ಈ ಸ್ಟಡಿ. ಥ್ಯಾಂಕ್ ಯು.
Thank you very much, Dr. Bhagya ma'am. She completed 3 minutes early. ನಿಮಗೆ ಏನಾದ್ರೂ ಪ್ರಶ್ನೆ ಇದ್ರೆ ಕೇಳ್ಬೋದು. 2 ನಿಮಿಷದಲ್ಲಿ ಕ್ಲೋಸ್ ಮಾಡೋಣ. ನಿಮಗೆ 2 ನಿಮಿಷ ಟೈಮ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಮೇಡಮ್ಗೆ ಏನಾದ್ರು ಪ್ರಶ್ನೆ ಇದ್ರೆ ಕೇಳ್ಬೋದು. ಎನಿ ಕ್ವಶನ್ಸ್? No. You can take her number and also you can forward your questions. So next, I would like to invite Dr. Yuvan Raj sir. Please come, and 10 minutes is there. You please complete within 10 minutes because one more session is there. ಆಗ್ಬೋದಾ? ಇನ್ನು ಒಂದು ಸೆಷನ್ ಇದೆ, ಅದಾದ್ಮೇಲೆ ಲಂಚ್ ಆಗ್ಬೇಕು. ಥ್ಯಾಂಕ್ ಯು.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಾವು ಹಕ್ಕಿ ಪಿಕ್ಕಿ ಜನಾಂಗ, ಅತಿ ಸಣ್ಣ ಜಾನುವಾರದಲ್ಲಿ ಒಂದು ಹೆಸರು ಅಕ್ಕಿ ಪಿಕ್ಕಿ ಅಂತ, ಆ ಜನಾಂಗದಲ್ಲಿ ಹುಟ್ಟಿ ಬೆಳೆದದು. ಈ ಗಿಡಮೂಲಿಕೆದ ಬಗೆದಲ್ಲಿ ನಾವು ಪರಂಪರೆ ನಮ್ದು, ನಮ್ಮ ಪರಂಪರೆ ಗಿಡಮೂಲಿಕೆದಲ್ಲಿ ನಾವು ಕಾಲ ಕಳೆದಿರೋದು ಯಾವ ಎಫೆಕ್ಟ್ನು ನಮ್ಗೆ ಆಗಿತ್ತಲ್ಲ. ಇದುವರೆಗೂ ನಾವು ಗಿಡಮೂಲಿಕೆದಲ್ಲಿನೇ ಇದ್ದೀವಿ. ಇದರಲ್ಲಿ ನೋವುಗಳು ಎಣ್ಣೆ, ಇನ್ನು ತಲೆನೋವು, ಹಲ್ಲು ನೋವು, ಕುದುಲ್ ಬೇಳೆ ಎಣ್ಣೆ, ಅದನ್ನೆಲ್ಲ ಸ್ವಂತ ನಾವು ತಯಾರು ಮಾಡ್ತೀವಿ. ನಾವು ನಮ್ದು ಪರಂಪರೆ ಇದು. ಇನ್ನು ನಮ್ಮ ಮಕ್ಕಳಿಗೆಲ್ಲ ಯಾವ ಡಾಕ್ಟರ್ ತಗೊಂಡು ಹೋಗ್ತಿದ್ದಿಲ್ಲ, ಏನಿಲ್ಲ, ಎಲ್ಲಿನೂ ಕರ್ಕೊಂಡು ಹೋಗ್ತಿದ್ದಿಲ್ಲ ನಾವೆಲ್ಲ. ನಾವು ಹುಟ್ಟಿ ಬೆಳೆದಿರೋದು ಗಿಡಮೂಲಿಕೆದಲ್ಲಿ. ಒಂದ್ ಸಣ್ಣ ಮಕ್ಕಳಿಗೆ ಏನಾದ್ರೂ ತಲೆನೋವಾಗ್ಲಿ, ಏನಾರ ನೆಗಡಿ ಆಗ್ಲಿ, ಶೀತ ಆಗ್ಲಿ, ಅದು ನಮ್ ಕೈ ಮೆಡಿಸಿನ್. ಅದು ಕೈ ಮೆಡಿಸಿನ್ ಅಂತ ಹೇಳಿದ್ರೆ, ಇವತ್ತು ಡೆಲಿವರಿ ಆದ್ರೆ ನಾಳೆ ನಾವು ಭಿಕ್ಷೆ ಬಿಡಕ್ಕೆ ನಮ್ ಜನ ಜೋಳಿಗೆ ಕಟ್ಕೊಂಡು ಹೋಗೋದು. ಆ ಪರಂಪರೆಯಲ್ಲಿ ಹುಟ್ಟಿ ಬೆಳೆದಿರೋದು. ಒಂದು ಮಕ್ಕಳು ಇದು ನಾವು ಹುಟ್ಟಿ ಬೆಳೆದಿರೋದು. ಒಂದ್ ಮಕ್ಕಳು ಡಾಕ್ಟರ್ ಹೋಗಿ ಈ ರೀತಿಯಾಗಿ ಕಷ್ಟ ಬಂದೈತೆ ಅಂತ ಹೇಳ್ಕೊಂಡು ಯಾರ ಮುಂದೆ ನಾವು ಹೇಳೋಕೆ ಹೋಗಿಲ್ಲ. ನಮ್ ಕಷ್ಟ ನಾವೇ ನೋಡ್ಕೊಳೋದು. ಆದ್ರೆ ನಮ್ ಪರಂಪರೆ ಗಿಡಮೂಲಿಕೆದಲ್ಲ, ಆ ಧೈರ್ಯ ನಮ್ಗೆ ತುಂಬಾ ಇತ್ತು. ಒಂದ್ ಜಾಗದಲ್ಲಿ ಒಂದ್ ಮಗು ಡೆಲಿವರಿ ಆಗ್ಬೇಕಂತ ಹೇಳಿದ್ರೆ, ಅಟ್ಲೀಸ್ಟ್ ಒಂದು ಉದಾಹರಣೆ ನಾವು ಒಂದ್ ಹೇಳ್ತೀವಿ. ನನ್ಗೆ 5 ಮಕ್ಕಳು, ದೇವರು ಯಾವ ಡಾಕ್ಟರ್ ತ ಹೋಗಿಲ್ಲ. ನಾವು ಹಿಂಗೆ ದೇಶ ತಿರುಗಾಡಿ ಒಂದ್ ಮನೆ 2 ಮನೆ ನಮ್ ಮಿಸ್ಸೆಸ್ಗೆ ನಾವು ಡೆಲಿವರಿ ಮಾಡಿದ್ವಿ. ಲಾಸ್ಟ್ನೇ ಮಗು ಬ್ರಹ್ಮಾವರದಲ್ಲಿ ಹುಟ್ಬೇಕಂತ ಹೇಳಿದ್ರೆ ಅಲ್ಲಿ ನಾವು ಹೂವಿನ ವ್ಯಾಪಾರ ಮಾಡ್ತಿದ್ರು. 10 ರೂಪಾಯಿ ಹೂವಿನ ವ್ಯಾಪಾರ ಮಾಡ್ತಿದ್ರು. ಟೈಮ್ಗೆ ಏನಾಯ್ತು ಗೊತ್ತಾ, ನನ್ ಮಗ ಒಬ್ಬ ದೊಡ್ಡವನಾಗಿದ್ದ. ಆ ಮಗು ನಮ್ ಮಿಸ್ಸೆಸ್ಗೆ ಡೆಲಿವರಿ ಆಗೋ ಟೈಮು ಇರೋದೇ ನಾವು 4 ಜನ. ಆಮೇಲೆ ಏನಾಯ್ತು ಗೊತ್ತಾ, ಹಳೆ ಸೀರೆನ ತಗೊಂಡ್ಬಿಟ್ಟು ರೌಂಡ್ ಹಾಕ್ಬಿಟ್ಟು ಸ್ವಲ್ಪ ಅಳಿಯೋಕೆ ಶುರು ಮಾಡ್ಬಿಟ್ರು ನಮ್ ಮಿಸ್ಸೆಸ್. ಆಮೇಲೆ ಏನಾಯ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ಅಲ್ಲಿ ಸೀರೆನ ಕಟ್ಬಿಟ್ಟು ನಮ್ ಮಗು ಸೀರೆ ಕಟ್ತಿತ್ತು, ನಾನ್ ನಿಂತಿದೆ, ನಮ್ ಮಿಸ್ಸೆಸ್ ನಮ್ ಕಾಲು ಇಟ್ಕೊಂಡ್ಬಿಟ್ರು. ನೋವು ತಡೆಯೋಕೆ ಆಗಲ್ಲ ಅದೇ ಅಂತ. ನಮ್ ಮಗು ನನ್ ಕಾಲ್ ಮೇಲೆ ಬಿದ್ಬಿಡ್ತು ದೊಡ್ಡಂತ. ಆಮೇಲೆ ನಮ್ಮ ಮಗುನ್ಗೆ ಅಲ್ಲಿ ಹೋದೆ. ಏನ್ ಬಿಸಿ ನೀರ್ ಮಾಡ್ಸಿಲ್ಲ, ಏನಿಲ್ಲ. ಹೋಗಿದೆ ಕೆರೆದಲ್ಲಿ ನೀರ್ ಇತ್ತಲ್ಲ, ಆ ಕೆರೆದಲ್ಲಿ ನೀರ್ ತಗೊಂಡ್ ಬಂದ್ಬಿಟ್ಟು ನಮ್ ಹೆಂಗಸರನ್ನ ಸ್ನಾನ ಮಾಡಿಸಿ ಆ ಮಗುನ ಎಲ್ಲ ತೊಳೆದಾಗ್ಬಿಟ್ಟು ನಾನು ಎತ್ಕೊಂಡ್ ಮಡಿನಲ್ಲಿ ಕುತ್ಕೊಂಡ್ಬಿಟ್ಟೆ ಮಗುನ. ಆಮೇಲೆ ನಮ್ಮ ಮಿಸ್ಸೆಸ್ಗೆಲ್ಲ ಶೀತ ನೆಗಡಿ ಆಗೋ ಶುರು ಟೈಮ್ ನಲ್ಲಿ ಅವ್ರು ಏನ್ ಮಾಡಿದ್ರು ಗೊತ್ತಾ, ಅವ್ರ ಮೆಡಿಸಿನ್ ಅವ್ರಿಗೆ ಚೆನ್ನಾಗ್ ಗೊತ್ತು. ನಮ್ ಮಿಸ್ಸೆಸ್ ಒಂದು ಡಾಕ್ಟರ್ ಇದ್ದಂಗು. ಏನಿದ್ರು ಅಲ್ಲಿಂದ ತಕ್ಷಣ ಒಂದು ನಾವು ಬೇಟೆ ಮಾಡೋ ಹೋಗೋ ಟೈಮ್ನಲ್ಲಿ ಏನಾರೆ ಬಿದ್ದು ರಕ್ತ ಬಂದ್ಬಿಡ್ತು, ಏನಾರೆ ಆಗ್ಬಿಡ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಅಲ್ಲಿನೇ ಸೊಪ್ಪು ಕಿತ್ಕೊಂಡು ಅಲ್ಲಿನೇ ಜೀವನ ಮಾಡುತ್ತೆ. ಆ ರೀತಿಯಾಗಿ ಒಂದ್ ನೋವಿನ ಗಿಡಮೂಲಿಕೆ ಇದು. ಈ ಕಡವಲ್ ಹುಲ್ಲು ಅಂತ ಇರ್ತದೆ, ನೋವಿನ ಎಣ್ಣೆದಲ್ಲಿ ಬೆರೆಸ್ತೀನಿ ಸರ್. ಕಡವಲ್ ಹೂ ಅಂತ ಇರ್ತದೆ, ನೀಲಗಿರಿ ಸೊಪ್ಪು ಅಂತ ಇರ್ತದೆ, ಲೆಕ್ಕೆ ಸೊಪ್ಪು ಅಂತ ಇರ್ತದೆ, ಲಿಂಬೆ ಸೊಪ್ಪು ಅಂತ ಇರ್ತದೆ, ಇನ್ನು ಎಕ್ಕದ ಗಿಡದ ಬೇರು, ಇನ್ನು ಸೀಗೆ ಗಿಡದ ಬೇರು, ಅನಾರ್ ಗಿಡದ ಬೇರು. ಇದರಲ್ಲಿ ಎಣ್ಣೆನ ಬೆರಕ್ಷಿ ಮಾಡ್ತೀವಿ ನಾವು. ಸಾಸಿವೆ ಎಣ್ಣೆ, ಎಳ್ಳೆಣ್ಣೆ, ಹರಳೆಣ್ಣೆ ಚೆನ್ನಾಗಿ ಕಾಯಿಸ್ತೀವಿ ನಾವು. ಕಾಯಿಸಿ ಈ ಸೊಪ್ಪಿನಲ್ಲಿ ಇರೋದು, ಈ ಬೇರಿನಲ್ಲಿ ಇರೋದು ಹಸಿ ಅಂಶ ಎಲ್ಲ ಬೆಂದು ಹೋಗ್ಬೇಕು. ಈ ರಕ್ತದಲ್ಲಿ ಎಣ್ಣೆ ಬಂದ್ಬಿಡ್ಬೇಕು. ಈ ಸೊಪ್ಪು ಇದರಲ್ಲಿ ಇರೋದು ಅಂಶ ಹಸಿ ಅಂಶ ಇರಬಾರ್ದು. ಬೆಂದು ಹೋಗಿ ಹೊರತಾಗಿ ಎಣ್ಣೆನೆ ಬಂದ್ಬಿಡ್ಬೇಕು. ಅದನ್ನ ನೀವು ಸ್ವಂತ ನೋವಾಗಿರ್ಲಿ, ಮಂಡಿ ನೋವಾಗಿರ್ಲಿ, ನೋವಾಗಿರ್ಲಿ, ಬೆನ್ನು ನೋವಾಗಿರ್ಲಿ, ಅದೇ ಒಂದ್ ತಕ್ಷಣ ನಾವು ಈಗ ಒಂದು 6 ತಿಂಗಳ ಮುಂಚೆ ನಾನೇ ಗಾಡಿಯಲ್ಲಿ ಬಿದ್ದು ಮುಳ್ಳೆ ಮುರಿದೋಗಿತ್ತು ನನ್ನ ಕೈದು. ಡಾಕ್ಟರ್ ತ ಹೋಗುವಾಗ ಆಪರೇಷನ್ ಮಾಡಿಸ್ಬೇಕಂತ ಹೇಳಿದ್ರು. ನನ್ಗೆ ಹೆದರಿಕೆ ಆಗ್ಬಿಡ್ತು. ನಾನೇ ಗಿಡಮೂಲಿಕೆ ಅವರು ಡಾಕ್ಟರ್ ಏನ್ ಕೊಡ್ತಾರೆ ಅಂತ ಹೇಳ್ಕೊಂಡು ಇಂಜೆಕ್ಷನ್ ಹಾಕ್ತಾರೆ ಅಂತ ಹೇಳಿದ್ರು, ಆಪರೇಷನ್ ಮಾಡ್ತಾರೆ ಅಂತ ಹೇಳಿದ್ರು. ನನ್ಗೆ ಏನ್ ಬೇಕಾಗಿಲ್ಲಪ್ಪ, ಒಂದ್ ಬ್ಯಾಂಡೇಜ್ ತಗೊಂಡೆ, ಬ್ಯಾಂಡೇಜ್ ತಗೊಂಡು ನಮ್ ಎಣ್ಣೆ ಹಾಕೋದು, ಕಟ್ಕೊಳೋದು. ಕೇವಲ ಒಂದ್ 8 ನಿಮಿಷದಲ್ಲಿ ನನ್ನ ಕೈನೇ ವಾಸಿ ಆಗ್ಬಿಡ್ತು. ಆಮೇಲೆ ಡಾಕ್ಟರ್ ಹೋಗಿ ಇನ್ನೂ ಚೆಕಪ್ ಮಾಡಿಸಿ ನೋಡಿದ್ರೆ ಮೂಳೆ ಗೈಟ್ ಆಗ್ಬಿಡ್ತು ಅಂತ ಹೇಳಿದ್ರು. ಅಂತದ್ದು ನಮ್ದು ಪೌರ್ ಎಣ್ಣೆ. ಇನ್ನು ಈ ತಲೆನೋವು, ಹಲ್ನೋವಿಗೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದು ಏನಂತ ಹೇಳಿದ್ರೆ, ಕಾಡಿರುಳ್ಳಿ, ಕಾಡ್ ಬೆಳ್ಳುಳ್ಳಿ, ಕಾಡ್ ಶುಂಠಿ ಅದನ್ನೆಲ್ಲ ಸೇರಿಸ್ಬಿಟ್ಟು ಅದು ತೆಗೆದ್ರೆ ಹಲ್ಲು ನೀವು ತೆಗಿಯೋಂಗೇನೆ ಇಲ್ಲ ಸರ್. ಅದರಲ್ಲಿ ಕಿರ್ಮಿ ಇರ್ತದೆ. ಹಲ್ಲು ನೋವು ಬಂದ್ಬಿಟ್ರೆ ಕಿರ್ಮಿ ಇರ್ತದೆ. ಅದನ್ನ ಹಳ್ಳೆ ಬತ್ತಿಲಿ ಹಾಕೊಂಡು ಬಾಯಿನಲ್ಲಿ ಹಿಡ್ಕೊಂಡ್ಬಿಟ್ರೆ ಅದು ತಕ್ಷಣ ಕ್ರಿಮಿಗಳು ಸ್ಮೆಲ್ಗೆ ಭಾರಿ ಬಾತದು. ಬೇಕಾದ್ರೆ ನೀವು ನಮ್ ಮೀಟಿಂಗ್ ಮುಗಿದಾದ್ಮೇಲೆ ನಾನು ತಂದಿದ್ದೀನಿ, ಸ್ವಂತ ಎಣ್ಣೆನೂ ತಂದಿದ್ದೀನಿ ನಾನು. ಬಾಟ್ಲಿ ಎಲ್ಲ ಇದ್ದದೆ. ಇನ್ನು ತಲೆನೋವು ಬಾಟ್ಲಿನೂ ಇದ್ದದೆ. ಇನ್ನು ಕೂದಲುಬೇಳೆ ಎಣ್ಣೆನೂ ನಾವು ತಗೊಂಡ್ ಬಂದಿದ್ದೀನಿ ಸರ್. ನೀವು ಟೇಸ್ಟ್ ನೋಡ್ಬೇಕು, ಪರೀಕ್ಷೆ ಮಾಡ್ಬೋದು ನೀವು. ಇನ್ನು ಕೂದಲುಬೇಳೆ ಎಣ್ಣೆ ಏನಂತಾರೆ ಸರ್, ಈ ಬರ್ಮಿ ಅಂತ ಹೇಳ್ತಾರೆ. ನಮ್ಗೆಲ್ಲ ಗೊತ್ತು ಬರ್ಮಿ ಅಂತ ಹೇಳಿದ್ರೆ. ಅಂದ್ರೆ ಕೈ ಉಣ್ಣಿ, ದಾಸವಾಳ, ಲೋಳೆ ಸಾರ, ನನ್ನೆಕಾಯಿ, ನನ್ನೆದೆಲೆ, ತುಳಸಿ, ಸಣ್ಣೀರುಳ್ಳಿ, ಹಿಬಿಎಲೆ, ಕರಿಬೇವಿನ ಸೊಪ್ಪು, ಬೇವಿನ ಸೊಪ್ಪು, ಮಂದೆ ಸೊಪ್ಪು, ಅಶ್ವಗಂಧ, ಈ ಸೊಪ್ಪು ಎಲೆ, ಕುಂಡೆ ಸೊಪ್ಪು, ಬಿಳಿ ದಾಸವಾಳ ಸೊಪ್ಪು, ಅರೆಜೀರಿಗೆ, ಬಾದಾಮಿ, ಬಲಮುರಿ ಎಲೆ, ಇದು ಬೆಳೆಯೋದು ಈ ಎಣ್ಣೆ ಸರ್. ಇದು ಹಸಿ ಪದಾರ್ಥ ಇದು. ಆಮೇಲೆ ಇದರಲ್ಲಿ ಸರ್ ಹೂ ಬೆರಕೆ ಮಾಡ್ಬೇಕು. ಬರೀ ಎಲೆ ತಗೊಂಡು ಕಾಯಿಸ್ಕೊಂಡು ಏನ್ ಪ್ರಯೋಜನ ಇಲ್ಲ. ಅದರಲ್ಲಿ ಎಲೆ ಹೂ ತಗೊಳ್ಬೇಕು. ಗುಲಾಬಿ ಹೂ, ಕುಚಲಿ, ಬೇರು, ಹರಳಿ ಬೇರು, ಕಾಯಿ, ಬರಕೆ ಬೇರು, ಬೆಳ್ಳುಳ್ಳಿ ಬೇರು. ಇದಿಲ್ಲ ಸರ್, ಇದನ್ನ ಏನ್ ಮಾಡೋದು ಅಂತ ಹೇಳಿದ್ರೆ ಇದನ್ನ ಎಣ್ಣೆ ಬೆಳಕೆ ಮಾಡ್ಬೇಕು. ಈ ಕೂದಲು ಬೆಳೆ ಎಣ್ಣೆಗೆ ಕೊಬ್ಬರಿ ಎಣ್ಣೆ, ಕೈ ಎಣ್ಣೆ, ಆ ಬಾದಾಮಿ ಎಣ್ಣೆ, ಬೇವಿನ ಎಣ್ಣೆ, ಇದು ಚೆನ್ನಾಗಿ ಎಲ್ಲ ಕಾಯಿಸಿ ಸರ್. ಅದು ಎಲ್ಲ ಬೆಂದ್ ಹೋಗ್ಬೇಕು. ಬೆಂದಾದ್ಮೇಲೆ ಸರ್ ತಗೊಂಡು ಒಂದು 25 ದಿವಸ 30 ದಿನ, ಒಂದ್ ತಿಂಗಳ ಒಳಗಾಗಿ ನೀವು ಸ್ವಲ್ಪ ರಿಸಲ್ಟ್ ನೋಡ್ಬೇಕು. ಆದ್ರೆ ನಾವು ಹೇಳೋ ಅಷ್ಟು ನಾವು ಹೇಳೋ ಏನ್ ಹೇಳ್ತೀವಿ ಆ ಪ್ರಕಾರ ಮಾಡ್ಬೇಕು. ಒಬ್ರು ತಕೊಂಡ್ಬಿಟ್ಟು ಏನು ಈಗ ಕೂದಲು ಬೆಳೆದಿಲ್ಲ ಹಿಂಗ್ ಬೆಳೆದಿಲ್ಲ ಅಂತ ಹೇಳ್ಕೊಂಡು ನಮ್ಮಲ್ಲಿ ಹೇಳಕ್ಕೆ ಶುರು ಮಾಡ್ಬಿಡ್ತಾರೆ. ಆದ್ರೆ ನಾವು ಹೇಳೋದು ಇದಕ್ಕೆ 3 ಸ್ಟೆಪ್ ಇದ್ದಾರೆ. ಒಂದ್ ಸ್ಟೆಪ್ ನಲ್ಲಿ ಆಗದೆ ಹೋದ್ರೆ ಒಂದ್ ಸ್ಟೆಪ್ ಹೇಳ್ತೀವಿ, ಒಂದ್ ಸ್ಟೆಪ್ ಆಗದೆ ಇದ್ರೆ ಒಂದ್ ಸ್ಟೆಪ್ ಹೇಳ್ತೀವಿ. ಆ ರೀತಿಯಾಗಿ 3% ಸ್ಟೆಪ್ ಹೇಳ್ಬೇಕಾಯ್ತದೆ. ಆ ರೀತಿ ಆದ್ರೆ 100ಕ್ಕೆ 100 ಗ್ಯಾರಂಟಿ ಸರ್. ನನ್ನ ವಯಸ್ಸು 65 ವರ್ಷ ಆಗೈತೆ ಸರ್. ನನ್ ಕೂದಲು ನಾನು ಕಟ್ ಮಾಡ್ಕೊಂಡ್ ಬಂದಿದ್ದೀನಿ, ಇಲ್ಲ ತುಂಬಾ ಕೂದಲಿತ್ತು ನನ್ಗೆ. ನೀವು ನೋಡಿದ್ರೆ ಏನ್ ಡೂಪ್ಲಿಕೇಟ್ ಹಾಕೊಂಡ್ ಬಂದಿದ್ರೆ ಅಂತ ಈ ರೀತಿಯಾಗಿ ತೋರಿಸ್ಬಿಡು. ಆದ್ರೆ ನನ್ಗೆ 65 ವರ್ಷ ಆಗೈತೆ, ಕೂದರಲ್ಲ. ನಮ್ಗೆ ನಿಮ್ಮಲ್ಲಿ ಬೋಳಾಗ್ಬಿಟ್ರೆ ಒಳ್ಳೇದು ಅಂತ ಹೇಳ್ಕೊಂಡು ನಾನು ತಿಂಗಳಿಗೆ ತಿಂಗಳ 100 ರೂಪಾಯಿ ಬೇಕು ಹೋಗಿ ಇದು ಮಾಡ್ಬೇಕಂತ ಹೇಳ್ಕೊಂಡು ಈ ಗಿಡ ಮೂಲಿಕೆ ನಾವೆಲ್ಲ ಜೀವನ ಮಾಡ್ಕೊಂಡು ಇದರಲ್ಲಿ ತುಂಬಾ ನಾವು ಬೆಳೆದಿ ಸರ್. ನಮ್ದು ಆಯುರ್ವೇದಿ ಸರ್ ಇದು. ಈ ಆಯುರ್ವೇದದಲ್ಲಿ ಏನೇ ನಮ್ಮ ಇಂಡಿಯಾದಲ್ಲಿನೋ ಎಲ್ಲಿನೂ ಎಫೆಕ್ಟ್ ಅಂತೂ ಆಗಿಲ್ಲ. ನಮ್ಮ ಎಣ್ಣೆಗ್ಲಿ ಎಫೆಕ್ಟ್ ಆಗಿರ್ಬೇಕಾದ್ರೆ ನೀವು ನಿಮ್ ತಾವೆಲ್ಲ ಕಂಪ್ಲೇಂಟ್ ಬಂದಿರ್ಬೋದು ಅಥವಾ ಹೇಳ್ಬೋದು ಸರ್. ಅದಕ್ಕೆ ಉತ್ತರ ಬೇಕಾದ್ರೆ ನಾವು ಕೊಡ್ತೀವಿ. ನಮ್ಮಲ್ಲಿ ನಾವು ಹುಟ್ಟಿದ ಪರಂಪರೆಯಿಂದನೇ ನಮ್ ಎಣ್ಣೆ ಗಿಡಮೂಲಿಕೆ ಎಣ್ಣೆಯಲ್ಲಿ ಯಾವ ಪ್ರಾಬ್ಲಮ್ ಬಂದಿಲ್ಲ ಸರ್. ಇದನ್ನ ದಯವಿಟ್ಟು ನಾವೆಲ್ಲರೂ ನಮ್ ಜೊತೆ ಇದ್ದು ನಮ್ಮನ್ನ ಪ್ರೋತ್ಸಾಹ ಮಾಡ್ಬಿಟ್ಟು ಇನ್ನೂ ಬೆಳೆಸಿ ಮಾಡ್ಬೇಕು. ಯಾಕಂತ ಹೇಳಿದ್ರೆ ನಮ್ಗೆ ಆ ಕಾಲದಲ್ಲಿ ಹಳ್ಳಿ ಮೇಲೆ ಹೋಗಿ ನಾವು ವ್ಯಾಪಾರ ಮಾಡ್ಕೊಂಡು ಸರ್ ರಾಗಿ ಜೋಳಕ್ಕೆ ದಾಖಲೆ ಎಲ್ಲ ಮಾಡ್ಕೊಂಡು ಬರ್ತಿದ್ರು. ಈಗ ಬರ್ತಾ ಸ್ವಲ್ಪ ಮಕ್ಕಳಿಗೆ ವಿದ್ಯಾಭ್ಯಾಸ ಆಗ್ಬಿಟ್ರು, ಯೂಟ್ಯೂಬ್ ಅಂತ ಬಂದ್ಬಿಡ್ತು ಸರ್. ಏನಿತ್ತು ಗೊತ್ತಾ, ಹುಡುಗರು ಒಂದು ಪ್ರಚಾರ ಮಾಡಿದ್ರು. ಪ್ರಚಾರ ಮಾಡಿರುವಾಗ ನಮ್ ಜನಗಳಿಗೆ ಮುಂದೆ ಹೊಟ್ಟೆ ಚಿಕ್ಕ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ರು. ಇದುವರೆಗೂ ನಮ್ಮೇಲೆ ಕಂಪ್ಲೀಟ್ ಮಾಡ್ತಾರೆ. ಅಯ್ಯೋ ಈ ಜಾತಿ ಎಲ್ಲ ಇಲ್ಲಿ ಬೆಳೆದ್ಬಿಟ್ರಲ್ಲ, ಇವ್ರಿಗೆ ಏನ್ ಸುರಕ್ಷಿತ ಸೌಲಭ್ಯ ಕೊಡ್ಬೇಕಂತ ಹೇಳ್ತಾರೆ. ಮತ್ತೆ ನೋಡಿದ್ರೆ ಒಂದು ಊರಿನಲ್ಲಿ ಇರೋದು ಒಂದು 10-20 ಜನ ಇಷ್ಟೇ. ಪಾಪ ಏನೋ ಎಣ್ಣೆ ಪಣ್ಣದಲ್ಲಿ ಇನ್ನು ಬೇರೆ ಜನ ಸರ ಈ ಜೀರಿಗೆ ಮೆಣಸು ಮಾಡ್ಕೊಂಡು ಜೀವನ ಮಾಡ್ತಾವ್ರಿ. ಅಂತವ್ರನ್ನ ಸರ್ಕಾರದ ಸೌಲಭ್ಯ ಏನ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ನಮ್ಗೆ ತುಂಬಾ ಅನ್ಯಾಯ ನಡೀತಿದೆ. ಇದನ್ನ ಮುಂದೆ ನಮ್ಮನ್ನ ತಂದು ಜನರು ನಮ್ಗೆ ಸೇರಿಸ್ಕೊಳ್ಬೇಕು ಅಂತ ದಯವಿಟ್ಟು ನಾನು ಮಾತನ್ನು ಮುಗಿಸ್ತೀನಿ.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಇವನ್ ರಾಜು ಅವರು. ತುಂಬಾ ಚೆನ್ನಾಗಿ ತಿಳ್ಕೊಂಡಿದ್ದೀರಿ. he has given so many recipes for hair fall and also so many other disorders. Later you can collect from him. ಸೊ ನಿಮಗೆ ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ರೈಟ್ ಟೈಮ್ ಅಲ್ಲಿ ಮುಗಿಸ್ಕೊಟ್ಟಿದ್ದೀರಿ. ಇನ್ನು no, I make an arrangement to make translation for them. So, as a president remark, starting from Dr. Harindran P, Assistant Professor, he has given a wonderful narration, but the time is very less. So, next time probably you can present for half an hour, sir. So, your study is very good and you presented it in English. Of course, it is a mixed language here. It is a national seminar. ನ್ಯಾಷನಲ್ ಸೆಮಿನಾರ್ ಆದ್ರಿಂದ ಇಂಗ್ಲಿಷ್ ಅಥವಾ ಹಿಂದಿನೇ ಮಾತಾಡ್ಬೇಕಾಗ್ತದೆ. ಆಗ್ಲಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಡಾಕ್ಟರ್ ಹರೀಂದ್ರನ್ ಮತ್ತೆ ಡಾಕ್ಟರ್ ಕೆರೋಲಿನಾ ಮ್ಯಾಮ್. ಸೊ ಶಿ ಆಲ್ಸೋ ಪ್ರೆಸೆಂಟೆಡ್ ವೆರಿ ವೆಲ್. ಈ ನೋಡಿ ನಮ್ಮ ರೋಡ್ ಸೈಡ್ ಅಲ್ಲೆಲ್ಲ ಮರ ಬೆಳೆದಿರುತ್ತೆ. ವಿ ಡೋಂಟ್ ನೋ ದ ಯೂಸ್ ಆಫ್ ದಟ್, ಬಟ್ ಶಿ ಹೈಲೈಟೆಡ್ ಇಟ್ ಇನ್ renal calculus and all, such a wonderful drug. And Dr. Shibu, Assistant Professor Anthropology, sir also presented very well. They have taken ICMR project, Indian Council for Research in Indian Medicine project. So it is an authenticated project. So wish you good luck for that, sir. You have done a wonderful job. Okay. And Dr. Bhagya ma'am from Kergalli, ಕರ್ನಾಟಕದಲ್ಲೇ ತುಂಬಾ ಫೇಮಸ್ ಆದಂತ ಕಾಲೇಜ್, ಆಯುರ್ವೇದ ಕಾಲೇಜ್. ಅಲ್ಲಿ ಯೂನಿವರ್ಸಿಟಿ ಕೂಡ ಆಗಿದೆ. ಸೊ ಮೇಡಮ್ ಶಿ ರೆಪ್ರೆಸೆಂಟೆಡ್ ಫ್ರಮ್ ದಟ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್. ಅವ್ರದ್ದು ಕೂಡ ಶರಪುಂಕ ಅಂದ್ರೆ ಏನ್ ಗೊತ್ತಾ? ದಟ್ ಲೀವ್, ಒನ್ಸ್ ಇಫ್ ಯು ಕಟ್ ಇಟ್ ಲೈಕ್ ದಿಸ್, ಪುಲ್ ಇಟ್ ಲೈಕ್ ದಿಸ್, ಇಟ್ ಲುಕ್ಸ್ ಲೈಕ್ ಆರೋ ಅಂಡ್ ಬೋ. ಈ ಬಾಣ ಬಿಲ್ಲು ಇರುತ್ತಲ್ಲ, ಅದಕ್ಕೆ ಶರ ಅಂದ್ರೆ ಅದೇ. ಬಾಣ. ಆ ಬಾಣದ ತರ ಕಾಣುತ್ತೆ ಎಲ್ಲ. ಬಟ್ ಇಟ್ ಈಸ್ ಎ ವೆರಿ ಗುಡ್ ಲಿವರ್ ಅಂಡ್ ಸ್ಪ್ಲೀನ್ ಪ್ರೊಟೆಕ್ಟಿವ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಬಟ್ ಮೇಡಮ್ ಹ್ಯಾಸ್ ಡನ್ ಎ ವಂಡರ್ಫುಲ್ ವರ್ಕ್ ಆನ್ ದಟ್ ಪ್ರಿವೆಂಟಿಂಗ್ ಕಗ್ನಿಟಿವ್ ಇಂಪೈರ್ಮೆಂಟ್. ಅದು ಎಲ್ಲ ಮಾಡಿದ್ದಾರೆ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಮೇಡಮ್. ಅಂಡ್ ಲಾಸ್ಟ್ಲಿ ಯುವನ್ ರಾಜ್, ಎಲ್ಲ ಕನ್ನಡದಲ್ಲೇ ಹೇಳಿದ್ದೀರಿ ಆಯ್ತಲ್ಲ, ಅದನ್ನ ಇಲ್ಲಿ ಈ ಸಂಸ್ಥೆ ಇಂಗ್ಲಿಷ್ ನಲ್ಲಿ ಯಾರಿಗ್ ಬೇಕು ಟ್ರಾನ್ಸ್ಲೇಟ್ ಮಾಡಿ ಕೊಡ್ತಾರೆ ಎಲ್ಲ. ಸೊ ಬಹಳ ಚೆನ್ನಾಗಿ ಹೇಳಿದಿರಿ ಎಲ್ಲ. ಯುವನ್ ರಾಜ್ ಅವರು, ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ವೆರಿ ಮಚ್ ಫಾರ್ ದ ಕನ್ಕ್ಲೂಷನ್. ಸೊ ಡಾಕ್ಟರ್ ಪಲ್ವಿ ಮ್ಯಾಮ್.
Thank you, sir. Thank you for your valuable remarks regarding the paper presentation. Thank you so much. Yeah, thank you, sir.
ಈ ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿಕೊಂಡಂತ ಕೃಷ್ಣಮೂರ್ತಿ ಸರ್ ಅವ್ರಿಗೆ ಗೌರವ ಸಮರ್ಪಣೆ ಮಾಡ್ಬೇಕಂತ ಕೇಳ್ಕೊಳ್ತೀನಿ.
ಥ್ಯಾಂಕ್ ಯು ಮಂಜುನಾಥ್, ರಿಪೋರ್ಟರ್ ಕೆಲಸ ಮಾಡಿಕೊಟ್ಟಿದ್ದಕ್ಕೆ. ಹಾಗೆ ಎರಡನೇ ಸೆಷನ್, ದಿ ಇಂಪ್ಯಾಕ್ಟ್ ಆಫ್ ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂಡ್ ಕಲ್ಚರಲ್ ಬಿಲೀಫ್ಸ್ ಆನ್ ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ಅಂಡ್ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರಾಕ್ಟೀಸಸ್. ಈ ಟೆಕ್ನಿಕಲ್ ಸೆಷನ್ ಎರಡಕ್ಕೆ ಆಧಾರದ ಸ್ವಾಗತ. ಈ ಸೆಷನ್ನಿನ ಚೇರ್ ಆಗಿ ಡಾಕ್ಟರ್ ಸುಧೇಂದ್ರ ನಾವಲೆ, ಇವರು ಪ್ರೊಫೆಸರ್ ಅಂಡ್ ಹೆಡ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಟ್ರೈಬಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸ್ವಸ್ಥಮಿತ್ರ ಗವರ್ಮೆಂಟ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. ಇವರು MD ಅಂಡ್ BAMS STM ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜಲ್ಲಿ 2005ರಲ್ಲಿ, ಶ್ರೀ BMK ಆಯುರ್ವೇದಿಕ್ ಮಹಾವಿದ್ಯಾಲಯ ಬೆಳಗಾವಿನಲ್ಲಿ 2001ರಲ್ಲಿ ಕೆಲಸ ಮಾಡಿದ್ರು. ಟೆಕ್ನಿಕಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ 19 ವರ್ಷ ಇವರ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇದೆ. ಹಾಗೆ ಅಕಾಡೆಮಿಕ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಆಗಿ ಚೀಫ್ ಕೋಆರ್ಡಿನೇಟರ್ IEC ಕಮಿಟಿ ಅಂಡ್ SCP TSP 2019-22ರಲ್ಲಿ. ಹಾಗೆ ಸಬ್ಜೆಕ್ಟ್ ಎಕ್ಸ್ಪರ್ಟ್ ಆಗಿ ಅಂಡ್ ಕೋಆರ್ಡಿನೇಟರ್ ಡೆವಲಪ್ಮೆಂಟ್ UG ಕರಿಕ್ಯುಲಮ್ ರಫ್ RGUHS ಬೆಂಗಳೂರು ಕರ್ನಾಟಕ 2024ರಲ್ಲಿ. PP ಸೆಕ್ಟರ್ ಫಾರ್ ರಫ್ ಬೆಂಗಳೂರು ಕರ್ನಾಟಕ ಅಂಡ್ KNRUHS ವಾರಂಗಲ್ ತೆಲಂಗಾಣ ಸ್ಟೇಟ್. ಇವ್ಯಾಲ್ಯೂಯೇಟರ್ UG ರಿಸರ್ಚರ್ ಪ್ರೊಫೆಸರ್ ಆಫ್ RGUHS ಬೆಂಗಳೂರು ಕರ್ನಾಟಕ. ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟಿವ್ ಎಕ್ಸ್ಪರ್ಟ್ ಆಗಿ ನೋಡಲ್ ಆಫೀಸರ್ ಕೋಆರ್ಡಿನೇಟರ್, ಹಾಗೆ ಕೋಆರ್ಡಿನೇಟರ್ DPR ಪ್ರಿಪರೇಷನ್ CSR, ಹಾಗೆ ರಿಸರ್ಚ್ ಅಂಡ್ ಪಬ್ಲಿಕೇಶನ್ಸ್ 10 ನ್ಯಾಷನಲ್ ಅಂಡ್ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಜರ್ನಲ್ಸ್ ಅಲ್ಲಿ ಪಬ್ಲಿಕೇಶನ್ ಆಗಿದೆ. ಹಾಗೆ PG ಗೈಡ್ಶಿಪ್ ಆಗಿ ಗೈಡೆಡ್ ಪೋಸ್ಟ್ ಗ್ರಾಜುಯೇಟ್ ಸ್ಕಾಲರ್ಸ್ 2021-22ಗೆ, ಕರೆಂಟ್ಲಿ ಗೈಡೆಡ್ ಪೋಸ್ಟ್ 4 ಗ್ರಾಜುಯೇಟ್ ಸ್ಕಾಲರ್ಸ್ 2023 and 2024ಗೆ. Participations as resource person, invited and resource person several national conference ROTP programs and CME. Sir, please welcome sir. Thank you. ಹಾಗೆ ಈ ಸೆಮಿನಾರ್ಗೆ Shabu AS, Research Scholar, Department of Vocalist and Tribal Studies, Central University of Karnataka. Central University Karnataka. Suresh KP RA, ಹಾಗೆ ಬಂಡು ಸುರೇಶ್ ಕೆಂಪೇವಾಡಿ ಅಸಿಸ್ಟೆಂಟ್ ಪ್ರೊಫೆಸರ್ ಅಂಡ್ ಚೇರ್ಮನ್ ಆಫ್ ಕರ್ನಾಟಕ ಪೋಕ್ಲರ್ ಯೂನಿವರ್ಸಿಟಿ. ಹಾಗೆ ರತ್ನ್ ಮಹಾರಾಜ್, ರಾಜ್ಬನ್ ಟ್ರೈಬಲ್ ಟ್ರೆಡಿಷನ್ ಮೆಡಿಸಿನ್ ಹೀಲರ್, ಇವರು ವೇದಿಕೆಗೆ ಆಗಮಿಸಬೇಕು ಅಂತ ಕೇಳ್ಕೊತೀನಿ. ಶಬು ಎಸ್, ಸುರೇಶ್ ಕೆಪಿ, ಡಾಕ್ಟರ್ ಬಂಡು ಸುರೇಶ್ ಅಂಡ್ ರತ್ನ್ ಮಹಾರಾಜ್, ಪ್ಲೀಸ್ ವೇದಿಕೆಗೆ ಬನ್ನಿ. ಬಂಡು ಸುರೇಶ್ ಆಗ್ತೀರಾ? ಆಮೇಲೆ ಬನ್ನಿ. ಎಲ್ಲರಿಗೂ ಆಧಾರದ ಸ್ವಾಗತ. ಸಮಯ ತುಂಬಾ ಆಗಿದೆ, ಊಟದ ಸಮಯ. ಹಾಗಾಗಿ ನಿಮ್ಮ ಸಮಯನ್ನ ಆದಷ್ಟು ಸಂಕ್ಷಿಪ್ತಗೊಳಿಸ್ಕೊಂಡು ಏನನ್ನ ಹೇಳ್ಬೇಕು ಅನ್ಕೊಂಡಿದ್ದೀರೋ ಅದನ್ನ ಸಂಕ್ಷಿಪ್ತವಾಗಿ ಹೇಳಿ 10 ನಿಮಿಷದಲ್ಲಿ ನಿಮ್ ಪೇಪರ್ ಪ್ರೆಸೆಂಟ್ ಮಾಡ್ಬೇಕು ಅಂತ ಕೇಳ್ಕೊತೀನಿ. ಮೊದಲಿಗೆ Sabu AS, Research Scholar, Department of Folklorist and Tribal Studies, Central University of Karnataka. Sir, please come on the dais. Thank you. PPT. Yes. So, very good afternoon to all. Respected chairperson, distinguished scholars and participants. Myself Shabu, research scholar from Central University of Karnataka. Actually, as we all know, health is our wealth. So today I'm going to presenting a paper titled Indigenous Health Practice Among Tribal Communities of Western Ghats, a study from Palakkad district, Kerala. So indigenous practice, if you take, is deeply rooted in the traditional ecological knowledge. So this research is based on fieldwork conducted in Nellambadi, Rambakolam regions of Palakkad, and the study examines how indigenous health system continue to function within ecological, cultural, and policy framework. Indigenous health practices are merely medical alternatives. They are knowledge systems embedded with the ecological values of foods, cultural beliefs, spiritual worldviews, and food tradition, as you all know. And the Western Ghats of Kerala, as we take, the tribal communities are historically dependent on forest and health systems. And it may be included in all of the India and the world, right? That's a herbal medicine, food-based therapies, ritual-centered, preventive ecological practices. World Health Organization recognizes traditional medicine as a vital component of primary healthcare, especially among indigenous people populations. The statement of problem that I had noticed that indigenous health systems in tribal regions are gradually declining. Environmental degradation and the medical plans. The problem is not only the knowledge erosion, but also the government exclusions that I'm point out, and the research gap majorly focusing or emphasis on plan documentation, lack of mixed method approach, that and lack of limited district level policy integration studies now comes to framework for the region, and objectives to document indigenous health practices, to analyze medical and use of food therapies, to understand ecological components, to examine interaction between traditional business and government healthcare, to assess transformation under socio-economic change. The main methodology that I had used is a primary data collection that in fieldwork and semi-structured interviews and informal discussion, fieldwork observation, and purposive and snowball sampling. I took the fieldwork. And as we take in the tribal settlements, we can easily say that one Yojana natural mission, green mission in the forest and wood certification. So things are there, but kindly we have some limitations in our field. Mainly suggestions that I am from the findings, I need to point out that biodiversity conservation linked to tribal health policy and community-based forest management to ensure medicinal plant sustainability, gender-sensitive and youth-oriented knowledge transmission programs, and the sustainable development goal that needs to be integrated with good health, education, sustainability, and life of land. And conclusion that I point out, healthcare means not only the hospital that mentioned in our inaugural section, that belief it's connected with survival, dignity, and emotions. That's the main point of this. And this was the reference, and these are some images while going in the field. I got it, and thank you.
Thank you, Subha. Thank you, Shibu, for your informative presentation. Next, I would like to call upon Dr. Suresh KP, Research Associate, Anthropology, for his next session. Thank you, sir. Um, Respected Chair, respected delegates, and dear friends. First of all, I express my sincere thanks to the organizers for inviting me to present this seminar. The title of my paper is The Indigenous Healing Practices and the Process of Formalization, a case study of tribal medicine in Kerala. Excuse me. This one. Right side. Okay. The background of the study. Kerala, the scheduled tribe population is 4.85 lakhs according to the 2011 census. It is 1.4% of the total tribal population. The main concentrated area is Wayanad, Idukki, Kasaragod, and Palakkad district. The indigenous healing integrates plants, rituals, and belief system. Healing is the cultural ecology of health. And due to the rapid transformation and modernization, the institutional interventions, the healing practices are rapidly changed. The research problems, indigenous healing systems are changing rapidly. State institutional between the preservations and the formalization. The objectives of the study. Understand the indigenous healing practices among the tribal communities. Changes. So elements of the tribal healing. The healthcare access in remote areas and the cultural, the healing practice is the cultural identity and continuity, and it's an ecological knowledge and biodiversity conservation, and it's also a livelihood opportunity, and it's sustainable use of resources. What is formalization? Formalization is the structured process of documenting, standardizing, regulating, and integrating traditional knowledge system into modern institutional frameworks like health policy, intellectual property laws, and commercial systems. Methodology of the study is mainly depends on the qualitative methodology, and fieldwork is the study conducted in the Wayanad and Kasaragod district. The healing practice, the rituals is observation, and semi-structured interviews used for this study, and also the secondary sources also used. The tribal healing practices, the community-based healing systems, and it is an integration of mind, body, and belief. And they have rich herbal pharmacology, and oral tradition transmission from generation to generation. The types of illness treated: bone fractures, respiratory diseases, skin disorders, allergy, body pain, chronic illness, and other diseases. And the method of treatment is herbal medicines, massage therapy, steam bath, ritual healing. The research activities or interventions of KITARs, the documentation of ethnomedical knowledge, training and certification programs, research collaborations and policy advocacy, institutional formations and financial support. What are the process? Means first documentation, legal protection, standardization, and institutional support. First, ethnomedical survey and healers documentation, database preparation and prepare a directory, and efficacy testing. A 3-year certificate course in CCTA, means certificate course in tribal medicine, and NGO formation, and initiated the treatment centers. That's documenting tribal medicine since 1976. The knowledge of the 10 tribal communities documented by 1984, and a PhD thesis submitted to Calcutta University by Dr. N. Vishwanath Nair in tribal health and medicine. And TRI continued their healers identification 1887 to 92, and database development with IAPS, Indian Indigenous Knowledge People Service Society. It is initiated by the KITARs, and published a healers directory in 2008. 100 healers included this directory, and it's revised in 2013, 2018, and 2025. Now, currently 300 healers in this list. And the training and capacity building, 3-year certificate course in tribal medicine, sanctioned by the government of Kerala, and knowledge pooled from 3 tribal healers, and 8 trained tribal youth functions as a healers since 1997. And second batch, 20 students completed CCTM in 2003 and 2006. Annual state workshop participants grew from 27 to 80, and national workshop with the healers from various states such as Manipur, Tamil Nadu, Karnataka, Andhra Pradesh, and a national workshop with IGRMS in 2024. It's a photograph from the national workshop. It's inaugurated by the chief tribal healer, Achappa Vaidar. And research policy and initiatives, MOU with the Regional Research Laboratory in 1995 for bioassay research, and draft bill on IPR protection submitted to Government of Kerala in 1996, and continued ethnomedical research collaborations advocacy for safeguarding traditional knowledge. This photograph from the field study and the treatment camp. Another treatment camp conducted by the KITARs and other allied departments. And institutionalization and financial support. Grant 27 healers for medicinal plant cultivation in 1996, and currently 10,000 rupees for grant for 300 healers, and tribal medicine treatment camps since 1992, and formation of IAPS I already mentioned, and expansion of tribal treatment centers beyond the settlements. Earlier, these treatments conducted in their settlements only, and collaboration with the allied departments conducted many treatments camps. And outcome of formalization, the development of specialist healers, sponsorships, rheumatism, skin and urinary diseases. And now the youth healers use X-rays and lab diagnostics, and establishment of treatment centers in their own initiative. Now around 50 centers in various districts. Formation of a state tribal healers organization by the community members itself. And after the post-COVID development, state level healers organization formation, and the regular district and state meeting, demand for legal recognition and protection, increased public visibility of the tribal healing, and it is by the influence of the social media. And what are the key changes, challenges? The lack of licensing and illegal licensing, the conflict with the allopathic and art practitioners, loss of cultural and ecological context of the community, and exploitation of the pharmaceutical industries and research departments. This knowledge is considered as a devalued knowledge because it's an oral knowledge. And ethical risk for documentation and biopiracy and discussions. A need for community-centered formalization, ethical governance of indigenous knowledge, balanced preservation and autonomy of knowledge, recognition of healing systems, intellectual property rights, and benefit sharing. Conclusion. Formalization is a double-edged process and offers institutional recognition and autonomy. Sustainable future requires participatory policy frameworks, and indigenous leaders must remain central actors. These are the references. Thank you.
Thank you, Suresh KP, for your informative session. Especially, we came to know that what and all the tribal medicine history and their practices are there in Kerala, and how far we can implement documentation and institutionalize the health practices. The worshipper and the person worshipping the Phoenicia. I am not the what I'm talking, but spirit from the evil eye of ಒಂದು ಸ್ವಲ್ಪ ಮುಂದೆ ಹೋಗಿ ಇನ್ನು ಮುಂದೆ ಕೆಳಗೆ ಬನ್ನಿ ಹಾ Earlier in India, the even not only the tourism, even the government of India and the Ministry of Oils also not given the proper consideration and importance for medical tourism. Earlier, whatever the medical tourism means, the medical tourism like the healthcare system, they are giving importance. But nowadays, in providing the medical services and allied industry, the tourism also giving importance to Panchakarmas, Ayurveda, Siddha, and Unani. And this is the new segment emerging in tourism areas. Next. So indigenous health systems, not only compared to the Achanakmar Amarkantak biosphere, in entire northern part, especially in the Sundarbans, in the Myanmar, some places in the Kashmir region, like Bakriwala Street, and even in Achanak Amarkantak, also they given the proper commodification and standardization of health practices, and even the Madhya Pradesh government giving importance to the tribal certificate by Ministry of Ayush from the Madhya Pradesh Medical Department. Stop. So what exactly my research gap is? Because whether the wellness activities and the medical tourism, whether we are taking the proper inclusion of these tribal peoples in the policy framework or strategies. But when it seeing the list of the recent documents, might govern the proper provision of tribal medicine systems strategies. ಇನ್ನು ಮೇಲೆ ಬನ್ನಿ. This is a theoretical framework of my paper, the wellness motivation, support for the tribal health integration and sustainability awareness. Means the tourism means not utilization of the resource or not making the commercial and making awareness to the any particular sites. It has the interrelated between the tribal resource and even sustainability and the traveler facilities. Both the 3 points has to be interrelated and correlated. And these are the theories which gives the Indians for this particular paper. Next. So this is a study area, and this particular area is a transitory point of Vindhya, Satara, and Michael Hill ranges. And this is a very rich biodiversity which was established in the year 2005. The sample was 601, and we have collected more liquor scale problem. Next. Wow. So these are the implications of my paper. The first one is the establishment of certification system for tribal healers. So when you visit Narmada temple, you will find more than 300 to 400 because everyone will say that I am the ethno medicine healer. But there is no proper certification is done for the tribal healer. One is exactly the true one. So therefore, government needs to take consideration for this issue. And the second is implement the intellectual property safeguards for medical knowledge. So this is very serious society in these particular areas. And promote the community to help tourism cooperatives. So especially in Achanakmar Amarkantak Biosphere Reserve, they are giving the medicine nearly for around 6 to 7 as metals and the diseases. The well known for this is snake bite, jaundice, and also. And the Baiga committee, one who gives the excellent medicine for jaundice, and the Goins, one who gives the excellent medicine for the snake bite. Is here we want to make the cooperative movement and community participation in tourism arena. And there should be a proper importance to go to the ecological planning capacity. And
My view is very clear. Ethno-medicines, cultural beliefs, tourism avenues has to correlate and interrelated with these all the factors. And it should be the folklore should be the future of India. And this is my paper. And thank you each and everyone for your cooperation. Dr. Dr. Suresh Kempade. In the lighter note, I could say nowadays, in the case of movie language from regional, we have turned to pan India. So today's session, we can see the tribal medicine knowledge not only from the southern part, even from the northern part. So all over India, how this traditional tribal health system, it is the contributing to the health of the community. This is what we can get from this session. Next, I would like to call upon uh, Ratan Maharaj.
ओम धन्वंतरि देवताय नमः। आपको हिंदी आता है ना? मुझे थोड़ा ये अंग्रेजी तो आता नहीं। हम लोग राजगोंड आदिवासी लोग हैं। अभी ये साहब ने बताया नर्मदा तट, उसी तट के उसी घाट से के रहने वाले लोग हैं। छत्तीसगढ़ अमरकंटक नर्मदा तट। अभी फिल वक्त हम लोग बीदर में है। हमारी परंपराएं ही वैदिक गुरु है। कितने पीढ़ियां चली गई पता नहीं, केवल हम लोग आयुर्वेदिक जड़ी बूटी से ही हमारा आज तक भी पालन चलता है। आज 20 साल 22 साल हो गए हमारे कलेक्टर साहब कलेक्टर साहब थे ढूंढ कर बताने के लिए को बेचने के लिए जमीन दिया है। उस पर जन सेवा आश्रम के नाम से उसको एक नामकरण किया है और हम 125 लोगों को 10 बेटियों का ज्ञान देकर प्रचार में लगाया है। इसीलिए कुछ साहब ने किताब रचना की, उनका नाम था बसवन्ना गौड़ा साहब। अंग्रेज में छापे उसमें तकरीबन 250 किस्म के बड़ी बूटियों का लिखा गया है। इसमें दिल है छापे मैं 250 जड़ी बूटियों के वर्णन तो मैं यहाँ बता नहीं पा सकता हूँ। दो जड़ी बूटियों का चुटकुला बताऊंगा। से होता है चाहे सफेद हो पीला हो, पेट बड़ा हो जाता है, हाथ पैर छोटे छोटे होते हैं, तो होता है किसी के साथ नहीं होता, उसका तो कौन से बीमारी। तो उसी बीमारी के लिए मैं चुटकुला बताता हूँ। वो बीमारी विश्व से करते आया हुआ चुटकुला है। एक मोरंडी का पत्ता, इडली, मूली और काली मिर्च, ये तीनों को बारीक कूट कर मोरंडी का एक पत्ता के रस निकाल कर 1 चम्मच अगर वो रस पिला दे सुबह शाम उस बच्चे को केवल 7 दिन, तो जीवन का बीमारी नहीं होगा, कितना भी क्रोनिक डिसीज नष्ट हो जाएगा। दूसरा चुटकुला बीमारी के लिए, दूसरा आपकी भाषा में उपरणी कहते हैं। उत्तर में चाहे लाल हो या सफेद हो, उस जड़ को उतारना चाहिए, उस झाड़ को। वो कर जो उसी को बड़ा होता है, छोटे छोटे टुकड़े करकर बांध कर जिसकी मंजिल देंगे उसका तेल अपने आप नष्ट हो जाएगा। लेकिन एतवार की भी धारण करना चाहिए। ये एतवार में बैठना तो दूसरे मेहमान को निकाल कर मुंह में डालना चाहिए। बस इसी तरह से उनका खीरा भी और उनके बुखार नष्ट हो जाएगा। पोस्ट-कॉलोनियल भक्तवंती बचपन पान उसके शहर में चाहती हो तो कल्ट को खिला जान। पोस्ट-कॉलोनियल कुछ टिप्पणी और दान ये केवल एक सूरत को लोग कहते हैं धर्म ठीक नहीं होता है, धर्म का आकर होता है। लेकिन हमारे आदिवासियों के पास ऐसी चुटकुला है बनना चले जाएगा और बनी रह जाएगा। पोस्ट कॉलोनियल भाषा बच पीपल चाहती तो कंठ को खिला जान। इसी प्रकार मनुष्य मरण केवल 4 प्रकार से होते हैं। तो 4 ही प्रकार से सभी मनुष्यों में व्याधि आ जाता है। वात, कफ, ज्वर। इसीलिए हमारी परंपरा के अनुसार उसको सुला दो उसका जो ठीक हो जाएगा। उसको हो आवश्यकता नहीं है उसको लंबी करवा दो मोटी करवा दो उसका कफ रोग ठीक होगा। ऊपर से कोई नहीं लगाना आवश्यकता नहीं है उसको खाली विरोचन करो विरोचन दो उसका विरोचन से नष्ट होने लगा। ठीक है और तो आपके दिल से भी तो बोल दीजिए कि हमें इस चीज की आवश्यकता है उस पर कोई आप बताइए बाबा तो बताएंगे वैसे तो है आपको मुझे देखकर अच्छा लगा कि वहाँ सब्जी और आप नाचू लग गए जो है चाहे मंदिर हो वो कहीं पर से भी हो आप वैद्य हैं और वैद्य समावन है सभी वैद्य यहाँ आते हैं एक पैदा होता है जैसे ये काम होता है कितने वैद्य हैं सब वैद्य के पास किसी के पास वात का पित्त का कफ का अनेक प्रकार के रोगों का इलाज एक आदमी के पास हो तो समझ लो आगे 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 इसलिए इसलिए वात पित्त और कफ के लिए एक औषधि है का बोलते हैं उसी का पत्ता जो छोटा छोटा होता है खाने से बहुत कड़वा होता है माता माता इसी को कहते हैं बोलवरांड माता नहीं कोई कैसी का बोलते हैं वो वात पित्त कफ के में रामकृष्ण औषधि से चिकित्सा है यानी आप मैक्सिमम थोड़ा सा बीच में मनोरंजन का भी 2-4 चुटकुला बताएंगे ये है वैसा रखे हैं मैं 2 बात बोलते हैं बहुत बड़ी लाइन में देख बड़ा आदिवासी
Good afternoon, all. Myself, Dr. Surendra Jinavale. I'm working as a professor in the Department of Preventive Medicine in Government Ayurveda Medical College, Mysuru. Actually, this was the session which was supposed to be chaired by our respected principal, Dr. Srivat sir. But because of some urgent work, he has to meet newly appointed health commissioner, Ayush commissioner. So I have been given this task of conduct session. So first, on behalf of our institute, I would like to express my sincere gratitude to the Karnataka State Tribal Research Institute, Mysuru, who organized this wonderful scientific seminar on effect of globalization and cultural beliefs on tribal health and social systems, which is organized by the Ministry of Tribal Welfare and with the Association of State Government of Karnataka. As far as this session, the presentations are concerned, as I told earlier, we can get the picture of how this tribal medicine traditional system in different dimensions we can understand not only in the state of Karnataka, which was supposed to be got in the morning session. In this session, we could get this aspects of various traditional tribal health traditional systems from even states of Kerala and northern part of India. So here, ultimately, the motto or objective of the government to conduct such seminar is only for upliftment of the tribal people and the strong areas of these tribal people is one is indigenous knowledge. They are having indigenous knowledge. They have the wisdom which is ecologically friendly, and they have the personal health knowledge which is culturally rich. Okay, so in the light of globalization, where we are imparting primary health centers, we have advanced with the immunization and malnutrition like disease, we have counted a lot. At the same time, whatever this health belief system which is practiced by these tribal people, so at the core, we should not disturb that knowledge which is indigenous and that tradition, health tradition which is ecologically which is supportive. So with core of that, whatever globalization we are thinking, we have to think in the alignment in the tune of that only. Okay. So otherwise, we have seen many times there is exploitation of these people from the people who are always think of commercially profitable thinking. This type of everyday people, they will always make use of such people. So it is the responsibility of the government and such organizations to conduct such a seminars and scientific sessions so that we can bring them to the mainstream so that in coming days these digital healers can become the part of our primary healthcare system. That type of thinking we can bring in the coming days. And same time, we should always think that whatever the things they are contributing in their community in the forest, it has to be get documented. So that most of the times, what is happening is for many thousand years they are doing some good work in the field of health, in the field of social justice or social interaction, but it's all in vain unless until it's not documented. So in this direction you have to think, and in those to come, conduct such conferences at the practical level or a workshop level where we can call upon all those traditional healers, whatever type of healing they are doing, the scientific evidence of that, we can call upon the different concerned authorities so that we can come together and make some institutional organization where this can be documented and submitted to the Government of Canada or Government of India. So once again, I am expressing my gratitude to the organizers for inviting me for this scientific session. Thank you.
Thank you, sir.
ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ದ ವ್ಯಾಲ್ಯೂಯಬಲ್ ಸ್ಪೀಚ್. ನಮ್ಮ ಉಪನಿರ್ದೇಶಕರು ಡಾಕ್ಟರ್ ಸುರೇಂದ್ರ ಜಿ ನವಲೆ ಎಂ ಡಿ ಪ್ರೊಫೆಸರ್ ಅಂಡ್ ಹೆಡ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸ್ವಾಸ್ಥ್ಯ ಗವರ್ಮೆಂಟ್ ಆಫ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು ಇವರನ್ನು ಸನ್ಮಾನಿಸಬೇಕೆಂದು ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು. ಈ 2ನೇ ಸೆಷನ್ ಅನ್ನ ಮಂಡಿಸಿದ ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಈಗ ಊಟದ ಸಮಯ. ಸುಬ್ಬಲಕ್ಷ್ಮಿ, ರಮೇಶ್ ಶೆಟ್ಟಿ, ಶಿಲ್ಪ, ಸುಮಿತ್ ನನ್ನನ್ನ ಭೇಟಿ ಮಾಡಿ ಈಗ ಎಲ್ರಿಗೂ ಊಟ ಟೈಮ್ ಊಟ ಮುಗಿಸಿ ಒಂದು ಹಾಫ್ ಅನ್ ಅವರ್ ನೆಕ್ಸ್ಟ್ ಸೆಷನ್ಸ್ ಕಮೆನ್ಸ್ ಆಗ್ತದೆ. ದಯವಿಟ್ಟು
ವರ್ಷಗಳಲ್ಲಿ ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣಕ್ಕೆ ಕಂಕಣಬದ್ಧವಾಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸುತ್ತಿದೆ. ಇಲಾಖೆಯ ವಿಶೇಷ ಮುತುವರ್ಜಿಯ ಫಲವಾಗಿ ವಿವಿಧ 50 ಬುಡಕಟ್ಟು ಸಮುದಾಯಗಳ ಸರ್ವಾಂಗೀಣ ಅಭಿವೃದ್ಧಿಯ ನಿಟ್ಟಿನಲ್ಲಿ ಅನೇಕ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಅನುಷ್ಠಾನಗೊಳಿಸಿದೆ. ಯಾವುದೇ ಸಮುದಾಯ ಹಾಗೂ ಸಮಾಜ ಅಭಿವೃದ್ಧಿಯತ್ತ ಹೆಜ್ಜೆ ಹಾಕಬೇಕೆಂದರೆ ಮುಖ್ಯವಾಗಿ ಶೈಕ್ಷಣಿಕ ಪ್ರಗತಿಯನ್ನ ಸಾಧಿಸಬೇಕು. ಆ ಕಾರಣಕ್ಕೆ ಇಲಾಖೆಯು 119 ಮಹರ್ಷಿ ವಾಲ್ಮೀಕಿ ಆದಿವಾಸಿ ಬುಡಕಟ್ಟು ವಸತಿ ಶಾಲೆ, 135 ಮೆಟ್ರಿಕ್ ಪೂರ್ವ ವಿದ್ಯಾರ್ಥಿ ನಿಲಯ, 149 ಮೆಟ್ರಿಕ್ ನಂತರದ ವಿದ್ಯಾರ್ಥಿ ನಿಲಯ ಸೇರಿದಂತೆ ಒಟ್ಟು 409 ಸಂಸ್ಥೆಗಳನ್ನು ನಡೆಸುತ್ತಿದ್ದು, ಆ ಮೂಲಕ 45,360 ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಉಚಿತವಾಗಿ ಗುಣಮಟ್ಟದ ಎಲ್ಲಾ ಸೌಕರ್ಯಗಳನ್ನು ಸೌಲಭ್ಯಗಳ ಸಹಿತ ಅತ್ಯುತ್ತಮ ಶಿಕ್ಷಣ ನೀಡಲಾಗುತ್ತಿದೆ. ಪರಿಶಿಷ್ಟ ಪಂಗಡಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆಯ ವತಿಯಿಂದ ಕಾರ್ಯನಿರ್ವಹಿಸುತ್ತಿರುವ ಮಹರ್ಷಿ ವಾಲ್ಮೀಕಿ ಆದಿವಾಸಿ ಬುಡಕಟ್ಟು ವಸತಿ ಶಾಲೆಗಳ ವಿದ್ಯಾರ್ಥಿಗಳ ಸಂಖ್ಯಾಬಲವನ್ನ 25ರಿಂದ 40ಕ್ಕೆ ಹೆಚ್ಚಿಸಲಾಗಿದೆ. ಹಾಗೆಯೇ 1ರಿಂದ 5ನೇ ತರಗತಿಯ ಶಾಲೆಗಳಲ್ಲಿ 6ನೇ ತರಗತಿ ಹಾಗೂ 1ರಿಂದ 7ನೇ ತರಗತಿಯ ಶಾಲೆಗಳಲ್ಲಿ 8ನೇ ತರಗತಿಯನ್ನ ಆರಂಭಿಸಲಾಗಿದೆ. ಅದರಂತೆ ಚಾಮರಾಜನಗರ, ಮೈಸೂರು ಮತ್ತು ಕೊಡಗು ಜಿಲ್ಲೆಗಳಲ್ಲಿ 5 ವಸತಿ ಶಾಲೆಗಳನ್ನ 12ನೇ ತರಗತಿಯವರೆಗೆ ಮೇಲ್ದರ್ಜೆಗೆ ಏರಿಸಲಾಗಿದೆ. ಇನ್ನು ಕಳೆದ ಸಾಲಿನಲ್ಲಿ ಅಂದ್ರೆ 2024-25ರಲ್ಲಿ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಮೆಟ್ರಿಕ್ ನಂತರದ 14 ಮತ್ತು 2025-26ನೇ ಸಾಲಿನಲ್ಲಿ 20 ವಿದ್ಯಾರ್ಥಿ ನಿಲಯಗಳು ಸೇರಿದಂತೆ ಒಟ್ಟು 34 ವಿದ್ಯಾರ್ಥಿ ನಿಲಯಗಳನ್ನು ನೂತನವಾಗಿ ಆರಂಭಿಸಲು ಮಂಜೂರಾತಿ ನೀಡಲಾಗಿದೆ. ಗಣನೀಯವಾಗಿ ಹೆಚ್ಚಳವಾಗುತ್ತಿರುವ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಶೈಕ್ಷಣಿಕ ಪ್ರಗತಿ ಸಾಧಿಸಲು ಅನುವಾಗಿದೆ. ಕಳೆದ 2 ವರ್ಷಗಳಲ್ಲಿ ಸಮುದಾಯದ ಮಕ್ಕಳ ಶೈಕ್ಷಣಿಕ ಪ್ರಗತಿಗೆ ಸಾಕಷ್ಟು ಅನುಕೂಲಗಳನ್ನು ಒದಗಿಸಲಾಗಿದ್ದು, ಆ ನಿಟ್ಟಿನಲ್ಲಿ ದಾಖಲೆ ಮೊತ್ತದ ವಿದ್ಯಾರ್ಥಿ ವೇತನವನ್ನು ನೀಡಲಾಗಿದೆ. ಪರಿಶಿಷ್ಟ ವರ್ಗದ ಮೆಟ್ರಿಕ್ ಪೂರ್ವ ವಿದ್ಯಾರ್ಥಿ ವೇತನ ಕಾರ್ಯಕ್ರಮದ ಅಡಿಯಲ್ಲಿ 2023-24ರಿಂದ ಇಲ್ಲಿಯವರೆಗೆ ಒಟ್ಟು 6,53,452 ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಒಟ್ಟು 106 ಕೋಟಿಯನ್ನ ವಿದ್ಯಾರ್ಥಿಗಳ ಬ್ಯಾಂಕ್ ಖಾತೆಗೆ ಡಿಬಿಟಿ ಮೂಲಕ ಜಮಾ ಮಾಡಲಾಗಿದೆ. ಪರಿಶಿಷ್ಟ ವರ್ಗದ ಮೆಟ್ರಿಕ್ ನಂತರದ ವಿದ್ಯಾರ್ಥಿ ವೇತನ ಕಾರ್ಯಕ್ರಮದ ಅಡಿಯಲ್ಲಿ 2023-24ರಿಂದ ಇಲ್ಲಿಯವರೆಗೆ ಒಟ್ಟು 2,13,715 ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಒಟ್ಟು 304.93 ಕೋಟಿಯನ್ನ ವಿದ್ಯಾರ್ಥಿಗಳ ಆಧಾರ್ ಜೋಡಿತ ಬ್ಯಾಂಕ್ ಖಾತೆಗೆ ಜಮಾ ಮಾಡಲಾಗಿದೆ. ಇನ್ನು 2023-24ರಿಂದ ಇಲ್ಲಿಯವರೆಗೆ ಎಸ್ಎಸ್ಎಲ್ಸಿ ಮತ್ತು ಮೆಟ್ರಿಕ್ ನಂತರದ ಕೋರ್ಸ್ಗಳಲ್ಲಿ ಪ್ರಥಮ ಪ್ರಯತ್ನದಲ್ಲಿ ಪ್ರಥಮ ದರ್ಜೆಯಲ್ಲಿ ಉತ್ತೀರ್ಣರಾದ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ 1,656 ಪ್ರತಿಭಾನ್ವಿತ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ 165.52 ಕೋಟಿ ಪ್ರೋತ್ಸಾಹಧನವನ್ನು ಬಿಡುಗಡೆ ಮಾಡಲಾಗಿದೆ. 2025-26ನೇ ಸಾಲಿನಿಂದ ಖಾಸಗಿ ವಿದ್ಯಾಸಂಸ್ಥೆಗಳಲ್ಲಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಎನ್ಐಆರ್ ಕೋಟಾದ ಅಡಿ ಪ್ರವೇಶ ಪಡೆದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಬೋಧನಾ ಶುಲ್ಕವನ್ನ ಮರುಪಾವತಿ ಮಾಡಲಾಗುತ್ತಿದೆ. 2025-26ನೇ ಸಾಲಿನಿಂದ ಸರ್ಕಾರಿ ಮತ್ತು ಖಾಸಗಿ ಮೆಡಿಕಲ್ ಮತ್ತು ಎಂಜಿನಿಯರಿಂಗ್ ಕಾಲೇಜುಗಳಲ್ಲಿ ವ್ಯಾಸಂಗ ಮಾಡುತ್ತಿರುವ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ವಸತಿ ನಿಲಯ ವೆಚ್ಚಕ್ಕಾಗಿ ಪ್ರತಿ ತಿಂಗಳು 3,500 ರೂಪಾಯಿಗಳನ್ನ ಮರುಪಾವತಿ ಮಾಡಲಾಗುತ್ತಿದೆ. ಇನ್ನು ತೀವ್ರ ಪೈಪೋಟಿಯ ಸಂದರ್ಭದಲ್ಲಿ ಅತ್ಯುತ್ತಮ ಅವಕಾಶಗಳಿಂದ ಹಾಗೂ ಸರ್ಕಾರದಲ್ಲಿನ ಉನ್ನತ ಹುದ್ದೆಗಳಿಂದ ಪರಿಶಿಷ್ಟ ವರ್ಗದ ವಿದ್ಯಾರ್ಥಿಗಳು ವಂಚಿತರಾಗಬಾರದು, ಅವರು ಕೂಡ ಸಮನಾಗಿ ಸ್ಪರ್ಧೆ ಒಡ್ಡುವಂತೆ ಸಿದ್ಧರಾಗಬೇಕು ಎನ್ನುವ ಕಾರಣದಿಂದಾಗಿ ಐಎಎಸ್ ಹಾಗೂ ಕೆಎಎಸ್ ಸೇರಿದಂತೆ ವಿವಿಧ ಸ್ಪರ್ಧಾತ್ಮಕ ಪರೀಕ್ಷೆಗಳಲ್ಲಿ ತೇರ್ಗಡೆ ಹೊಂದಲು ನೆರವಾಗುವ ನಿಟ್ಟಿನಲ್ಲಿ ಕಳೆದ 2 ವರ್ಷಗಳಲ್ಲಿ ಪರಿಶಿಷ್ಟ ವರ್ಗದ 2,830 ಅಭ್ಯರ್ಥಿಗಳಿಗೆ ನವದೆಹಲಿ, ಹೈದರಾಬಾದ್, ಚೆನ್ನೈ, ಬೆಂಗಳೂರು ಸೇರಿದಂತೆ ವಿವಿಧ ಸ್ಥಳಗಳಲ್ಲಿರುವ ದೇಶದ ಪ್ರತಿಷ್ಠಿತ ಸಂಸ್ಥೆಗಳ ಮೂಲಕ ತರಬೇತಿಯನ್ನು ನೀಡಲಾಗಿದೆ. ವಿದೇಶಿ ವಿಶ್ವವಿದ್ಯಾಲಯಗಳಲ್ಲಿ ಉನ್ನತ ವ್ಯಾಸಂಗ ಕೈಗೊಳ್ಳುವ ಪರಿಶಿಷ್ಟ ವರ್ಗದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆಂದೇ ಪ್ರಬುದ್ಧ ಯೋಜನೆ ರೂಪಿಸಲಾಗಿದ್ದು, ಇದರಡಿಯಲ್ಲಿ 109 ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ 2023-24ನೇ ಸಾಲಿನಿಂದ ಇಲ್ಲಿಯವರೆಗೆ ಒಟ್ಟು 38.83 ಕೋಟಿ ರೂಪಾಯಿಗಳನ್ನ ಸಾಗರೋತ್ತರ ವಿದ್ಯಾರ್ಥಿ ವೇತನವಾಗಿ ಮಂಜೂರು ಮಾಡಲಾಗಿದೆ. ಹಾಗೆಯೇ ಐಎಸ್ಇಸಿ ಸಂಸ್ಥೆಯಲ್ಲಿ ಪಿಎಚ್ಡಿ ಅಧ್ಯಯನ ಕೈಗೊಳ್ಳುವ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಶಿಷ್ಯ ವೇತನ ನೀಡಲು ಸುಮಾರು 40 ಲಕ್ಷ ಕಾರ್ಪಸ್ ಫಂಡ್ ಅನ್ನ ಒದಗಿಸಲಾಗಿದೆ. ಕಾನೂನು ಪದವಿಯನ್ನ ಪೂರ್ಣಗೊಳಿಸಿ ಹಿರಿಯ ವಕೀಲರ ಮಾರ್ಗದರ್ಶನದಲ್ಲಿ ತರಬೇತಿ ಪಡೆಯುವ ಪ್ರಶಿಕ್ಷಣಾರ್ಥಿಗಳಿಗೆ ಸ್ಟೈಫಂಡ್ ಕೂಡ ನೀಡಲಾಗುತ್ತಿದೆ ಮತ್ತು 2025-26ನೇ ಸಾಲಿನಿಂದ ಖಾಸಗಿ ವಿದ್ಯಾಸಂಸ್ಥೆಗಳಲ್ಲಿ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಕೋಟಾದಡಿ ಪ್ರವೇಶಾತಿ ಪಡೆಯುವ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಬೋಧನಾ ಶುಲ್ಕವನ್ನ ಮರುಪಾವತಿ ಮಾಡಲಾಗುವುದು. ಇನ್ನು ಶೈಕ್ಷಣಿಕವಾಗಿ ಪರಿಶಿಷ್ಟ ಪಂಗಡಗಳ ಸಮುದಾಯವನ್ನ ಸದೃಢಗೊಳಿಸುವುದರ ಜೊತೆಗೆ ಆರ್ಥಿಕವಾಗಿ ಸಬಲರನ್ನಾಗಿಸುವ ಕಾರ್ಯ ಕೂಡ ಆಗುತ್ತಿದೆ. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಕಳೆದ 2 ವರ್ಷಗಳಲ್ಲಿ 4% ಬಡ್ಡಿ ಸಹಾಯಧನ ಯೋಜನೆ ಅಡಿ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ 350 ಉದ್ಯಮಿದಾರರಿಗೆ ಸುಮಾರು 34.50 ಕೋಟಿ ಸಹಾಯಧನವನ್ನ ನೀಡಲಾಗಿದೆ. ಕಿರು ಅರಣ್ಯ ಉತ್ಪನ್ನಗಳನ್ನು ಸಂಗ್ರಹಿಸಿ ಸಂಸ್ಕರಿಸಲು ನೆರವಾಗುವಂತೆ ಲ್ಯಾಂಬ್ಸ್ ಸಹಕಾರ ಸಂಘಗಳಿಗೆ ದುಡಿಯುವ ಬಂಡವಾಳ ರೂಪದಲ್ಲಿ ತಲಾ 5 ಲಕ್ಷ ರೂಪಾಯಿ ಸಹಾಯಧನ ನೀಡಲು ಕ್ರಮ ಕೈಗೊಳ್ಳಲಾಗಿದೆ. 2023-24ರಿಂದ ಸಮಾನಾಂತರ KSTRI ಯೋಜನೆ ಅಡಿ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಹಣಕಾಸು ಸಂಸ್ಥೆಯಿಂದ ಸಾಲ ಪಡೆಯುವ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಉದ್ಯಮಿಗಳಿಗೆ 2 ಕೋಟಿ ರೂಪಾಯಿಯವರೆಗೆ ಸರ್ಕಾರದಿಂದ ನೀಡುತ್ತಿರುವ ಸಮಾನಾಂತರ KSTRIಯನ್ನ ರಾಷ್ಟ್ರೀಕೃತ ಬ್ಯಾಂಕ್ಗಳಿಂದ ಪಡೆಯುವ ಸಾಲ ಸೌಲಭ್ಯಕ್ಕೂ ವಿಸ್ತರಿಸಲಾಗಿದೆ. ಶೈಕ್ಷಣಿಕ ಹಾಗೂ ಆರ್ಥಿಕ ನೆರವಿನ ಜೊತೆಗೆ ಸಾಮಾಜಿಕವಾಗಿಯೂ ಸಮುದಾಯದ ಶ್ರೇಯೋಭಿವೃದ್ಧಿಗೆ 10 ಹಲವು ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ರೂಪಿಸಲಾಗಿದೆ. ಸಮುದಾಯದ ಜನ ವಾಸಿಸುವ ಕಾಲೋನಿಗಳಲ್ಲಿ ಮೂಲ ಸೌಕರ್ಯ ಅಭಿವೃದ್ಧಿಗೆ ವಿಶೇಷ ಒತ್ತು ನೀಡಲಾಗಿದ್ದು, ಕಳೆದ 2 ವರ್ಷಗಳಲ್ಲಿ ಸುಮಾರು 158.83 ಕೋಟಿಗಳನ್ನು ವಿನಿಯೋಗಿಸಲಾಗಿದೆ. ಆ ಮೂಲಕ ಪರಿಶಿಷ್ಟ ಪಂಗಡದವರು ವಾಸಿಸುವ ಹಾಡಿಗಳಲ್ಲಿ ಮೂಲಭೂತ ಸೌಲಭ್ಯಗಳಾದ ಸಿಸಿ ರಸ್ತೆ, ಒಳಚರಂಡಿ ವ್ಯವಸ್ಥೆ, ಕುಡಿಯುವ ನೀರಿನ ಸೌಲಭ್ಯ, ವಿದ್ಯುತ್ ದೀಪ ಸೇರಿದಂತೆ ಮತ್ತಿತರೆ ಸವಲತ್ತುಗಳನ್ನು ವ್ಯವಸ್ಥಿತವಾಗಿ ನಿರ್ಮಿಸಿಕೊಡಲಾಗಿದೆ. ಅರಣ್ಯ ಹಾಗೂ ಅರಣ್ಯದಂಚಿನ ಹಾಡಿಗಳಲ್ಲಿ ವಾಸ ಮಾಡುತ್ತಿರುವ ಸೋಲಿಗ, ಹಸಲರು, ಜೇನುಕುರುಬ, ಕಾಡುಕುರುಬ, ಎರುಳಿಗ, ಕೊರಗ, ಬೆಟ್ಟಕುರುಬ, ಯರವ, ಪಣಿಯನ್ ಸೇರಿದಂತೆ ಇತರೆ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಬುಡಕಟ್ಟುಗಳ ಸಮುದಾಯದವರಿಗೆ ಮೂಲ ಸೌಕರ್ಯ ಒದಗಿಸಲು ಸುಮಾರು 200 ಕೋಟಿ ರೂಪಾಯಿಗಳಷ್ಟು ಅನುದಾನವನ್ನ ಒದಗಿಸಲಾಗುತ್ತಿದೆ. ಇನ್ನು ಸಮಾನತೆ ಮೂಡಿಸುವುದರ ಜೊತೆಗೆ ಸಾಮಾಜಿಕ ಸಬಲೀಕರಣ ಕೈಗೊಳ್ಳುವ ನಿಟ್ಟಿನಲ್ಲಿ ಕಲ್ಯಾಣ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಜಾರಿಗೊಳಿಸಿದ್ದು, ಸರಳ ವಿವಾಹ ಯೋಜನೆ ಅಡಿಯಲ್ಲಿ ವಿವಾಹವಾಗುವ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ದಂಪತಿಗಳಿಗೆ 50,000 ರೂಪಾಯಿ ಪ್ರೋತ್ಸಾಹಧನವನ್ನ ನೀಡಲಾಗುವುದು. ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ವಿಧವೆಯು ಮರುಮದುವೆಯಾದಲ್ಲಿ 3 ಲಕ್ಷ ಪ್ರೋತ್ಸಾಹಧನ ಕೊಡಲಾಗುವುದು. ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಯುವಕ ಯುವತಿಯರು ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಒಳಗೆ ಅಂತರ್ಜಾತಿ ವಿವಾಹವಾದಲ್ಲಿ ಅವರುಗಳಿಗೆ 2 ಲಕ್ಷ ರೂಪಾಯಿ ಪ್ರೋತ್ಸಾಹಧನ. ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಯುವಕ ಯುವತಿಯರು ಅನ್ಯ ಜಾತಿಯವರನ್ನ ವಿವಾಹವಾದಲ್ಲಿ ಪುರುಷರಿಗೆ 2 ಲಕ್ಷ ರೂಪಾಯಿ, ಮಹಿಳೆಯರಿಗೆ 3 ಲಕ್ಷ ರೂಪಾಯಿಗಳನ್ನ ಸಹಾಯಧನವಾಗಿ ಕೊಡಲಾಗುತ್ತಿದೆ. ಹಾಗೆಯೇ ಗುರುತಿಸಲ್ಪಟ್ಟ ಮಾಜಿ ದೇವದಾಸಿ ಮಕ್ಕಳ ವಿವಾಹಕ್ಕೂ ಪ್ರೋತ್ಸಾಹಧನವನ್ನ ನೀಡಲಾಗುತ್ತಿದೆ. ಇನ್ನು 2024-25ನೇ ಸಾಲಿನಲ್ಲಿ ವಾಲ್ಮೀಕಿ ಭವನ ಹಾಗೂ ಸಮುದಾಯ ಭವನಗಳ ನಿರ್ಮಾಣಕ್ಕೆ 35 ಕೋಟಿಗಳಷ್ಟು ಅನುದಾನ ವೆಚ್ಚವನ್ನ ಭರಿಸಲಾಗಿದೆ. ಪೌಷ್ಟಿಕ ಆಹಾರ ಯೋಜನೆ ಅಡಿ 12 ಬುಡಕಟ್ಟು ಸಮುದಾಯಗಳ 47,981 ಕುಟುಂಬಗಳಿಗೆ ಪೌಷ್ಟಿಕ ಆಹಾರ ಪದಾರ್ಥಗಳನ್ನು ವಿತರಿಸಲು 261 ಕೋಟಿಗಳನ್ನು ವಿನಿಯೋಗಿಸಲಾಗಿದ್ದು, ಅಪೌಷ್ಟಿಕತೆಯನ್ನು ನಿವಾರಿಸಲು ಸಾರ್ವಜನಿಕ ಪಡಿತರದ ಜೊತೆಗೆ ಪೌಷ್ಟಿಕ ಆಹಾರವನ್ನು ವಿತರಿಸಲಾಗುತ್ತಿದೆ. ಅರಣ್ಯ ಹಾಗೂ ಅರಣ್ಯದಂಚಿನಲ್ಲಿರುವ ವಸತಿ ರಹಿತ ಬುಡಕಟ್ಟು ಸಮುದಾಯದವರಿಗೆ 12,286 ಮನೆಗಳನ್ನು ನಿರ್ಮಿಸಲು ಮಂಜೂರಾತಿ ನೀಡಲಾಗಿದೆ. ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಸರ್ವತೋಮುಖ ಅಭಿವೃದ್ಧಿಗೆ ಕಟ್ಟಿಬದ್ಧವಾಗಿರುವ ಸರ್ಕಾರ ಹಲವು ಖಾತರಿ ಯೋಜನೆಗಳನ್ನು ಅನುಷ್ಠಾನಗೊಳಿಸಿದ್ದು, ಅದರ ಜೊತೆಗೆ ಸಮುದಾಯಕ್ಕೆ ಪ್ರತ್ಯೇಕ ಸಚಿವಾಲಯವನ್ನೇ ಪ್ರಾರಂಭಿಸಿದ್ದು ಅದರ ಬದ್ಧತೆಗೆ ಸಾಕ್ಷಿಯಾಗಿದೆ. ಅದರಂತೆ ರಾಜ್ಯದ ಬುಡಕಟ್ಟುಗಳ ಅನನ್ಯ ಸಂಸ್ಕೃತಿಯನ್ನ ಅನಾವರಣಗೊಳಿಸಲು ಮೈಸೂರು ನಗರದಲ್ಲಿ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಕೇಂದ್ರದ ಆವರಣದಲ್ಲಿ ಬುಡಕಟ್ಟು ವಸ್ತು ಸಂಗ್ರಹಾಲಯವನ್ನ ಸ್ಥಾಪಿಸಲು ಕ್ರಮ ಕೈಗೊಳ್ಳಲಾಗಿದೆ. ಸನ್ಮಾನ್ಯ ಮುಖ್ಯಮಂತ್ರಿ ಶ್ರೀ ಸಿದ್ದರಾಮಯ್ಯನವರ ನೇತೃತ್ವದ ಘನ ಸರ್ಕಾರವು ಪರಿಶಿಷ್ಟ ವರ್ಗಗಳ ಕಲ್ಯಾಣ ಇಲಾಖೆಯ ಮೂಲಕ ಸಾಮಾಜಿಕ ನ್ಯಾಯ ಮತ್ತು ಸಮಾನತೆಯ ಸಂವಿಧಾನಾತ್ಮಕ ಆಶಯಗಳನ್ನು ಈಡೇರಿಸುವ ನಿಟ್ಟಿನಲ್ಲಿ ದೃಢ ಹೆಜ್ಜೆಯನ್ನ ಇಟ್ಟಿದೆ. ಶಿಕ್ಷಣ, ಉದ್ಯೋಗ ಮತ್ತು ವಸತಿ ಕ್ಷೇತ್ರಗಳಲ್ಲಿ ಜಾರಿಗೆ ತಂದ ಕಲ್ಯಾಣ ಯೋಜನೆಗಳು ಸಾವಿರಾರು ಕುಟುಂಬಗಳ ಬಾಳಿನಲ್ಲಿ ನವ ಮನ್ವಂತರಕ್ಕೆ ನಾಂದಿ ಹಾಡಿವೆ. ವಿದ್ಯಾರ್ಥಿ ವೇತನಗಳು, ತರಬೇತಿ ಕಾರ್ಯಕ್ರಮಗಳು ಮತ್ತು ಮೂಲ ಸೌಕರ್ಯಗಳ ಅಭಿವೃದ್ಧಿಯು ಒಂದೊಮ್ಮೆ ಹಿಂದುಳಿದಿದ್ದ ಸಮುದಾಯವನ್ನ ಸಮಾಜದ ಮುಖ್ಯವಾಹಿನಿಗೆ ತರುವಲ್ಲಿ ನಿರ್ಣಾಯಕ ಪಾತ್ರ ವಹಿಸಿವೆ. ಈ ಮೂಲಕ ಸರ್ಕಾರದ ಆಶಯ, ಇಲಾಖೆ ಹಾಗೂ ಅಧಿಕಾರಿ ವರ್ಗಗಳ ಬದ್ಧತೆಯಿಂದಾಗಿ ಪರಿಶಿಷ್ಟ ಪಂಗಡದ ಸಮುದಾಯಗಳಲ್ಲಿ ನೆಮ್ಮದಿ ಮೂಡುತ್ತಿದೆ. ಸಮುದಾಯವು ಈ ಯೋಜನೆಗಳನ್ನ ಸದ್ಬಳಕೆ ಮಾಡಿಕೊಂಡು ಮತ್ತಷ್ಟು ಅಭಿವೃದ್ಧಿಯ ಪಥಕ್ಕೇರಲಿ ಎಂದು ಹಾರೈಸೋಣ.
ಯಾರು ಪ್ರೆಸೆಂಟ್ ಮಾಡೋರು ಇದ್ರೆ ಅವರೆಲ್ಲ ಇಲ್ಲಿ ಹಾಜರಾಗಿರ್ಬೇಕು. ಓಕೆ,
ಮೂರನೇ ಸೆಷನ್ಗೆ ಎಲ್ರಿಗೂ ಸ್ವಾಗತ. ಈ ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನ ಚೇರ್ಪರ್ಸನ್ ಪ್ರೊಫೆಸರ್ ಕಂಡಿಕೆರೆ ಆರ್ ಶ್ರೀಧರ್, ವಿಸಿಟಿಂಗ್ ಪ್ರೊಫೆಸರ್, ಸೆಂಟ್ರಲ್ ರಿಸರ್ಚ್ ಲ್ಯಾಬೊರೇಟರಿ NITTE, ಡಿಮ್ಡ್ ಯೂನಿವರ್ಸಿಟಿ ಮಂಗಳೂರು ಇವರು ವಹಿಸ್ಕೊಡ್ಬೇಕು ಅಂತ ಕೇಳ್ಕೊತಾ ಇದೀವಿ. ಸರ್ ಸ್ಟೇಜ್ ಬರಬೇಕು. ಎಲ್ಲ ಅವರಾದ್ಮೇಲೆ ಈ ಸೆಷನ್ ನಲ್ಲಿ 5 ಜನ ಪತ್ರಿಕೆ ಮಂಡನೆಕಾರರಿದ್ದು ಅವರ ಹೆಸರುಗಳನ್ನ ನಾವು ಮೆನ್ಷನ್ ಮಾಡ್ತೀವಿ. ದಯಮಾಡಿ ಎಲ್ಲ ವೇದಿಕೆಗೆ ಬರಬೇಕು. ಡಾಕ್ಟರ್ ನಯನ DR, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಕಾಯಚಿಕಿತ್ಸಾ, ಗವರ್ನಮೆಂಟ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್, ಮೈಸೂರು. ಇಂಪ್ಯಾಕ್ಟ್ ಆಫ್ ಮಾಡರ್ನೈಸೇಷನ್ ಅಂಡ್ ಗ್ಲೋಬಲೈಸೇಷನ್ ಆನ್ ಟ್ರೈಬಲ್ ನ್ಯೂಟ್ರಿಷನ್ ಅಂಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ವಿಷಯದ ಬಗ್ಗೆ ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಅವರು ಸ್ಟೇಜ್ ಬರಬೇಕು. ಆಕಾಶ್, ರಿಸರ್ಚ್ ಸ್ಕಾಲರ್, ಇಂಡಿಯನ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಂಡ್ ಲಿಟರರಿ ಸ್ಟಡೀಸ್, ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಡೆಲ್ಲಿ. ಇವರು ವ್ಯಾನಿಸಿಂಗ್ ವಿದ್ಯಾಸ್, ರಾಜಗೊಂಡ ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರಾಕ್ಟೀಸಸ್, ಗ್ಲೋಬಲೈಸೇಷನ್ ಅಂಡ್ ಕಲ್ಚರ್ ಬಿಲೀಫ್ಸ್ ವಿಷಯದ ಬಗ್ಗೆ ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಅವರು ಸ್ಟೇಜ್ ಬರಬೇಕು. ಡಾಕ್ಟರ್ ಭವನ, ಫಾರ್ಮರ್ ರಿಸರ್ಚ್ ಆಫೀಸರ್ ಅಂಡ್ ಜಾಯಿಂಟ್ ಡೈರೆಕ್ಟರ್, ARD ಡಿಪಾರ್ಟ್ಮೆಂಟ್, ಗವರ್ನಮೆಂಟ್ ಒಡಿಶಾ, ಭುವನೇಶ್ವರ್. ಇವರು ಟ್ರೈಬಲ್ ಹೆಲ್ತ್, ಇಂಡಿಜಿನಸ್ ಮೆಡಿಸಿನ್ಸ್ ಅಂಡ್ ಗ್ಲೋಬಲೈಸೇಷನ್, ಇಂಟಿಗ್ರೇಟಿಂಗ್ ಕಲ್ಚರ್ ನಾಲೆಡ್ಜ್ ವಿತ್ ಇನ್ ಒನ್ ಹೆಲ್ತ್ ಫ್ರೇಮ್ವರ್ಕ್ ವಿಷಯದ ಬಗ್ಗೆ ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಅವರು ಸ್ಟೇಜ್ ಬರಬೇಕು. ಡಾಕ್ಟರ್ ತನ್ವಿ ಡಿ ಶೆಟ್ಟಿ, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸಂಹಿತಾ ಅಂಡ್ ಸಿದ್ಧಾಂತ, GMC ಮೈಸೂರು. ಇವರು ಇಂಟೆಲೆಕ್ಚುಯಲ್ ಪ್ರಾಪರ್ಟಿ ರೈಟ್ಸ್, ಎ ಸೇಫ್ ಲಾಕರ್ ಫಾರ್ ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ನಾಲೆಡ್ಜ್ ಅಂಡ್ ಪ್ರಾಕ್ಟೀಸ್ ವಿಷಯದ ಬಗ್ಗೆ ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಇವರು ಸ್ಟೇಜ್ ಬರಬೇಕು. ಡಾಕ್ಟರ್ ಶುಭಲಕ್ಷ್ಮಿ ಕೆ, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸಂಹಿತ್ ಅಂಡ್ ಸಿದ್ಧಾಂತ, JMC ಮೈಸೂರು. ಇವರು ಟೈಟಲ್ ಆಫ್ ಪೇಪರ್ ಪ್ರೆಸೆಂಟೇಷನ್, ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ಅನಾಲಿಸಿಸ್, ಸ್ಟ್ರೆಂತ್, ವೀಕ್ನೆಸ್, ಆಪರ್ಚುನಿಟೀಸ್ ಅಂಡ್ ಥ್ರೆಟ್ಸ್ ವಿಷಯದ ಬಗ್ಗೆ ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಇವರು ವೇದಿಕೆ ಮೇಲೆ ಬರಬೇಕು. ಗೋಷ್ಠಿ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿಕೊಂಡ ಡಾಕ್ಟರ್ ಚೇರ್ಪರ್ಸನ್ ಪ್ರೊಫೆಸರ್ ಕಂಡಿಕೆ ಆರ್ ಶ್ರೀಧರ್ ಸರ್ ಅವರಿಗೆ ಪೂರ್ವಕವಾದ ಸ್ವಾಗತವನ್ನ ಕೋರ್ತೇವೆ. ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಮೊದಲಿಗೆ ಡಾಕ್ಟರ್ ನಯನ DR.
Good afternoon, all. Respected dignitaries, myself Dr. Naina DR from Government Ayurveda Medical College, Mysuru. As we all know that modernization and globalization spreads all over the world, which will impact the lifestyle of the person. In this presentation, I am going to explain about how this modernization and globalization, which impacts the tribal people, especially food and lifestyle. Topic of my presentation is impact of modernization and globalization in tribal nutrition and lifestyle. Here is the introduction. So, tribal community known for their close connection with the nature as the unique food habits that are deeply rooted in their culture and the environment. Their diets traditionally consist of locally available grains and roots, forest product produces, and organic resources. However, with the spread of modernization, tribal food system have started to change. The introduction of market-based food and processed items and modern agricultural practices has altered their dietary lifestyle and their food habits. In India, there is nearly about 700 scheduled tribes, which consist of 8.6% of total population. So, next, these are all the traditional food habits which are used by the tribal peoples. Those are all millets, especially mainly ragi, jowar, and forest-based produces like tubers, mushroom, and wild berries, and seasonal food habits, natural fermentation practices, and low glycemic index foods. These are all protective against the mainly non-communicable diseases like obesity, type 2 diabetes mellitus, hypertension, and other metabolic disorders. These food habits mainly have the high fiber-rich content and micronutrient fibers. These are rich in micronutrients like vitamins and many minerals. So these are having low saturated fat and protective against non-communicable diseases. Here is the nutrition transition in tribal communities. From traditional food, these are converted into processed foods like millets. Earlier, they are using the millets. Now these millets can be converted into polished white rice. This polished white rice, they consist of mainly endosperm. These are having the high glycemic index. So, and there will be lack of other fiber content. And forest greens, instead of forest greens, now they are using mainly market-based vegetables and homemade fermented foods. Instead of that, they are using a packed food. Natural fats, now they are using refined oils, resulting in by using these products, there will be iron deficiency, anemia, and vitamin B12 deficiency, reduced dietary diversity, and high protein energy malnutrition. Next, ecological and environmental changes. In that first one, deforestation and biodiversity. Industrial projects and mining reduces the availability of wild foods and medicinal plants and traditional tubers and greens. Many researches which were conducted so that in the region of Odisha and Jharkhand, the forest-dependent tribes have reported reduced access to minor forest produces. And second one, climate change impact. Irregular rainfall affect the shifting cultivation, and crop failure increases the food insecurity. Seasonal hunger becomes the more common. And the next, double burden of malnutrition. This by using these processed food, there will be infectious diseases burden, tuberculosis, malaria, diarrhea, diarrheal diseases, etc. And stage 2 non-communicable diseases like type 2 diabetes mellitus, hypertension, and other obesity. This overlap creates a triple burden, which causes undernutrition, micronutrient deficiency, and non-communicable diseases. Many studies among the tribal population in Kerala and Maharashtra shows the increasing diabetic prevalence. Here is the changes in food system. Initially, they are using traditional food habits. Those are all having seasonal heating and community sharing, natural fermented foods. No chemical preservatives were used in the traditional food system, and those are all low glycemic index food. Now, those traditional food can be converted into modern food system. Those are all having the characteristics like Their year-round availability due to adding of preservatives, they can preserve this food up to 1 year like that. And ultra-processed food habits, high salt and sugar, and marketing influences. These fast foods and packed food industries penetrate even remote areas due to globalization. The next, socio-cultural transformation. In that, there will be loss of indigenous knowledge. Traditional fermentation methods, those are all disappearing due to this industrialization and globalization, and ritual-based fasting replaced by the irregular food habits. Then decline in use of medicinal resources, medicinal herbs, and due to westernization of aspirants, there will be preference of use of polished rice over the millets, and also packed food items. Here is the some of positive impact of globalization. In that first one, there will be due to this globalization, vaccination system is improved, and there will be assessment of institutional deliveries in that remote areas also, and digital health services. Some of the government schemes like Poshan Abhiyan are used. Then road connectivity improving the emergency case assess. Last conclusion. Modernization and globalization have significantly changed tribal nutrition and lifestyle, where they are improving access to healthcare, education, infrastructure, and they have also disrupting the traditional millet-based and diverse diets and physically active lifestyle. This shift has led to reduced dietary diversity, increased consumption of processed foods, and emergency of double burden of malnutrition. Then there will be loss of food sovereignty and cultural erosion, environmental changes, and further worsen the health inequalities. So therefore, development must be culturally sensitive and sustainable, integrating with the traditional food items with modern public health strategies that ensure the long-term nutritional security and overall well-being of tribal communities. Thank you all.
Thank you, Dr. Bhavana. Is it a literature review or your experiments?
Literature.
Survey, literature review. Okay. Any question? One or two questions to Nayana? Dr. Nayana? Any questions? If there are no questions, I invite the next speaker, Mr. Akash, University of Delhi.
Good afternoon. Good afternoon, respected chair and all the dignitaries. My topic is Vanishing Vedas, Rajgond Tribal Healthcare Practice, Globalization and Cultural Beliefs. So, background of my research paper is basically first I want to tell the tribal India in the India around 700 plus communities, 8 to 10% of the national population. The Gond, basically my focus on Rajgond. So first, Rajgond is also a part of the subgroup of the Gond community. So basically, Gond, the largest group of the central India historically, they are the hills people. As per the, if we are going to see the Rajgond, Gond traditional name is Koitur, and in Telugu it's saying like hills people. So basically, the Rajgond legacy, the formal ruling lineage of the Gondwana region, knowledge custodian maintained elite status by preserving scared, medicinal, and the spiritual wisdom. The geographical focus Madhya Pradesh, Maharashtra, Telangana, and northern Karnataka. But my research is based on the northern Karnataka, that is Bihar. So the introduction in this paper I covered first the ancient heritage, the oral ethnomedicinal knowledge, the passed down from milestones. The Rajkon view the holistic balance of body, mind, and spirit nature. For them, the medicinal, for them, these medicinal practices is not the simply medicines. They are on the basis of belief system. And on the same hand, the oral literature, Basically, the Rajkond knowledge system is based on oral form as compared to like we see in the text Charak Samhita. In the Charak Samhita, we saw like so many Ayurveda, they are in the written form, but in the Rajkond community, they are the oral form. So because of oral form, in the current scenario, they also like make some changes as per the situation, but in the limitations are there in the written. The conflict with the globalization, basically what is the effect because of the globalization, preferences for allopathic medicines nowadays people are giving, and shift from the traditional, because in the traditional era like these communities are providing services not as the commercial way, they are doing as their duties, like the patients are offering gifts and all, like voluntarily they are giving, but now the things change, they are doing their services as the commercial. The risk because of this globalization, now people are shifting, so so many people are preferring allopathic medicines, so their younger generation are not focusing on this Rajgond oral tradition, they are not much interested. Basically, my statement of problem in this research paper, first is the irreversible loss of oral corpus. Because of this, like now because of globalization, these are all our changes. Socioeconomic displacement, they all are start migrating from their homelands. Ecological and institutional neglect also. The research gap, basically so many research when I'm writing this paper, so I saw so many articles, everyone is focusing on their traditional medicines importance, but no one is talking about their condition, their socioeconomic conditions. So in this paper, like I'm majorly highlighting the issues what they are facing in the current scenario. These are the research questions in my research papers. What are the core features and are the holistic philosophies of Rajgond traditions, traditional medicinal practices? How have globalization and the shift of cash-based economic dispersed traditional knowledge transmission? What are the consequences of losing the oral medicinal corpus for both community health and the local biodiversity? The objective of my research to document the core ethno-medicinal practices, the holistic health philosophies of Rajgond community, to analyze how globalization and the expansion of allopathic medicine have reshaped the traditional healthcare dependence, to examine the economic condition of practice and the factors of leading their transition into a informal labor. And the last one is to identify major challenges and suggest strategies for the preservation of their formal recognition of their oral tradition. The research methodology. In this methodology, basically, I done oral interviews, semi-structured interviews, focused group discussion, and data collection by talking with the local community members. And along with this, some secondary data are also there. Rajgond healthcare system, holistic view, body, mind, spirit, environmental balance, remedies from local flora and fauna, includes ritual and dietary practices, oral transmission through apprenticeship, no formal written text. Traditional medicines are used by these communities when I visited there in the Bidar. So I collected these medicines. Like along with these medicines, they are not even simply giving like these are your problem and you can take simply medicines like the allopathic. They are giving the proper methodology how to use and how to take. Along with this, some other artifacts I have collected. This shows like they have some belief system also, like tiger nail. This is used for the protection from negative energy, like a safety guard. Hat jodi for the well-being of the family. They are putting in some people are in their home. The tiger nail. This is used for the protection from negative energy, like a safety guard. The current practices, the field findings, basically the medicines sold in the market and roadsides. Nowadays, these people are doing their practices in the roadsides, railway stations in Delhi. I am belongs to Delhi, so I also made them in the Delhi also. So nowadays in cities also they are doing some stalls in some melas and some local areas they are doing. So this is the thing. Treat common like elements. Basically, their main medicines are famous, very famous: diabetes, cold, pain, etc. Accurate plant identifications and preparations. They knows the importance of each and ecology about the plants, flora and fauna. Spiritual artifacts, which I have already mentioned. Traditional and economic. In the beginning, like I have already mentioned, they are doing as a barter system. They are providing their services. They are getting things from the like patients voluntarily. They are not asking anything. Healing is moral services for them. Strengthen the community's ties and shift to cash economies because of nowadays like this like that barter system shift to the cash based economy. Now if anyone is going to take the medicines, so we need to pay, because in the globalized world this is all are the changes now we see. Next is the impact of globalization. So basically availability of the allopathic medicines is easily in hospitals in the cities we are living, and we are so generally we are for the cold easily taking paracetamol, cetirizine. It's a very normal thing now we are taking. Declining reliance on traditional healers, migration of alternative employments. Youths are not that much interested because now in the globalized world they are also want to be engineer, doctor, and they very lack job opportunities also very less. Environmental challenges. Along with this, if we are not focusing on their knowledge system, now the environmental challenges is also there. Ability of the allopathic medicines in hospitals declining. Just a minute. Migration, alternative youth friend. Oh, sorry. Some error is there. Recommendations. According to the WHO, also recommendation in 2014 and 2023 in their reports, they mention integrate traditional medicine into a national health systems, promote research and scientific validations, improve access in rural areas, support education and practitioners trainings, protect indigenous knowledge and biodiversities, encourage collaboration with the modern medicines. These are the things, and the revitalization strategies, the systematic documentation of their oral knowledge system. Now it's doing okay. So I'm coming on the conclusion. Basically, their knowledge system is sophisticated, ingenious healthcare framework under threat, facing decline due to the globalization and economic pressure, and they are the urgent preservation measures required. These are the work cited, and thank you.
Mr. Akash,
Yes.
any questions to Mr. Akash pertain to Rajgond community? Is it literature survey or your experiment experience?
Literature, sir.
Yeah,
The
your
ethnographic study.
personal
Yes.
visit also.
Yes, sir.
Okay. I have one question.
Yes.
You have mentioned that you have collected different plants that have been used as medicine by the Rajgond community. Are there any medicinal plants where they are using the roots of plants? Roots.
Yes, sir, they have mentioned, but I am they are talking in their local language, so some language barriers are there for me. So they show me, but I didn't mention
No,
yet.
the reason I am asking you is if you look into conservation, if any of the plants use leaves, if they are using stem, flowers,
Yes.
and inflorescence and such type of material is used, there is no problem. If anyone is using roots as one of the materials for medicine,
Yes.
so those type of plants will be usually conservation is very, very important.
Yes.
You please concentrate in your next study whether they are using any roots of the plants, which are those plants, and what are the modes of conservation of such type of plants. Okay, you may suggest to some of the botany departments where they can collect it and propagate it, or whatever they can do for with regard to conservation is concerned.
Okay, sir. Thank
So
you so much, sir.
thank you
for your
very much.
suggestion.
So next speaker
So that is Professor S.K. Nanda was the joint director. He wasn't able to come today. I'm so sorry. And so I'm presenting on his behalf. It is all his research. I'm just the voice. Namasabhayam, Sabhadyakshayam. India is a home to. I'm really so sorry. I'm dropping everything. Sorry. India is home to 8.6% of. India is the largest. Has the largest tribal population in the world, that is around 104 million. And they represent culturally distinct ecological community whose health systems evolved in intimate interaction with forests, wildlife, climate patterns, and seasonal cycles. Health within a tribal cosmology is not defined narrowly as the absence of disease. Rather, it reflects a state of equilibrium between body, environment, livestock, ancestors, and spiritual forces. The healer is not simply a medical practitioner, but a mediator between ecological, social, and spiritual domains. The One Health, oh, sorry. Sorry, the One Health framework, which has been coined recently by the WHO and World Organization of Animal Health, talks about the equilibrium between the three, uh, environmental health, human health, and animal health, but it has been in practice in the tribal communities ever since. So this paper examines the dynamic relationship between the tribal health systems, globalization, and ecological transformation, situating the discussion within a One Health paradigm. It argues that integration of validated ethno-medicinal knowledge into formal health systems is essential for sustainable and equitable healthcare. So this One Health paradigm rests on four interrelated principles. Human health is linked to the animal health. Ecosystem stability influences the disease emergence. Environmental degradation alters the pathogen ecology, and antimicrobial resistance transcends species boundaries. The tribal communities can observe the migration pattern of birds and animals and insects and anticipate the changes in the monsoon, variations, and disease outbreaks. So, if we include this folklore into the mainstream knowledge system, then we'll be getting these health benefits, these knowledge benefit also as an interdisciplinary science, or we will be losing this knowledge. So, this globalization is actually not just seeing the bad things in that, but it is actually beneficial for the mainstream education if we integrate the tribal medicine, tribal knowledge into the mainstream knowledge system. So the tribal communities have, okay, next. Indigenous medicine and pharmacological validation. We know about the reserpine from Raupolian serpent, like Sarpaganda, and artemisinin for malaria, which are actually from the tribal knowledge itself. So, but this what modern pharmacology uses is the isolated alkaloids, but what tribes use is the polyherbal formulations. So, based on drug synergy, the tribal medicines actually work faster and better. So, this actually needs a pharmacological validation also. Antimicrobial resistance and relevance of ethnomedicine. India is the largest consumer of antibiotics in the world, and it faces multi-drug resistant tuberculosis, resistant enteric pathogens, and hospital-acquired infections. So, One Health dimension of AMR is particularly important. Antibiotics administered in livestock may contribute to resistant strains that spread to humans through food chain, water sources, or environmental contamination. In rural and tribal contexts where humans, livestock, and wildlife interact closely, the ecological circulation of resistant microbes can be rapid and complex. So, ethno-veterinary medicine and livestock health in tribal regions. Tribal pastoralists demonstrate this observational skills regarding animal behavior, grazing pattern, and disease onset. Their knowledge may complement the veterinary surveillance system. Ethical governance, knowledge sovereignty, and benefit sharing. So, historical instances of biopiracy have generated mistrust. The Convention on Biodiversity of 1992 and Nagoya Protocol emphasize prior informed consent and equitable benefit sharing. India passed Biological Diversity Act in 2002 and established a legal mechanism to regulate the access. But then there are still policy gaps, and one is the also lack of awareness about this among the tribal community. Discussion, the interface between the tribal health, globalization, and ecological transformation is complex and multidimensional. Biomedical expansion has reduced mortality from infectious diseases and improved maternal survival. At the same time, cultural homogenization and environmental degradation threaten indigenous autonomy and biodiversity. The One Health framework provides conceptual coherence and reconcile these dynamics. Tribal health traditions inherently recognize interdependence among the humans, animals, and ecosystems. The scientific validation of selected ethnomedical practices can contribute to antimicrobial stewardship and biodiversity conservation. However, integration must avoid extremes, neither romantic glorification or dismissive rejection. Evidence-based, ethically governed collaboration represents the most balanced path forward. To conclude, tribal healthcare systems embody centuries of ecological intelligence and experiential pharmacology. In an era defined by AMR, climate change, zoonotic emergence, and widening health inequities, ignoring indigenous knowledge would constitute a strategic oversight. Reframing the tribal health through a One Health lens allows integration of validated ethnomedicine with modern biomedical advances. Such integration supports biodiversity conservation, antimicrobial stewardship, and culturally respectful healthcare delivery. Preserving the tribal knowledge is not an act of nostalgia, but an investment in sustainable public health and ecological resilience. Thank you.
So, any questions to Dr. Bhavana? I guess your work is literature based.
Literature.
Yeah. I would like to point out that the tribals are also maybe suffering from zoonosis. Have you heard of the term zoonosis?
Yes, sir.
Yeah.
The one which actually you get it from the animals,
Yeah.
like H1N1.
Pet animals and also wild animals will have certain pathogens, and they are going to attack not only tribals, but even at home also we may get from cat or whatever rats or whatever birds and what we are cultivating. So that point you may have to include in your future study or in your paper or so. So no other questions to Dr. Bhavana? If there are no questions, I will thank you for your, I'm thanking you for your presentation. And next speaker is Dr. Tanvi D. Shetty from Mysuru. Yeah, please.
Good afternoon, all. Myself, Dr. Tanvi D. Shetty from Government Ayurveda Medical College, Mysuru. My topic of presentation is intellectual property rights, safe lockup for tribal health knowledge practices under the guidance of Dr. Srivatsa sir. Introduction. India boasts ginormous amount of tribal communities who are the safekeepers of indigenous knowledge. They usually maintain a very good rapport with the flora and fauna of the region they are settled in. Hence, whatever the knowledge they are generating, it is very region specific, invaluable, and is very rooted to the nature and holistic. So, with the globalization of Ayurveda and other traditional systems of medicine, there is increased interest towards our indigenous knowledge, with which comes the inevitable exploitation of the ethnical communities. While this goes on, there is an increased need for the awareness about the intellectual property rights. So the objectives of this presentation are to understand the concept of IPR with special reference to the indigenous people and the knowledge, and to explore how the IPR helps generate income and the opportunities. Moving on, to understand why IPRs are necessary, we should first understand what is biopiracy. So, the biopiracy is the unauthorized commercial exploitation of biological resources and traditional knowledge from indigenous communities or developing nations, typically by corporations patenting these resources without permission or fair compensation. So, this is how the biopiracy takes place. First, the whatever the companies or the MNCs, they will identify the indigenous medicinal use or the knowledge. That is, if any tribal community or ethnic community is using a specific plant for a specific disease, they'll observe the knowledge for a certain time and they will record it, and then they will extract the biological resource. That if they identify a plant, they may take the plant as such, or they may extract the phytoconstituent of that plant, and they will patent the knowledge in some other country. After the patent is done, they will commercialize it globally, and during these all the processes, the entire ethnical community is neglected, and neither they will share the benefits of the whatever the knowledge they have shared with the same tribal community. This is where the intellectual property rights come in. Moving on, intellectual property rights refer to the legal protections granted to the creators and innovators over their intellectual creations such as inventions, literary or artistic works. From the anthropological perspective, it refers to legal systems that regulate ownership and control over knowledge, creativity and biological resources, while often conflicting with indigenous and traditional knowledge systems that are collectively owned, orally transmitted and culturally embedded. That is, usually patents or IPRs are granted to single people, but when it comes to this things like the traditional medicines, they are collectively given. They are collectively given to a certain community. These are the types of intellectual property rights, that are patents, copyrights, trademarks, industrial design, geographical indications, trade secrets, and plant variety protection. First, patents. These patents protect any new inventions, product, or processes. The copyright protects literary, artistic, musical, or digital works. In the tribal context, any folklore practices of art or music, it will be protected by the copyright. Trademarks protects any brand names or logos. Industrial designs protect any aesthetic features of a particular product. Geographical indications protect products linked to a specific region. Trade secrets protect confidential business information. And plant variety protection protects new plant varieties developed by breeders. So how the types of IPRs are relevant to the tribal people? First one, the geographical indications. The geographical indications protects products whose quality and reputation are linked to a specific tribal region or community. The simple example is the Mysore silk. The GI is tagged to the Mysore. Similar way, if any tribal community has certain product, they can tag it to the geographical indication. Next is the patents, which are considered as defensive use in the tribal context, because the tribal medicines or any traditional medicines are considered as prior art. They are practiced from prior mechanisms. Hence, this will be recorded in something called as traditional knowledge digital library. Once anything is recorded in the traditional knowledge digital library, it is not up to be patented by any others. It protects the knowledge from the exploitation from others. Next is the plant variety protection. That is, if any tribal community, see, they are cultivating a new variety of the plant from the previously existing plant variety, the new variety will be given patent to that tribal community. So then anything that related to the plant, be it seeds, while it is marketed, the whole profit will go to the tribal community. Next is the copyright. It protects the documentation of folklore, art, songs, and cultural expressions. So any music of the tribes or the art of the tribes, it is comes under the copyright and it cannot be used by any other people. Next is the trade secret. If the tribal community is using any medicine that is very specific to that particular community, and if they have formulations the others do not know about, they can keep it under the trade secrets and they can document it. The others won't be able to profit from it. So how to access these rights? How do we help them to access these rights? This can be done by the government facilitation, or the NGOs can help them, or the anthropologist, or they can consult the legal institutions for the protection of their rights. This is also the discussion, continuation of the previous discussion. Geographical indication, commercial use of traditional products is facilitated by the GI. Patents, it controls the commercialization, licensing, and the benefit sharing. Plant variety protection is through seed sales, licensing, and legal protection against the unauthorized use. And trade secrets help keep the knowledge of the tribe to avoid exploitation. These are the examples. In Andaman and Nicobar, the Nicobaris have documented 124 types of plants and 34 types of the diseases in something called as community biodiversity register. In Madiagon tribe of the Lavari village, community forest rights have been given to the tribe in 536 hectares of the land. In Kerala, the Kani tribe uses something a drug called as Arogya Pacha, which is used against fatigue and malaise. A company has created a drug called the formulation called Jeevani from the Arogya Pacha drug. So whenever the company markets the drug and whenever they get the profits, profits will be equally shared with the Kani tribe of the Kerala. This is how the profits will be done with the intellectual property rights. Coming to the conclusion, India's cultural and academic heritage gets its diversity and richness from its ethnical communities. And in the pretense of globalization and commercialization, whenever the foreign commercial firms, whenever they acquire this knowledge, the whatever the holistic knowledge is there, it just turns into a materialistic entity with no original essence. So prevent this, there should be a very good awareness about the intellectual property rights, and we should help the tribal people to access these rights so that our country can become economically stable. Thank you.
Dr. Tanvi, it is secondary based, literature based, isn't it? It is very interesting to know about the intellectual property rights, biopiracy, and other things. I'm sure you know about any questions to Tanvi? So it is a very interesting topic, and our culture and our plants and our systems are drained by Indians itself many occasions. You know the story of Neem.
Neem and
The
turmeric,
Neem,
yes.
Neem, that we won the case in the international court because the Neem is used from the ancient time in India. Therefore, we could win that and we got it back. GI has been brought back to India. Then even turmeric. In turmeric, in our Vedic language and Talegari and all, information is already there because they were using turmeric for wound healing, of the surgical wound healing. So that information has been submitted to the international court, and then the turmeric aspect also we won. So these are a few examples pertain to some of the legal problems. But there are hundreds and hundreds of plant species, animal species, and even microbes will be drained from India, and there is a um, uh, stringent policy not to share some of the biodiversity to other countries. But still, directly or indirectly, that is going on, but that has to be prevented in future. So thank you for your presentation. And if there are no questions, I will invite the last speaker, Dr. Shubhalakshmi.
I'm Dr. Subbulakshmi from the Department of Ayurveda Samhita and Siddhanta, Government Ayurveda Medical College, Mysuru. So today I will be briefly presenting regarding ecological and public health perspective on tribal health in India under the structured framework using SWOT analysis. So SWOT analysis is strength, weakness, opportunity, and threat. Regarding the tribal health in India. So moving on to tribal health transition in India.
So, among a total population of India, which constitute 8% about tribal people. So, among them, the recent data has been noted that majorly affecting are the metabolic disorder due to the impact of globalization. So, in that, the majority of them are suffering from hypertension and diabetes mellitus. So, these are considered as dual burden of disease in the recent data. Then moving on to why a SWOT analysis framework methodology for this particular conceptual study. So, in order to identify the strengths and recognize the systemic weaknesses which are persisting in the tribal people, and also map the external opportunities and threats among the tribal people healthcare system, and also support or propose a public health planning program in the perspective of ecological system. So in Charaka Samhita, it has been mentioned that yavanto hi lokah bhava visheshaha tavantah purushah, yavanto hi purushah bhava visheshaha tavantah lokah. So in order to understand the complete living system among the human beings, the best teacher is considered as the ecological system. So with this perspective, will be highlighting the strength, weakness, opportunities, and threats among the tribal people with respect to the healthcare system. So, under strengths, so what are the strengths regarding the healthcare system in the tribal people? So, we look into that. In that, particularly the ecological food diversity and also medicinal plant knowledge among those people having regarding the medicinal system, and also indigenous healing system knowledge, and also community cohesion regarding the healthcare practices among the tribe people. So moving on to the weaknesses. So already I had said that the dual burden, so which consists of metabolic disorders, hypertension and diabetes mellitus. But historically, it has been noted that undernutrition and also infectious diseases are also have been noted under weaknesses among the healthcare system in the tribe people. So, what are the opportunities? So, regarding this integrative public health planning, so it means combining the traditional healthcare food practices and the medicinal knowledge system into the mainstream of healthcare system. So, that comes under integrative public health planning, and also the revival of local food system and also documenting them. So it comes under the opportunities. And moving on to the threats. So when we look into the threats, so it includes deforestation and mining, and also the erosion of indigenous system. So all these are the threats for the practice or the sustainability of healthcare among the tribe people. So, as I already said that in Charaka Samhita, it has been mentioned that the best teacher to understand comprehensive about the living system of human being, it is the ecological system. So, we cannot see the healthcare practices in the tribe people like isolation from the ecological system. So, in if the ecological disruption happens, which in turn affect the food system among the people or the here particularly the tribe people, and in turn it affects the metabolic system, and it will lead into the long term health outcome. So there is a need for ecological public health approach, means the integrating the ecological culturally sensitive health practices into the mainstream of healthcare system. So moving on to the conclusion. So we already seen that the burden or the threats and weaknesses which are pertaining among the tribe people. So the solution is the strength and also the opportunities. So by using that, the culturally grounded and planned essential tribal health which requires the ecologically culturally sensitive public health care system for the sustainable health maintenance and all the health beneficiaries. So thank you. These are the references.
Thank you, Dr. Subbalakshmi. It is a nice presentation. Any questions to Dr. Subbalakshmi? Maybe she has given some idea about SWOT, SWOT. Yeah. And I have one question. Do you have any idea that tribals have any measures to bring down the forest fire? Forest fire. How they control forest fire? Any knowledge, any indigenous knowledge by the tribals? If there is any fire, forest fire, how do they bring it down? Or any other measures? It is one of the aspects to think of, because we know helicopters will go and do all these things, but there is no time for that. But they may have some indigenous knowledge that has to be explored.
Yes, sir. I will read regarding.
Okay,
Yes.
thank you.
Thank you.
Thank you. Thank you very much.
Thanks.
So this session is over this is the last presentation. I would like to give a overall picture of the session. Session was started with presentation of Nayana. She spoke about tribal food system, especially millets and tubers, mushrooms, and also what are the deficiencies in tribals, especially iron and vitamin B12, malnutrition and diseases. And she mentioned that traditional food system has to be integrated with the modern food system, or the what are the basic problems pertain to modern food system, and what are the problems faced by the fast foods and such type of things. Second presentation by Akash, he mentioned about the Rajgond community in North Karnataka, Bidar, and he has mentioned about some of the problems of these people, especially migration, traditional and traditional medicinal plants they are using, and also animal materials they are using for various purposes. We don't know whether it is really going to help people, but they are using animal materials. And also, that is the youth or disinterest in, especially with regard to traditional aspects. So third presentation by Dr. Bhavana, she mentioned about the tribal One Health knowledge. One Health knowledge. This is one of the recent concepts of WHO. In many of these European and other countries are trying to concentrate on One Health. So that is health of human beings, health of animals, and health of environment. In that context, she has given some general ideas, and also Sarpagandha is one of the important plant material that is used by the tribals, and that mainly comes from the tribals knowledge rather than sophisticated community. So next presentation by Dr. Tanvi D. Shetty, she spoke about the intellectual property rights and geographic indication, copyright, trade secrets and patents, and also how this cultural changes is going to take place. Like some of this, our culture is trained because of many reasons. So the last presentation by Dr. Subbalakshmi, she she spoke about the SWOT, strength, weakness, opportunities, and threats by giving specific examples. And also the community, tribal communities are suffering from health problem, especially diabetes and hypertension, and therefore it is necessary to shift from human-centered developments to nature-centered development. That was the uh, message she has given. So altogether, all the presentations were very good, and they are all thought-provoking, and hopefully they have initiated some interest among the audience to go further. Thank you very much for your patience. Thank you.
ಪತ್ರಿಕೆ ಮಂಡನೆ ಮಾಡಿದ ಡಾಕ್ಟರ್ ನಯನ ಡಿಆರ್, ಆಕಾಶ್, ಡಾಕ್ಟರ್ ಭವನ, ಡಾಕ್ಟರ್ ತನ್ವಿ ಟಿ ಶೆಟ್ಟಿ, ಡಾಕ್ಟರ್ ಶುಭಲಕ್ಷ್ಮಿ ಎಲ್ಲರಿಗೂ ಹೃತ್ಪೂರ್ವಕದ ವಂದನೆಗಳು. ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆ ವಹಿಸಿ ನಡೆಸಿಕೊಟ್ಟ ಪ್ರೊಫೆಸರ್ ಕಂಡಿಕೆರೆ ಆರ್ ಶ್ರೀಧರ್ ಸರ್ ಅವರಿಗೆ ಹೃತ್ಪೂರ್ವಕದ ವಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತೇನೆ. ಅವರು ನಡೆಸ್ಕೊಡ್ಬೇಕಂತ ಮನವಿ ಮಾಡ್ಕೊಳ್ತೀನಿ.
ನಮಸ್ಕಾರ. ಈ 4ನೇ ಗೋಷ್ಠಿಗೆ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಈ ಒಂದು 4ನೇ ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ಡಾಕ್ಟರ್ ಎಚ್ ಹೇಮಲತಾ ಮೇಡಮ್, ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್, ಮೈಸೂರು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ರಿಸರ್ಚ್ ಅಂಡ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಮೈಸೂರು, ಇವರು ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸ್ಕೋಬೇಕಂತ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ.
ಹೇಮಲತಾ ಮೇಡಮ್ನ ಇಂಟ್ರೊಡಕ್ಷನ್ ಡಾಕ್ಟರ್ ಪಲ್ಲವಿ ಮೇಡಮ್ ಮಾಡ್ಕೊಡ್ತಾರೆ. ಮೇಡಮ್ ಪ್ಲೀಸ್ ವೆಲ್ಕಮ್.
Good afternoon for each and everyone. I welcome today's chairperson, Dr. Hemlata CR, to the gathering. She is an associate professor in Department of Obstetrics and Gynecology from Mysuru Medical College and Research Institute, Mysore. She has done her MBBS from WIMS from Ballari and DGO from Bengaluru Medical College, Bangalore, and MS from KEM, Mumbai. She has done her certificate courses in Caesarean section from London and certificate course in infertility from Kerala. So she is a past secretary and she is a past secretary of Mysore Obstetrics and Gynecological Society, Mysore. She has a huge experience in treating complicated pregnancies and complicated gynecological disorders. Her area of interest is in high-risk pregnancy. She has presented numerous papers in national and international level. She has got many awards and she is treating many tribal women. And it's a privilege to have you here, ma'am. So I welcome once again. Thank you.
ಮೇಡಮ್ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಈ ಒಂದು ಗೋಷ್ಠಿಯಲ್ಲಿ ಒಟ್ಟು 6 ಪತ್ರಿಕೆಗಳನ್ನ ಮಂಡನೆ ಆಗ್ತವೆ. ಆ ಮಂಡಕರ ಹೆಸರನ್ನ ಕರಿತೀನಿ, ಅವ್ರ ವೇದಿಕೆ ಬರ್ಬೇಕಂತ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಡಾಕ್ಟರ್ ರಾಮಕೃಷ್ಣ, ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಮೈಸೂರು, ಮೈಸೂರು. ಇವರು ಎ ಸ್ಟಡಿ ಆನ್ ಸೋಸಿಯೋ ಎಕನಾಮಿಕ್ ಡೆವಲಪ್ಮೆಂಟ್ ಆಫ್ ಅಕ್ಕಿಪಿಕ್ಕಿ ಕಮ್ಯುನಿಟಿ ಇನ್ ಅಂಗಡಿಹಳ್ಳಿ, ಬೇಲೂರು ತಾಲೂಕು, ಹಾಸನ ಡಿಸ್ಟಿಕ್. ಓಕೆ ಓಕೆ ಇರ್ಲಿ ಪರವಾಗಿಲ್ಲ. ಡಾಕ್ಟರ್ ಸಿದ್ಧಲಿಂಗ ಸ್ವಾಮಿ, ಜೆಎಂ, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಕಾಯ ಚಿಕಿತ್ಸಾ, ಗವರ್ಮೆಂಟ್ ಆಫ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್, ಮೈಸೂರು. ಇವರು ಕಲ್ಚರಲ್ ಬಿಲೀಫ್ಸ್ ಅಂಡ್ ಹೆಲ್ತ್ ಸೀಕಿಂಗ್ ಬಿಹೇವಿಯರ್ ಅಮಾಂಗ್ ದಿ ಟ್ರೈಬಲ್ ಕಮ್ಯುನಿಟಿ, ಈ ಒಂದು ವಿಚಾರದ ಮೇಲೆ ಪತ್ರಿಕೆಯನ್ನು ಮಂಡಿಸ್ತಾರೆ. ಡಾಕ್ಟರ್ ಅಶೋಕ್ ಪಾಟೀಲ್, ಕರ್ನಾಟಕ ಯೂನಿವರ್ಸಿಟಿ, ಧಾರವಾಡ. ಇವರು ಇಂಪ್ಯಾಕ್ಟ್ ಆಫ್ ಗ್ಲೋಬಲೈಸೇಷನ್, ಕಲ್ಚರಲ್ ಬಿಲೀಫ್ಸ್ ಆನ್ ಟ್ರೈಬಲ್ ಹೆಲ್ತ್ ಅಂಡ್ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರಾಕ್ಟೀಸಸ್, ಇದ್ರ ಮೇಲೆ ಪೇಪರ್ ಅನ್ನ ಮಂಡಿಸ್ತಾರೆ. Dr. B. Ravi Prasad, former senior fellow, ICSSR, New Delhi, those in anthropology, University of Mysore. ಇವರು a study of the Tonga and Lampion community of Andaman Nicobar Highlands. ಈ ಪತ್ರಿಕೆಯನ್ನು ಮಂಡಿಸ್ತಾರೆ. ಡಾಕ್ಟರ್ ಪೂರ್ಣಿಮಾ, ಗವರ್ಮೆಂಟ್ ಆಫ್ ಆಯುರ್ವೇದ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. ಇವರು ವಾಟರ್ ಬರ್ನ್ ಅಂಡ್ ವೆಕ್ಟರ್ ಬರ್ನ್ disease in tribal community, the impact of globalization, Ayurvedic management and impact for safe was practices. ಇದರ ಮೇಲೆ ಪತ್ರಿಕೆಯನ್ನು ಮಂಡಿಸ್ತಾರೆ. ಸುಮಂತ್ ಮಂಟಯ್ಯ, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸಂಹಿತಾ ಅಂಡ್ ಸಿದ್ಧಾಂತ, ಗವರ್ಮೆಂಟ್ ಆಯುರ್ವೇದಿಕ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. ಇವರು ಬ್ರಿಡ್ಜಿಂಗ್ ಟ್ರೈಬಲ್ medicinal knowledge and Ayurveda pathways towards evidence-based healthcare in the era of globalization. ಇದ್ರ ಮೇಲೆ ಪತ್ರಿಕೆನ ಮಂಡಿಸ್ತಾರೆ. ಈಗ ಮೇಡಮ್ ಅವರ ಪತ್ರಿಕೆ ಮಂಡಿಸೋರ್ಗೆ ಇನ್ಸ್ಟ್ರಕ್ಷನ್ಸ್ ಹೇಳ್ತಾರೆ.
I wish all the very best for the presenters, and I hope they have prepared very well and put a lot of efforts on this presentation. I just request them to complete in the stipulated time, and if any questions are there, we'll take up in the end. Thank you.
Good evening, everyone. Respected chairpersons of these sessions, myself, Dr. Ramakrishna, working as a faculty member in the Institute of Development Studies, Manasangutri, Mysuru. Today, I am going to present a study on health of Akipiki community, tribal community in Angadihalli, Belur Taluk, Hassan district. For the purpose of, particularly, I am concentrating on this health aspects, particularly for Akipiki communities in Angadihalli. Hassan district begins at the bottom of same Western Ghats and continues into Deccan Plateaus. It located between 12 degree and 33 north latitudes, longitudes. The extreme variations of climate conditions, especially in rainfall, naturally results a wide range of vegetations. Angadihalli is the village on the Hassan Belur road. On the way, it has been selected for the rehabilitations of members of the Akipiki tribes. The village had a population around 200 houses of Akipiki tribals with the more than the 1,500 peoples of other tribals such as different Silekata, Budbudke. Many peoples are also staying that. For the purpose of the study, I have been concentrating on a sample of 50 tribes was used for conducting a primary survey. Based on that, I have analyzed some of the information, particularly I have concentrating on health. Particularly in the health, it's most important in every tribal aspects. Particularly there are these kinds of the tribals has been depending upon their livelihoods on making of the hair oils, body massage oils, and other medicinal plants has been growing. They're depending upon their livelihoods on these medicinal plants. On the basis of that, some of the social aspects has been used for the Akipiki status, particularly the populations in the Angadihalli district. Particularly the literacy rate, 70% of comes under the belongs to illiterates. Only 15% of the literates people have been identified that. Family size, joint family has been identified more than 72% of that family households. And type of the house owned, Kacha house, more than 40% have been identified at the time of the primary survey. And also social participations, also they have to opinion about 40% or nearly 80% of the people has been socially participation. Tribals are located there. Here, most of the tribal problems has been arises particularly in that area during those days. Actually, when I was a co-investigator of the project of human development, a small area study has been conducted particularly in the Angadihalli village. At that time, we have to consider health as well as education as well as standard of living or income. Based on that indicators, I have concentrating only on health aspects. Some of the problems also I have identified for these purposes. The Hakipiki tribes have a lot of problems which influences them socially, culturally, as well as health is concerned. Under that, Their lifestyle have progressively come under this strain. The major difficulties of nomadic found of settlements at the same extreme poverty, ignorance of outside world, they have to marketing their products. They attack the South Asian countries in Malaysia, Bangkok, Thailand, or something like that. And also it attacks some East or West African countries also, the attack of their medicinal plants. At the same time, early marriages, homeless, and getting always migrations, illiteracy, unemployment, lack of unity and political leadership, scattered groups, alcoholisms, drug abuses, lack of civic communities, social service in the nomadic settlements. And also, some of the arrests identified by some of the police men or something such work on daily wages and construction group, hotels, thieves, difficulty in the pursuing formal schooling due to a nomadic life of style of the parents, non-availing the welfare measure schemes. Here, what identifies that, madam, here they don't have a toilet facilities, they don't have a safe drinking water, still they don't have a electricity problem, they don't have a pakka road facilities or connectivity. At the same time, housing also there is a problem for that. We have to identify, and also malnutrition in the children's also we have to identify at the time of survey. At the same time, even the toilet facilities in the human development in all the 30 districts has been implemented a Swachh Bharat Andolan. Still today, they did not have a good toilet facilities has been accessible for the Takipiki communities. We have identified for that. And also the migrations in the human development, what our vision or thoughts is like that everyone comes under the getting educations. They bring them into the mainframe to provide education facilities. That's what the human development also successful completed, but they away from the benefits of lack of benefits, particularly for the infrastructure facilities, safe drinking waters, high health aspects, particularly for the institutional deliveries. In the pandemic, after pandemic of institutional deliveries like medicinals, medicines, prescriptions, what are the other medicine has been required? Need-based medicines must be required for them. At the same time, some of the suggestions also I have suggested that lack of facilities, basic facilities such as safe drinking water, electricity, schooling, identification of the citizen, and also private loans, and also health issues due to lifestyle, malnutrition, hygienic, and also changing socioeconomic phases of current problems. These types are found in increasingly difficulty to meet their basic requirements of shelter, security, and their livelihoods, a permanent livelihoods. The wandering tribes are still suffering from the identified crisis because of their wandering lifestyle, different lifestyle compared to common lifestyles. It is very different. The food habits is different, culture is different, and the staying, housing is the problem. Only thing is that what I thought is that to first we have to provide our concerned person must be provide as a education facilities for them. It has been extended. Right. Government should provide a good housing facilities. Then only they can stay and get educations of their children. Another one is that health education of sanitation hygienics must be practices and give more awarenesses for that. The best example is for that some of the medical practitioners has been conducting some health camps. That would be best practices for the to give or create awareness among the Akipiki community in the Hungary Helli. That would be then only they can come from the common man to see the present world. Maybe they can change gradually. They can change their attitudes, customs, traditions, fashions, everything. But at the same time, the education's department must concentrating to provide educations from the grassroots, particularly for the childhood till the higher education. That would be changing of their educational, cultural, and life expectancy. Also, very most important for that, and also provide institutional deliveries. Particularly, finally, this Akipiki tribe is very low, maybe the low literacy rate, social dominations by higher hierarchy dominance, and also old age, time inquiry, majority of the illiterates, more than half of the respondents belong to low family incomes. And also they can engaging of some of the small agriculture and allied activities like sheep rearing, goat rearing, hens rearing, also practicing along with their So the head of the family has been whenever they have to went some other country, all the family responsibility has been maintaining the housewives only. They can lead the life, families and children, take care of them also. All the response for meat consumers nutritional status is low because of unbalanced food rations are a commodities. They don't accessibility of that to make ensures the government make ensures or a concerned policymakers can ensure to extend all kind of the facilities, particularly for the education, for the health, and also infrastructure facilities as well as in the civic amenities for them. It has been extended. Swachh Bharat is the concept for that to avoid to using of the natural this one practices. Instead of that, they have to concentrate. This comes under the Agare Grama Panchayati village, Belur PDO. I met many times. Maybe they can tell so many other reasons for that. This is the situations. But what I feel as a personally, we have submitted in the Human Development Report in the Hassan districts. Earlier it was 11th rank. Now it was 9th rank. It occupies HDI rankings, particularly in the indicators of health, education, as well as in. But they neglected of these Akipiki communities. What I found out at the time of conducting primary survey must be a concentrating on to fulfill all the three indicators instead of including the health hygienicness, food accessibility to ensure to extend, and also what our scientist, President of India, Abdul Kalamji says that Pura concept, providing urban facilities or amenities into rural area, it would be extend, irrespective of tribals community, must be extend and provide. This is also my personal opinion and my personal thoughts also, visions also. That's it from this presentation. Thank you for giving opportunities, dear chairperson.
Thank you, Ramakrishna sir. Any questions from the audience? If not, we'll move on to the next. I'll give the comments in the meantime. The next paper presentation is by Dr. Siddhalinga Swami JM.
No.
Sorry, Ashok Patil. Impact of globalization and cultural beliefs on tribal health and healthcare practices. Welcome you, sir.
Thank you, ma'am. Good evening to all. Myself, Dr. Ashok Patil from Karnataka University, Dharwad, and from consultant in CMDR, Center for Multidisciplinary Development Research, and ICSSR Institute, Government of India. Actually, my this paper is basically on the secondary source of information collected from various literature reviews, from ResearchGate, Google Scholar, and published news articles. As we know that the tribal communities represents some of the most culturally distinct populations in the world, possessing rich traditions, indigenous knowledge system, that is tribal knowledge system, and unique healthcare practices. These healthcare traditions have evolved over centuries in these community groups in different time and spaces across the world. However, these communities often experiences unequal health burdens due to socioeconomic conditions, marginalization, geographical isolation, and limited access to modern healthcare services. These are these are deeply rooted in cultural beliefs, continue to shape the tribal perceptions of illness, healing, health-seeking behavior, and healthcare practices. Health within a tribal society is not merely a biological condition, it is a holistic concept of encompassing physical, spiritual, social, and environmental well being.
Adjectives, as I said, paper shed light on the impact of globalization and cultural beliefs on tribals, health and healthcare practices, and the perception towards health illness. Also, the paper explores how globalization can both improve healthcare access and interrupts indigenous systems, while cultural beliefs can serve as a effective factors as well as barriers to modern medical care. Globalization characterized by increased global interconnection, connectedness, technological advancement, ecological economic integration has profoundly influenced the traditional societies nowadays. It has emerged as a powerful force influencing tribal health by introducing biomedical healthcare systems, that is modern medical systems, that is also called as allopathic or English medicine, new lifestyle changes due to westernization, technological innovations in the Western societies, and global health policies into traditional societies. While health has facilitated expansion of modern healthcare services, pharmaceutical and public health programs, it has also challenged ingenious knowledge systems and cultural autonomy across the world. The tribal communities now find themselves navigating between traditional health benefits and modern biomedical practices parallelly. Understanding the complex interactions between globalization and cultural beliefs is essential for designing effective health policies and interventions in the tribal blocks. Globalization and health, as we know that globalization affects health through multiple pathways, including, as I already said, economic development, cultural exchange, technological diffusion, policy transfer. In tribal context, globalization often manifests as expansion of government healthcare infrastructure, introduction to allopathic medicine, health education campaigns, market-driven lifestyle changes. While these processes can enhance access to the healthcare, they can also marginalize traditional practices and exacerbate inequalities among these groups. What are the positive? There are two types of effects, as we know: there's positive impact, negative impact. What positive impact on these societies or indigenous groups? Improved access to healthcare services. Globalization also contributed expansion of primary healthcare centers, immunization programs, maternal and child healthcare services to tribal regions. National and international health initiatives, as per WHO, have reduced the mortality from infectious diseases such as malaria, tuberculosis, measles, and several tribal populations. Availability of modern medicines and technological even innovations. Because today we are moving towards more tech civilized to technological innovations and also industrial innovations. These totally the human beings depends on the Adivasi medicine also. Along with that, the more effective medicines on their side, antibiotics, diagnostic tools, and emergency care has significantly improved the survival rates for acute illness diseases. Telemedicine and mobile health initiatives has further bridged the gap between the remote tribal areas and urban healthcare citizens. Nowadays, in tribal blocks, mobile health clinics are working. They're monitoring heart children and issuing the services to these deprived people and increasing health awareness. Government of India has undertaken several programs under the Ministry of Tribal Affairs. They are doing some grassroots level programs to uplift these communities pertaining to modern healthcare like sickle cell anemia. Then negative impacts of globalizations, erosion of indigenous knowledge system. Globalization is contributing positive impact also, negative impact also. Negative impact, though the traditional knowledge will diminish day by day because most of their knowledges are unwritten. They are in oral forms. One of the most significant consequences of globalization is the gradual decline of traditional healing systems. Indigenous medical knowledge, often transmitted orally across generations, is increasingly undervalued in favor of biomedical models. Even though we are using tribal knowledge, that is also called as Ayurveda. Today we will call in broader perspective, we call it as Ayurveda, but it is primarily a Adivasi medicine coined by those indigenous peoples. Epidemiological and lifestyle conditions. Globalization has also altered our dietary patterns, psychological activity levels, physical activity levels and social structures in that societies. Traditional diets, rich natural foods, are being replaced by the processed foods, leading to the rise of non-communicable diseases such as diabetes, hypertension, obesity among these tribal population. Nowadays, insidious diseases are more prone, prone by these people because of their eating junk foods, whatever we call as more modern food systems they are following. Persistent health inequalities. Despite of healthcare expansion, tribal communities are continued to face structural barriers such as infrastructure. In their areas, there are lack of infrastructure facilities. Even government is doing inequality is stopping, language barriers and discrimination. As one of our fellow mentioned that language barriers. Language is very important when we go to study the tribal and their traditional medicine system. I belong to Kannada. Then when I go to Konkani, example Konkani region, they have Tulu. The words will differ. That is, phonetics is very important when studying these tribal medicine systems and tribal healer knowledges. Cultural beliefs and tribal healthcare practices. Traditional concepts of health and illnesses. They have their own perception towards health, health-seeking behavior, and treatment-seeking behavior. Those are more towards spiritual oriented, cultural oriented. Illness often perceived as a result of supernatural processes among these communities. They follow in M.N. Srinivas, the concept in famous anthropologist stated nature, man, spirit. On these circles only, their medicine system will always revolve and evolve. Role of traditional healers. Traditional healers in this, we call them as a shamans. Shaman is always हिंदी बोलते हैं ना वो पूरा शमन करेगा मीन्स he stop all the sufferings of these people by doing some religious psychological solutions. For example, there is one doctor in Dharwad. He's a famous psychologist, Pandarangi, one fellow incident mental illness. He said, you are suffering from anxiety and irritability, mental disorders. Suddenly said, no, for the psychological medicine little bit works, but you go and visit temples, go some thread, do some puja. These are also spiritual philosophy. These concepts were established by these indigenous people. They don't have own patent also. American people, they have patent, as already sir was said. They from basmati they made as a texmati rice like that. Then influence on health seeking behaviors. Modern medical systems also changing their health seeking behaviors. When you visit tribal areas, they suddenly won't allow these things you noticed during COVID-19 pandemic. When they convince no the emic and ethic perspectives are there. When we go through them, then they allow us and they think we are one among them, then they allow, then take our medicines, then they follow. That is, the cultural beliefs are strongly influenced the decisions regarding when, where, from whom healthcare is sought. Many travel individuals prepare traditional healers and the first point to care of. For example, there is one community, then Tumkur district, during menstrual cycle period, they kept out. During delivery also, they kept outside on shelter. It is also practiced like that. They have their own cultural beliefs. They are strongly rooted. When we convenience them, then they align. These are the health seeking behaviors of that community. That is the modern healthcare systems only when conditions worse. This can delay diagnosis and treatment, particularly in maternal and child healthcare services. Intersection of globalization and cultural beliefs. This amalgamation of, that is, coexistence of traditional and modern medicine systems, like whatever Ayurveda, allopathy, they are using these healers' knowledge and they are preparing the medicines, modern medicines. Like example, the calcipra tablets is made by that is the plant produce. Calcipra. That is how these tribals, then also in Cone type of Maharashtra, they have patent on cancer actually. They have their own patent, cancer. But these tribal peoples have. We have to mingle with them, then again we will get some information, then we start giving them patent rights to Indian shares. Like cultural barriers in modern healthcare delivery. Modern healthcare systems often fail to accommodate tribal languages, as I said, belief systems, social norms, lack of culture sensitivity among healthcare providers. can lead to mistrust, non-compliance, and underutilized of the services. Like what happens when it comes to our knowledge, if knowledge came from Western society, we believe that it is own knowledge, we have our own indigenous knowledge. That is nowadays the government of India. Globalization can marginalize tribal voices in health decision making and development projects. Environmental degradation and displacement further disrupt traditional lifestyles, indirectly impacting health and well-being. For example, Soliga people of Chamaraj Nagar, they worship Debba Sampige Madeshwara, that is Sampige tree. They have their own religious and spiritual, along with healing, spiritual healing, that area they have. If the modern people of the political authorities and forest people, they brought them on the name of development outside the core area, from inside the core area. But they lose their identity. Nowadays, you go and they ask the data regarding these people, they ask liquor, then they will give the data. This is the scenario why these people became more addicted. We researcher will go give false on the name of information. We will give false truth to them. We do these things. We never do. Like whenever we go there, we should understand their developments regarding that is this. When it comes to yours, tribal people have their own example. When our grandfather died, that place where we bury, that is sacred for them. They worship spirits. That's in Tulunadu belt. You observe that. Like that, we have to give. We have to give development as a that is SDG goals. As per the SDG goals, tribal people also including on these goals, sustainable 17 goals. Like policy implications and recommendations, culturally competent healthcare professionals should be trained to understand tribal belief systems and cultural practices. So we have to become one among them. Then they will give the information. They will share their knowledge systems. Otherwise, we will do whatever ism, what we call as ism. Outsider will their own ism. For example, Buddhism is what Buddha said. It is his intention. After that, one who came, no, ism started their own theories. They have started building. That's why those things will harm the society. That's why they have their own cultural competent healthcare professionals to train to understand the tribal belief systems. Introduction of traditional medicine, as I also said, traditional health and indigenous knowledge should be recognized and integrated into public health strategies were appropriate. With these people's knowledge were needed, as sir, morning said, in psychological aspects where these knowledges were needed, we have to adopt them. We have to give the credits to those people who have established their indigenous knowledge. Community participation. Tribal communities must be actively involved in planning, implementing, and evaluating healthcare systems. Example, what those community means people centric. Not people need centric will after that come. People centric we have to develop, as sir has also said, nature centric in their overall presentation, like that. Then documentation of indigenous knowledge. We have these are the oral traditions. They know their knowledges. When you go to study these ethnomedicines, they will not take you to those fields. They prepare the medicines. They will give you the medicine. Creation methodology they never say. Well, because that essence will go. They think that they have in their mind that essence will go. That's why indigenous knowledge system they have maintained their own spirit. They do some mantra, then tantric some rituals they do. They are positive when it comes to illness healing. They are positive towards. Like that, we have to use these knowledges, then inculcate within the our knowledge system. Then we have to produce and serve for the society. Conclusion. The impact of globalization and cultural beliefs on tribal health and healthcare practices are complex and multidimensional. While it has enhanced access to modern healthcare and health informations, it has also disrupted traditional systems and introduced new health risks. Cultural beliefs continues to shape health perceptions and behaviors serving as both protective resources and barriers for modern care. Sustainable improvements, that is, as per the SDA goal in tribal health, requires culturally sensitive, inclusive, and inclusive. That word has its own theme: inclusive growth, sensitive, and integrative approaches that respects indigenous traditions while ensuring access to quality healthcare service, that is accessibility, availability, affordability, and accountability. Balancing global health advancements with cultural preservation is essential for achieving health equity among these indigenous peoples. These are the references where I went through. Thank you. That is in Kannada, Sharanu Sharanarthi. Thank you.
Thank you, Dr. Ashok Patil. Any questions from the audience? If no questions, then we'll move on to the next paper presentation by B.V. Ravi Prasad. The paper is on a study of the drainage and shampoo of communities of Andaman and Nicobar Islands. Welcome, you, sir.
Good afternoon to all of you, and respected chairperson and the organizing secretary for giving me opportunity for presentation today. So my paper is on health and well-being implications of extremely isolated tribal communities, a study of Wongi and Shompen of Andaman and Nicobar Islands. So many of you know that the Andaman and Nicobar Islands is a group of islands, and this is the Union Territory, and it is about 150 kilometers of the north of the Indonesia, and it is very close to the Indonesia, and separated from Thailand and Myanmar by the Andaman Sea on the east side, and we have a Bay of Bengal on the west side. This is Bay of Bengal, and this is the Andaman Sea. So Andaman and Nicobar Islands both are separated by a 10-degree channel, which equates with the Earth 10 degrees latitude. So there are about 572 islands, islets, and rocks, and the length of the Andaman Islands is 467 kilometers. Maximum width is 52 kilometers. Length of the Nicobar Islands is 259 kilometers, and maximum width is 58 kilometers. See, the population is about 3.80 lakhs, and the density is 46 persons per square kilometer. So in Andaman and Nicobar Islands, many of you know that there are two type of racial strains are there, racial groups are there, and one is Negrito, and the upper one is they are all called as Negritos, and we have a Negrito, Great Andamanese, Ang, that means Jarawa, and Wongi, and Sentinelese. These are the four groups under the Negrito group, and Mongoloids, they are Shompen and Nicobaris. This is the typical Shompen, and these above are they are the typical Wongi. That means that is the Negrito people. So now all the Negritos, they share a characteristic feature, some of the physical features. They are very short in stature, well proportioned body build, and broad head, face shape round and or square, and straight nose, dark skin, peppercorn hair, and scanty body hair, and they have sometimes a steatophysia, which is very prominent in the some of the women with a lumbar curve. So Spanish people, they thought that in the 17th century, they start explore the Luzon. Luzon is almost above the Philippines. There they have a black skinned, frizzly haired people. They are known as Agata, and which named as Negritos de Monte. And it was believed that many of the Britishers said that these people, they have reached the Andamans by a shipwrecked Negroes from the Arab or Portuguese. So this view was subsequently corroborated by many for a quite long time. For about a centuries together, this was the view of the how these people they reached the Andamans. So the Mongoloids, they share yellow-brown skin color, straight coarse hair, scanty beard, and prominent cheekbones, oblique eyes, and shovel-shaped incisors, and maxillary shovel-shaped incisors is quite high. And these are the people of the Shompen of the Great Nicobar Islands. These photographs were taken for quite long, a much longer time, about 40 to 45 years back. That's why you can show the, can see some of the not good in condition. So these are the about the area, population, male and female of the six tribal communities in the Andaman and Nicobar Islands. And it is now the Great Andamanese, they are rehabilitated, and Wongi also has rehabilitated. Where they are still in the interior of the Great Nicobar Islands. So the population is 64, 119, 40, 466, 150, that is a estimated population, and Shompen is also 238. These are the as per the 2011 census figures. So the Nicobar Islands, they have a strategic location because they are very close to the Strait of the Malacca, and that's why all the ships which pass through from the from Iran or Iraq towards the Singapore or Thailand, they have to pass through the Strait of the Malacca only. That's why the Nicobar Islands, they have a constant international sea. It is on the almost in the international sea route. So several people they have attracted because of there is a lot of coconut plantation is there. So in the mid 17th century onwards, several sailors they used to come and they used to have some sort of contacts with these people, and there was a quite prevalent barter system existed in these islands. So the first one is Danish Moravian missionaries. They have established a first they explored the Nicobar Islands, and but they failed because there is a harsh climatic conditions and malaria fever was very high. And lastly, the Danish missionaries they left the Nicobar Islands, and at that time the health facilities in these islands were non-existent or almost remained poor. So the same situation persisted after the British took over the islands in the late 19th century. So the six indigenous tribes of the Andaman and Nicobar Islands, they were declared as in 1959 as the first scheduled tribes. That is a protection of the aboriginal tribes of the regulation 1956. And after that, in the 1975-76, they were declared as the poorest of the poor. And in 1993, they declared as the primitive tribal groups, and now we are calling as them as particularly vulnerable tribes, because the primitive is the word is replaced by particularly because it is loaded with a cultural sensitivity. So these are the people of the Shompen, and this is the down one is the Ongi. Now, my present study is that in the Shompen and Ongi, both are the PVTGs. That means particularly vulnerable tribes. And the Shompen, they are nomadic, and they are hunter-gatherers in the Great Nicobar Island. And Ongi, they are rehabilitated, and in Jugang Creek in Little Andaman in the late 1970s, and mostly depend on the government ration, and they have reached almost a settled way of life. Occasionally, they hunt a wild boar or gather roots and tubers, honey, and from micro environments of the island. So, health facilities are at the doorstep of the Wongi. That means the two ANMs are posted, and in Jugang Creek, they monitor their health. In case of Shompen, the medical staff they periodically they visit the settlements, and or whenever any information received that any individual sick, then they immediately rushed with the medicines and life saving machines to campsites. So both these communities were isolated island communities. That means had a little contact or a no direct contact with the outside world. So it is believed that perception of medical practitioners and health professionals, when a community is isolated, transmission of diseases either whether via pathogens or a person to person contact is absent. So spread of diseases from other communities is not possible. So culture change limited and almost negligible. This is the island contact whenever we are talking about the community isolations. So we conducted the field works in the Great Nicobar Islands and Jugong Creek settlement of the Little Andaman Island before and after tsunami 2004. One of the authors in this study, one of my co-author, he had done his field work in the Shompen in 1984-85 and published several research articles in the 1986 onwards. So we have a lot of publications on these tribal communities, and now we are talking about the Great Nicobar Island. So it is the last island in the group of the island in the Nicobar Islands, and it is about 1045.1 square kilometers is the geographical area of the island, and almost 85% of the island is now declared as the Great Nicobar biosphere by because of the unique flora and fauna. So it has a undulating terrain because it has a 5 rivers, and there is a hill is there, the Mount Thulier. That hill is quite huge, and because it is not, whereas the other Nicobar Islands are very flat, but this island has a undulating terrain. So here there are the 5 rivers they flow, and one is flowing towards south, and Alexandria is west, Dogmar west, and Amrit Kaur and Jubilee here. These rivers are quite and navigable, and Galathia is navigable up to 30 kilometers, and whereas the other rivers are navigable only for 20 kilometers. So before going to this one, just I am showing you here, these are the rivers of the Great Nicobar Island, and this is the west coast of the island. This is Pulo Kunj to Hatnoria, that is Indira Point, that is west coast. This is all the about the settlements of the Nicobaris, where we have on the east side, we have a ex-serviceman settlement is there, and we in between these Alexandria River, Galathia River, we find the Shompen are living. So that is the basic ecological distribution of the communities. So all these rivers are to some extent navigable. So the population is, according to 2011 census, 8,046, and scheduled tribes is 898. That means here the scheduled tribes are the Nicobaris and the Shompen. And the population density is 7.69, almost per 8 persons per square kilometer, whereas the Andaman density in Andaman Islands density is about only 46 persons per square kilometer. So the Campbell Bay is the headquarters of the where the all the activities, that means government activities, everything happens there, and we have a health and wellness center is there, and some territorial army battalion is there, one navy is there, copra units are there, and all the ships pass through they touch the Campbell Bay while once in a month, while passing through the Chennai. So here, I think in the 1985, when the Mrs. Gandhi, she wanted to create one of the ex-servicemen settlement here, because these islands are strategically important from the defense point of view. And so she proposed at the time, initially to settle 2,000 families of the ex-servicemen. But finally, what has happened, about 333 families only finally settled, and the remaining were not settled. And in the whatever the land was reclaimed, and in that reclamation land, what has happened? The other people they have, and Ranchi people, some Telugu, other people, they voluntarily they came and they settled there. So this is the now that's why the population of the island is substantially very high. And Shompen settlements, as I told you, that is all the river points where the rivers are there, Galathia, Alexandria, Dagmar, and in around these rivers only the Shompens they live. So in that sense, the Shompens, they are quite inaccessible, or inaccessible even today now also. So this is about the second population which you are talking about, the Little Andaman. This is about it is a flat island, and mode of the moderate elevations are there. And along the coast of the island, the land is flat, which is not more than 50 feet from the height. And Hut Bay is the hub of the activities of the from the. This is the one of the channels. This is known as the Jugong Creek, where we are going to the Jugong Creek settlement. This is the Jugong Creek, where from Hut Bay we have to from capital, that means Sri Vijayapuram, now it is called earlier Port Blair. Now from there we have to reach the Hut Bay. From Hut Bay we have to go to another village, that is a village number 22, that is a Bengali settlement. From there we have to hire a boat and we have to reach the through this channel the Jugong Creek settlement. So this is the actual settlement of the Jugong Creek in the Little Andaman, where the Wongi were rehabilitated in the 1976 and 77. In this settlement, all the facilities are there. That means a health center is there, a sub center is there, a school is there, pump house is there, and electricity is there. They get their drinking water at their doorstep. All these facilities are there. So the life of the Wongi in the settlement is far better than any other PVTZ in the entire India. Whatever sir has told that in the previously Haki-Piki situation, but here the quite opposite situation is everything is available. Their life is almost nothing, what all everything we are provided. So ANM here, one interesting thing is that here ANM every day morning with a water bottle, they go to their doorstep and they administer the drug to the Wongi and she has to come back. This is the situation where you don't find such type of situation anywhere in the any PVTs, because I have visited so many PVTs during my last 30, 40 years of in this field. So emergency medical cases, we have airlift. That means from the Jugong Creek to wherever, where it is Chennai or Vijayapuram. So till 76, no assistance was given. After 1976 onwards, when they declared as PTZ, so all these facilities they are getting. So Little Andaman is the last island where the Bengali refugees were settled. Here also settlements are there. Bengali settlement is there. In the Great Nicobar Island, we have ex-servicemen settlement. Here is a Bengali settlement. So in the context, so these are the settlements are happened, and Nicobaris were settled, and Moflas were settled here, Burmese were settled, and Sri Lankan Tamilians were settled in these islands. So all these, whatever the resource base of the Wongi, earlier it was 50 for 1950s, now it is shrinked to a few kilometers only, few square areas has come down. So this is the Great Nicobar Island Shompen. These are the on the west coast. We have all these villages are the Nicobaris, and east coast and internal near the rivers are the settlements of these things. So the first Danish missionaries, as I told you, they have first explored these things, and their I don't go much about the ethnography now. He had a constant. One of the thing is the very important thing is that always the Shompen they had a constant feud with the Nicobaris in the west coast. Though now it is stopped, but in the earlier it was they used to ride these west coast villages very quite often. So they eat pandanus fruit is the staple food, and the meat of the wild boar and fish. That is their thing. And we have established a Shompen complex in 1984. Since that time, we have a contact with the Shompen. Till such time, whatever we say, that is only head count. What was the population? So this is the Ongi of the Little Andaman Island. These people also, they staple food is wild boar and fish and root. And here all the facilities are provided. And these are the this is their hostile this there sometimes I think friendly relations were established 1886, 1887, much later than we have established the friendly relations with the because here in this case it is much earlier. The first Danish identified about 1831. That means we have a established contact with the Shompen in 1831. But whereas in Ongi it much later. That means 1886, 1887. So these are some of the things which is very important. These are the population of the Ongi and Shompen, and from 1901 to 2020. And this is how the population, there is a grab from 348 in the Shompen population in 1901, it has drastically reduced to 20, and 7192, again it is 212, and now it is 219. So these are the now, because in these periods of time, there was no actual counting of the population, because it is head count they used to do. How many huts are there? What is the how many each hut? How many can be accommodated? Like that they used to do. So that's why these figures are little. Sometimes it is more, sometimes it is less also. So this is the population of the Wongi. It is 672 in 1901, which gradually reduced to the 118, and the population from 1981 to 2001, it is almost stabilized. That means 96, 97, like that only. It was there is a slight increase after 2001. So, although first contact established by British Danish missionaries, um, population is quite available from 1961 onwards only. So, these are all about how the population decreased. That I have already discussed now. And the Wongi were estimated in first time in 1901, and first time in the 1931 census. There is there is a first time there's a ethnographic account of the Shompen was written in 1931 census. So we from that time onwards we have these are the Nicobar Islands. As was the disease were quite prevalent, and syphilis, elephantiasis, all these diseases were prevalent. And here Portman observed hereditary syphilis and elephantiasis, scurvy, all these things. And Verma reported 30% of the sterility and 47% of mortality, major causes for these things. So these are the food and drinks, and almost a adult Wongi consumes almost 1 kilogram of the traditional food, which comprises protein, 0.80 grams, and 2 point carbohydrate, and fruit and honey. So these are the foods of this is the pandanus fruit. Just 5 minutes. Pandanus fruit, and these are the some, starfish. This is all, and these things are the thing. And these are some of the ethno-medical practices of the Ongi and Shompen. These are Botanical Survey of India people. They have reported these things, and here we talk about the four. These are the now introduced items. Rice and all these things are introduced in their society, and these are the height and weight of the arm circumference and skin fold thickness of these Shompen, male and female. And this is the regional medical center, ICMR, Port Blair. They have done all these studies, and these are the weight, how it is decreased, and arm girth, it is increased in these populations, Shompen. And this is the about the all these the data were collected from them. So this is all about the publications of the ASI, Anthropological Survey of India, and NIN Hyderabad, and RMRC Port Blair. So these are the items we introduced into the Wongi and Great Andamanis. These are this is about the Wongi male and female. They are the height, weight, and all these things, arm girth and skin fold thickness. Here it is there is a gradual increase in the height, and there was both in male and females, and there is a gradual increase of the there is a slight almost in some increase is there in the body weight. And this is all about these are the things about we discussed here. These are some of the publications of ours, and based on these publications only this presentation is presented. Thank you for listening patiently, and thank you all.
Thank you, Ravi Prasad sir. It was a wonderful presentation. Any questions from the audience? Okay.
ಒಟ್ಟು ಈ ಗೋಷ್ಠಿಯಲ್ಲಿ 3 ಪತ್ರಿಕೆಗಳನ್ನು ಮಂಡಿಸಲಾಯಿತು. ಆ 3 ಜನರಿಗೆ ವಂದನೆಗಳನ್ನು ತಿಳಿಸ್ತಾ ಈಗ ಅಧ್ಯಕ್ಷ ಹೇಮಲತಾ ಮೇಡಮ್ ಅಧ್ಯಕ್ಷ ನುಡಿಗಳನ್ನ ಆಡ್ಬೇಕಂತ ಕೇಳಕೊಳ್ತಾ ಇದ್ದೀನಿ.
All the three presentations were very wonderful, and I congratulate all the presenters as well. And if I have to give comments, I'm not such a great person to give very good comments, but still, whatever I have observed, I would like to present them. Coming to the first paper presented by Dr. Ramakrishna sir, study on socio-economic development of Akkipikki community in Belur Taluk, Hassan district. Sir has wonderfully observed certain social parameters and as well as their economic developments, their barriers, and he has wonderfully brought out the points of identity crisis in them, which we usually neglect and which we feel that that is the last thing to be observed. But I appreciate sir for identifying that fact. And sir has also give wonderful conclusions as well. I just wanted one clarity from sir. Whenever you were doing the study, did you ever think of meeting the community head and finding out the barriers why they are not getting the things?
Instead of that, I connected to the concerned PDOs also, Belur. I connected, interconnected. They told me that, next month we will provide you all the facilities. We have to extend. Not only they can answer me, head of the one community, particularly for Akipiki. It's besides on the way of the Belurs. I asked him. He told me like that. He is the head of that Akipiki community. He told me that gradually they can, whenever we have go to ask in the Jila Panchayat CPO or something like that, they told me the same thing. It has been gradually extending, madam. When it will, we don't know about that. He told me like that at the time of conducting primary survey. Thank you very much, madam.
Okay, thank you, sir. And also, the second thing I would like to understand as a practicing obstetrician, that did you observe any factors why there was early marriage in them, and were there any could you help them out in getting the knowledge that early marriages can lead to health?
Actually, they don't have a basic awarenesses for that. Particularly, they have to, we have to conduct seminars like that. Anyhow, awareness programs must be essentially required for them to extend the exact age. What's the age, 18 or 21, must be clear. To clearly they tell them. Usually, this early marriages has been generation to generation has been continuing, madam. Should be avoided. Like a best sociologist or anthropologist must tell the truth of that why they're getting early marriages. It should be sometimes negative, sometimes positive things also it is there. But anyhow, the concerned the either doctors or something, the related persons, they can tell. First, they have to create the awarenesses, madam. They have to extend the age. What they have to fix according to demographers. That would be such a one kind of the development is concerned, what I feel is that, madam. That would be the another drawbacks for that. I have identified while I am conducting that. Well, I have also suggested that many times, though I have to meet a concerned gynecologist or something like that. That would be, most essential for that. Even though, madam, one thing also I highlight mentioned in the as of now, the demographer says that according to our HTA rankings, Human Development Index, the life expectancy ratio has been gradually declining. 79 women, 73 men, now 72, 69, 69 to 63, 66 to 62, 63 to 61, gradually declining the life expectancy of the average age. It has been less. They have to, demographer has been identified. But at the same thing, Human Development Report in and education, but at the same time, health. Whenever the peoples of the Akipika community is educated, maybe they converted gradually all the things, maybe upliftment gradually things. This is I would like to share. Thank you very much.
Thank you, sir. I congratulate once again to Dr. Ramakrishna sir for presenting such a wonderful paper. And there are a lot of things which help us understand this community, and also it opens up more scientific research to be done in this area where sir has pointed out so many things. So it was really a very informational paper. Thank you, sir. Thank you. Coming to the next paper presented by Dr. Rishabh Patel sir on the impact of globalization and cultural beliefs on tribal health and healthcare practices. Sir has wonderfully told about the positive impact regarding access to healthcare services, modern medicine technologies, and also negative impact like erosion of the indigenous knowledge system, epidemiological and lifestyle transition, cultural beliefs and tribal healthcare practices, he has told. Um, I was I want to congratulate sir for observing this one very important point, that is the strength of the group. I would say the most important point is the coexistence of traditional and modern system, potency of the drugs. So this would not only bring economic empowerment to the community, it will also bring the social empowerment, and we also can learn from them, and they also will learn. This is very important strength of the paper, I would say, and we would take this knowledge. And I did not understand one weakness of this paper. That one point I was not clear with was how we how do you think it is a threat to the cultural autonomy? Our globalization. How do you think this is a threat to the cultural autonomy of the tribal people? It was not so well explained. I did not understand properly.
On the name of the development, as per now, the UNO got SDG goals, Sustainable Development Goals, also known as Human Development Index. These factors also counts. Now, I have Human Development Index repeating for Uttar Karnataka, and Uttar Karnataka districts and Dhara district. Currently, we are working. They will consider these parameters. We have to go specific sample size. When it comes to totalistic approach, those things will not count. That's why they have a fear that their cultural backgrounds will go. That will alter. Another researcher will come that take that knowledge, he alter, align them accordingly for his mindset and knowledge. That's why that knowledge will go to the free, then it is okay. Otherwise, it alters, but essence will go. That is my intention according to that.
Okay, thank you, sir. Congratulate once again to Ashok sir for his wonderful presentation. There are a lot of things to take from his paper. And coming to the last presentation, last but not the least, his most wonderful presentation of the session, that is conducted by B.V. Ravi Prasad sir. Sir, my one clarification is, was the study done? What was the study duration, sir? From which year to which year have you conducted the study?
I was actually posted in 1990 in Andaman and Nicobar Islands. That was my first posting from in Anthropological Survey of India. I stayed about 7 years there, 97, and again I was went in a higher position to same Port Blair in 2015 and 2017. So my Wongi study was done in 2017, but whereas the Shampan we did in the 1990s, and my co-author is a very senior now. He is about nearly 70 years, and he was doing for the last 40 years. That means 1985.
I would like to have the audience to applaud sir, because he has personally stayed in very close to the Andaman and Nicobar indigenous peoples. It's very rare to see. Please, once again, I really applaud from my heart. I also want to applaud sir, and for knowing the people, how the people in very near contact. You have brought out very nicely the information regarding the Range and the Champagne tribals, and you have told us that if we our efforts, we will be able to reach out the tribal areas. So hopefully, when you have told the Onge people, they have got all the facilities. They have the Anganwadi worker visiting them every day. So we just have to find out what are the barriers where we are lacking when we are reaching other tribal areas. So that is one. If you can reach only, why are we not able to reach others? Well, that is one question, curious question from myself. If I do it only, why can't we do it for other tribals? That is my thing.
One thing, if a death happens in Ongi, it goes up to the parliament.
Okay.
If a death happens in the Hakipiki, it will not reach is to the Mysore also. So this is the difference.
So,
That's
to stay in this.
Ah.
Welcome. We request the organizers to invite some MPs or MLAs or please let them understand how it is to make an impact, to bring an impact, what it is, what it takes. So really congratulate, sir. Thank you very much. Thank you for all the patient hearing. Thank you.
Sir, ma'am, along with sir also, one of IAS officer working there, Auradi sir, he's from Belgaum district. He's working only on these tribals only. When it comes to population, they are decreasing population. Government is investing lot of money compared to these tribes. They are investing. Sir, already know that those things. They are working there. We're also happy, madam, that see such a people. They can't allow actually. Madhubala Chakravarti worker. But one anthropologist from Chatterjee, no, sir, no, Dwivedi. He also went first time, professor. We visited. After that, one missionary went. They did not allow. They killed him. On the name of conversion, he went that time. Thank you.
ಎಲ್ಲರಿಗೂ ವಂದನೆಗಳನ್ನು ತಿಳಿಸುತ್ತಾ ಈಗ ಡಾಕ್ಟರ್ ಹೇಮಲತಾ ಮೇಡಮ್ಗೆ ಗೌರವ ಸಮರ್ಪಣೆ ನೀಡಬೇಕಾಗಿ ಸಂಸ್ಥೆ ಉಪನಿರ್ದೇಶಕರಲ್ಲಿ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಎಲ್ಲರಿಗೂ ವಂದನೆಗಳನ್ನು ತಿಳಿಸುತ್ತಾ ಈಗ 5ನೇ ಗೋಷ್ಠಿಯನ್ನ ಡಾಕ್ಟರ್ ಕಲಾವತಿ ಕ್ಷೇತ್ರ ಸಂಶೋಧಕರನ್ನ ಅಭಿವೃದ್ಧಿಕೊಳ್ಬೇಕಂತ ಕೇಳುತ್ತೇನೆ.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈ ದಿನದ ಕೊನೆಯ ಸೆಷನ್ಗೆ ಎಲ್ರಿಗೂ ಸ್ವಾಗತವನ್ನು ಬಯಸ್ತಾ ಈ ಸೆಷನ್ನ ಗೋಷ್ಠಿಯನ್ನ ಡಾಕ್ಟರ್ ಮಂಜುನಾಥ್ ಪಿ, ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್ DOS ಅಂಡ್ ರಿಸರ್ಚ್ ಇನ್ ಸೈಕಾಲಜಿ, KSOU ಮೈಸೂರು, ಇವರು ವಹಿಸ್ಕೊಳ್ಬೇಕಾಗಿ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ. ಹಾಗೆ ಡಾಕ್ಟರ್ ಪೂರ್ಣಿಮಾ, ಗವರ್ನಮೆಂಟ್ ಆಯುರ್ವೇದ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು, ಇವರು ವಾಟರ್ ಬೋರ್ನ್ ಅಂಡ್ ವೆಕ್ಟರ್ ಬೋರ್ನ್ ಡಿಸೀಸ್ ಬರ್ಡನ್ ಇನ್ ಟ್ರೈಬಲ್ ಕಮ್ಯುನಿಟೀಸ್, the impact of globalization, Ayurvedic management, and the imperative for safe wash practices. Professor Kandikere R. Sridhar, visiting professor, Central Research Laboratory, NIT, Dean to the University, Mangalore, Karnataka. ಇವರನ್ನು ಕೂಡ ವೇದಿಕೆಗೆ ಆಹ್ವಾನಿಸುತ್ತಿದ್ದೇನೆ. ಡಾಕ್ಟರ್ ಪಿ ವೈಷ್ಣವಿ, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಪಂಚಕರ್ಮ, GAMCG and Mysuru. ಇವರು ರಿಚುವಲಿಸ್ಟಿಕ್ ಪಾತ್ ಟು ಮೆಟಾಬಾಲಿಕ್ ಹೆಲ್ತ್ and Ayurvedic decoding of the Buddha practice in Kanchipura. ಈ ವಿಷಯದ ಮೇಲೆ ಪ್ರಬಂಧ ಮಂಡನೆಯನ್ನು ಮಾಡುತ್ತಾರೆ. ಹಾಗೆ ಡಾಕ್ಟರ್ ಅನುಶ್ರೀ MS, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಪಂಚಕರ್ಮ, GAMC and Mysuru. ಇವರು environmental radiation exposure and its health implications among tribal communities of Karnataka and Ayurvedic perspective ಎಂಬ ವಿಷಯದ ಕುರಿತು ಪ್ರಬಂಧ ಮಂಡನೆ ಮಾಡಲಿದ್ದಾರೆ. ಸುಮಾ ಮಂತ್ರಯನಮನ್, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಸಂಹಿತ ಅಂಡ್ ಸಿದ್ಧಾಂತ, ಗವರ್ನಮೆಂಟ್ ಆಯುರ್ವೇದ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. ಇವರು ಬ್ರಿಡ್ಜಿಂಗ್ ಟ್ರೈಬಲ್ medicinal knowledge and Ayurveda pathways toward evidence-based healthcare in the era of globalization. ಈ ವಿಷಯದ ಕುರಿತು ಪ್ರಬಂಧ ಮಂಡನೆಯನ್ನು ಮಾಡಲಿದ್ದಾರೆ. ಡಾಕ್ಟರ್ ಶಿಲ್ಪಾ ಹಜೇರಿ, ಗವರ್ನಮೆಂಟ್ ಆಯುರ್ವೇದ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. ಇವರು equity in action, transforming tribal women health care ಡೆಲಿವರಿ ಥ್ರೂ ಇನ್ಕ್ಲೂಸಿವ್ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಪಾಲಿಸೀಸ್ ಎಂಬ ವಿಷಯದ ಕುರಿತು ಪ್ರಬಂಧ ಮಂಡನೆಯನ್ನು ಮಾಡಲಿದ್ದಾರೆ. ಪ್ರಬಂಧ ಮಂಡನೆಯನ್ನು ಮಾಡಲಿರುವ ಎಲ್ಲರಿಗೂ ಕೂಡ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನು ಬಯಸ್ತೇನೆ. ಹಾಗೆ ಈ ದಿನದ ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿರುವ ಡಾಕ್ಟರ್ ರಮೇಶ್ ಡಾಕ್ಟರ್ ಮಂಜುನಾಥ್ ಪಿ, ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್, ಇವರಿಗೂ ಕೂಡ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನು ಬಯಸ್ತೇನೆ. ಅದು ಹೇಳಿದ್ದೀನಿ. ಪ್ರಬಂಧ ಮಂಡನಕಾರರಿಗೆ ಸಮಯದ ಅಭಾವ ಆಗಿರೋದ್ರಿಂದ ಕೆಲವು 10 ನಿಮಿಷಗಳ ಕಾಲ ಇದಾಗಿರುತ್ತೆ. ಸರ್ಗೆ ಸ್ಪೆಷಲ್ ಸೆಷನ್ ಇರುತ್ತೆ. ಪ್ರೊಫೆಸರ್ ಖಂಡಿಕೆರೆ ಆರಿಸಿದ್ದಾರೆ ಸರ್ ಅವರದ್ದು. ಪ್ರೊಫೆಸರ್ ಖಂಡಿಕೆರೆ ಆರ್ ಶ್ರೀಧರ್ ಸರ್, ವಿಸಿಟಿಂಗ್ ಪ್ರೊಫೆಸರ್, ಸೆಂಟ್ರಲ್ ರಿಸರ್ಚ್ ಲ್ಯಾಬೊರೇಟರಿ ನಿಟ್ಟೆ, ಇವರನ್ನ ವೇದಿಕೆಗೆ ಆಹ್ವಾನಿಸುತ್ತಿದ್ದೇನೆ ಪ್ರಬಂಧ ಮಂಡನೆಗಾಗಿ.
Dear Chairman and reporter and audience and organizers and students. I have already mentioned that I am not an anthropologist and also I am not a tribal, I didn't do much of tribal studies, but because of our interest, we have done some work pertaining to the medicinal plants or wild plants and also wild mushrooms from Western Ghats and West Coast of Karnataka. And our whatever research we carried out, I am presenting it here. I hope you will bear with me. Human nutrition, health, and livelihood. These are basic needs for human beings. That is roti, kapda, and makan. So unless we have this, I don't think that our mind works further. So in that context, that nutrition, shelter, and health is very, very important. That we have already have indigenous knowledge, that is indigenous food items. A lot of people can prepare their own recipe, and the indigenous knowledge is very important with regard to Oriental foods, and we have Oriental medicine. That is dealing with whatever people discussed about medicine by the tribals is nothing but Oriental medicine. Similarly, we have our own ethnic knowledge with regard to merchandise. Whatever implements we need, whatever equipments we need, some of them are agricultural implements we need. That is our indigenous knowledge. So the traditional ecological knowledge, in fact, the term traditional ecological, I made a small change, the traditional ethnic knowledge. So that is ecological is important, but traditional ethnic knowledge, I made a small change relate to culture, livelihood, and biodiversity. Unless we have good biodiversity, I don't think that we can flourish. So that is what I am going to contemplate, that we are heavily dependent on plants, animals, and microbes, directly or indirectly. My talk is going to provide you some information pertaining to plants and microbes, not on animals. But nevertheless, animals are also important with regard to the necessity of human being. So that all these things ponder around conservation of nature, and we should think that we are part of nature rather than we are alone like that. So we are part of nature. By that we can start loving nature rather than standing outside the nature like that. We are not independent entity. We are all invariably we are attached with the plants, animals, microbes, and we harbor lots and lots of bacteria and fungi in our skin surface. And also we have a lot of fungi, bacteria, protozoans in our intestine. If microbes are not there, I don't think that we can survive. So the traditional ethnic knowledge, as I mentioned, animals, microbes, and plants. Animals, wild and cultivated. Products, you think about meat, leather, wool, and other byproducts. Processed food, medicine, and products. With regard to microbes, wild bacteria and fungi, food processing and fermentation, food, beverage, and medicine. See, tribals may not have good knowledge on microbes. They may not know what are these virus, what is this bacteria, what is this fungi, protozoans like that. But invariably, they are using that for their food preparation or fermentation. Indirectly, they are going to support microorganisms. With regard to plants, everyone is aware that it is wild and cultivated, or that plants and agriculture and forestry dependent on different types of plants, and food and fodder and medicine comes from the plants. But we all know that what is happening with regard to monoculture. So the monoculture is always dangerous, because if something goes wrong, entire thing will be vanished. Either viral disease, or bacterial disease, or any type of pathogenic fungal disease is going to ultimately wipe out some of the plants. So the traditional knowledge is pondering around these different types of organisms. And with regard to plants, nutrition and medicine, this we are depending heavily on plants for nutrition and medicine. And about 17 tribes in Kodagu use wild plants, leaves, fruits, tubers, as nutraceutical source. Nutraceutical means it is a blend of nutrition and pharmaceutical. So, but certain food material will have nutritional property as well as pharmaceutical property. That's why it is referred as nutraceutical. That term has been coined as nutraceutical, and it is by taking that, it is possible to. It is something like you are eating a banana, or orange, or apple, that is having certain stimulant to produce some of the features in our gut intestine. Stimulus can be given by that. So that's how it is edible vaccine. They are referred as edible vaccine. So the vaccine inducing property will be there in some of the plants, that is engineered plants. Anyway, nutritional and medicinally rich, for example, Diplasmium esculentum is a fern that is known as Thermesoppu. I don't know if those who are from Kodagu, they may know Thermesoppu. There are several varieties of that Diplasmium, and that is referred as fiddleheads. Fiddleheads, it is circle like, it is the tip of that is circled. That part is tender part is used for edible purpose and also medicinal purpose. Floral honey is used as source of vitamin, minerals, and also it has a lot of sugars and fiber. And to treat some of the diseases, dermal diseases, honey is used. That traditional people they know how to use honey as a medicine. And nearly 20 different types in Karnataka use 130 plant species treating for specific ailments like cough, dermal diseases, piles and wounds and such type of things. And in Gulbarga region, there is the Lambani tribe use Lactuca seriola, one of the plants that is in Kannada. It is referred as Hattarke Soppu, that is used for the as it is part of vegetable of some people in Gulbarga, and also that is given for the lactating woman. It is going to increase the lactation in case of women. So these are some of the examples. For example, Justicia. Justicia is known as Artisoppu. It is known as Artisoppu in Canada. Second one, top second one is that is Garcinia gamigata. That is Punarpudi. Otherwise, it is also known as Muruganahuli. In Kannada, it is referred as Muruganavali or Punarpudi in Tulu. And the third one, that left one, that is what I mentioned, Thermesoppu. That is the plant. And lower one, you can see that the fiddleheads are circled like that. And that is used by a lot of people in Western Ghats. And then last one is the Hattarke Suppu. That is a very important plant. And it grows in most of the agricultural fields. And it looks like it is a weed. But although this is a weed, it is very useful for for our human nutrition. So, with regard to coastal region is concerned, lot of coastal people or coastal tribes are using uh, 25 legumes as nutritional, medicinal, and pasture foods. So, legumes means dicots. So, the bele, whatever bele agutte, that they are referred as dicots. And this dicot, we are very particular about dicots because it is nitrogen fixing. It will fix atmosphere nitrogen. You need not necessarily to spend more energy for that. Automatically, it will gain energy from the atmosphere, and ultimately, it is going to do that because they have NIF gene in them. And there are two important plants known as Cannevillia cathartica and Cannevillia maritima. That is in Tulu, it is known as abare. Whatever we use here, abare, it is same type, but it is slightly different than that. And tender pods used as vegetable, and the seeds, so seed integument or the testa consists of two important toxins. One is cannabinine, another one is canaline. So cannabinine is another. So these are the toxic materials, and that those are present in the integument of the seeds. So they have the knowledge to remove that integument. ನಾವು ಹಿಸ್ಕವರೆ ಬೇಳೆ ಅಂತ ಮಾಡ್ತೇವೆ. ಐ ಥಿಂಕ್ ಯು ನೋ ವೆರಿ ವೆಲ್. ಅವರೇ ಹಿಸ್ಕವರೆ ಎಲ್ಲ ತೆಗೆದುಬಿಡ್ತೇವೆ ಮತ್ತೆ ಅದನ್ನ ಮಾಡ್ತಾರೆ. ದಟ್ ಇಸ್ ಇಟ್ಸ್ ಓನ್ aroma and flavor. Same thing they do and they eat it. All this knowledge comes from the traditional. They're inherited by elders. Like up to 12 coastal wild plant species serve as food, fodder, and pharmaceuticals. We have published a lot of papers on how these plants are useful as pharmaceuticals, including some of the coastal sand dune plants can be used to dye preparation. Some of them can yield dye. So textile dyeing, and even we can use that dye for food preparation. So that is edible food, edible dyes, where now ಬೇರೆ ಏನೋ ಕಲರ್ ಹಾಕೋದಕ್ಕಿಂತ natural color is always biodegradable and it is good for health. And similarly, formulations. What is formulation? If you have particular type of food material, how do you transform that into um, eatable or edible purposes? Or how do you transform? For example, if I give you some example that if you eat uh, any type of food material, it should have some taste and its texture is very important. So ನೀವು ಐಸ್ ಕ್ರೀಮ್ ತಿಂದ್ರೆ ಐಸ್ ಕ್ರೀಮ್ ಟೆಕ್ಸ್ಚರ್ ಇರಬೇಕು. ಅದು ಇಫ್ ಇಟ್ ಈಸ್ beverage like you cannot enjoy drinking a ice cream like beverage. So ice cream ಅಂದ್ರೆ ಐಸ್ ಕ್ರೀಮ್ ಆಗಿರ್ಬೇಕು, ಅದೇ ಟೆಕ್ಸ್ಚರ್ ಇರಬೇಕು, ಅದೇ ಇರಬೇಕು. So those are all they prepare juice, leaf consumption, paste. They make paste and topical applications. There are formulations either for food purposes or for the medicinal purposes. And there is one more type of legume that is known as three types of legumes are there in Bangalore coast. That is Susbania bispinosa, Susbania grandiflora, Susbania speciosa. So Susbania speciosa ಅದು ಹೇಗೆಂದ್ರೆ ನಮ್ಮ the Susbania bispinosa has seeds. It is something like a bullet-like seeds. Whereas Susbania speciosa ನಮ್ದು ಹುರುಳಿಕಾಳು ಇರುತ್ತಲ್ಲ, ಚಪ್ಪಟೆ ಆಗಿರುತ್ತಲ್ಲ, ಆ ರೀತಿ ಸೀಡ್ಸ್. ಸೊ ದಟ್ಸ್ ಹೌ ಯು ಕ್ಯಾನ್ ಐಡೆಂಟಿಫೈ. Tribals are identifying that. And the grandiflora is different. And I have seen only one grandiflora in Mangalore city. I don't know whether it is still there. It has been removed. But these are all very useful plants used for nutritional source, human nutritional source. Flowers are used. Grandiflora flowers are used. Foliage is green manure and fodder. So these are the plants what I was mentioning. Cannevillia cathartica. This is Cannevillia maritima. How do you identify them? So Cannevillia cathartica have pointed leaves, whereas Cannevillia maritima has blunt tips. It is blunt, whereas it is pointed, bigger leaves. These are smaller leaves. And another interesting feature is, if you take a seed, there is a hilum. Hilum is the region where it germinates. Hilum. The hilum is lengthy in case of cathartica, whereas maritima it is sharp. So this is ethnic knowledge. People know that this is ಅಬ್ರೆ ಬೇರೆ ಸರ್, ಇದು ಬೇರೆ ಸರ್, ಇದೇ ಬೇರೆ ಸರ್ ಅಂತ ಹೇಳ್ತಾರೆ ನಾವು ಇದು ಕೋಸ್ಟಲ್ ರೀಜನ್ಗೆ ಹೋದಾಗ. So this is again the Cannevillia maritima plant. It is the pasture. A lot of foliage eaten by the livestock. And this is the ripened pods. And that's what I'm mentioning you. This is cathartica. The hilum is lengthy. But in case of maritima, it is very short. It is half of this, not this much. It is almost 75% of the length covered by hilum. So this is how people will distinguish. So these are all Susbania bispinosa, Susbania speciosa, and Susbania grandiflora. These are the three different plant species used by tribals of coastal region. So there are several types of beverages are there. Some of them are non-alcoholic beverages. Wild palms are used for production of beverages. Borassus flabellifer, Caryota urans serve as extract for nira for inflorescence. So this nira is having a lot of minerals and a lot of vitamins, especially vitamin A and C are plenty in that. So therefore, before sunlight, it has to be taken, consumed. Or now we have to, as we are sophisticated people, we have to find out how to keep the nira without transforming into arak. How to preserve it, how to maintain the nira quality, not transform into arak like that. So that's what modern techniques are required. With low sugar, highly suitable for diabetic patients. And also there is another point Professor Prasad mentioned about this pandanus, another wild plant in the coastal sand dunes. Pandanus, different tectorius and such type of species common in coastal region. They produce interesting fruits, very rich in vitamins, vitamin A. And the African coast has lot of pandanus. And the women and also everyone is going. It is something like a jackfruit like, and it can be opened and it can be eaten like. So I will show see, this is the Borassus flabellifer. See, people are cutting all these things erratically and without knowing its importance. See, this is where they produce nira, and this is Caryota urans. Caryota urans attracts a particular type of animal. It is in Tulu, it is known as beru. I don't know the correct name of that zoological name. See what they do. Beru will come here and lay the litter, and they raise the family on the canopy, and then they go away from this. So this is a very interesting plant. In my garden, I have one plant of this. I never allowed anybody to cut it. I have preserved it. But unfortunately, I don't have this. In Tamil Nadu, there is a lot of coastal region. There is a lot of Boraces flabellifer, and also there whatever tender coconut-like thing that will be used for during summer. They are using that. So the pandanus, see this is the fruit, unripened and ripened fruit, and this is the plant, and also it is referred as true pine in coastal region, Mangalore. They make a sort of rice item known as mude. So this what they do is they put inside this and then bake it, and this is the made up this utensil like thing made up of leaves of pandanus. So it gives a sort of flavor to the flavor to the dish what they're preparing mude, and also sometimes it is also referred as pottige. Pottige is also another name for that. And a lot of microbes are important for us. And of course, we harbor without microbes we cannot live, and microbes as microbes also cannot survive like that. So it is a sort of symbiotic association, mutualistic association. So certain type of ethnic foods serve as prebiotics and probiotics. So, for example, I gave information about the uh, uh, Susbania, bispinosa, and so the three species are there. This Susbania consists of a particular type of gum known as galactomenon. Galactomenon is a gum. It is a carbohydrate. That carbohydrate will not be digested in our body, but it supports useful bacteria. They are referred as prebiotics. So, like lactic acid bacteria, bifidum, lactobacillus bifidus, and such type of bacteria will be promoted. So this galactomenon act as a prebiotic. It is supporting that, but it will not be digested in the body. But our intestine will be very nice with this movement. Bowel movement is possible by galactomenon. Lactic acid bacteria and also yeast also very important. 51 species of mushrooms serve as food source for Kodagu tribes. We have evaluated, because fortunately I had a student known as Dr. Karan Chinnappa. He worked with me, and we went to different tribes of Kodagu, and then since he knows about the mushrooms, we evaluated several nearly 17 to 18 different tribals, and then found out 51 species are edible, and they know where to search, and whatever it grows on the termite mounds are edible. And they also know which are all the mushrooms they grow on a particular type of food material, either dead or live, like that. So you know that in Kodagu there is one type of the kesavu. In Kannada it is referred as kesavu or kesu, that grows on the treetop, on the canopy, and that is very delicious rather than the one which is growing on the soil, because canopy is going to accumulate lots and lots of organic material, and this material will be used by different types of organisms, and mushrooms also will grow there. And we need not necessarily to search only mushrooms only on the floor. Instead, we should look up and see whether there is any mushroom on the tree top. Like so, they know the idea how to identify edible, non-edible mushrooms, their substrate, growth stage, and processing. 18 termite mound mushrooms are used. Among 51, 18 mushrooms are termite mound mushrooms, they are termitomyces. And 100 mushrooms have been identified as possessing medicinal values by ethnic knowledge by one of our colleagues who is one of our colleagues who has evaluated these 100 mushrooms. They have medicinal value like that. So these are all termites, the termitomyces, all growing on the termite mound. So different names are there. These are all highly edible and also very important. They also act as prebiotics. And this is the picture sent by my colleague from Madhav Kumar from Andaman, and that is the tribes. Professor Prasad has mentioned that Ranchi and lot of people from West Bengal they are there. Tribals are Ranchi settled in Andaman Island, collecting wild edible mushrooms. See, this is top-like mushroom, And this, I think this is the dermatomyces, and these are the Ranchi tribals are settled there and using mushrooms as food. So ethnic edible mushrooms, there are Amanita species. Amanita, usually they are poisonous, usually. But there are Amanita, they are edible. So fortunately, we got Amanita conagensis. We have given the name of Konaje, where Mangalore University is housed, and it is edible. And in the tender stage, it is known as motte anabe. So there is another that is eaten in the egg stage. Another mushroom known as Astraeus hygrometricus and also odoratus known as Fellanabe. It grows in the lateritic stone, and if we scratch the soil, we will get the that is Fellanabe. That is the stone mushroom like. And the truffles are there. They're underneath. So very interesting feature that they're all underneath. They grow and disseminate underneath. But wild animals, no, because they produce a sort of aroma. That aroma will be not we cannot get it, but animals can do that. So usually people will take dogs with them and they start scratching. That means there is underneath there is a mushroom like that. So that's how truffles are hidden, and that they're delicious and very prized mushroom. Although tribes of Western Ghats consume mushrooms as occur underneath, they will be mistaken as plant tubers. They know they eat mushrooms, they collect the mushrooms, but they think that it is a tuber. Like ಗೆಣಸು ಇರಬಹುದು ಅಂತ, but it is not. But actually in India only 3 or 4 species have been reported on truffles. No other species are reported. So next one, see, this is what I mentioned, Amanita conagensis. It is in Mangalore University campus. These are all egg stage, beak stage, but it has been cut into that. It is dumble stage, and this stage onwards they will not eat it. The reason is it is going to accumulate, most likely it is going to accumulate Amanita toxin when it becomes mature. So till dumble stage they are going to eat. So this is the traditional knowledge. And these are the Astraeus hygrometricus I mentioned, Fellanabe. When it opens up, it looks like this. It is like a earth star like. A star is different, but it looks like earth star. And this is another species. It's something like sitting a spider sitting on the floor, like no, with legs like. So this is the tender stage. It will be eaten. This is looks like baby potatoes. And these are the truffles. Truffles, it is I have taken from the internet. The truffles are underneath. They have taken out, and we have published a book on in CRC Press about the truffles, not from India, but from outside. That is Europe and other regions, and even Brazil and North America and all. We have written a book, and these two books and journals. See, these two books where Professor Gangadhar has contributed for this, and his colleagues like I remember Srinivas and also Lokesh, they are all contributed for this book. And we published two volumes, volume 1 and volume 2, Ethnic Knowledge and Perspectives of Medicinal Plants, Ethnic Knowledge and Pursuit of Medicinal Plants. If anybody wants these books, I will send you soft copy. I have only one hard copy. Soft copy I will send you. Then we have another journal known as Indian Journal of Traditional Knowledge, Journal of Ethnic and Cultural Studies. These are the good journals where we can publish. Future perspective. What is the future perspective? Systematic documentation. Everyone is talking about documentation. We are lacking. Validation of ethnic crimes. It has to be validated. We have instrumentation. We have GLC. We have HPLC. We have a lot of instrumentation. Unless you validate, somebody says it is cancer controlling agent, that has to be tested. Similarly, methodology of formulations for food or medicine. Methods of administration, whether it is intraoral, intravenous, or intramuscular, what type of administration has to be done, like whether it is topical application, and the roles of tribes in environmental conservation, what type of message they give us with regard to conservation is concerned, and also impact of deforestation on tribal community, and also outreach of ethnic knowledge. This is very important because a lot of people have mentioned about how to outreach possible, and digital repository is very important. So I'm highly thankful to Central Research Laboratory, NITA deemed university, where I am visiting professor currently, and also I am adjunct professor in the Department of Bioscience, Bangalore University, and they supported me a lot. Even after my retirement, they are supporting me. Please come to and also give some lecture students like that. And my students, I used to give them lecture, but they used to go to field and collect the material. And also sometimes, most of the time, I used to go with them for collection of samples. And thank you very much for your patience.
Thank you, Professor Kandikere Sridhar sir. Your presentation is very insightful and entire. Your topic is evidence-based and indigenous practice of Ayurveda medicine. Okay, behalf of our Karnataka State Tribal Research Center, once again, thank you for your presentation. Okay, thank you, sir. Now, okay, first presentation by Dr. Purnima, Government Ayurveda Medical College, Mysuru. Topic title is Water-borne and Vector-borne disease burden in tribal communities. Your time limit 10 minutes only, madam. Okay.
Good evening, all. Myself, Dr. Purnima, second year Panchakarma PG scholar, GMC Mysore. My topic of presentation is waterborne and vector-borne disease burden in tribal communities, the impact of globalization, Ayurvedic management, and the imperative for safe wash practices. So, let's go on to the introduction. A disproportionate burden. That is, while comparing to the national average, tribal communities across India face a significantly higher incidence of waterborne diseases like cholera, diarrhea, etc., as well as vector-borne illnesses, especially I have mentioned here regarding malaria. So the root causes include the slow-moving streams in tribal habitations. They provide an ideal breeding grounds for efficient malaria vectors, and the inadequate wash structure, that is water, sanitation and hygiene services, then poor housing which leads to vector exposure, and malnutrition leading to lower immunity and thereby leading to more severe cases and high mortality rates. Along with the causes, we can mention about the impact of globalization here. It has both negative as well as positive impacts. So, first 3 points I have mentioned regarding the negative impacts. First is tap water paradox. That is, they have provided more tap water supplies, but the supply is intermittent, which leads to storing in pots, drums, etc., which leads to contamination, thereby causing diarrhea, dysentery, enteric infections. Similarly, open storage will also cause increased mosquito breeding, which also leads to diseases like malaria. Next is environmental change due to globalization. Uh, Due to increased plastic waste, it will lead to blocked drainage, leading to contaminated water, thereby leading to diarrheal outbreaks as well as increased mosquito breeding. Next is urban spillover in Karnataka. That is, industrial effluence has been increased, which makes the tribal water sources contaminated, which leads to again infections. Similarly, shifting to tube wells has caused fluoride and bacterial contamination, as well as the migration near tribal bells, which caused drug resistant malarial strain exposure to the tribal people. Next is the positive impact. While looking into the positive impact, there is expanded vaccination as well as more funding during these times, as well as more outreach programs to the tribal people. Similarly, ashram schools, where they provide education for the children along with providing filtered water, routine healthcare, which helps to reduce the infection risk as well as improve their immunity. Next, these are the materials and methods where I have referred Ayurvedic classics, contemporary peer-reviewed articles, as well as other epidemiological data. Next, going into the results, disease incidence in tribal versus national average. There is more incidence in tribal area, as I already told, and it mainly is caused due to the open defecation practices as well as untreated natural water bodies, which are the primary sources for these infections. Next, these are some of the common waterborne diseases, that is typhoid, cholera, amoebiasis, acute diarrhea. And I have mentioned the symptoms, which I have, being an Ayurvedic student, I have correlated it to some Ayurvedic conditions, where typhoid can be correlated to Paitiga Jwara, cholera Vishujiga, amoebiasis to Adisara, and acute diarrhea again to Adisara. Next, this is the Ayurvedic management that we can adopt in case of waterborne diseases. So first I told typhoid, Pitta Jwara symptoms mentioned in Ayurveda is similar to typhoid symptoms like stepladder fever. So I have mentioned Pitta Jwara Chikitsa here, where they have mentioned drugs like Indrayava, Gana, Kadugi, Musta, Parpadagam, Tenva, Ashrabu, Nimba, etc. Of these, some of the drugs have been already practiced by tribal people in their daily life. Then Vishujiga Chikitsa. Vishujiga, the main feature of Vishujiga condition is Urdhva Adho Pravritti. That is, both vomiting as well as diarrheal symptoms will be shown, which can be correlated to cholera symptoms. So I have mentioned there Vishujiga Chikitsa. Later, amoebiasis can be considered as one of the condition under Adisara, and the treatment also I have mentioned there. It is to show that already the drugs that have been mentioned in Ayurvedic text is also being used by the tribal people. Similarly, Adisara Chikitsa, the main treatment protocol is we have to do Upavasa Langana kind of treatment. Langana means Upavasa. I hope everyone knows Upavasa. Then they have also mentioned Natu Sangrahanam Yojyam Purvam Amadi Sarini. That is, once they are affected by diarrhea, we should not immediately stop the Vegas or immediately stop. We should, it is like something got infected, it should be removed as such. So initially, we should not stop Adisara or diarrheal diseases. Next is vector-borne diseases. I have mentioned especially here malaria. In malaria, the main feature is there will be a sudden onset of intense chills and severe shivering in the first stage. Later, there will be rapid rising high fever. Later, there will be a rapidly dropping temperature. So, there will be temperature fluctuations which can be correlated to Vishama Jwara, which is mentioned in Ayurveda. Vishama Jwara means Vishama, the term Vishama means irregularity in which is the irregularity in onset, duration, as well as manifestation. In Ayurvedic texts, they have mentioned Vishama Jwara Kashaya based on the symptoms that is presented. So, Nimbam, Amrada, that is Guduchi, these are all used by tribal people, which is also mentioned in Ayurvedic text. So, I have mentioned regarding that. And next is ethnomedical knowledge of plants used by Kunabi tribe of Karnataka in India. Based on that, some of the drugs I have mentioned here. One is Adatoda vasike, which is specifically given in respiratory disorders. Then Osimum sanctum, it is good in case of Jwara. Then Glycyrrhiza glabra or Yeshti Madhu, Andrographis paniculata, Talmega, which is also good in Jwara. Acidoraxta indica has a good antimicrobial property, and Guduchi is also antipyretic in nature and also an immune booster. Now I am mentioning the preventive measures that the tribal people should adopt to in order to avoid such conditions. So the imperative for safe wash practices, that is Nidana Parivarjana, to avoid the disease. So first is breaking the cycle of reinfection. Clinical treatment fails if patients return to contaminated environments. Safe wash practices, that is safe water, sanitation, as well as hygiene practices breaks the transmission cycle of vector and waterborne diseases. Then Nidana Parivarjana, removal of cost, that is to maintain the hygiene. Next is mitigating antimicrobial resistance. Unsafe water leads to repeated infections and overuse of antibiotics, and thereby it will lead to antimicrobial resistance. And last, I have mentioned nutritional synergy and Vyadhikshamatvam. Chronic drug infections impair nutrient absorption. Safe wash is essential to combat malnutrition, preserve urges, and strengthen Vyadhikshamatvam. Vyadhikshamatva means immunity. So, proper nutrition should be provided to the tribal people in order to maintain their immunity, and and thereby it doesn't any disease, even if it is caused, it might not lead to severe stages. And concluding, the recurrence of malaria as well as diarrhea in tribal communities is a systemic issue fundamentally linked to wash failures, and the sustainable healthcare model for tribal populations requires the immediate integration of robust wash infrastructure alongside traditional Ayurvedic interventions and modern acute care. These are the references. Thank you.
Thank you, madam. Very nice and informative presentation regarding waterborne disease.
Thank you.
And any questions from audience side? Okay.
Yes, sir.
Whether in Ayurveda you differentiate different type of malaria because malaria is caused by different or when it is only one malaria is one type of treatment.
In Vishamajwara itself, we have 5 kinds of Vishamajwara, in which one is daily morning they will get fever. In the afternoon period, they won't have any temperature. In the evening, it will again rise. In another type, they will tell alternate days they will get fever. In some cases, in 72 hours. So in modern also they have told like some 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 parasites of malaria causing parasites, they will exhibit symptoms like 72 hours. In 72 hours, again fever will recur. Similarly, within 48 hours, fever will recur. That they have mentioned. Similarly, in Ayurveda also, Sandadam, Sadadam, like that, different conditions are there. So, one condition mentions like alternate days, some conditions morning and evening, some conditions 2-day gap. So, based on that, we can manage the condition.
So in that way, you also differentiate.
Yeah, yes.
Thank you.
Okay, madam, mentioning some clinical symptoms of Vishamasvita Jwara like that. Okay, what basis you identify the symptoms? Any clinical references through your Ayurveda?
Means generally malaria will present
Okay,
with
generally.
temperature fluctuations.
Okay.
So Vishamajwara is also having similar. It will have irregularity in its onset. It will show temperature at different intervals, which is mentioned in Ayurvedic classics.
Okay.
So based on the symptoms, we can correlate malaria to Vishamajwara.
Okay. Okay, thank you. Good. Okay. Next paper presenter is Dr. P. Vaishnavi, Department of Panchakarma, Mysuru. Topic is the ritualistic path to metabolic health and Ayurvedic decoding of the Uttara Gudda practice in Kanchipura.
Good evening, everybody. Myself, I'm Dr. Vaishnavi from Department of Ayurveda Samhita and Siddhanta from JMC Mysore. Here to present a topic on the ritualistic path to metabolic health and Ayurvedic decoding of the Uttare Gudda practice in Kanchipura. So coming to introduction, as we know, like the tribal health systems are usually, we think it as a superstitions, which is like we usually believe like that. But why we think it is like that is because of due to lack of scientific documentation. So, but such practices are not mere faith or belief, but they have some scientific reasoning is there behind every ritualistic practices. So, in this article, I am trying to decode one such ritualistic practice that is called Uttare Gudda practice, which they do in Kanchipura of Chitradurga, and let us see how it is scientifically relevant. So coming to the understanding of the ritual, which is called Uttare Betta practice or Uttare Gudda practice, here there is a temple called Kanchipura in Shivanagar, in Chitradurga, wherein the devotees, I mean the Grama Devata, there is Kanchi Varadaraja Swami. And the devotees of that village, I mean devotees of Kanchi Varada, they prepare, like usually on the September, usually on the Sunday, first Sunday, they prepare curd rice. Not curd rice, it's rice preparation, where there will be rice, curd, milk, ghee, and then onion, garlic, and a little dal they'll be using in that. They'll prepare it and they'll do puja to the god. And all the devotees will, they will put that preparation in one white cloth, that is cotton cloth, and they'll put that inside a bamboo pot. And anyone, in shifting, they will be carrying it to Uttare Gudda, the one mountain which is called Uttare Gudda, where one more lord, that is Siddheshwara god, is laying there. They go there for 15 kilometers trek, and they will keep it a small amount of that rice preparation as prasadam, and they again trek back. But there is certain rules during these rituals where people are not supposed to wear any footwear, and they're not supposed to use any umbrella or any cloth on their head. Like they should be exposed to sunlight, and they should be exposed to rain, whatever it is. And they're not supposed to have like normal food too. Like Sunday evening they're going to leave, and it takes around 1 day. Like by Monday evening they'll return back. And only thing which they're supposed to have is moong dal, what we call as kosambari in Kannada. They're supposed to have only moong dal kosambari and a little bit of panaka. And then on Tuesday, again, Monday evening they'll return back, and Tuesday they're going to do puja for that same prasada, and it will be given in small amount to everybody, like to all the devotees they will give that. So let us find what is the scientific basis. Like all the devotees are practicing it only blindly on belief. But me being an Ayurvedic doctor, I've tried to decode the scientific rationality behind it. So analysis, like based on interrogative analysis, when we questioned the people who practiced this ritual, we came to know that many diseases were treated through this practice. And one among that was prameha, which is not equal to diabetes, but it can be closely related to diabetes in contemporary science. So in this article, the scientific analysis of the same disease has been done. So coming to the understanding of prameha in Ayurveda, so the kledata, something called kledata is present in everyone's body. So as most of them here are non-medical, let me try to tell you in simple words. So if you think your body as a garden, we need to put some water, and then that water has to get transformed in such a way that nice plants will grow. Like that, all your tissues will be properly watered. And then even some excretory system also must be present to take out the unwanted water from your body. So in the same way, there is something called kleda in our body. And if this kledata has been maintained properly, like all the tissues of the body and glucose uptake, like what we call insulin sensitivity in our body, will be in proper manner. And if this kledata is being left like that, either in the form of intake, that is food which you are giving, or the transformation, that is insulin sensitivity, if it is not happening properly, or the excretory, that is through your kidney, if it is not processed and if it is not excreted properly, this kledata will be like in soil, how we see the dampness happen, right? In the same way, the dushita kleda will be present in our body. And this is the main reason for all those prameha like symptoms which we like, diabetic like symptoms which we see, and this main kledata is the main reason for that. So how this kledata dushi, it gets hampered is, it can be because of the ahara intake, the water which you give there, and the transformation is not occurring properly, that is insulin sensitivity, or the excretion is not happening properly. And the main reason for this is the lethargic or the sedentary lifestyle what people are usually going through in this generation. So the treatment must mainly focus on making this kledata normalized. We need to remove that dampness from the body. So in Ayurveda, all the treatments will mainly focus on three things. That is ahara, that is food, and vihara, all the practices which we do every day. And achara is something like the well-being or the mental healthness, everything like that. That can be considered as achara. So first, let me clarify how that one thing I forgot is this rice preparation which they prepare on Sunday, it will be I mean, it will not be spoiled even on Tuesday also, when they have it on the Tuesday. According to belief, they think it is due to God. It has been, I mean, it is fresh even after Tuesday. But when I tried to trace it, there might be many other things which I have traced this. Garlic was used in this preparation, which is again acting as an antimicrobial, that is Crimigna agent. And bamboo pot was used. When we go through that also, bamboo pot will lead to what is that? Aeration and even antibacterial property. This might be having, there might be still other factors, but I was able to trace these two things. So now coming to the treatment of Prameha. So I told three entities will be there, that is Ahara, Vihara and Achara. Coming to Ahara, only moong dal, as I told you, Kosambri was used here to the people who were going for the trek. And that moong is said as Pathya for Prameha in our Ayurveda, where the glycemic index is actually low, which will help to treat the diabetic patient. And even rice, that is shali, what we call in Ayurveda, but this rice was not, it was given just as a prasadam. And at the end of Tuesday, it will be fermented, and this is good, again good for Prameha patient. And even at the end of 3 days, as it is even rice also, their glycemic index will be lowered, which is again acting to treat Prameha. And garlic and onion was used. Garlic here, Medohara. Meda is also a kind of tissue which can be closely related to Kleda only. It is going to make the Haran of the Kleda. And onion, that is Agni Deepaka. Agni Deepaka means, I told you, we put water, it should get transformed also. For the transformation to occur properly, there must be some Agni or some chemical reaction which should be happening in our body. So this onion is going to act on that. And then avoidance of food means it is like something like intermittent fasting, not complete avoidance also, but they're having moong kosambri, as I told. That is again, as my friend was telling, it acts as langhana. Means it is not complete fasting, but an intermittent fasting again, which can help the Prameha patients. And this is believed as ritual purity in according to those types, but it is actually acting as a kleda upashoshana. Shoshana means drying up that kleda. So this is how I was able to decode in terms of ahara. Coming to vihara, even there is a reference wherein that at the last you can see karyani apatarpanani in Charaka Samhita Chikitsa Sthana of Prameha, it is told apatarpana chikitsa should be done. Apatarpana, tarpana is something where you have and you feel trupti like that. Apatarpana means you need to remove the tarpana from your body to treat the prameha. So again, all these factors, that is vihara, as I told you, it is some activities which you do. So we are walking for 15 kilometers, that is trek, that is again acting as a vyayama, where this lethargic or sedentary lifestyle will be removed from that. And then again, there is no footwear, but we need to be careful about this also. Because usually diabetic patient might get wound easily. So I think this ritual will work in initial diabetic stages. So there is no footwear, where marma stimulation can occur. Through that also treatment is happening. And then it is a terrain. It is not like a normal walking. It is a terrain where they're climbing and more amount of their energy is used. And again, it is acting as a langana type of, that is apatarpana, where high intensity activity to burn excess meda or excess kleda, whichever is present in their body. And then they're not using umbrella. That is, we call it as atapa sevana, exposure to sunlight. And some studies suggest that, tell that when we are exposed to vitamin D, the insulin, there is improvement in the insulin sensitivity also. Again, it is adding on to the treatment. And no artificial lights. One more thing I forgot, that during night also, they're not supposed to use any kind of artificial light. They should just aim and they should go, that's all. So by doing this, due to this, dark will increase the focus and releases the hormones that contract the lethargy. So whenever you are in darkness, you will be so active. It is common, we will be more active, like what might be there in front, like that. Even that is also removing your lethargy. So coming to achara, people like tribal people, they're just blindly believing God and doing that. And usually if we only go for some trek, we feel our mind is fresh. So as an achara, mental health also has been improved here. So like this, by ahara, achara and vihara, it is actually acting on prameha. So coming to conclusion, I would like to tell you that these ritualistic practices are not just on belief, but we being in our own, for example, now I'm being an Ayurvedic doctor, I was able to trace something about it. Like that, if we trace all such rituals, we can give the scientific documentation and we can give the proper answering to all these ritualistic practices. So thank you for this opportunity.
Thank you, Vaishnavi. Any questions from audience side? No questions? Okay, good. But yeah. So Uttaraguda practice is blind belief treatment, one kind of blind belief treatment.
ಅವರು ಜಸ್ಟ್ ನಂಬಿಕೆ ಮೇಲೆ ಅದನ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಸರ್. ಬಟ್ ಐ ವಾಂಟೆಡ್ ಟು ನೋ ಇಫ್ ದೇರ್ ಇಸ್ ಎನಿ ಸೈಂಟಿಫಿಕ್ ಬೇಸಿಸ್ ಇದೆಯಾ ಅಂತ ನೋಡೋದಕ್ಕೋಸ್ಕರ ಐ ವಾಸ್ ಏಬಲ್ ಟು
Okay, what types of method you analyze this treatment? Already you says some analysis. Okay, second slide.
I told based on interrogative analysis.
Interrogative analysis. Which types of method are you using interactive analysis?
Means I personally asked the people who were following that ritual, and many of them were telling for like sugar ಇದ್ದವ್ರಿಗೆ ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ ನಿಲ್ಲಾಗಿದೆ, ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ ಕಡಿಮೆ ಆಗಿದೆ. So I thought, why don't I work on that only? And when I opened Charaka, like it was matching with the principles which were given in Samhitas. So I was able to trace this. Sir, it's actually near my village only, this ritual. So I was able to trace this.
Okay.
Thank you, sir.
Okay, good. Thank you. Next participant, Dr. Anushri MS, Department of Panchakarma, Mysuru.
Good evening, everyone. Myself, Dr. Anusri MS, second year PG scholar from Department of Panchakarma, GMC Mysuru. My topic is environmental radiation exposure and its health implication among tribal communities of Karnataka and Ayurvedic perspective. Coming to introduction, we know that rapid telecommunication expansion in tribal belts and installation of mobile towers in forest village and presence of Kaiga nuclear power plant in Uttara Kannada district. These all causes that mobile towers and causes non-ionizing radiation and ionizing radiation by the nuclear power plants like that, and scientific debate regarding long-term low dose exposure to these radiations, and these tribes are vulnerable population and they require precautionary approach. That is the background of this study. Then coming to the context in tribal group in Karnataka, it is forest-based communities in Karnataka. That is, their socio-economic vulnerability will be less and limited healthcare access they get, and nutritional deficiency also they are facing. Then in Karnataka, it is a home to several tribal communities such as Soliga, Janukuruba, and Koraga. These are some types of tribals in Karnataka, and these communities largely depends on forest-based livelihood. Then they often have limited access to advanced healthcare facilities and face nutritional challenges. Because of this vulnerability, even minor environmental stresses may produce significant health effects. So, this radiation may cause some effects to them. Coming to the aim and objective, the aim to evaluate environmental radiation exposure in tribal Karnataka through modern biomedical and Ayurvedic frameworks. Coming to objectives, identify radiation sources and review reported health effects, interpret through Dosha Dadu Ojas model, it is through Ayurveda perspective, and suggestive preventive and curative strategies, and propose integrative policy measures. These are the main objectives of my this presentation. Coming to method, study design is the narrative review approach and conceptual analytical study integrative framework. Then I get the data sources from article on mobile tower radiation. It was on 2026 published, and classical Ayurvedic text, government radiation safety guidelines, and public health reports. Coming to analytic framework, this dosha dhatu ojas correlation with Ayurveda perspective and preventive and curative model development. What are the results from this? The non-ionizing radiation from radio frequency electromagnetic radiation. It will cause it reported associations are through some article and all. I got the reference that some may cause headache, sleep disturbances, irritability, memory complaints, and oxidative stress. Possible long-term tumor risk. Then this ionizing radiation may high dose evidence may cause DNA damage also. Then leukemia, thyroid malignancy, developmental abnormalities. That even though they are regulated levels, but risk may remain under study. Then coming to Ayurvedic interpretations, concept of Janapado it is like through any environment cause can cause disease in the person. So it is in Ayurvedic textbooks and all, they correlated with the Janapado Damsa. Then dosha correlation, here Vada Pitta Kapha, that's the main basics of our Ayurvedic science. In that, Pitta Vriddhi may cause that heat, inflammation, oxidative stress, they all can correlate that Pitta dosha vitiation. And Vada Pragoba, there will be neurological symptoms, insomnia and all. So they can be correlated with the Vada Pragoba. Next is Dhatu involvement. In Ayurveda, Sapta Dhadus are told. In that Rekta Dhatu, in Rekta level, there will be cellular damage. Then Majja Dhatu, that is correlated with our nervous system. So nervous system disturbance may this ionizing radiation and non-ionizing radiation also may cause this nervous system damage. Coming to Ayurveda perspective, that Ojas and Vyadik Shamatva. That Ojas is the old Sara of our Saptadhadus. So this is the main for a human being. Ojas is main thing, and this chronic environmental stress may cause Ojas Shaya and reduce immunity and resilience. Increased disease susceptibility also will cause. Then malnutrition worsens vulnerability. This support one slogan, Ojas Sarva Dhatu Saram. It is from Charga Samhita I taken. In the socio-economic influences, that malnutrition, low awareness, poor housing, increased vulnerability, these are the socio-economic influence to the tribal people. And integrity findings that include that radiation effects not conclusively proven at low levels, but vulnerable groups need precautions. Ayurveda supports resilience building. Coming to discussion part, in the preventive and curative model, in modern prevention, we can go to radiation mapping and safe tower placements, periodic screening camps, then awareness programs. For in Ayurvedic prevention, we can Dinacharya, Rudhucharya. This Dinacharya, all are these tribes people are following this, and Rudhucharya also they may follow. Then Ridu Shodhana, it is a concept in Ayurveda. Then Rasayana therapy. This Rasayana therapy can enhance the ojas. Coming to curative approach, Pitta Shamana, I told Pitta vitiation may be occur due to radiation. So Pitta Shamana Chikitsa can be do. Then Medhya Rasayanas can, for neurological involvement, Medhya Rasayanas can be given. For coming to Dinacharya, that Brahma Muhurta Jagarana, it is the first concept, wake up early. These all are followed by tribes. Then elimination of natural urges, brushing teeth and tongue cleaning. These all are, then Abhinga. Abhinga is the daily oil massage. And Vyayama, Udvartana, Snana. These all are comes under Dinacharya. Then coming to Riducharya, Hemanta and Shishira Ridu, it comes under November to February month. And these also follow some Ahara Vihara. Ahara, they have to follow heavy food because digestive fire will be more, the capacity will be more in this months. So we have to follow Snigdha, Madhura, that is oily food, and sweet. Amla means sour food, and salt also should be included in their food. Then Viharas, they are including Abhinga, that's oil massage, and Ushna Jala Snana, in hot water bath we have to do. Like that, so much things they told. And Vasanta Ridu, that is March, April, like this we have to do. Ahara, Legu, Ruksha, that's light food, Ruksha, Ahara, Kadu, and like this and all. Grishma Ridu, this May and June it will come. That also Ahara should be like in this manner we have to follow like Acharyas told. In Varsha Ridu, July and August, it's Aharas are Ushna, Legu, Amla Rasa, Lavana Rasa and all should be included. And Viharas should be Bhakti, Jala Varjana, and then they told like that. Coming to Ridu Shodhana, it is a concept that for elimination of the toxins in our body, in each Ridu, we have to do some procedure in Panchakarma. That is, in Varsha Ridu, it comes in rainy season. That is, Bhakti should be adopted. In concept of Ayurveda, that Vada Dosha Pragoba will be there. So we have to follow Bhakti. Bhakti is the enema therapy. With a lot of medications we are telling, with associated with the toxins and condition of the patient, we are choosing the medicine. And Vasanta Rudu, Vamana, that is emesis, and Sharat Rudu, Virejana, that is purgation process. These all are medicine will vary upon the patients. Then conclusion and future scope are given. The technological development has reached tribal forest. Radiation exposure concern required balanced evaluation, and evidence for low dose harm remains evolving, and tribal population are socio-economically vulnerable, and Ayurveda offers a preventive resilience based healthcare model, and integrative public health strategy is recommended. For future scope, there should be a long-term cohort study in this population, and radiation mapping in tribal belts, and Ayush public health collaboration also should be there. These are my references. Thank you.
Thank you. Any questions from audience side? No questions. Your study consists of narrative research design.
Narrative.
Okay. How many samples you have?
No, sir. I refer to articles. Depend upon that, any radiation effects may cause these things.
This is study only review based paper.
Review based.
Okay, not a empirical study.
No, sir. That
Okay.
time I didn't got.
Okay, okay. Thank you.
Thank you, sir.
Next, Suma Mantyamanant.
Shri Gurubhyam Namaha. Namaste everyone. Myself, Dr. Suma, second year PG scholar, Department of Samhita Siddhanta, JMC Mysuru. Title of my study, Bridging Tribal Medicinal Knowledge and Ayurveda, Pathways Towards Evidence-Based Healthcare in the Era of Globalization, Focus, Karnataka Tribal Communities, Ethnobotanical Wisdom and Ayurveda Integration, Conservation and Healthcare Relevance. Introduction. Tribal communities possess rich indigenous medicinal knowledge developed through long interaction with forest and ecosystem. Each forest produce is believed to hold medicinal value, forming a time-honored ancestral healthcare system. However, globalization and modernization are influencing lifestyle, knowledge transmission, and biodiversity. So there is an urgent need to document, conserve, and scientifically interpret tribal knowledge before it disappears. Tribal diversity in Karnataka. Karnataka is rich in floristic and ethnic diversity with vegetation ranging from tropical evergreen forest to scrub jungles. The state hosts 14 forest-dwelling tribes including Jenu Kuruba, Soliga, Erava, Betta Kuruba, Hakipiki, Kadu Kuruba, and etc. Scheduled tribe population cover approximately 6.95% of the state's population. Communities maintain traditional lifestyle in remote forest hamlets with limited modern amenities. So geographic distribution, tribal populations are concentrated in districts such as Mysuru, Kodagu, Uttara Kannada and Chamarajanagar mainly. These are all the biodiversity hotspots with abundant medicinal plants. Communities practice traditional agriculture, tuber cultivation and forest-based livelihood. Integration in indigenous medicinal knowledge system, knowledge transmitted orally across generations,
includes herbal remedies, dietary practices, preventive healthcare methods, spiritual and community healing approaches. So strong belief that every plant has a medicinal properties waiting to be identified. So which is what mentioned in Samhitas also, Jagati evam anaushadam. Everything is having its medicinal value. So one such example is Jenu Kurba tribe. Jenu Kurba tribe, as the name itself suggests, the occupation of them is forest honey collection, herbal medicinal knowledge, use of local plants for wounds, fever, digestive disorders, and snake bite. Plants used by them are few of them: neem, rhizome of turmeric, forest mushroom, as Sir told, 120 varieties of mushrooms, forest mushrooms for boosting immunity, shatavari for treating female reproductive diseases. Their knowledge system reflects deep ecological understanding and sustainable use of resources. So conservation is essential to prevent exploitation of forest hubs. Conceptual link with Ayurveda. Tribal practices share similarities with Ayurveda principles like Desha, Satmya, and one of the important branch of Ayurveda, that is Dravya Guna, which deals with the study of the medicinal plants. And Desha concept, where the tribal community belongs to a particular area and the practice some ahara viharas related to that desha. Satmya is the concept which is habituated to the person living there. And some examples from the Ayurveda are Ashwagandha and Nirgundi, which are having medicinal properties. And Ayurveda provides a scientific framework to interpret tribal remedies. From traditional wisdom to evidence-based practice, validation and credibility, evidence-based medicine helps scientifically validate tribal medicinal knowledge through research and clinical studies, enhancing its safety, reliability, and acceptance in mainstream healthcare. Integrative healthcare development, applying EBM principles enables the integration of tribal practices with Ayurveda to create affordable, culturally acceptable, standardized healthcare models while preserving traditional knowledge. Impact of globalization, pros and cons. The pros are improved healthcare access, research opportunities, communication, and education. The cons are loss of traditional knowledge transmission, lifestyle disorders due to globalization, biodiversity depletion, commercial exploitation of forest resources. Need for integration and conservation, documentation of ethnobotanical knowledge, pharmacological validation and clinical research, ethical collaboration with the tribal communities, integration with Ayurveda for culturally acceptable healthcare. Concluding, tribal medicinal knowledge represents a valuable healthcare heritage developed over centuries. Karnataka's tribal communities offer immense ethnobotanical potential that remains underexplored. Integrating indigenous wisdom with Ayurveda and scientific research can improve affordable healthcare. Conservation of ancestral knowledge in its original form is essential to prevent exploitation. Collaborative approaches can promote sustainable health systems, biodiversity protection, and community empowerment. Thank you.
Thank you, Suma. Valuable presentation. Okay. Any questions? No question. Okay. Last paper presenter name is Dr. Shilpa Hajeri.
Namaste everyone. Myself Dr. Shilpa Hajeri, second year PG scholar from the Department of Ayurveda Samhita and Siddhanta, GMC Mysuru. The topic for my presentation is equity in action, that is transforming the tribal women healthcare deliveries through inclusive public health policies. Coming to the introduction, in a tribal population in India, it faces the persistent health inequity due to the geographical isolation, poverty, cultural barriers, and limited access to quality healthcare. Despite of government initiatives, significant disparities in a maternal health, child health, and nutrition, and the disease burden to continue to the affected to the tribal women. From the Ayurvedic perspective, the tribal health disparities reflect disturbance in both individual balance and the border social ecological fabric. It is described under Janapada Dvamsa. Therefore, addressing these inequalities requires cultural sensitivity, community-driven public health policies, and that integrate the holistic Ayurvedic principle with a equitable healthcare framework. So this paper critically examines the public health policies and the tribal healthcare delivery system focus on the empowerment of the women in a tribal of the India. So the public health vision and the mission of this in tribal health is the vision is to position the Ayush system of medicine. It is preferred to the living and healthcare practices for improving women's health in a tribal India. And missions, it includes broader functional areas like information, education, and communication, administration and quality control, human resource development, and conservation of medical plants, and research for evidence-based practice. So, the barriers faced by the tribal women are geographical inaccessibility in a remote and forest areas, and the cultural linguistic gaps with the healthcare providers, and the high out of pocket that is expenditure, and the low insurance coverage, nutritional insecurity, and high anemic prevalence, and poor socio-cultural adaptation in health system, and curative services often bypass the vulnerable tribal women. For these barriers, our government of India introduced National Rural Health Mission. Under this, the major objective includes a reduction of the maternal and child mortality, promotion and institutional delivery, enhancement of the universal immunization coverage, and strengthening the primary healthcare services, and integration of Ayurvedic system to the main health stream. So the common gynecological issues in a tribal woman, I have listed some of the disease like dysmenorrhea, leukorrhea, and menstrual irregularities. Due to it is linked to poor hygienic and infection practices. For these, in Ayurveda, we have shamanic and shodhana treatment, and and for antenatal care in Ayurveda, our acharyas have mentioned 9 months of garbhini paricharyas. Through this, what are the ahara, vihara, and the vichara, what the pregnant woman should follow. And also, it mentioned that how the sutika after the delivery, what are the practices the woman should follow. And also for the menopausal condition, the symptoms like anxiety, sleep disturbances, and many mood fluctuations, we have the treatment like vata shamaniya treatment, balya line of treatment, jeevaniya, rasayaniya, brahmaniya. So our acharya charaka acharya mentions 50 mahakashaya ganas in our text. We can use that drug. So, for the health empowerment of the tribal women, the health empowerment of the women is essential for the achieving the quality and enabling their meaningful perception of in family and society. However, many tribal women continue to face the unequal access to healthcare and inadequate counseling and persistent socio-cultural barriers. Addressing these challenges requires the improved education, health awareness, and gender sensitization, and positive shift in the social attributes towards the women, and strengthening the reproductive and child health services through the innovative community-based and approaches. The crucial special focus on adolescents and their families is needed to promote disease prevention, delay the age of marriage, and improve the nutrition and anemia status, and encourages the informed decision making for the sustainable health outcomes. So the healthy woman, which she lead the healthy family and the healthy society and the healthy country, and ultimately the healthy world. So proposed strategic interventions are community level of IEC, that is information and communication on anemia prevention, deworming nutrition, and early marriage awareness, and the strengthen the conflict skill of ashas and anganwadi workers and the nutritional midwiferys, and promote the local available iron rich food, and the effective implementation of Kishori Shakti Yojana initiation that is taken in Orissa state, and strengthening the school-based, that is iron and folic acid programs, deworming and peer outreach programs, sensitization of the community, school and faith elected leaders, and the intersectional coverages of health education, etc. So coming to the conclusion, health equality of the tribal women is development goal and a moral responsibility. Persistent disparities in the maternal health and nutrition healthcare access reflect the deeper structural inequalities despite of efforts and the national rural health mission. So the Ayurveda is a holistic concept of swasthya through the Garbhini Paricharya, Sutika Paricharya and the Rasayana offer the preventive life cycle based solutions. So integrating the Ahara, Vihara and the Achara which is culturally sensitive public health strategies can ensure the sustainable health system. So that empowerment requires healthy education, nutritional security, delayed early marriage and financial protection and community participation, mainstreaming the Ayush within the primary care. And they can provide the culturally acceptable and affordable solution. Thus, aligning with the Ayurvedic wisdom with the equitable public health policies, we can truly transfer the equity into the action. Thank you.
Thank you, Shilpa Ajiri. Any questions from audience? Okay.
We are all providing all those facilities, through different channels. We are providing facilities to them. So why they are not improving? What is the reason? We are providing all those facilities. What you have said, I think almost all it is reaching at their doorstep. But where is the lacking?
Maybe the negligence of the caretakers. Because the government is providing so much of
whether it is the literacy we have to improve or socioeconomic status we have to improve. Which one you have to improve? You said you are the presenter, no?
in all the levels we have to improve.
Each community has its own system, because you cannot apply what you apply to the Janukuruba to other communities, because each community we have to individually we have to see the things.
But we have to convenience first by communication only we can start the.
Where we are communicating with them. We are communicating with them. We are not. They are almost on the globalization. You are saying no. They are coming to the globalization only. It is a part of communication only. Then think and try to understand the future. In future, you can.
Okay, thank you for presentation.
ಪ್ರಬಂಧ ಮಂಡಕರೆಲ್ಲರೂ ವೇದಿಕೆಗೆ ಬನ್ನಿ.
First and foremost, I would congratulate all the paper presenters, and I would congratulate Karnataka State Tribal Research Center, Mysuru, organizing the 2 days national seminar on impact of globalization and cultural beliefs on tribal health and healthcare practices. In present scenario, the seminar topic is very significant and very relevant. Entire paper presenters' major ideology is our psychological or physical well-being depends on ahara, vihara and achara. So ahara means food, vihara means environmental factors. Vichara means cognitive functioning. Cognitive functioning means positive thoughts, positive attitudes. So, our human beings always suffering from some negative feelings like frustration, negative attitudes, like that. So, entire Ayurvedic based treatment or diagnosis is based on that ahara, vihara, and achara. So, very simple topic. But some people in day to day life to face lot of problems regarding some cognitive functioning achara. So, simple strategy is we maintain psychological well-being, we practice some acharas. Acharas means sincerity is not important. So, seniority is not important. Sincerity is most important. Seniority is not important. Sincerity is most important. Designation is not important. Dedication is most important. Status is not important. Mental status is most important. Vetana is not important. Chetana is most important. Chetana means manassu or mindset. So this is called achara. This is called achara. So in India has a second largest tribal population in the world, but tribal community face lot of unique challenges regarding healthcare systems due to the lack of knowledge about modern medicines, cultural barriers, and health infrastructures, scarcity of health professionals. So many challenges and causes are there behind that healthcare service of community and tribal community. So, in that context, this kind of seminars is very useful and very fruitful. So, that's why once again I would congratulate our Karnataka tribal, Karnataka State Tribal Research Centers and staff, and thank you one and all participants, paper presenters. Thank you.
ವಿಚಾರ ಸಂಕಿರಣದ ಈ ಕೊನೆಯ ಗೋಷ್ಠಿಯಲ್ಲಿ ಪ್ರಬಂಧ ಮಂಡನೆಯನ್ನು ಮಾಡಿದಂತ ಡಾಕ್ಟರ್ ಪೂರ್ಣಿಮಾ, ಪ್ರೊಫೆಸರ್ ಖಂಡಿಕೆ ಆರ್ ಶ್ರೀಧರ್ ಸರ್, ಡಾಕ್ಟರ್ ಪಿ ವೈಷ್ಣವಿ, ಡಾಕ್ಟರ್ ಅನುಶ್ರೀ, ಡಾಕ್ಟರ್ ಸುಮಾ, ಡಾಕ್ಟರ್ ಶಿಲ್ಪಾ ಹಜೇರಿ ಇವರಿಗೆ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಬುಡಕಟ್ಟು ಸಂಶೋಧನಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನ ಬಯಸ್ತೇನೆ. ಈಗ ಗೋಷ್ಠಿಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿಕೊಂಡಿರುವ ಡಾಕ್ಟರ್ ಮಂಜುನಾಥ್ ಪಿ, ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್ ಡಿವೋರ್ಸ್ ಅಂಡ್ ರಿಸರ್ಚ್ ಇನ್ ಸೈಕಾಲಜಿ, KSOU ಮೈಸೂರು ಇವರಿಗೆ ಗೌರವ ಸ್ಮರಣಿಕೆಯನ್ನು ನೀಡಬೇಕಾಗಿ ಸಂಸ್ಥೆಯ ಉಪನಿರ್ದೇಶಕರಾದ ಗಿರಿಜಾಂಬ ಮೇಡಮ್ ರವರಲ್ಲಿ ಕೇಳಿಕೊಳ್ತಾ ಇದ್ದೀನಿ.
ಹಾಗೆಯೇ ಇವರ ಜೊತೆಯಲ್ಲಿ ನಮ್ಮ ಮಾನವಶಾಸ್ತ್ರಜ್ಞರಾದಂತಹ ರವಿ ಪ್ರಸಾದ್ ಸರ್ಗೂ ಕೂಡ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಮೂಲಕ ಒಂದು ಕಿರು ಸನ್ಮಾನವನ್ನು ಸ್ವೀಕರಿಸಬೇಕು ಅಂತ ಹೇಳಿ ಈ ಮೂಲಕ ಕೇಳ್ಕೊಳ್ತೀನಿ ಸರ್, ಪ್ಲೀಸ್.
ಇಷ್ಟೊತ್ತು ನಮ್ಮೊಂದಿಗೆ ಸಹಕರಿಸಿದ ಎಲ್ಲ ಪ್ರೆಸೆಂಟರ್ಗಳಿಗೂ ಹಾಗೆ ಭಾಗವಹಿಸಿದಂತ ಸಮುದಾಯ ಬಾಂಧವರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇಲ್ಲಿಗೆ ಇವತ್ತಿನ ವಿಚಾರ ಸಂಕಿರಣ ಕಾರ್ಯಕ್ರಮ ಮುಗಿಸ್ತಾ ಇದ್ದೀವಿ. ನಾಳೆ 9:00ವರೆಗೆ ಪ್ರಾರಂಭ ಆಗ್ತದೆ. ಎಲ್ಲರೂ ಸಮಯಕ್ಕೆ ಸರಿಯಾಗಿ ಭಾಗವಹಿಸಬೇಕು.